have asked as best we can to stay ahead of this. And I think in terms of what we control, I'm feeling really good about where we are. But I need the experts in terms of what we don't control, what's the unexpected, because that's what could, take us back a little bit. Right now, we're ahead of the curve, and I'm doing everything I can to stay ahead of the curve. Thanks for being here, you guys.
Complications again over the past day. Yesterday, in our paper release, we had put out that we had lost 21 blessed souls. So that's a combination of 58 over 2 days. The statewide total number of deaths is now 198. Each one of them a precious life lost. God rest their souls. You may have heard that there is clearly a challenge at the Lakeland Health Center in Passaic County. I've instructed, not that she needed it, Judy and her team, to give full support to Mayor Dan Mahler to get to the bottom of that. Clearly, we saw in Washington State, and we're living it in our own reality right now. Long-term care facilities are a particular area of concern and focus, and we know that lots of folks out there are worried about moms and dads, grandfathers and grandmothers who are in facilities around the state. We're doing everything we can to as aggressively get out ahead of this as fast as possible. We also lost New Jersey National Guard Captain Douglas Lynn Hickok this weekend. He was a drilling guardsman and physician's assistant, originally from Jackson, New Jersey. He was a Pennsylvania resident at his death and passed away in a Pennsylvania hospital. And while he will not be counted among our state's COVID-19 losses, this loss hurts no less because of that. I just got off the phone with his wife, Marianne. Bless her and bless them. I sent her and Tammy's and indeed our entire state's condolences to her and their children, Alexander and Robert, who I spoke to with her, as well as Noah and Chandrea and their family. Captain Hickok is prominent in our thoughts, as is every New Jerseyan we have lost. Each of their lives was precious, and I know their memories will be precious, and I hope they are a source of strength to their families and friends at this time, and may God bless them all. These numbers, as I have said before, never get any easier to report. They're never going to be easier until that number, frankly, stands at zero. But I also shudder to think about what these numbers would be had we not taken the strong stance we have as it pertains to social distancing. As I have said before, social distancing is absolutely necessary for us to slow the spread of COVID-19, to flatten the curve of new cases, to save lives, and to protect the ability of our healthcare system, one of the best in our country, if not the world, to help those who need the help the most. We try every day to hammer this point home, sometimes with levity, sometimes by standing up to those who have failed this lesson as examples. And before we go to questions today, I'm going to ask Pat to weigh in with a couple of the overnight enforcement news, but we'll do that in a couple of minutes. I want to make this point, and by the way, as I mentioned, I spoke to Captain Hickok's wife, Marianne, and 2 of their 4 children, and she asked me literally to make the point, when we say stay at home, we mean stay at home. And she went through a number of examples where people were hanging out, going to the beach, flaunting the clear mandate that we have put in place, and that will not allow us to achieve what we must achieve, which is to flatten this curve as fast as possible, and therefore take the pressure off our healthcare system and be able to deal with each one of these folks who are sick in the very best way possible. So I've tried different ways. Today I want to do it with a graphic, and maybe you can pull this one up. This chart, which is, I think, the chart on the left over here. There we go. This chart is built from the actual data that we have received on the ground. It is our best understanding of how fast COVID-19 would have spread across our state without social distancing, as counted in the number of hospitalizations that would have risen. Without social distancing, we would have expected to hit our entire statewide capacity for intensive care unit beds on Wednesday. In just 10 days from now, we would be expecting to exhaust our entire supply of available hospital beds. Eventually, the number of residents needing ventilators would not just far exceed the number of available ventilators, but our entire availability of beds. And all this assumes that just 5% of all cases would require hospitalization, and only 1% would eventually require a ventilator. This chart is the nightmare scenario that we are desperately working to avoid and that we are urging every New Jerseyan to help us avoid. This is what we mean by flattening the curve and why we have taken all the steps we have taken since January. This is why it is absolutely necessary for everyone to stay in unless you need to be out or unless we need you as part of our response. This is why we're going to continue enforcing the prohibition against gatherings and parties as stringently as we have. And again, you'll hear more from Pat in a few minutes on that. And even with all we are doing, we are preparing for the eventuality that we are going to need extra hospital beds. Judy will talk about, if you can go back to the chart, if that's okay. I don't know who's got that. Just if you can't see the actual data there, let me just tell you what the blue line are persons hospitalized. That's the top line. And it comes in at just under 80,000 at a peak which is essentially in early to mid-May. And you have at the same chart current capacity of hospital beds, Judy, of about 18,000. And so you could see the mismatch that is before us unless we succeed at social distancing. There's literally no amount of effort or energy we can apply to that chart that you're looking at that will close the gap between what we will need and what we have. Literally, there's nothing we could do if we did everything within our power. So the absolute number one weapon at our disposal is the one that we've been pounding away on day in and day out, and that is stay at home, practice social distancing, period. And again, Judy will give you a little bit more color on what might possibly be achieved. Let me just say what's underlying that really graphic chart that you see behind me at the moment. It assumes no social distancing. It assumes that infections double every 6 days. Hospitalizations among the infected is 5%. ICU among the infected, 2%. Ventilator use among infected, 1%. Average length of stay in a hospital, 7 days. ICU length of stay, 9 days. Ventilator length of stay, 9 days. There's really, and Judy can tell me if she disagrees with this later, there's really only two variables there that we could control. One is social distancing, and then that in turn is the infection doubling time. The more of a social distancing reality that is fed into that model, the longer it takes for cases to double, the flatter that curve becomes. So we can then go to the hospital systems. This is exactly why we are working with our hospital systems, and here's a map of our acute care hospitals and health systems to expand their bed capacities in their existing facilities and to reopen closed hospitals to bring online an additional 1,300 plus beds. And that's why we have partnered with the U.S. Army Corps of Engineers to stand up 3 regional field medical stations capable of adding another 1,000 beds, the first one of which, Pat, I believe will be up and running by the end of the week.
That's correct, Governor.
So looking forward to that. I was back and forth this morning with the likes of Bob Garrett at Hackensack, Barry Ostrovsky at Barnabas, Kevin Slavin at St. Joe's, but also the chair of the Hospital Association, Mike Marin over the weekend, Kevin O'Dowd, and others over the weekend. It's why we've put not just beds, but it's why we'll put the call out to retired healthcare workers, among many others, to return to service to help us. And I thank the many volunteers who have already stepped forward. As of right now, we have had 3,611 individuals respond to this call, and we're incredibly grateful for their selflessness and patriotism. I welcome anyone else with prior medical experience to visit the website you see, covid19.nj.gov/volunteer, to join our army against COVID-19. And it is why I have turned my focus in my ongoing and daily discussions with the Trump administration to our dire need for more ventilators. This is right now concern number one. Following a number of conversations, and this, as you can imagine, given the weekend, we had a flurry of them, including a couple with the president himself, with the vice president. We just got off a video transmission with the president and vice president and their teams. But after all of this back and forth over the past number of days, I received word last night that a shipment of 300 ventilators from the Strategic National Stockpile is on its way to New Jersey. This is welcome news, and we are grateful, and I thank the administration. But to be absolutely clear, this is far, far from what we ultimately will need. I am going to continue advocating constantly for more, and in addition to that, turning over every stone we have both in this state and our networks around the country and around the world. We know that our hospitals are quickly running toward full ventilator capacity. We are working with them to ensure the supply given what we know we have in state and what's on the way. Even knowing this, we are working with our hospitals and FEMA to allow them to co-vent or have two patients connected to the same ventilator. This is a necessary step that will buy us precious time. This is real life, and this is life and death. We need more ventilators, and I will continue to say these four words in every phone call I have with the President, Vice President, and the administration until, God willing, we get them. I just repeated them on the video call we just had. Along with everyone up here, I'll keep fighting for the equipment we need, whether it be more ventilators or personal protective equipment. And through state procurement, millions of articles of PPE will be coming to New Jersey for distribution this week. We continue to accept donations of PPE through covid19.nj.gov/PPE donations. That's covid19.nj.gov/PPE donations. And I would like to I want to give a shout out to, again, our corporate citizens have been huge. I want to give a shout out to Sherwin-Williams, who contacted me over the weekend to report that they'll be donating an additional 2,500 N95 masks and 1,000 gloves on top of what they have already done. Tammy and I hosted a call this morning with a whole range of philanthropic and corporate interests to repeat the need for PPE and other ways that folks can participate. I'm looking forward to a call later this afternoon with the Johnson & Johnson folks. Again, it takes a village. We can't do it all on our own. Again, I hope to give a fuller accounting on PPE in the next day or two, so please bear with me. But together, as I said, as New Jerseyans, our mission must be to flatten the curve. We need you to do your part and take the necessary steps so you don't land on any graph. Switching gears, a quick announcement on testing. Tomorrow, Tuesday, March 31st, the Bergen County College drive-through site will be open beginning at 8 a.m. for all residents, again, exhibiting symptoms of respiratory illness. Again, you must be symptomatic to receive a test. The PNC Bank Arts Center will be closed tomorrow. Regardless of where you live, if you are exhibiting symptoms of respiratory illness, call your primary care practitioner and they can assess whether you need to be tested for COVID-19 and if so, where you can be tested. The Bergen Community College and PNC Bank Arts Center sites are public mass testing sites operated in partnership with FEMA. And a list of all public testing sites is available, again, at covid19.nj.gov. But tests are available elsewhere and in every region of the state. I also encourage you to visit covid19.nj.gov to take a self-test. There's a symptom page in that website. I encourage you to go there first, perhaps, if you're wondering yourself whether or not you are exhibiting symptoms. Also, I want to thank Senator Joe Cryan, who reached out to me earlier today with Judy, and also Senator Nick Scuteri. Union County's drive-through testing site is opening to all frontline healthcare workers and members of law enforcement, fire personnel, and EMTs from across the state, not just from Union County. If you are experiencing symptoms, again, you've got to be symptomatic and believe you need to be tested, visit UC, as in Union County, ucnj.org for information on making an appointment. This site is open 6 days a week, again, to all frontline workers, and I thank our brothers and sisters in Union County for doing this. I want to actually hold up an exhibit I held up the other day. This is now an expanded list of all the testing sites in the state. So I would just say, with all due respect to some of the stuff you may read about testing, we completely understand the enormous demand of folks to want to get tested. This is a time of high anxiety. We get that. And we also appreciate the fact that folks who are in the worried well are stepping aside overwhelmingly to allow folks with symptoms to go forward and get tested. That's the way it should be, and that's been our focus from day one. We made the decision right out of the blocks, and again, we've been as aggressive as testing symptomatic people as any state in America. We made the bet, particularly limited federal resources. Would we like to be South Korea? Would I like to have unlimited specimen collection material? Would I like to have all the healthcare workers at my disposal? Would I like to have tests that turn around in 45 minutes, which I think we will have at some point sooner or later? You betcha. But in the absence of all of the above, in a limited supply reality, particularly from the federal government, you got to pick your spots. And there is no doubt, for obvious reasons, by the way, that testing symptomatic people is the place to hang your hat, and that's where we have chosen to hang our hat. Obviously, if somebody's sick, we want to make sure they know whether or not they've got this virus or not, for their own well-being, for their own peace of mind, and also for their own health care if, in fact, they've got it. But it's also the highest quality data that the people to my right need to allow them to try to get our arms around this virus and project where it's headed. So with all due respect to the perfect world, which we do not have, I don't control the amount of federal supplies. I wish I did, but I don't. The reality is, given what we have, and recognizing there's an overwhelming demand and interest in getting tested, which we completely understand, let's make a meal out of testing symptomatic individuals, addressing folks who are sick. For obvious reasons, that makes sense, but it also gives the epidemiologists and the other healthcare professionals the highest quality data that they need to be able to get our arms around this. Bless you, into your arm, I hope. I also have a few updates to provide. First, speaking of the PNC Bank Art Center, I am proud to announce that PNC Bank has signed on to the mortgage relief plan that we unveiled on Saturday, meaning more homeowners financially impacted by this emergency will be able to take advantage of the 90-day grace period on their mortgage payments. We urge those homeowners to work, if they've got a mortgage from PNC Bank, to go directly and work through PNC Bank. And likewise, if you've got a mortgage with any of the banks that we've listed, deal directly with them. Second, pursuant to the executive order I signed Saturday mandating daily reporting by our healthcare facilities of their PPE inventories, ventilator inventories, and bed counts, we have established an online portal for that reporting. We have opened our online portal for all impacted healthcare facilities at report.covid19.nj.gov. That's report.covid19.nj.gov. And as we committed on Saturday, we do intend to make some of this information public. My guess is later this week would be my guess, Judy. Attorney General, I think we may have jumped the queue on this slide if we want to go back a couple. Attorney General Gurbir Grewal and Acting State Comptroller Kevin Walsh, in partnership with the U.S. Attorney Craig Carpenito, have announced the formation of a joint federal-state task force to investigate and prosecute misconduct ranging from unlawful hoarding of medical supplies and price gouging to charity scams and procurement fraud, among other unlawful misleading activities. Residents may anonymously report any instance of these unlawful practices at the numbers behind me, 866-720-5721 or disaster@leo.gov, disaster@leo.gov. Make sure you make note of that. I also wish to amplify an announcement made Friday by the Department of Human Services that over the next 2 months, $70 million in additional SNAP or food stamps benefits made available by the federal response bill will be given to qualified New Jersey beneficiaries to help them with the purchase of groceries. These supplemental funds will be loaded directly onto a family's EBT card. And the Division of Alcoholic Beverage Control is issuing guidance to allow breweries, or brew pubs to provide home delivery to their customers. Home delivery has been prevented because of a ruling that ABC issued last May. Today, ABC has decided to relax that ruling and allow for home delivery. Also this morning, we issued an administrative order updating and clarifying Executive Order 107, specifically pertaining to which businesses may be allowed to operate during this emergency and the ways in which they can operate to ensure social distancing. We will allow auto dealerships to conduct online or remote sales and authorize dealers to deliver vehicles directly to their customers or to arrange for curbside or service lane pickup at a dealership. We also made 2 clarifications. The first allows realtors to operate and to show houses to prospective buyers, but only on a one-on-one basis or to immediate families, but continues the current prohibition on open houses. The second clarification reiterates that golf courses are closed and will remain and should remain closed as recreational businesses. In accordance with the guidance released over the weekend by the Federal Department of Homeland Security, we will allow firearms retailers to operate by appointment only and during limited hours to conduct business which under law must be done in person. Again, we are doing this in light of the federal guidance published Saturday night, which includes these retailers as part of critical infrastructure. It wouldn't have been my definition, but that is the definition at the federal level, and I didn't get a vote on that. We will continue to enforce all of our gun safety laws, and all gun owners are reminded of the need to keep their firearms locked in safe storage, and anyone who sees a firearms retailer acting in violation of this order should report them through covid19.nj.gov/violation, and law enforcement will respond. Finally, I wish to close by reiterating the words I said yesterday regarding the travel advisory the CDC announced on Saturday. We're already living what the CDC is calling for, and their advisory does not impact what we already have put in place to protect our state and our residents. My stay-at-home order remains firmly in effect. Unless you are absolutely needed to go out or unless your job is critical to our response, please, please, please stay home. We will get through this. There's no question in my mind. But we'll get through this more quickly and stronger if everyone, all 9 million of us, does our part. Don't think that because someone else is staying in that you don't have to. You got to do the smart thing. You got to do the right thing. That gives me a chance before I go to Judy. Pat, tell us what the overnight enforcement looked like, and also you wanted to clarify the amount of members of law enforcement who were exposed or had the coronavirus.
True, I'll start with that. And on Saturday, I had indicated basically just the wrong information. I had overstated the positive test. There's actually 3 categories that we're providing now daily. And as of today, to clarify for the record, there's 288 law enforcement officers tested positive. 2,477 are at home in a self-quarantine, and 618 are out for other reasons, whether that's sick or they're out injured. These, if you want to, we can report them. And the reason why we're keeping those is to keep operations to be planned tactically and operationally. If a squad or a station or a police department needs assistance, we want to plan for that. With regards to the overnight, there was an incident in Harrington Park where a male subject was arrested for driving under the influence. He was charged with eluding, obstruction, and driving under the influence. While being processed, he coughed in the direction of the officers and claimed to be COVID positive. There was also an incident in Lakewood. Lakewood Police Department responded to a gathering of 40 to 50 people. It was a bat mitzvah. It was a celebration that resulted in a child neglect charge as well as the charge for violating the governor's executive order. In Bridgeton, there was a gym that had an Herbalife session going on. That runner of that gym was charged, and in Woodbridge, there was a barber shop that was open, and that subject was charged. So over the time period that the executive order restrictions have been in place, there's been 70 compliance issues, which has resulted in, to date, 34 indictable offenses. Thanks, Gov.
Thank you, Pat. The Attorney General is not here, but I want to ask my colleagues, beginning with you and maybe Jared, I would like for us to consider the heft of the penalty that one has to pay in these times in some extraordinary fashion, particularly someone who willfully. It's one thing to be ignorant, although the patience for ignorance is about zero, given we've been pounding away on this every which way, morning, noon, and night. But for somebody to willfully ignore this and put someone else's life at stake, and you're doing it, by the way, if you have a gathering, you're doing it in a more benign way than if you cough on somebody and say you've got coronavirus. But in both cases, you're wrong, and you're out of compliance, and it's illegal behavior. And I want to, if anything, tighten the screws on the price that those folks will pay. With that, with lots to talk about, with color on the cases overnight, bless the fatalities, as well as some of the charts that I already began to refer to, please help me welcome the Commissioner of the Department of Health, Judy Persicelli.
Thank you, Governor, and good afternoon, everyone. As I've mentioned previously, the department has been modeling when the peak of COVID-19 cases will hit our state and when we expect this surge to be at our hospitals. This is directly related to the availability of hospital beds and the resources needed to care for our patients. That's medical surgical beds, critical care beds, and things like ventilations. We're using the CHIME model. The CHIME model was developed by Penn Medicine. It stands for COVID-19 Hospital Impact Model for Epidemics. It projects how many patients will need hospitalizations, and it projects the resources that are needed. So just to level set before we go over the charts, right now, if we did nothing, we have 18,000 medical surgical beds and about 2,000 critical care beds. If you look at the chart with the greatest peak, the highest peak, that is the chart that we're calling pre-mitigation. That was before all of the mitigation interventions. In other words, we did nothing at all. Let people go about their lives as they knew it. I think you can see by looking at that chart, the peak is the hospitalizations. We would have a little bit shy of 80,000 hospitalizations, certainly far higher than the available beds that we have. The ICU capacity would have to have 40,000 beds. And you know, if we did nothing, we would have 2,000. So we show this because it really points out that the real only tool we have in our toolkit is social distancing and the impact that it can have. If you look at the second chart, this identifies the impact of social distancing at 31%. Now, you might ask, why did you choose 31%? Well, that's in the literature of the compliance rate of social distancing by history, by other epidemics. We've identified the infection doubling rate. And remember, this is a point in time. We run this a number of times a week because it changes. The infection doubling time, the rate of new cases doubling, every so many days, we've identified that as 6 days. The hospitalization rate among infected individuals, we've identified at 5 The ICU, the number of individuals who would then need an intensive care bed is at 2%, and half of them would need a ventilator. And then you factor in the average length of stay overall of the hospitalizations, and then the ICU length of stay and the ventilator length of stay. So if you look at the chart with 31% social distancing, you can see that we reach our ICU bed capacity on April 11th. That's pretty soon, right? Well, this assumes that we've done nothing. I think I reported last week that we asked all of the hospitals to double their ICU critical care capacity. We asked them if they had 10 critical care beds to move it up to 20, if they had 40 to move it up to 80. It's a 100% increase. If you also look at this chart, you see that we reach our all bed capacity on May 8th. Sorry, May 8th. But you also see the delta between the existing beds of 18,000 and the requirement of over 30,000. So if we were doing nothing with hospitals, no planning, we would be short. But what I can report is that we are increasing our critical care beds. And we are increasing the availability of additional medical surgical beds for lower acuity patients. In discussions with the CEOs, they are prepared to accept the fact that the primary hospitals will become large critical care units, and that we will be decanting, and this already started, we will be decanting to lower levels of care into field hospitals, opened general hospitals that have been closed within the last 5 years, and increasing our additional bed capacity between 1,500 and 2,000 beds. Additionally, we're looking at dormitories and hotels to be able to take care of all of our patients in the safest way possible. So this modeling relies on the impact of social distancing, the number of positive cases reported daily, the number of cases in our hospital and their length of stay, in critical care and then medical surgical, along with the number of positive cases and cases under investigation. We're assuming that every case under investigation is a positive case. It's probably not 100%, but it gives us a marker. So I assume the next question you're going to ask is, well, if social distancing is the only tool we have in our toolkit, what should that percentage move up to be? Well, we know at 50% we have more than adequate beds right now. But we also know that 50% is pretty aggressive social distancing. So the real number is probably between 40 and 45%, and may not be that much of a reach considering the compliance that we're assuming right now. So this is a projection. It's based on the available data that we have. It's a point in time. More beds will be brought online. We believe the infection doubling rate will increase. We believe that social distancing percentages will increase. And we believe we will significantly flatten the curve by the initiatives and the interventions that we have already initiated. As the governor mentioned, today we're reporting 3,347 new cases for a total of 16,636 cases in the state. And sadly, new deaths have been reported to the department. They number 37. 4 of those deaths are associated with long-term care facilities. I have shared with you repeatedly our concern for long-term care facilities. Right now, 73 long-term care facilities report at least one COVID positive case. In long-term care facilities, we have identified approximately 34 deaths associated with COVID-19. However, in long-term care facilities, we have reported a total number of deaths of over 80. It's about 81 or 82. I point that out to share with you that every reported death in a long-term care facility is not necessarily due to COVID-19. The county breakdown of new cases is as follows: Atlantic, 5, Bergen, 249, Burlington, 28, Camden, 36, Cumberland, 1, Essex, 280, Gloucester, 17, Hudson, 289, Hunterdon, 10, Mercer, 45, Middlesex, 171, Monmouth, 134, Morris, 74, Ocean, 84, Passaic, 124, Somerset, 47, Sussex, 9, Union, 226, and Warren, 10. I also am reporting that another of New Jersey State Psychiatric Hospital employees has been affected. There is one staff member at Ancora that tested positive for COVID-19, and we now have one resident in a psychiatric facility testing positive. As of the data this morning of the major labs sending us their results, and we are getting results now from over 95% of the major labs, there have been 40,806 tests performed, of which 15,582 have tested positive, for an overall percent positivity rate of 38.19. So that ends my report. We believe that our social distancing mitigation interventions, our ability to slow down the rate of the doubling of the infection and the increase in the number of beds that we're bringing online will prepare us to handle the surge that we're expecting imminently. Thank you.
Judy, thank you. A couple of things before we go to questions. I mentioned on the video call with the President and Vice President, and I mentioned it again in a private conversation I just had with Speaker Pelosi, and I meant to say this earlier, as significant as the bill that the President signed on Friday was in terms of direct help to everyone from folks who are out of work to small businesses, hospitals, transit systems, and certainly to state government. As we've said all along, we're going to need more. We're going to need a lot more help. And our ability to understand both the rule book by which the money is dispensed that was signed by the President last week, as well as planning for next steps, which is why I was on the phone with Speaker Pelosi, are incredibly important. Secondly, Judy, you mentioned back to health, 73 long-term care facilities have at least one positive. Just to remind everybody again, if I get the denominator right, it's 375
That's right.
in the States. That's about 20%, just under 20%. And that number, if you've been listening to us, end of last week was, I think Thursday was 15. So that number has gone up, and that's not surprising, but it's an area of, I know, great concern. The counties, the top counties I usually read out after you finish of total cases: Bergen far and away number 1, Essex number 2, Hudson 3, Union has now jumped to 4th, and Middlesex 5th, with a couple right behind them. Could we put the charts back up, please, the two graphs side by side? So folks, this is going to be, I'm going to do my best to implore, to channel Winston Churchill when he took over as Prime Minister on May 10th.
All right, folks, welcome everyone here worldwide on News Now. We were taking just a listen of New Jersey. This was from yesterday. Now we got some live events coming in for us here. I just want to give you an update on the total numbers that we are seeing across the boards right here. Let's show you just the empty streets of New York City here. Just so bizarre to see, and we're seeing that now on an everyday basis, just showing you just how life has changed so much amidst this coronavirus pandemic that is coming to the U.S., and it's really taking a stronghold here, as now we are looking at 164,000 cases in the U.S. Total confirmed all over the world is at 803,000, getting close to that 1 million mark around the world. And unfortunately, 3,100 deaths in the U.S., the most coming from New York. Now we're going to go to a virtual town hall. Let's listen right here.
serve as mayor of this wonderful city remotely. Their support, their ideas, their coming together has been incredibly invaluable, not just to me, but to all the residents of the city of Miami. And I am eternally grateful to each one of them for their calls. I want to thank all our residents, each and every one of them who sent me messages through all the different mediums, through Twitter, through Instagram, the emails, the text messages. All of them kept me going, kept me upbeat throughout this entire process. Today, we are doing this press conference on a different format, and I want to thank all the members of the media who collaborated with us and who are collaborating with us today. I know many of you expressed concerns throughout these days as to how press conferences were being held. So this is our best attempt to try to abide by social distancing norms and to abide by the stay-at-home restrictions that we put in as a city. And so I want to thank you again for your patience throughout this process. I want to thank our citizens for being unified with us. We will, like Pitbull said in his song, we will win. We will beat COVID-19 together as a community. And that's why, with the support of the commission, I have been proactive from the very first moment in canceling large events. We're the first city in America to cancel large events such as Ultra and Calle. Some in this community criticized us and said that we were acting prematurely. Later on, they followed us. We were probably the second city to issue a stay-at-home order, a shelter-in-place, and I want to thank our manager for collaborating with us and all the other community of cities for collaborating with us on that. We're the first city to implement a curfew, something that cities like Hialeah and Coral Gables have already followed suit. So we have led in this crisis. We have garnered statewide, national, and international attention for the decisions that we've made. And all the decisions that we've made have been supported by all the commissioners with a view of protecting our citizens first and foremost and above all. And so today we're going to be announcing the opening of a second test site in Hadley Park. This is a test site that's being manned by our own employees, and it's being staffed. And the kits that we're using were kits that we acquired that are costing $50 per examination. Hopefully will be FEMA reimbursable. And right now we're asking people to call 305-960-5050, 305-960-5050. Our protocol is that the people be symptomatic, and most of the people that we've tested are 65 and older, although I will say that at the new testing site, we should be testing people of all ages. And we also, I know we've tested in-homes.
All right, folks, we are going to drop out of this, take you to Secretary of State Mike Pompeo doing a news conference right now.
Crisis in Venezuela. And then second, I want to talk about the really amazing historic work the State Department is doing in mounting an effort to repatriate Americans from all across the world in response to the pandemic. It's in the finest traditions of what the State Department has always done. First, Venezuela. I don't want to go into every detail. I've got Elliot Abrams here with me too. He'll happy to help me take questions here at the end. But I wanted to set up the framework for this pathway to democracy. Broadly speaking, it would put the elected members of the National Assembly representing both sides, would create an acceptable Council of State to serve as the transitional government until presidential and National Assembly elections could be held, we hope within 6 to 12 months. The president of the transitional government would not be able to run for president in those elections. Both Nicolas Maduro and Juan Guaido would accept the Council of State as the sole executive during this transitional period. If the conditions of the framework are met, including the departure of foreign security forces and elections deemed free and fair by international observers, then all remaining U.S. sanctions would be lifted. We've got the full text. You can see the agreement on our website. We hope that every Venezuelan will consider this framework carefully, thoughtfully, and seriously. We think it presents an opportunity for the Venezuelan people. Now turning to the State Department's truly heroic efforts to repatriate Americans. It was Super Bowl Sunday, February 2nd, when we all still had live sports on TV. Our team was working that day to arrange 2 flights to bring home Americans from Wuhan, China. One of our medical team's leaders wrote an email to his colleagues. I want to read part of it to you. A colleague wrote, quote, "While the whole country enjoys the game in the comfort of home or a pub, most will have no idea that a small group heads into the heart of the global outbreak with the singular focus of bringing their fellow countrymen out of hellacious conditions. No matter how it turns out, we happy few have dared greatly and given ourselves over to this worthy cause." End of quote. That mission was completed, bringing home more than 800 people from Wuhan, and it was the beginning of one of the most important and unprecedented missions in the history of the State Department. As of today, we've repatriated over 26 or 27,000 U.S. citizens from more than 50 countries. The stories of our team's heart and character and commitment to excellence are truly amazing. Let me give you just a couple of examples. In Bhutan, no easy place to get to. An American was critically ill from the virus, intubated on a ventilator, and frankly expected to die in a country located in one of the most remote corners of the world. But we came to the rescue. Our team arranged a biocontainment transport from Bhutan to an intensive care unit in Baltimore, Maryland, a distance of nearly 8,000 miles. To fly through Kathmandu, there's about 12 pilots that can make that flight. It was one of the most complex medical evacuations in history, and the State Department pulled it off. In Honduras, a double lung transplant recipient was running out of medications which aren't available there. Intrepid young consular officer figured out a way to get safe passage, got him a letter, got him to the airport. It was a city that was in complete and total lockdown. We got him home on the next flight. That man later told our team that we saved his life. The good news is, too, State Department's doing great, but we're not doing this alone. We're coordinating closely with other agencies in the federal government. My deputy, Steve Began, Brian Bulleto, the Undersecretary for Management, Keith Kroc, the Undersecretary for Economic Affairs, the 24/7 repatriation team are performing these duties amazingly. Never in the department's 230-year history have we led a worldwide evacuation of such enormous geographic complexity and such geographic scale. We have no higher duty to the American people than to pull this off. I've never been more proud of how the team has done than I am today. The 24/7 Repatriation Task Force will continue to bring home thousands more Americans in the coming days and weeks. At the same time, I want to deliver a message to Americans who are still abroad. We remain steadfast and committed to getting you all back. We do not know in some countries how long the continued commercial flights in your country may continue to operate. We can't guarantee the U.S. government's ability to arrange charter flights indefinitely where commercial options no longer exist. I urge Americans to register with their nearest embassy at step.state.gov and work your way back here. Americans abroad who wish to return home should do so immediately and make arrangements to accomplish that. Look, I'm just as proud of the work we're doing on repatriation as I am about the health and humanitarian assistance that the State Department's providing around the world, too. It's a topic that deserves more attention. We don't talk about it all that often. In America, we provide aid because we're generous and noble people. We also do it because we know from prior experiences that if we don't have good data, full transparency, and all-out effort to fight pandemics, they can harm Americans back home, too. And for both of these reasons, the United States was one of the first nations to step forward and offer help. In early February, it seems like a long time ago, in early February, we transported nearly 18 tons of medical supplies provided by Samaritan's Purse, the Church of Jesus Christ of Latter-day Saints, and others to Wuhan. That same month, we pledged $100 million in assistance to countries to fight what would become a pandemic, including an offer of assistance to China. Our response so far surpasses that initial pledge significantly. We've now made available a total of number $274 million in funding to as many as 64 countries. That money will go to some of the world's most at-risk peoples. You can go to state.gov to find a fact sheet. We'll talk about what we're doing country by country. It'll give the breakdown. We put that up at the end of last week. We've been at this a long time. We know how to help people around the world. Since 2009, American taxpayers have generously funded more than $100 billion in health assistance and nearly $70 billion in humanitarian assistance. That's billion with a B. But our help is much more than money. The CDC has 6 staffers on the ground working with Namibia's health ministry. The FDA, as an example, is co-chairing a virtual international conference on developing a COVID-19 vaccine. Americans from all across the Trump administration are working diligently to put this crisis back in the box. Another example, we're working constantly with NGOs to deliver medicines, medical supplies, and food to those in need in Syria, including in regime-held areas. This is a humanitarian crisis. 2, we'll continue helping UN agencies and NGOs build more water, sanitation, and health facilities in camps and informal IDP settings all across northern Syria to help prevent the spread of the virus in that difficult place. And as I referenced earlier, it isn't just our government helping around the world. American businesses, private charities have given $1.5 billion to the world to fight this pandemic. This is truly American exceptionalism at its finest. Our generosity, our pragmatism, aimed at saving American lives now and in the future, is also exemplified through our work with multilateral organizations. It's another underreported story. We've long maintained an unsurpassed commitment to global health and humanitarian assistance. Consider just the top end of this, our financial support for international organizations. And never mind all the scientists and technical people and other expertise that we bring around the world. The United States remains by far the largest contributor to the World Health Organization, as we've been since 1948. Our contribution exceeded $400 million last year, 10 times that of China. The U.S. contributed nearly $1.7 billion to the UN Refugee Agency, which is helping those least able to mitigate their exposure to the virus. This compares to $1.9 million from China. UNICEF is engaged in emergency actions in dozens of countries all across the globe, including in China and in Iran. In 2019, the U.S. supported UNICEF with more than $700 million. China gave just a mere fraction of that. The World Food Program, headed by America's own David Beasley, has sent more than 85 shipments of food and personal protection equipment to 74 countries to help them battle the virus. And we provided $8 billion in resources just last year, 42% of that organization's budget. Look, you all get the idea. We don't talk about assistance much, but the American people should be aware of and proud of our vast commitments to these important institutions. They not only help citizens around the world, but they protect Americans and keep us safe here as well. And with that, I'm happy to take a handful of questions this morning.
Try to get to everybody, so we'll start with Christina. Good morning, Mr. Secretary.
Hi, good morning.
From a colleague who's not allowed to come, and then I have my own. So
Who wasn't allowed to come, or she, because?
yeah, we're working from home. And
Great, wasn't because of the State Department. All right.
Not because, no, correct, sorry. Sean Tandon from AFP wanted to ask, on Venezuela, what future do you see for Guaido? Is this new framework a recognition that he hasn't caught fire? Will the U.S. for now support him as the rightful president of Venezuela? And is he able to run for president under this new framework that you're introducing?
So the answer to the last question is absolutely yes. I think he's the most popular politician in Venezuela. I think if there were an election held today, I think he'd do incredibly well. But more importantly, we continue to support him. When we put together this pathway to democracy, we worked closely with him. He was aware of how it is we were presenting this. We all, Juan Guaido and his entire team, understand that Nicolas Maduro must go. We must get this democracy started. We have now introduced this pathway to achieve that. We continue to remain enormously supportive of the work that the rightful president of the Venezuelan people, Juan Guaido, is engaged in.
Thank you. And then in light of this global pandemic, there's been a lot of renewed calls from the UN, from the Europeans, from others for sanctions relief. And I know what you're going to say. We've talked about it in this room, that any shortfalls in their healthcare systems are the fault of these regimes themselves. But I'm wondering if people are dying and sanctions relief would help, regardless of whether or not it empowers the regime, would it ever come to a point where you would reconsider your position? Thank you.
Well, of course, we evaluate all of our policies constantly. So the answer is, would we ever rethink it? Of course, we're constantly trying to make sure we have our policies right. When it comes to humanitarian assistance, medical devices, equipment, pharmaceuticals, things that people need in these difficult times, those are not sanctioned anywhere at any time that I'm aware of. When you just read that, whether it's not always an American sanction. In North Korea, there are UN Security Council resolutions. In other places, they are, in fact, American provisions. But in each of those, if you read them, it's quite on its face that these items aren't sanctioned. There's no prohibition on moving humanitarian assistance into these difficult and challenging places. You rightfully point out some of these countries continue to build bombs and missiles and nuclear capability, all the while their people are starving. So when they make the claim that, boy, they just don't have the money to feed their people, these are decisions that these people, leaders, have often made, not in the best interest of those peoples. It's indeed quite sad to see those governments make those decisions which harm their own people. The last thing I'll say is not only do we not sanction any of those, nor does any global entity sanction humanitarian assistance. The United States has worked in every one of those places to provide assistance. We've worked to try and get assistance into North Korea. We've made offers of assistance to Iran. You'll recall when we first began, we've worked diligently in Venezuela to get humanitarian assistance to the Venezuelan people as well. No, the United States understands this is a humanitarian challenge, a humanitarian crisis, and we are deeply committed to ensuring that humanitarian assistance gets to the people of those countries. We care more often about the people in those countries than their own leaders do. That's sad. That's a reflection of those regimes too often. It's the reason, in fact, that we're working to help those people raise up in their country so that they can get a better outcome for themselves as well.
Michelle?
Yeah, thank you. Thank you, Mr.
Yes, sir.
Secretary. I have 3 questions.
All right.
The attacks.
You're testing my patience now.
I know that you are. Please.
No worries.
The attacks on the military bases on Iraq have escalated lately. Will the U.S. Have any reaction soon? Second, what's your reaction to the Houthis' attack, missile attack on Saudi Arabia, and how the U.S. is confronting the disinformation war against the U.S. during this war against COVID-19?
Yeah, so let me try and take each of those 3. So we have seen attacks on Americans, attempted efforts in some cases as well inside of Iraq conducted by Shia militias. Our response has been very consistent. 2 things. One, we will always respond to protect and defend Americans, whether it's our diplomats in our embassies and consulates inside of Iraq or Department of Defense people who are serving there or civilians who are contractors. We'll always do everything we can to defend and protect them. We will respond if they are threatened. We've also made clear that in Iraq in particular, we know that those Shia militias who have attacked Americans are trained, equipped, underwritten by the regime of the Islamic Republic of Iran, and it's been President Trump's policy consistently that says that we will respond against all of those who facilitated, trained, equipped, and enabled those attacks on America. That holds as true today as it did 2 weeks, 4 weeks, or back in the beginning of January when we took a strike against Qasem Soleimani. The second question is about the missiles that were fired from Yemen by the Iranian-backed Houthis. The good news is it looks like the damage that was done by those was very minor. But nonetheless, there'd been a lot of work to reduce conflict, to take down the levels of violence that were there. And we'd had some success. The Saudis had been leading that effort, and it broke down that day. The Saudis have now responded, and I'm hopeful they can get back on the right path. We are hopeful that we can find a path forward with the UN Security Council resolution in Yemen to find a path to peace there. It'd be in the best interest of every participant in the region. Sadly, it appears that the Iranians don't share our vision for peace in Yemen and in Saudi Arabia. And lastly, you asked a question about disinformation in the moment here with the COVID-19 challenge. You know, I see it every day. Every morning I get up and I read the data set from across the world, not only the tragedies taking place here. We've had a State Department official pass away as a result of this virus, one of our team members. We now have 3,000 Americans who've been killed. This is tragic. My prayers go out to every American and every American family impacted by this. This data set matters the ability to trust the data that you're getting so that our scientists and doctors and experts at the World Health Organization all across the world who are trying to figure out how to remediate this, how to find therapies, how to identify a solution which will ultimately be a vaccine to determine whether the actions that we're taking, the social distancing, all the things that we're doing, limiting transportation, all those things to figure out if they're working so that we can save lives, depends on the ability to have confidence in information about what has actually transpired. This is the reason disinformation is dangerous. It's not because it's bad politics. It is because it puts lives at risk if we don't have confidence in the information that's coming from every country. So I would urge every nation, do your best to collect the data, do your best to share that information. We're doing that. We're collecting, we're sharing, and we're making sure that we have good, sound basis upon which to make decisions about how to fight this infectious disease. That's the risk that comes when countries choose to engage in campaigns of disinformation across the world.
Thank you.
Yes, sir.
Go ahead, Kim.
Hi, Kim Dozier with Time.
Hi, Kim.
Two questions, Venezuela and Afghanistan. On Venezuela, what is your message, perhaps Envoy Abrams' message, to the families of the Citgo 6, the American citizens being held since 2017 in a prison that now has cases of COVID-19? And I understand Citgo has decided not to pay them their salaries anymore, so their families are relying on church aid to survive. And in Afghanistan, Dr. Abdullah has now endorsed President Ghani's peace negotiating team. So could that lead to you yielding on giving them back some of the $1 billion that you've taken away for this year, especially since they're facing the COVID-19 crisis, because this might have a knock-on effect?
Kim, both excellent questions. I'll give a little bit on the Citgo 6, and then Elliot's going to come up and take a couple questions too. He can perhaps elaborate on that. We spent a lot of time and energy trying to get those folks back, just as we do with every American who's wrongfully detained. We've been unsuccessful with that so far. My message to those families: know that Elliot, our entire team, is never far from thinking about them. With respect to the issues in the prison, we've seen that too. We've made clear to the Venezuelans that that creates increased risk. They should be let out, not only because it's the right thing to do because they're wrongfully detained, but now there's a health risk on top of that as well. And as we've said for the detainees in Iran, now is the most appropriate moment to use this humanitarian challenge as a reason to allow these people to return to their families and their loved ones. State Department's working hard to get them back. The second question was about Afghanistan. Since I traveled there now, goodness, a week ago, almost exactly, we had some progress on the political front, the reason that I traveled there, so that's good news. We've seen a team identified. Looks like it's pretty inclusive, pretty broad. We're happy about that. We've begun to see some work done on prisoner releases as well, all elements that have to come together so we can get to the intra-Afghan negotiations, which will ultimately prove to be the only mechanism that has any hope of delivering peace and reconciliation to the people of Afghanistan. So it's good news. We will constantly reevaluate our posture with respect to Afghanistan, not only the security assistance and humanitarian aid and assistance we provide to them in addition to the decision we made last week on the $1 billion. We also announced that we were providing assistance to them to combat COVID. I think the number was 15 million. I'll get you the actual data, but we're going to do everything we can to help Afghanistan battle the coronavirus issue as well. So we'll relook it. We'll constantly evaluate it. We want to see progress on every element. It's worth noting, too, it's been overlooked. I stopped and met with the Taliban on my way out of Afghanistan. I met them in Doha. They need to reduce violence as well. They have made real commitments about the level of violence, the nature of what will take place, what they will do as we proceed towards the path where intra-Afghan negotiations begin. We have every expectation that the Taliban will hold up their end of the agreements that were put in place, goodness, now coming up on, 2 months ago, I guess, back at the end of January. Yes.
Rich, Kylie, can we make it quick? Go ahead.
Sure.
Thanks, Mr. Secretary. With oil prices as low as they've gone over the past month, do you see this as an opportunity to ratchet up sanctions more so than perhaps the administration otherwise would have done in Venezuela? And with the Maduro regime seemingly not receptive to previous proposals, Why would you think that this proposal might be accepted? And also, on understanding that there are sensitivities surrounding it, if you could give any more information about the State Department official who passed away because of COVID.
If I could, with respect to that last point, let me get the team to give you all that we're able to release at this point. I'll make sure we do our best to get the information as it's appropriate to release about all of that, all of the full status. We've had other members of the team come down with COVID-19 as well. I think we're now up to 4 or 5 dozen people who have tested positively inside the state. Well, this includes our locally employed staff, the full State Department team, and we're happy to provide that data to you as well. I think your first question was about Venezuela sanctions. The answer is no. We don't see this as an opportunity. The policy that's been laid out that the State Department and the United States government are executing with respect to how to deliver democracy to the Venezuelan people hasn't changed. Oil prices will go up, they'll go down. Our mission set remains unchanged, to deliver an opportunity for democracy. You saw, was it last week, Nicolas Maduro was indicted by the United States Department of Justice. I hope, as we now laid out this clear pathway to peace, that the Venezuelan people will demand that every leader inside of Venezuela, not just Maduro and his team, but every leader inside of Venezuela will look at this seriously and say that is a path which we can see our way forward, which will deliver this hope for democracy in Venezuela. That's the mission set that we had when we laid out this charting this new pathway. Did I get it? Did I get both your questions?
The final question was, Nicolas Maduro has rejected proposals in the past. Is there something about this proposal that you think he might be attractive to him?
We hope he'll take it seriously and consider it, just as we have. We've made clear all along that Nicolas Maduro will never again govern Venezuela, and that hasn't changed.
Hi.
Yes, ma'am.
I want to go back to what you just said about data sets mattering.
Mm-hmm.
And yesterday you spoke about the necessity to have numbers from China and Italy and Iran on coronavirus. But the numbers coming out of China right now indicate that the new cases of coronavirus are going down. So does the Trump administration believe that those are accurate new numbers, or are those manipulated disinformation numbers? And then I have a quick question on the sanctions front.
Go ahead, give me the second one. I'll try and take them both. Go ahead.
The second one is, Christina asked you about sanctions relief, but is there any point at which this pandemic could grow worldwide that the U.S. would consider sanctions relief, or is it just a no-go right now?
I think I answered that question. We reevaluate all of our policies, including our sanctions policy, constantly. If we conclude that it's in the best interest of American people to alter any of those policies, we'll certainly do that. I have to reiterate, the goods that are needed for each of these countries to resolve the coronavirus problem in their nations are not sanctioned. They were not sanctioned, they are not sanctioned, and they will not be sanctioned. Indeed, the United States has gone beyond that. It's not just that they're not sanctioned. It's not simply that they're prohibited. The United States, the American people, are working diligently in each of these countries that you're thinking of as sanctioned nations to try and assist getting humanitarian assistance into those countries, not only from the United States, but to help other countries deliver that humanitarian assistance to the people of those nations. This policy is deeply consistent with the finest traditions of the United States of America. Your first question was, remind me?
So the data sets.
The data sets.
The data set
I'll leave that to the medical professionals who are evaluating the data that's coming in from these countries. It's not in the first instance a State Department issue. So I'll leave that to HHS and CDC and the others who are trying to put these data sets together to make evaluations. So that's a question probably more properly lodged with them.
Okay.
Great. Thank you all very much. Have a good day.
Thank you. If you guys want, does anyone have questions for Elliot? Yeah.
All right, folks, we were listening there. Secretary of State Mike Pompeo. Let's continue on, bringing you the very latest from feeds from all over the country as we continue to always update you. Let's go back out to Miami here, where we're still doing this virtual town hall.
Thank you. Thank you, Doug. Going to think Billy Corbin. Not sure if he's on. Billy? Hey.
Good morning.
I see you. Yeah, I hear you. Good morning.
Morning, Mr. Mayor. Congratulations on your recovery. Happy that you and your family are healthy.
Thank you.
Dr. Adams said that none of the people that you came into contact with tested positive. I'm hearing reports that after you were exposed to COVID-19 in your meeting with the Brazilian delegation, that you were at the Green Spoon Martyr Miami Brickell office, and at least 7 to 9 employees there initially exhibited symptoms consistent with coronavirus. 3 continued with serious symptoms, and at least 1 went to the hospital. All who wanted were apparently denied tests in the time that you've had 3. Is this information accurate as you understand it? And has Dr. Adams tested anyone from the law office who may have been exposed?
I'm not aware of anyone from the law office that was either exposed or that tested or that has been hospitalized. So all the information, as you've asked that question, I'm not aware of any of that. And I think I would be aware of it. I think they would have told me, but I'm not aware of that. The only thing I'm aware of is that there were decontamination protocol, I believe, was implemented, and that's it. And that many employees went home. That's all I know.
And has Dr. Adams tested anyone at Green Spoon Martyr?
Not that I'm aware of. I don't believe so. Doctor, I don't think you've tested anyone from my law firm, right?
No, sir, I have not. I mean, everyone that I know of that you came into close contact with is all tested negative. Your close staff here in the mayor's office, your departmental leaders, some meetings with people that you had that day. Everyone that I know of that you had any intimate contact with tested negative. And that's very reassuring to me. You know, the virus is only going to be transmitted if you have close contact. The CDC says for over 15 minutes. And so it needs time to jump from one host to the next. And so I think we've done a fairly good job of testing anybody that you might have come into contact with to ensure their health.
Al Crespo.
Sure if he was
Al? No? Okay, guys, thank you so much. I very much appreciate it. This was a very interesting exercise, and I thank you all for being patient and allowing us. Is there anybody, did we miss anybody? Paul? Shishanto? Huh?
Can I
Did we miss
speak in one
anybody?
follow-up in Spanish real quick?
Yes, go ahead, we might as well. Yeah.
Gracias. What you mentioned about the consistency, the lack of consistency, la falta de consistencia, que no hay toque de queda en el condado Miami-Dade. Ayer el alcalde Carlos Jiménez dijo que no quería agotar lo que es la fuerza policial para ese esfuerzo porque no cree que es necesario. Hablando de la fuerza policial, tengo entendido que hay como 24 agentes de la policía de Miami que están en aislamiento debido a posible contagio. ¿Le preocupa que no hay suficientes agentes de la policía para enforzar algunas de estas medidas en la ciudad de Miami?
No, no me preocupa y te digo por qué. Anoche estábamos el tercer día con toque de queda, la tercera noche, y yo fui anoche y te puedo decir que una gran proporción de los residentes de la ciudad de Miami lo están respetando y es el shift de la noche. Y pues nada, teníamos más que suficientes policías. El jefe de la policía está haciendo una labor increíble en asegurar que que estamos protegiendo a nuestros policías, pero a la misma vez tenemos suficiente para patrullar en nuestros vecindarios. Yo me recuerdo que el comisionado Alexis Laportilla le preguntó precisamente eso durante la sesión virtual de la comisión y el jefe de policía indicó que va a haber más que suficientes policías para proteger a nuestros residentes.
¿Y qué están haciendo para velar sobre los tantos ancianos que viven en los edificios de bajos recursos para las personas mayores que quizás, o sea, no pueden salir a comprar cosas, no pueden recibir visitas y pueden sentirse muy solos en estos momentos?
De nuevo, en la última sesión de la comisión especial, los comisionados unánimemente aprobaron $1 millón para proveer comida para personas mayores, algo que va a ser esencial para ellos durante estos tiempos difíciles. Deseamos que nadie tendrá hambre durante este tiempo en cual es más difícil es salir de la casa y comprar.
All right, folks, we are going to switch away here, go to some other live events that are always happening here for us on News Now and at coronavirusnow.com. Let's go out to Washington, D.C. for the very latest.
Make all of the guidelines available and rely on people to do what is right for themselves, their family, for nurses, doctors, first responders in our city.
I have a question about the D.C. jail.
Yes.
The Public Defender's Office and the ACLU filed a lawsuit against the city yesterday over conditions in the jail. And having looked at it, I mean, a lot of it is about having cleaning materials. Are you satisfied with the current situation there?
I haven't really had a chance to review the suit, but we will address the suit. And we have posted at all of our government buildings, and we'll make sure that that's happened at the jail too, all of the cleaning schedules. So anybody that has to go into those buildings understands the regular cleaning that's happening at those buildings.
I'm talking about the people that are incarcerated. According to the lawsuit, they're given a bar of soap when they get in there, and many times that's all they get, even when that's used up.
As I said, I can't really comment on the lawsuit right now, Sam. We will review it and refer it to our legal teams. Yes?
Mayor Bowser, in other states, we're hearing about police officers pulling over people from out of state and asking them why they're there. Do you foresee that happening here in the city, where D.C. police officers will pull over people, say, from New York and ask them why they're in the city?
We don't expect that to happen. We certainly know that our borders are fluid, especially in the National Capital Region. There are people who live in Maryland that do essential work in D.C. and vice versa. So people are crossing our borders. We want to call everybody's attention, however, to all the essential things: food, medicine, going to an essential job or essential travel that you have to do. We have notified everybody in D.C. government, wherever they are in the region. I have employees that live all around this region to make sure that they have with them an ID that shows that they work for D.C. government, and they can demonstrate that they're on their way to essential work.
And if I can follow up, has anyone or any non-essential business in the city continued to operate that you're aware of that has been fined?
Not that I'm aware of. We do have the ability to fine. We also have the ability to revoke a business license for any business that is knowingly violating the order. Yes.
Mayor Bowser, you mentioned how you're not planning on just giving out fines willy-nilly to enforce the stay-at-home order, but is the city government doing anything different on going about enforcing it? Are police changing patrols, or other people in D.C. government hitting the streets to make sure people are staying at home or practicing social distancing?
As you know, Finn, we started that process last week. We started it longer than that to enforce social distancing around the tidal basin, where we're using the Metropolitan Police Department and the National Guard. We also we changed the contract that we have with our school safety officers so that they could be deployed to parks and playgrounds and recreation spots where we saw people distancing. We've used police tape, in some cases to indicate that the park or playground is closed. The police since last week have been encouraging people not to play pickup games all across the city. So all of those things continue to happen.
Does the city have any evidence that undocumented people aren't seeking care, or that might be an issue going forward with coronavirus?
We always want to make it clear to people that immigration status doesn't matter when calling on the government for resources, especially medical resources.
Have you had any evidence that people aren't seeking that medical care?
We don't want to have that evidence, Fennett. So that's the point. We yesterday gave part of our briefing yesterday was in Spanish to make clear to people to recognize what their symptoms are and call their medical providers.
You also mentioned yesterday that you're expecting a peak in medical surge in early May. Does that mean that residents should expect all these restrictions to continue into May?
Actually, what I said is that we would be providing a briefing on our expected surge later in the week. All of my orders are in place through April the 24th, which coincides with the approved emergency that I'm operating under. It is likely that we'll seek an extension of the public health emergency in the coming weeks.
Racial data on the coronavirus cases, we're seeing other jurisdictions start to release or push for that.
I told you what we are releasing. Age groups, gender, and ward. Yes. Yes.
The Public Defender Service has submitted a motion to release all sentenced misdemeanants in the D.C. jail. Do you think any or most or some misdemeanant serving sentences should be released?
I'm really not sure about that, what they filed, and I would have to review it to make further comment.
General policy, do you think misdemeanant serving sentences should be released from the jail?
I can't say that categorically. No, I can't say that. Yes.
Do you anticipate to include hospitalizations or in that data?
We have, can I confirm with you what we have with related to hospitalizations?
Sure. And then for the number of people who have recovered, the 121, are those folks still being advised to self-quarantine? What is the protocol there?
I'll have to have the Dr. Nesbitt confirm that with you as well. Yeah. Let me get to someone who has to ask the question. Yes.
Mayor Bowser, you mentioned the high volume testing. When did that start? Was it really yesterday that it started properly? And are you expecting a surge in positive identifications given the increase in testing?
I don't know. Yesterday was the first day we had it for our first responders at fire, at DOC, for DOC, and for MPD. So there were, I think, almost 80 people tested, and I think that we will have their test results today.
Daily average of the high volume for the first responders, about 80 a day?
I don't know, because I don't know how many will be referred. They're being referred by their providers. Yes.
So Governor Hogan mentioned yesterday that his stay-at-home order, I mean, he didn't issue any sort of travel ban, but he encouraged Marylanders not to leave the state. Also, if they're coming in from other states to self-quarantine. Is that the same in D.C., or how about a D.C. resident who has to, like, for an emergency reason, go visit a parent across state line and then they have to come back? Would they sort of self-quarantine? Should they? What's the guidance there?
I think that anybody who is visiting a high-incident area, which is a lot of areas in the United States right now, should follow that self-quarantining guidelines. Absolutely. Yes.
Can you give us a view into your thinking about issuing the order? What was the tipping point?
I'm sorry?
What was the tipping point for issuing the order to stay home? Can you give us a view?
As I mentioned, over several weeks, we've already closed down the city and for many weeks, and we've always wanted to be in lockstep with the region. So the regional message is the same. Yes. Yes.
Mayor, in Maryland, Maryland National Capital Park and Planning has actually taken down basketball hoops to prevent games from going on. Has Parks and Recreation here done the same?
I think we've had some instances of that, yes.
Is it simply where they're gathering, or are you hearing from different places where they're gathering and then you're choosing places to take the hoops down?
I don't know if they've taken all the hoops down. I expect a yes, or especially in areas where that you can't shut down the park, or you can't lock it, or you can't cut it off. So that's another way to prevent the pickup games. Yes.
Cases in homeless shelters. I'm seeing a report out of Harriet Tubman.
Yes.
So is it just the one?
I will let me have confirmation about the locations, but let me just say more generally, if we have a resident of a homeless shelter test positive, that resident is quarantined. Any close contacts follow the Department of Health guidelines. There's a cleaning protocol also put in place.
Some of the supplies. Does the district have, or are you getting the sterilization kits for the N95 masks? And then also, what about the expedited testing kits that show the result much faster? Do you have, or is the district getting those?
I think we have one on order, and we'll catch up today on, I know the announcement about the sanitizing machine was made yesterday, and we'll follow up with our FEMA contacts today. Yes.
Could be for you, could be for the deputy mayor. What was the script that you said that police officers are using in their loudspeakers, and is it going to be across the city for every officer, or is it just select places that they're doing this?
I will be confirming that with the chief today, and my expectation is that there's a general script that's used. Let's see if I can play it, and they'll tweak it as well. Give me a minute.
If you're receiving calls, social media, or anything about people being confused about the stay-at-home order, the differences between the three states, or just the difference between what it was like a couple days ago and the difference on starting tomorrow?
I think on social, some of the biggest questions I've seen are what exercise is allowable. That's been one. We've been pinged by some of our employees, like can they come to work? Can they travel? What does it mean for them, especially folks that don't live in D.C.? So that those are some of the ones that we've heard. And then I've gotten people say, why do you want to throw people in jail? I answered Sam at length.
Can I ask about the DYRS numbers? Is that Hope Village?
No. DYRS is New Beginnings and YSC.
And so you had been asked about Hope a few days ago and said you were going to send inspectors over there.
We did.
Yeah, can you tell us?
Kevin.
Thank you very much.
Hope Village is a halfway house run as a contract overseen by the Federal Bureau of Prisons that houses about 200 adult individuals, DC residents, who are transitioning from incarceration back into the community. There were allegations made last week, notably about a lack of basic supplies around soap, sanitizer, and the condition of the facility. The city has an independent office called the Corrections Information Council, or called CIC, that has the jurisdiction and authority to do unprompted inspections of those facilities. They did that and found that there were adequate supplies, in some cases perhaps even more than adequate supplies, around toiletries, around cleaning supplies, and they were able to do that site inspection to have their inspectors view it, photograph it, and be able to report out on it as an independent assessment of conditions there.
Okay, a few more. Yes, Martin.
I know part of this involves Park Service because of the federal lands, but there's been calls from some people to close down more roads or kind of expand sidewalks into roadways to give people space to ride bikes and walk because it's a form of acceptable recreational activity. Any thought to that? Have you asked MPS to consider closing Beach Drive on a more permanent basis during the emergency?
I have not. We will continue to. We have established a regular call with them, and we will continue to evaluate their properties. Yes.
What's the latest at St. Elizabeth's?
In terms of what?
Do you know how many people have tested positive? If there's anyone under quarantine?
Okay. Can I get back to you with those, with that number? Yes, sir.
I've heard people who've applied for unemployment benefits try and adhere to the advice to answer honestly when asked about the searching for work requirement, but they also get told from claims approvers to say, yes, they're looking for work, and they get emails from the government saying the same thing, so there's like conflicting advice. I'm wondering if you could clarify what people are supposed to answer.
Yes, I asked the DOES director to issue clarification, so I want to just turn to her advice, Director Morris Hughes, and we can provide you with all of the statements that she has made to be perfectly clear. And let me say a little bit more about that, because I think that you recognize that we made some changes to actually help people get benefits sooner. But those changes required a change to how our system works. And the computer system, we've been working to get those changes made in the system. We're hopeful that that will happen sooner rather than later. We think maybe by the end of the week, but by the beginning of the week, to have those questions related to searching for work and wait period changed in the system. And we think that will prevent any confusing messages generated automatically by the system.
Obviously, first responders and whatnot are the priority for but are you making any plans to try to find necessary supplies just for residents who are unable to find hand sanitizer or disinfectant or even toilet paper?
We always are focused on the kind of supply of food and goods. You heard us talk at the beginning of our response about making sure that grocery stores were essential businesses. Those businesses providing essential household items are also essential businesses. And we're relying on that chain. And we're grateful for all of those workers who are showing up, who are loading trucks, stocking shelves, manning and womaning cash registers, who are showing up to work to make sure that that vital supply is available. What the district is doing is obviously procuring for our needs, for our medical needs, and for our first responders and frontline workers. We're also, as Jay mentioned, creating a stockpile that we can support our medical providers. And we're working, searching the entire globe to find those items. But we are asking our residents to use judiciously, not hoard, not go out every single day to take care of their household items at all the commercial markets and stores. Yes?
What's the guidance on homemade masks? I know just civilians going around for essential business, and people want to be wearing masks, or they can't purchase it or they shouldn't be purchasing it.
Right.
So I wonder what the guidance is around.
Let us check what the CDC is saying about homemade items, and we'll post it on our website. Yes.
What's the situation with the SNAP program, food stamps? A lot of state governments have been appealing to USDA for blanket waivers, for greater autonomy, to expand the roles, to cut down paperwork, to deal with the increased need for food assistance, for food stamp assistance. What's the
I don't
situation
think
with
that
here?
we have anything different to report on SNAP. That one of the question has become, early on, we extended any recertification deadlines for people who are getting public benefits. And one question that I'll make sure that we confirm is that people who are newly applying, what all the procedures are for them as well. But please go to our website, coronavirus.dc.gov or just dc.gov, and look under public benefits, and that will explain to everyone what they need to do, whether they've been automatically recertified or whether they're applying for the first time.
Automatic renewal, so people don't have to reapply?
We've already done that. We did that early on. Yes.
Mayor Bowser, normally we would be in the budget season.
Yes.
Of course, we're in a public health emergency. Have you been talking with the DC Council in terms of when you possibly may present a budget?
In our the emergency that the council passed several weeks ago, we extended the submission timeline for the DC budget. I think the new date is May the 6th. And we'll be ready.
Mayor Bowser, what are you seeing as far as DC employees, particularly essential personnel who still have to go to work, calling out and not showing up? Do you have any data, any
numbers? Has that become a problem at all?
We're certainly trying to manage that, Mark. Early on, we put in an extraordinary way more than 50% of our folks on telework. And since that modified operations was announced, somebody remind me of the date, on March the 16th, we've added other people to teleworking. Most notably, we took all of our DMV operations virtual. So now there's no in-person DMV service, and we took all DC operations virtual. And in a number of other agencies, after the first week, we realized that more employees could be teleworking.
How about employment services? Is it becoming a problem there?
We're certainly working to keep everybody at work at employment services. Yes.
The Department of Health often highlights racial disparities with infectious diseases and other health problems. Why not with coronavirus?
As I said, FNN, we're trying to get out as much accurate data as fast as possible, and our reporting can evolve throughout the process, but this is where we are. Yes.
Real quick, following up on what Mark was asking about, with Mr. Valentine's passing, you had mentioned last week that there was going to be contact tracing. Has that been done? Is there a sense that there was any threat to anybody else that was essential in the government that worked around him?
I mentioned yesterday that 5 employees are self-quarantining. Yes, sir.
For those of us who usually use the computer to apply for unemployment, because all the computers, all the places we can go are shut down, how do we go about getting the application?
I need you to call employment services, and we will get you a phone number. Yes. Okay, last question.
I'm wondering about DC for the last several years has had a spike in rats, the rat population, which has been attributed to the growth in restaurants and economic activity. Are the pest control people working, and B, what's going to happen with that now that there's no restaurants? Are they all going to head for people's houses? Well, I guess question is, the pest control people working?
The pest control people are essential. Yes, they are working. Thank you, everybody.
All right, folks, and we are just now moments away from the Governor Andrew Cuomo of New York giving an update. We'll be featuring that for you in full as soon as that gets going. A live look right now at the Dow, up 109 points. You are watching coronavirusnow.com and worldwide, as we always bring you the top stories and headlines from all over the country, as this coronavirusnow.com featuring live content from all over the country.
I welcome anyone else with prior medical experience to visit the website you see, covid19.nj.gov/volunteer, to join our army against COVID-19. And it is why I have turned my focus in my ongoing and daily discussions with the Trump administration to our dire need for more ventilators. This is right now concern number one. Following a number of conversations, and this, as you can imagine, given the weekend.
All right, folks, we are going to now go to that Governor Andrew Cuomo news conference now, live.
To all, still is morning, just a long one. Let me go through where we are today on the numbers, just to give people an update. The number of cases still going up. We're all in search of the apex and the other side of the mountain, but we are still headed up the mountain. Number of people tested last night was a near record amount. We tested over 18,000 people. We're testing more people than any state in the country, and I'm very proud of that. More per capita than China and South Korea. Total number of people tested, 200,000. Population of 19 million. It's not going to give you a random sample, but it's been helping us track down the positive cases. Number of positive cases, 9,298. Total cases, 75,000 cases. You see the predominance in New York City, then Westchester, then Nassau, then Suffolk. than Rockland. So you can see it's that area of density, and it spreads out from that area of density. The march of coronavirus across the state of New York continues. We're down to just 2 counties that don't have a case. The overall numbers, 75,000 have tested positive, 10,000 people in our hospitals, 2,700 ICU patients. Good news, 4,900, almost 5,000 people discharged. That's up 771. So people come in, they get treated, they go home. Excuse me. New York is at 75,000 cases. Next state is 16,000. California is at 7,000. So you can see New York is a magnitude of difference more than any other state. 1,550 deaths. That's up from 1,218 yesterday. Again, we're studying the charts. We're trying to study the data, follow the data. The data is uneven. It bounces. Numbers often bounce in any model. There are variables in this model. The hospitals are reporting it. So what every hospital reported that day, were they busy? Are they combining a couple of days in one? It's an imperfect reporting mechanism. But you see the basic line is still up. What the statisticians will tell you is you basically draw the straight line that the columns indicate. And you see that we're still going up, which is what we see on the overall trajectory, that we're still going up. Number of intubations was down, not much, but it was down, and that's a good sign. You also see the number of discharges going up, and that's consistent. The longer people are in, they either get treated and leave, or they get put on a ventilator, and the longer you're on a ventilator, the less likelihood you will come off the ventilator. That is the blunt truth of this situation. We have 2 missions overall that we are pursuing. One is the front line of this battle is our hospital system. That's what this is going to come down to. The second is social responsibility, stay at home. Don't get infected in the first place. Don't get infected in the first place because it goes back to you're creating a burden on our healthcare system that our healthcare system cannot handle. We're talking about exceeding the capacity of our hospital system by some estimates 2 times. So what does this come down to, besides all the other issues? It comes down to not overwhelming the hospital system because those people who need acute care may not be able to get the acute care. So it's all about the hospital system. That is the front line. What we're doing is we are following the mathematical projections of the experts. We're speaking to all the healthcare professionals, all the healthcare providers, World Health Organization, National Institute of Health, Dr. Fauci, CDC, FDA, the whole alphabet soup of healthcare experts. And the mathematicians who then have different models. And we talk to about 5 different models, and we compare the models, and we try to find the median through the models. That's how we plan everything. Follow the data, follow the science. People ask me, what do you think? What do you think? I don't think about this. What do I know? I'm not an expert. I'm not opining. I talk to experts, and I follow people who know. But for the hospitals, procure equipment, identify the beds, support the staff. That's what it's been all about. Of those priorities, number 1 is support the staff. They are the front line, and they need relief. They are physically exhausted. Even more, they are emotionally exhausted. This is unlike other disasters, hurricanes, earthquakes, floods. They happen, they're fast, they're over, you start rebuilding. This is different. This is ongoing, and the duration itself is debilitating and exhausting and depressing. I'm speaking to healthcare professionals who say, look, more than physically tired, I'm just emotionally tired. Seeing the pain, seeing the death that they're dealing with every day. In general, I am tired of being behind this virus. We've been behind this virus from day one. The virus was in China. We knew it was in China. Unless we assume there's some immune system variation with Asian people, it was coming here. And we have been behind it from day one since it got here. And we've been playing catch up. You don't win playing catch up. We have to get ahead of it. The second rule is never underestimate your opponent. And we underestimated this virus. It's more powerful, it's more dangerous than we expected. And the third point is plan forward. Get ahead of it. Get ahead of it. Fight the fight today, yes, but anticipate the next battle and plan for the next battle. And the main battle is at the apex. We're still going up the mountain. The main battle is on the top of the mountain. That's where the main battle is going to be, the apex of the curve. And then we come down the other side of the mountain. We are planning now for the battle at the top of the mountain. That's what we are doing. Get a staffing plan ready now for the battle at the top of the mountain. Equipment stockpile now. We're gathering equipment that we don't need today because today is not the day of the battle. The battle is when we hit the apex, depending on who you believe, 14 days to 30 days from today. And also, we need a social acceptance of the time expectation. We're all anxious. We're all tired. We're all fatigued. It's been all bad news for a long time. Our whole lifestyle has been disrupted. Everybody wants to know one thing: when is it over? Nobody knows. Well, President said by Easter. This one said by this. Nobody knows. You can have a hypothesis, you can have a projection, you can have an opinion, but nobody knows. But I can say this: it is not going to be soon. If our apex is 14 to 21 days, that's our apex. You then have to come down the other side of the mountain once you hit the apex. So calibrate yourself and your expectations so you're not disappointed every morning you get up. Yesterday, we met with the entire state hospital system, Dr. Zucker and our team. First time they were all in one place. And we said to the hospital system, look, what I just said to you, we're dealing with a war. We're dealing with a war we've never dealt with before. We need a totally different mindset and organizational transformation. We can't do business the way we have always done business. We need an unprecedented sense of cooperation, of flexibility, communication, and speed. And that's what we talked through yesterday, and we have to do it now. The healthcare system is one of those balkanized systems. It's like our state education system. It's like our criminal justice system. It's in place. It's fragmented. They have their own identities, their own associations. It's regionally organized. That all has to change. We don't have the ability to meet the capacity of our healthcare system as an entirety. That assumes the healthcare system is working as an entirety. That's not how the healthcare system is organized now. We have New York City hospitals, and then we have Long Island hospitals, and then we have Westchester hospitals, and then we have upstate hospitals. That has to go. Even in New York City, you have two basic hospital systems in New York City. You have the private hospitals, voluntary hospitals, about 160 of them, which are some of the finest healthcare institutions in the United States of America. You know, this is Mount Sinai, Columbia Presbyterian, et cetera. Some of their members are also upstate, but they're the large private institutions. Greater New York Hospital Association. Ken Rasky runs that association of 160. You then have, in New York City, the public hospitals. The New York City Health and Hospitals Corporation. They are 11 public hospitals. They are a universe, and then you have the private hospitals as a separate universe. The 11 public hospitals are the hospitals that in many ways have always been under greater stress and greater need. We have to get those two systems, the private system and the public system in New York City, working together in a way they never did before. The distinction of private-public, that has to go out the window. We are one healthcare system. On top of that, it can't be the downstate hospitals and the upstate hospitals and the Long Island hospitals. When we talk about capacity of beds, when I say we now have 75,000 beds, that's a statewide number. That means those beds have to be available to the people in New York City or Nassau, even if those beds are up in Albany. So combining that whole system, and you're no longer just the Western New York hospitals or the Central New York hospitals. It's one coordinated system. It's much easier said than done, but we have to do it. On top of that, you have to overlay the new federal beds that came in, that are an entirely new component. We have Javits Center, 2,500 beds. We have the USNS Comfort, 1,000 beds. We're planning other federal facilities. These all have to be coordinated on top of the existing hospital network. So you see the organizational situation that we're dealing with. And let's be honest, and let's learn from the past. We know where we have to focus. We know where we're going to have problems in the next hospitals, because the hospitals that have the least capacity, that have already been stressed, are the hospitals that are not going to be able to handle the additional load. That is a fact. You know which hospitals were struggling. We do reports all the time about the financial capacity of hospitals and what hospitals are in stronger versus weaker position. The hospitals that are in a weaker position are the hospitals that are going to suffer when they then carry an added burden. That was Elmhurst Hospital. It happened to be a public hospital. It happened to be a public hospital in a place of density. It happened to get overwhelmed. And that's what, then you saw the burden on the staff. You saw the emotion. You saw the stress. That can't happen. And that's what we talked about yesterday. And people said, well, Elmhurst isn't my responsibility. Elmhurst is a public hospital. The city runs it. I don't run it. It's New York City. It's not a private hospital. I don't care which link breaks in the chain. The chain is still broken. It doesn't matter which hospital, which link. Any link breaks, the chain breaks. The healthcare system is a chain. It breaks anywhere, it breaks everywhere. That has to be our mentality. We laid out a full plan on how to do facility development, how to move people among hospitals so nobody gets overloaded, shifting patients, shifting staff, shifting supplies. None of us have enough supplies. Okay, then let's pool our supplies and let's put them out to the people who need them. And just because one hospital happened to have found a vendor from China who delivered 5 million masks, let's share those masks. And we talked about that yesterday. We also talked again at length about ventilators. which is, everybody knows, is a key piece of equipment, identifying all the ventilators in the state, who has them in a stockpile, who ordered them, who expects them to come in, and we'll have one stockpile of ventilators that we can distribute for everyone who needs them. We also talked about splitting of ventilators, because that's a technology that does exist. It's been used before. It's not ideal. You take one ventilator and it's used for 2 patients. The federal government is a partner in this, obviously. I spoke to the president again yesterday about this situation. I spoke to the vice president. I spoke to Jared Kushner. The White House has been very helpful. We have to get the federal agencies on the ground to understand how this operates, especially FEMA, because we have to be coordinated and people have to know what they're doing, and this is no time for anyone to be learning on the job, and we're going to be working through that today. PPE, same thing. We want to know what everybody has. One stockpile would distribute it fairly. Testing. How do we get out? When does this end? This ends when we get a fast-track test, an at-home test, a 15-minute test, and people can then find out when they can go back to work because they're negative. We're working on additional testing. As I said, the Department of Health has a new test, but that's when this ends. We're also working on the new medications. We're leading the country in many of those developments. We have saliva testing now. We're working on the antibody testing, and we're working on the plasma testing at the same time. We put together a central coordinating team. It's going to be led by the Department of Health. Westchester's on it, Greater New York is on it, Haines is on it, New York City is on it, Long Island is on it. If the federal government is going to participate, they have to be part of this team, because we have to know what we're doing, and I don't want FEMA coming in and blowing the coordination of what everyone is trying to do. The coordinating team is going to organize upstate, downstate transfers, set patient loads for hospitals, right? So if one hospital gets up near a overload capacity, let's call it, those hospitals start to send patients to other hospitals before they get up to their max within the New York City public hospital system, within the Greater New York private system, and then among the different systems. So different mentality, but we have to do it. We said 2 missions. One was hospitals, second was individual responsibility. Individual responsibility is about discipline, it's about selflessness, and it's about being informed. The basic point is stay at home. The point is stay at home. I know it's hard to stay at home. And I know everyone thinks, I can go out and I can be smart and I won't get infected because it's me. I'm a superhero. It's not going to be me. That is not true. And it's not just about you. It's not just about your health and your life that you're playing with here, my friend. You can infect other people. So I've been trying to communicate this many different ways for many days. We still see people coming out who don't need to be out. Even for essential workers, people have to be careful. And again, I've been trying to communicate that everyone is subject to this virus. It is the great equalizer. I don't care how smart, how rich, how powerful you think you are. I don't care how young, how old. This virus is the great equalizer. My brother Chris is positive for coronavirus, found out this morning. He is going to be fine. He's young, in good shape, strong, not as strong as he thinks, but he will be fine. But there's a lesson in this. He's an essential worker, member of the press, so he's been out there. If you go out there, the chance that you get infected is very high. I spoke to him this morning, and he's going to be quarantined in his basement at home. He's just worried about his daughter and his kids, that he hopes he didn't get them infected. You don't really know Chris. You know, you see Chris, he has a show on 9 o'clock on CNN. But you just see one dimension, right? You see a person in his job. And in his job, he's combative and he's argumentative and he's pushing people. But that's his job. That's really not who he is. He's a really sweet, beautiful guy. And he's my best friend. My father was always working, so it was always just me and Chris. And he's a lawyer also, Chris. He's a lawyer because growing up, the decision point came to what do you want to do after college? And my father was a very strong personality. And my father basically suggested forcefully to Chris that he should be a lawyer. It was a different time and a different place, you know. Now, my daughters, Cara, who's here, you know, they all follow their individual stars. This is their destiny, which is right. If you had said to my father, I want to follow my individual star, he would say, yeah, you're going to follow your individual star right out that door. You know, that's what he would have said. So Chris went to law school, but he never really had a desire to practice law. He calls me when he's about 26. He's at a law firm. And he said, you know, I don't want to be a lawyer. I said, yeah, I know, but you are now a lawyer. You are. He said, yeah, but I don't want to be a lawyer. I said, what do you want to be? He said, I want to be a journalist. I said, you want to be a journalist? I said, it's too late. You're a lawyer. You have to pay law school bills. You didn't go to journalism school. It's too late. No, I think I can do it. And God bless him. He quit the law firm, went to work for Fox TV, which is a whole separate conversation in the House, and then worked his way up. He's at CNN. He does a beautiful job. But a sweet guy. And now he's quarantined in the basement. But he's funny as heck. He says to me, even the dogs won't come downstairs, he says. So, but he is concerned about his wife and his kids. But the reason I raise it is he's smart. He social distancing, yes. But you wind up exposing yourself. People wind up exposing you, and then they find out they're positive a couple of days later. And I had a situation with Christopher 2 weeks ago that I even mentioned. My mother was at his house. And I said, that is a mistake. Now, my mother is in a different situation. She's older, and she's healthy, but I said, you can't have mom at the house. And he said, no, mom is lonely. She wants to be at the house. I feel bad. She's cooped up in the apartment. I said, yeah, I feel bad she's cooped up in the apartment too. But you bring her to your house, you expose her to a lot of things. You have the kids there. You have your wife there. You're coming and going. Your wife is coming and going. And you could expose mom to the virus. And love is sometimes a little, needs to be a little smarter than just reactive. And we had a whole discussion. And truth, now he's informed, I'm informed. Was that dangerous? Was that not dangerous? So I went back to Dr. Zucker. I said, look, we have to tell people, what are the rules? How does this work? That's when I came up with Matilda's Law. And I said I named it for my mother. And it was very clear about people who are older and what they should be exposed to. My brother, that was 2 weeks ago, if my brother still had my mother at his house, again, out of love and comfort, and my mother wanted to be at the house anyway, by the way. She didn't want to be sitting at home in an apartment. So she would have been doing what she wanted to do. He would have been doing what he wanted to do. It would have seemed great and harmless, But now we'd have a much different situation, because if he was exposed, chances are she may very well have been exposed, and then we would be looking at a different situation than just my brother sitting in his basement for 2 weeks. So think about that, right? My brother's smart. He was acting out of love. Luckily, we caught it early enough. But it's my family, it's your family, it's all of our families. And this virus is that insidious. And we have to keep that in mind. Keep in mind Matilda's law. Remember who is vulnerable here and protect them. You want to go out and act stupid for yourself? That's one thing. But your stupid actions don't just affect you. You come home, you can infect someone else, and you can cause a serious illness or even death for them by your actions. And people have to really get this and internalize it, because it can happen to anyone. 2 weeks with my mother and Christopher. Today is a very different situation. Last point, there is nothing that I have said different since I started these briefings. And there's nothing that we have learned that is different since I've started these briefings. We know what to do. We just have to do it. It is individual discipline to stay at home. That's what it is. It's discipline. No social distancing. It's discipline. Well, I'm bored. I know. I'm bored. It's discipline. Making this healthcare system work, that's government skill, that's government performance. That's saying to that healthcare system, I don't care how it worked yesterday. I don't care whose turf this is. I don't care whose ego is involved. I'm sorry. We have to find a way to work a better way. It's time to say to that federal government and to FEMA and HHS, you have to learn how to do your job, and you have to learn how to do it quickly, because time is not our friend. It's about a social stamina. This is not 1 week, 2 weeks, 3 weeks, 4 weeks, 5 weeks, 6 weeks. Okay? This is not going to be an Easter surprise. Understand that and have the stamina to deal with it. And it's unity. Let's help one another. New York needs help now. Yesterday, I asked for healthcare workers from across the country to come here because we need help. We will pay you, and more importantly, we will return the favor. This is going to be a rolling wave across the country. New York, then it'll be Detroit, then it'll be New Orleans, then it will be California. If we were smart as a nation, come help us in New York. Get the equipment, get the training, get the experience, and then let's all go help the next place, and then the next place, and then the next place. That would be a smart national way of doing this and showing that unity. And unity meaning we're not, I know this is a political year, and everything is a political backdrop, and Democrats want to criticize Republicans, and Republicans want to criticize Democrats. Not now. Not now. There are no red states. There are no blue states. The virus doesn't attack and kill red Americans or blue Americans. It attacks all Americans. And keep that in mind, because there is a unifying wisdom in that. Any questions? Let's do on-topic questions first. If anyone has any questions on local issues, we'll do that afterwards.
How many extra healthcare workers are on the ground right now? Are all the New York workers who want to work on the ground? We're hearing of some people who are trying to apply and are in New York, and they're not getting answers from the state about, or any responses about when that'll happen.
Yeah. Well, let's remember what we said. We have now, a few days ago, we put out the question is, are all healthcare workers working? The problem is healthcare workers are working too much. They're overstressed. They're working too many shifts. They're afraid to go home. They may bring the virus home. They're under immense physical and emotional stress. We put out a request a couple of days ago to ask retirees to come forward. We have now about 78,000 people who said that they would help. God bless the state of New York, and God bless humanity. We now are working with the hospitals, and we did this in the meeting yesterday also, sorting those 78,000 people by region and by expertise across the state. And we have a portal that Jim or Howard can explain, because we then have to link them up with the hospital, right? You don't need, we have the 78,000 pool of 78,000. You then have to coordinate that with the hospital in that region with those skills. And that's what we're doing now. Jim, you want to mention?
The Governor's right. So today the portal will be launched and live. The 78,000 or so, we have to do some pre-checking. So we checked for licenses, discipline, and those people who didn't have a license or had disciplinary issues were taken out, so the hospitals could more easily access the workforce. And as the governor said, they're broken down by region, by discipline, and now they can go in. And what we're trying to do is prioritize the availability of the portal to the hospitals that need it the most right now, who have that need some extra help in the field. But we're working very closely with the entire system, like the governor said, to make sure we're linking up those new healthcare workers to those needed facilities. So it will be live today.
And is that connected with the out-of-state workers who are coming?
It's everyone, everyone. So what we're trying to do is prioritize the in-state workers, which we have by region. So we know the potential healthcare workers in every region of the state, where they are and what their status is. We want to get those people in first because they're here in New York. We want to prioritize actually the New York regional, downstate regional employees, because we know that they're closer to those facilities that are in need now, and we're going to need the upstate employees potentially later. And then we have the out-of-state employees that are potentially, we're trying to keep those folks close too. So looking at the folks from New Jersey, looking at the folks from Connecticut and other places there where they don't have to travel from long distances.
What's the timeline for getting those people on? Are there any concerns about individuals who are over, who are elderly helping?
We are looking at age, and we're going through a background. We have about 175 people doing backgrounds on every person who comes into the portal, and the hospitals we're working with as well will also do their own checks to make sure the person's up to it. So if they may not be up to one job, they may actually be up to another job, so we're making sure we have some cross-coordination there as well. And some of the hospitals could potentially have some of these folks in needed areas by Thursday.
New figures that are coming in. Have you any more new projections as to when the apex might hit in New York City and the state as a whole?
When does the new apex hit? That is the $64,000 question. We have literally 5 models that we look at. It's true to say almost no two are the same. The range on the apex is somewhere between let's say 7 to 21 days. If you look at all 5, it's 7 to 21 days from now. And look, Jesse, I say this does me no good. What is it, 7 to 21? The range is too broad. Do I have 7 or do I have 3 weeks? There's all sorts of variables that they're looking at. On one hand, you would think they would be able to tell because you have the China model, you have the South Korea data, et cetera. But then you have variables here. How effective is the social distancing? How many people are actually staying home? How does the density relate? So there are variables, but it goes from the apex estimate 7 to 21. That's not the only estimate that varies. They then vary on how many beds you would need, right? We have 53,000 beds statewide if we operated as a state. We mandated 50% more beds, so now we're up to 75,000 beds. All of them say you need more than the 75,000, and the high estimate is 140,000. The ventilator estimate among those projections goes from 10 to 40,000. Are those right, Jim? Do you remember, Howard?
It's roughly 20 to 40,000 on most average projected. Correct. In addition to what we have.
You're going to talk about the hospitals and coordinating them. One of the executive orders that you signed actually will let you put in a receiver into some of these hospitals if they don't meet that 50% threshold or even go above that. Do you foresee having to do that, and what would that allow you and Dr. Zucker to do?
The hospitals have been cooperative. The question is, we have the ability to appoint a receiver if a hospital is not being cooperative. The hospitals have been cooperative. We put out that rule that you have to add 50% capacity. They all added 50% capacity. They've all responded. We're sending out a rule today that says, I want to know your stock, what you have in stock, what your stockpile is, what your inventory is, because we really need to share. You know, nobody has enough, so like everybody put everything into the middle in a pot, and then we'll distribute it. We're doing that. It's not, Joe, going to be as much they're not listening. It's going to be their capacity level, right? You have, let's take downstate New York. You have about 170 hospitals. If we sat here 2 months ago, we could have graded almost all 170 hospitals. And you would have had some stronger and some weaker. As a general rule, the public hospitals would have been on the weaker spectrum, less financing, et cetera, history of being more troubled. You now put weight on all 170. Even if you put the equal amount of weight on all 170, you're going to see a different reaction in the hospital depending on the underlying strength of that hospital. You put a differentiated weight, well, you happen to be in Brooklyn and there happens to be more density in Brooklyn, and that hospital gets more weight, you'd get a different variable. But in general, what you're going to see is the hospitals that were stressed can't take the stress, right? It's not even a medical concept. The works with personalities too. The personalities who are having trouble dealing with stress are having more trouble dealing with this stress. So the health and hospital corporations, what I said to, which are the public hospitals, I said to the private hospitals, you have to help them. And we have to watch when they get up near capacity, transfer patients. Elmhurst got up to capacity. You had other public hospitals that had open beds. We have to get better and faster at transferring patients to other facilities, right? A perfect system, everybody's at 51%. Everybody's at 60%. Everybody's at 80%. Not some people are at 40% and some people are at 110%. That's not the way the system is organized right now. They all talk, you know, they all have, but they're different fiefdoms, they're different systems. And that, you know, you almost have to shock the system into actually saying, okay, we're really going to operate as one.
So that order gives you to wait. If you don't see them making those shifts, gives you to wait to go in and basically demand it?
Yes. But look, no hospital is going to say, I want to be over capacity. It's just they didn't have the cooperation or the system to call someone up and say, you know, I'm drowning. I need to have somebody else accept 150 patients. And that's going to have to be managed into the system, because it's something we never did before. As ironic, because we've never been here. You know, normally you have beds that are hospitals fighting for patients, because patients are revenue, right? So you never had a situation where they said, I'm going to send you patients. They wanted the patients. They wanted the revenues. So this is a much different situation. I'm sorry.
Have New York City area patients been transferred to upstate hospitals yet?
No. First, we have levels of sort of triage. First, we're going to try to bring upstate staff down to New York State hospitals. It's one of the requests we're going to make today. You have upstate hospitals that are nowhere near capacity. Send your staff down to New York City hospitals. worse step, you're over capacity in all New York City hospitals. You've redistributed the load, you're still over capacity, then send people to the upstate hospital. Is that right, Howard?
That's correct.
Who will pay the cost for those types of transfers, and how does the staffing work with union issues? Who's paying the staff that comes upstate? Who makes the decisions about whether
It would all be voluntary.
all be voluntary? Who's going to pay the cost for?
Well, we're all paying the cost, right? The hospitals are paying the cost, the state is paying the cost. And I said to them, look, frankly, we'll figure out the cost, because this is about saving lives. And I'm not going to get, who pays the bill should not determine whether or not people live or die. So I said, do whatever we have to do to save lives, and then we'll figure out the bill afterwards.
You previously said that the state has 3,000 ICU beds. How much has that grown at this point? You have 2,700 people in the ICU so far, leaving 300 beds.
No, I said I needed 30,000.
Right, so how many do we have now?
Well, that's an interesting question. We have ordered 17,000 from China.
Ventilators?
Yes. That we would pay for, roughly $25,000 each. By the way, anyone who says, oh, maybe you don't need that many ventilators, you're saying 30,000 ventilators, you don't need that many. You don't really believe you need that many. You know how you know I really, really believe that number? Because we are paying $25,000 per ventilator, and we are broke. And the last thing I want to do is buy a single ventilator that I don't need. The complexity with ventilators is we ordered 17,000 from China. So did California, so did Illinois, so did the federal government, so did Italy. And what's happening is China, the orders into China are very slow in coming out. Exactly how and why, we're not sure. It's just that they have such a tremendous demand. Of the 17,000, we only have a firm expectation on 2,500. Is that right, Kara? Yes. Only have a firm expectation on 2,500.
When are those supposed to come in? And
They're supposed to come in over the next 2 weeks.
So that means that the ICU capacity will then increase by 2,500?
Yes. No, the ventilator capacity increases 2,500. An ICU bed in this situation is essentially a bed with oxygen and a ventilator. But you can't have an ICU bed in this situation without a ventilator.
Will that be too late, though, to address the surge, if it's 2 weeks?
It depends if it's 6 weeks or 21 days, right? That's what we're dealing with. And you can't accelerate the orders anymore from China. When we go back and do a retrospective, and I don't want to do it now, but look at the bizarre situation we wind up in. Every state does its own purchasing. So New York is purchasing, California is purchasing, Illinois is purchasing. We're all trying to buy the same commodity, literally the same exact item. So you have 50 states competing to buy the same item. We all wind up bidding up each other and competing against each other, where you now literally will have a company call you up and say, well, California just outbid you. It's like being on eBay with 50 other states bidding on a ventilator. And you see the bid go up because California bid, Illinois bid, Florida bid, New York bids, California rebids. That's literally what we're doing. I mean, how inefficient. And then FEMA gets involved and FEMA starts bidding. And now FEMA is bidding on top of the 50. So FEMA is driving up the price. What sense does this make? The federal government, FEMA, should have been the purchasing agent, buy everything, and then allocate it by need to the states. Why would you create a situation where the 50 states are competing with each other and then the federal government through FEMA comes in and competes with the rest of it?
Governor, how do
non-coronavirus emergencies factor into these plans to better coordinate the healthcare system, presumably with first responders getting overwhelmed, heart attacks?
Oh, look, Zach, we're learning lessons, necessity is the mother of invention. We're learning things here that, it's not that we're learning things here. Anyone could have told you a lot of these things, right? The situation I just explained with purchasing, did you really have to learn that 50 states shouldn't compete against 50 states, and then FEMA shouldn't come in late and then compete with 50 states? It's not like you had to go to the Harvard Kennedy School to learn this, right? Should you really have a hospital system in New York State where you have private hospitals, you have these struggling public hospitals, there's two separate systems, the upstate is separate, Long Island is separate. Shouldn't you have planned a comprehensive system? Yes, but the commercial barriers to that, the political barriers to that, were so intense that if you didn't have a disaster, an emergency, you couldn't break through them. Conversation I had with these hospital leaders yesterday in that room, if it was not for the coronavirus, I would have never made it out of that room. I mean, what I was saying was so antithetical to the foundation of the business of healthcare in this state, which, by the way, is a multi-billion-dollar business. It's right, it was common sense, but sometimes you need the emergency to force change that would be very, very difficult otherwise.
But wouldn't there be, again, are there specific efforts to shore up the capacity of the healthcare system to handle non-coronavirus related emergencies?
Sure. So the healthcare system is working on all those other areas as well, and regularly, pretty much every day, I've spoken to doctors and nurses who are working on the front lines, and all of those other patients, whether the person with the heart attack, the person with the stroke, the system is continuing to move forward. It is stressed, as the governor has said. The system is stressed, but the patients are cared for. Those other emergencies are getting cared for as well. Just put a strain on the system.
Let me give you an analogy. If I said to you, look, I know normally you write for your outlet and then there are other outlets, but we have a situation and you're going to write and you have to give it to all the other outlets. What you write is no longer just for your publication. You have to give it to all the other outlets because we don't have 10 people who can come. You have to write for everybody else. If I said that in the normal course of business, forget it. If it was an emergency and you were the only reporter there, then you would do it. And that's true in so many different situations. You're violating basic commercial rules here and business rules and practices. And I'm a local government and I'm in charge. And, to override all that garbage, you really need extraordinary times.
From the White House or their states on your idea for ventilators to get sent to New York and then other hotspots. The Illinois governor was talking about it this weekend and said that there's questions about when the next hotspot would get the ventilators if that moves forward.
J.B. Pritzker, your Governor Pritzker, he's a good man. He's a good friend of mine. He does a beautiful job. He's right. You'll have curves, right? You have a New York curve. You'll have an Illinois curve. You'll have a New Orleans curve. How do you know the New York curve is going to end before the Illinois curve peaks? You don't. You don't for sure. Basically, there's going to be a spatial, sequential factor, but you don't know that we're going to be effectively done before Illinois ramps up. So it can't be literally, New York has all the equipment, Illinois has none, and then we run to Illinois with the equipment. It can't be that literal, but essentially it would work, right? And the alternative is also true. Not everybody should have to buy everything. Once we get through this and we have whatever we wind up with, 15,000 ventilators and 15,000 ventilator splitters and 1,100 BiPAPs, you know, if we can help someone else, let's help somebody else.
Governor, about 1 out of every 8 New York City police officers called in sick this morning. Are you worried about staffing of law enforcement in New York City? And conversely, would you consider sending the state police to help with that?
Oh, I'm worried about staffing. Yes, my word, yes. You're going to see it with healthcare workers. You're going to see it with for all first responders. Look, it's back to my brother Chris. Yeah, if you are out there, your chance of getting infected is very high. Yes, and then we'll do whatever we need to backfill. If we need state police, I would do that.
On the ventilators, you did talk about forming like some sort of consortium with states. Is that still possible? Is that still doable?
What's happening, Nick, is it is almost impossible to buy a ventilator. To the extent anyone is successful in buying ventilators, FEMA basically came in and is now capturing the market because the ventilators are coming out of China, and FEMA basically big-footed the states in China. So to the extent anyone is buying it, it's FEMA. And that's why the federal distribution is going to be so important, because they are the only ones. I can't buy a ventilator. I can't buy a ventilator. Whatever we're willing to pay, I can't buy a ventilator. So it really comes down to how the federal government distributes it, and that's why it's so important. Let's do someone who hasn't asked a question.
Governor, what happens when the state runs out of ventilators? Who do you decide who gets them?
When the state runs out of ventilators, where do I decide to get some?
No. How will the state decide who gets ventilators if we run out and we have too many patients that need them?
Well, first, I don't even want to think about that consequence. I want to do everything I can to have as many ventilators as we'll need.
Well, it's going to come in 7 days. Haven't you developed some sort of...
7 to 21 days. No, there's no protocol. We're working to get as many ventilators. And we have now a number of options. We have, we're looking at all the ventilators all across the state. We are then redeploying anesthesia machines as ventilators by changing a vent. We're then doing this ventilator splitting, which effectively turns one ventilator into two by literally running two tubes. We're using, Northwell developed an idea to use a BiPAP machine. We've ordered 7,000 of those. So we're still in it. We're creative and we're working and figuring it out, and I still am hopeful that at the end of the day we have what we need.
Governor, I don't know if you consider this on topic, many people think it is. Do you plan on signing an extension bill so that state employees will get paid on time?
I plan on signing a budget. Do you know, Rob, can the state employees, when we pass a budget, the state, if we pass a budget on time, the state employees get paid, right?
Yeah, the controller currently has the legal authority to make the payments now, right? The payments that are due tomorrow and today, those are actually for payroll from 2 weeks ago. So the controller presently has the authority. They have a technical issue with their computer system that they need to deal with, but they have the authority to make those payments today. It has nothing to do with when the budget is passed. The budget is always passed on the 31st or the 1st of each year. So that is a relative controller's office issue.
Begins in the next fiscal year?
Yes, that's right. They have sufficient appropriation authority to make those payments presently.
It's going to be delayed, though, because just the way the pay period fell this year, right?
No, it has nothing to do with how the pay period fell. They presently have the authority to do it. They presently have full legal authority and appropriation authority to make the payments.
The controller has never not paid the state employees.
Okay,
Even when the budget was late.
Take a budget?
Yes.
So
Budget questions.
So what's the update with the budget at this point?
No update. See how easy?
It's due. It's coming.
It's either coming or it's not coming. We are where we are. You know, the numbers are what the numbers are. The numbers don't lie. The numbers leave you few alternatives. Federal government says they're going to provide funding. If they provide the funding, then the next few months we should have some additional money. But am I going to say to the people of the state, I believe the federal government is going to deliver money to the state government? Heard it before, and it didn't happen. So I'm not going to count on money that we don't have.
Right, and it doesn't look
especially when the political process is the process that's supposed to deliver the money.
And it doesn't look like there's going to be a new relief bill anytime soon, at least by tomorrow. So what options are left now for the state when it comes to what spending is ultimately going to be cut here in the budget?
Well, it's all sort of, it's interesting because it's all basically contingent. We have the budget, we do a budget on the projections we now have. If we get more funding, we increase the allocations. If we don't get more funding, we reduce the allocations. That's basically what the budget says, right? It's essentially honest and transparent in a way. I'm starting the year, I'm earning $15,000 a year. I don't know what I can pay you, because I don't know what I'll be earning as we go through the year. The boss tells me he's going to give me a raise. I don't know if I should believe him or not. Some people say there's going to be a cut. I don't really know. So here's the budget. I'm making $15,000. If I get a raise, I will give you the raise quarterly as I get it. If I get cut, I will give you less quarterly as I get cut. That's all you can do.
Is the legislature going to give you that authority? Have they agreed to that?
I don't care. Let them come and cut a budget. How fast you think? Do you really believe that they want to come back here and cut the budget? I give them total authority to cut the budget.
They can come back.
Come back, tell me to cut the budget.
Are you satisfied that the unemployment system is working as smoothly as you would like to see it?
No.
People are able to...
It is not. It is not working as smoothly as I would like to see it. It's compounding people's stress. You're unemployed. You're trying to get on some darn website. You can't get through the website. We have companies working on it. We have literally hundreds of people working on it. I apologize for the pain. It must be infuriating to deal with. I am telling you, we have every technology company working on it. We're spending a lot of money. The site is so deluged that it keeps crashing because you literally have hundreds of thousands of people at any time trying to get on the site, and it continues to crash. Do you have any update on that? Do you, Rob?
Just the numbers. We usually get 50,000 calls a week. We got 1.2 million calls yesterday and 7.8 million calls last week. So that's just the order of magnitude. But as the governor said, we have all the resources devoted to improving the system.
1.2 million calls.
Is that unique callers or just people calling repeatedly?
Well, you don't know unless you...
500 times.
Usually there are 50,000 a week. Yesterday alone, 1.2 million. Last week, over 7 million. So that's the order of magnitude, and that's the volume that we're dealing with. But as the governor said, we're putting all the resources in to improve the system and be responsive.
Governor, there's 123 guards and 14 inmates at state prisons who are positive for corona. But DOCS is not saying where those guards or where those inmates are. Is there a reason for that? That would seem to be counter to public safety, no?
I've never heard that, Jesse. I'll check. It's the first I've heard of it.
Chief medical officer said the state's seen
Anyone, excuse me 1 second, anyone who hasn't asked a question and wants to ask a question?
Concerning eviction freezes and rent relief for people overall, I know that was largely intended for people in residential areas, but does that also extend to businesses like restaurants that may be renting?
We extended it to commercial.
We did. We extended it to commercial.
And how long is that?
You cannot be evicted for non-payment of rent residential nor commercial for 3 months. Again, we pick these intervals, and you can say they're somewhat random, but when is it going to end? Nobody knows. Pick an interval, so we said 3 months. You can't be evicted, residential or commercial, for non-payment of rent for 90 days. On that basis, my daughters have stopped paying me rent. I'm not even sure that their finances have dropped significantly, but I think they're just taking advantage of the non-eviction order that I myself posted, and I resent it. But there's nothing I can do about it legally.
Governor, yesterday you reported the first minor who died of coronavirus. Do we know how old they were, what their underlying condition was? This is someone between the ages of 0 and 17, which is all we can tell so far.
Yes, the person had another, underlying medical condition.
What kind of underlying?
Well, I usually don't like to give out clinical information, but I can see why the complication of this virus would have caused, a problem for that individual.
Okay.
They were minor.
Right, well, New York City Health Department puts that information out, but it's 0 to 17 years old. Were they a child, a teenager?
You have health privacy laws that if the doctor doesn't want to, or if he wants to stay in his current occupation, he has to be a little careful.
Marijuana, is there any chance you'll be able to get a deal on that here?
Not likely.
What happened? It's just too much to deal with?
Too much, too little time.
What about the top line numbers for the budget? Like
Bail reform, we said, we've been working, look, bail reform is something we've talked about until we're blue in the face for 2 years. Yeah, well, you covered it. So bail reform we have to get done. Last question, Zach.
Governor.
But you're going to share this, or we agree that you're going to share this reporting with all your colleagues before you post it?
Of course. Governor, what do you
I
say
love when they lie to me.
renters should do once your 90-day moratorium on evictions ends and they likely owe, several months of rent? Unemployment is obviously
We'll deal with that when we get to it. I hear you. There has to be some smoothing.
What's the top number in the budget? What's the total size of the budget that we're looking at now?
We have to finish the budget to tell you the size of the budget.
Facility, and we know that they have a negative test result right now, but I can't have them going and working in other facilities when right now they have a negative test result and it could be positive here in the next 2 days, and then we infect whole other communities.
Were any of the staff who did test positive, were they employees or in service at other long-term care facilities or nursing homes?
No. Right. And
one more.
Yes, Connie.
What is the average incubation period from the time the person's been exposed to the point where they're showing symptoms?
That's a great question. It's anywhere from 2 to 14 days. In the cases that I just know of myself that we've investigated within my health department, I have seen people that had direct contact with somebody and 2 days later they're symptomatic. I've seen someone that's had direct contact with somebody and it's been 7 days later, and then I believe I even seen one where it was at about 10 days. So it really is across the board. There's also some indication that you can also be shedding the virus while you are asymptomatic, meaning you don't have symptoms. The rationale or the thought process with this is there's so much about this that we don't know. It's a brand new strain. It came about in December, started in Wuhan, China. We will be learning from this, as we go forward. So what we're doing right now is, with the information that we have, making the best possible decisions that we can to ensure that we're trying to keep people as healthy and safe as we can, especially within our vulnerable populations.
Should the average person start wearing a mask?
No. Those masks those masks are needed for our healthcare workers and for those who are symptomatic. The only people that should be wearing masks is if they have symptoms, or they've been around, they're a healthcare worker that needs to do it, within a facility. Okay. One more question. How can we be as safe as possible if we weren't told who is infected, where they've been, or where they've been sent? So I'm going to end with this question. We've been asked this numerous times. Put yourself in this person's place. If it was you, would you want your information shared? No. Second of all, it doesn't matter now where they've been because it's all over and it's circulating. And the other thing, the other caveat that I want to give you is a lot of the cases we've investigated, once they became symptomatic, they stayed home. That means they did exactly what they should have. So anytime that you would see releases where they were out in the community, that means that they had symptoms and were out doing stuff in the general population. We have so many people now that are doing that, we can't even keep track, people that we're not even testing. So no, we're not going to tell who those people are. And the only thing I guess that I would ask is for those to think if that was them, they wouldn't want that information shared either. So with that, thank you all very, very much for your time today.
We just got off a video transmission with the president and vice president and their teams. But after all of this back and forth over the past number of days, I received word last night that a shipment of 300 ventilators from the Strategic National Stockpile is on its way to New Jersey. This is welcome news, and we are grateful, and I thank the administration. But to be absolutely clear, this is far, far from what we ultimately will need. I'm going to continue advocating constantly for more, and in addition to that, turning over every stone we have both in this state and our networks around the country and around the world. We know that our hospitals are quickly running toward full ventilator capacity. We are working with them to ensure the supply given what we know we have in state and what's on the way. Even knowing this, we are working with our hospitals and FEMA to allow them to co-vent or have two patients connected to the same ventilator. This is a necessary step that will buy us precious time. This is real life, and this is life and death. We need more ventilators, and I will continue to say these 4 words in every phone call I have with the President, Vice President, and the administration until, God willing, we get them. I just repeated them on the video call we just had. Along with everyone up here, I'll keep fighting for the equipment we need, whether it be more ventilators or personal protective equipment. And through state procurement, millions of articles of PPE will be coming to New Jersey for distribution this week. We continue to accept donations of PPE through covid19.nj.gov/PPE donations. That's covid19.nj.gov/PPE donations. And I would like to I want to give a shout out to, again, our corporate citizens have been huge. I want to give a shout out to Sherwin Williams, who contacted me over the weekend to report that they'll be donating an additional 2,500 N95 masks and 1,000 gloves on top of what they have already done. Tammy and I hosted a call this morning with a whole range of philanthropic and corporate interests to repeat the need for PPE and other ways that folks can participate. I'm looking forward to a call later this afternoon with the Johnson & Johnson folks. Again, it takes a village. We can't do it all on our own. Again, I hope to give a fuller accounting on PPE in the next day or two, so please bear with me. But together, as I said, as New Jerseyans, our mission must be to flatten the curve. We need you to do your part and take the necessary steps so you don't land on any graph. Switching gears, a quick announcement on testing. Tomorrow, Tuesday, March 31st, The Bergen County College drive-through site will be open beginning at 8 a.m. for all residents, again, exhibiting symptoms of respiratory illness. Again, you must be symptomatic to receive a test. The PNC Bank Arts Center will be closed tomorrow. Regardless of where you live, if you are exhibiting symptoms of respiratory illness, call your primary care practitioner and they can assess whether you need to be tested for COVID-19 and if so, where you can be tested. The Bergen Community College and PNC Bank Arts Center sites are public mass testing sites operated in partnership with FEMA. And a list of all public testing sites is available, again, at covid19.nj.gov. But tests are available elsewhere and in every region of the state. I also encourage you to visit covid19.nj.gov to take a self-test. There's a symptom page in that website. I encourage you to go there first, perhaps, if you're wondering yourself whether or not you are exhibiting symptoms. Also, I want to thank Senator Joe Cryan, who reached out to me earlier today with Judy, and also Senator Nick Scuteri. Union County's drive-through testing site is opening to all frontline healthcare workers and members of law enforcement, fire personnel, and EMTs from across the state, not just from Union County. If you are experiencing symptoms, again, you've got to be symptomatic and believe you need to be tested, visit UC, as in Union County, ucnj.org for information on making an appointment. This site is open 6 days a week, again, to all frontline workers, and I thank our brothers and sisters in Union County for doing this. I want to actually hold up an exhibit I held up the other day. This is now an expanded list of all the testing sites in the state. So I would just say, with all due respect to some of the stuff you may read about testing, we completely understand the enormous demand of folks to want to get tested. This is a time of high anxiety. We get that. And we also appreciate the fact that folks who are in the worried well are stepping aside overwhelmingly to allow folks with symptoms to go forward and get tested. That's the way it should be, and that's been our focus from day one. We made the decision right out of the blocks, and again, we've been as aggressive as testing symptomatic people as any state in America. We made the bet, particularly limited federal resources. Would we like to be South Korea? Would I like to have unlimited specimen collection material? Would I like to have all the healthcare workers at my disposal? Would I like to have tests that turn around in 45 minutes, which I think we will have at some point sooner or later? You betcha. But in the absence of all of the above, in a limited supply reality, particularly from the federal government, you got to pick your spots. And there is no doubt, for obvious reasons, by the way, that testing symptomatic people is the place to hang your hat, and that's where we have chosen to hang our hat. Obviously, if somebody's sick, we want to make sure they know whether or not they've got this virus or not, for their own well-being, for their own peace of mind, and also for their own health care if, in fact, they've got it. But it's also the highest quality data that the people to my right need to allow them to try to get our arms around this virus and project where it's headed. So with all due respect to the perfect world, which we do not have, I don't control the amount of federal supplies. I wish I did, but I don't. The reality is, given what we have, and recognizing there's an overwhelming demand and interest in getting tested, which we completely understand, let's make a meal out of testing symptomatic individuals, addressing folks who are sick. For obvious reasons, that makes sense, but it also gives the epidemiologists and the other healthcare professionals the highest quality data that they need to be able to get our arms around this. Bless you, into your arm, I hope. I also have a few updates to provide. First, speaking of the PNC Bank Arts Center, I am proud to announce that PNC Bank has signed on to the mortgage relief plan that we unveiled on Saturday, meaning more homeowners financially impacted by this emergency will be able to take advantage of the 90-day grace period on their mortgage payments. We urge those homeowners to work, if they've got a mortgage from PNC Bank, to go directly and work through PNC Bank. And likewise, if you've got a mortgage with any of the banks that we've listed, deal directly with them. Second, pursuant to the executive order I signed Saturday mandating daily reporting by our healthcare facilities of their PPE inventories, ventilator inventories, and bed counts, we have established an online portal for that reporting. We have opened our online portal for all impacted healthcare facilities at report.covid19.nj.gov. That's report.covid19.nj.gov. And as we committed on Saturday, we do intend to make some of this information public. My guess is later this week would be my guess, Judy. Attorney General, I think we may have jumped the queue on this slide if we want to go back a couple. Attorney General Gurbir Grewal and Acting State Comptroller Kevin Walsh, in partnership with the U.S. Attorney Craig Carpenito, have announced the formation of a joint federal-state task force to investigate and prosecute misconduct ranging from unlawful hoarding of medical supplies and price gouging to charity scams and procurement fraud, among other unlawful misleading activities. Residents may anonymously report any instance of these unlawful practices at the numbers behind me, 866-720-5721 or disaster@leo.gov, disaster@leo.gov. Make sure you make note of that. I also wish to amplify an announcement made Friday by the Department of Human Services that over the next 2 months, $70 million in additional SNAP or food stamps benefits made available by the federal response bill will be given to qualified New Jersey beneficiaries to help them with the purchase of groceries. These supplemental funds will be loaded directly onto a family's EBT card. And the Division of Alcoholic Beverage Control is issuing guidance to allow microbreweries, or brew pubs to provide home delivery to their customers. Home delivery has been prevented because of a ruling that ABC issued last May. Today, ABC has decided to relax that ruling and allow for home delivery. Also this morning, we issued an administrative order updating and clarifying Executive Order 107, specifically pertaining to which businesses may be allowed to operate during this emergency and the ways in which they can operate to ensure social distancing. We will allow auto dealerships to conduct online or remote sales and authorize dealers to deliver vehicles directly to their customers or to arrange for curbside or service lane pickup at a dealership. We also made 2 clarifications. The first allows realtors to operate and to show houses to prospective buyers, but only on a one-on-one basis or to immediate families, but continues the current prohibition on open houses. The second clarification reiterates that golf courses are closed and will remain and should remain closed as recreational businesses. In accordance with the guidance released over the weekend by the Federal Department of Homeland Security, we will allow firearms retailers to operate by appointment only and during limited hours to conduct business which under law must be done in person. Again, we are doing this in light of the federal guidance published Saturday night, which includes these retailers as part of critical infrastructure. It wouldn't have been my definition, but that is the definition at the federal level, and I didn't get a vote on that. We will continue to enforce all of our gun safety laws, and all gun owners are reminded of the need to keep their firearms locked in safe storage, and anyone who sees a firearms retailer acting in violation of this order should report them through covid19.nj.gov/violation, and law enforcement will respond. Finally, I wish to close by reiterating the words I said yesterday regarding the travel advisory the CDC announced on Saturday. We're already living what the CDC is calling for, and their advisory does not impact what we already have put in place to protect our state and our residents. My stay-at-home order remains firmly in effect. Unless you are absolutely needed to go out, or unless your job is critical to our response, please, please, please stay home. We will get through this. There's no question in my mind. But we'll get through this more quickly and stronger if everyone, all 9 million of us, does our part. Don't think that because someone else is staying in that you don't have to. You got to do the smart thing. You got to do the right thing. That gives me a chance before I go to Judy. Pat, tell us what the overnight enforcement looked like, and also you wanted to clarify the amount of members of law enforcement who were exposed or had the coronavirus.
True, I'll start with that. And on Saturday, I had indicated basically just the wrong information. I had overstated the positive tests. There's actually 3 categories that we're providing now daily. And as of today, to clarify for the record, there's 288 law enforcement officers tested positive. 2,477 are at home in a self-quarantine, and 618 are out for other reasons, whether that's sick or they're out injured. These, if you want to, we can report them. And the reason why we're keeping those is to keep operations to be planned tactically and operationally. If a squad or a station or a police department needs assistance, we want to plan for that. With regards to the overnight, there was an incident in Harrington Park where a male subject was arrested for driving under the influence. He was charged with eluding, obstruction, and driving under the influence. While being processed, he coughed in the direction of the officers and claimed to be COVID positive. There was also an incident in Lakewood. Lakewood Police Department responded to a gathering of 40 to 50 people. It was a bat mitzvah. It was a celebration that resulted in a child neglect charge, as well as the charge for violating the governor's executive order. In Bridgeton, there was a gym that had an Herbalife session going on. That runner of that gym was charged, and in Woodbridge, there was a barber shop that was open, and that subject was charged. So over the time period that the executive order restrictions have been in place, there's been 70 compliance issues, which has resulted in, to date, 34 indictable offenses. Thanks, Gov.
Thank you, Pat. The Attorney General is not here, but I want to ask my colleagues, beginning with you and maybe Jared, I would like for us to consider the heft of the penalty that one has to pay in these times in some extraordinary fashion, particularly someone who willfully. It's one thing to be ignorant, although the patience for ignorance is about zero, given we've been pounding away on this every which way, morning, noon, and night. But for somebody to willfully ignore this and put someone else's life at stake. And you're doing it, by the way, if you have a gathering, you're doing it in a more benign way than if you cough on somebody and say you've got coronavirus. But in both cases, you're wrong, and you're out of compliance, and it's illegal behavior. And I want to, if anything, tighten the screws on the price that those folks will pay. With that, with lots to talk about, with color on the cases overnight, bless the fatalities, as well as some of the charts that I already began to refer to, please help me welcome the Commissioner of the Department of Health, Judy Persicelli.
Thank you, Governor, and good afternoon, everyone. As I've mentioned previously, the department has been modeling when the peak of COVID-19 cases will hit our state and when we expect this surge to be at our hospitals. This is directly related to the availability of hospital beds and the resources needed to care for our patients. That's medical surgical beds, critical care beds, and things like ventilations. We're using the CHIME model. The CHIME model was developed by Penn Medicine. It stands for COVID-19 Hospital Impact Model for Epidemics. It projects how many patients will need hospitalizations, and it projects the resources that are needed. So just to level set before we go over the charts, right now, if we did nothing, we have 18,000 medical surgical beds and about 2,000 critical care beds. If you look at the chart with the greatest peak,
Welcome everyone here to News Now on Fox 10 Extra and everybody watching from around the globe on coronavirusnow.com. Live look at the White House where, well, really the White House has now become a daily briefing center featuring the president. And of course, he will be doing another briefing today happening at 5 o'clock Eastern, 2 o'clock Arizona time. Of course, we'll feature that for you on coronavirusnow.com and our Fox 10 Phoenix YouTube page. Hi, everyone. Mike Page here. So great to be here with you. I know a lot of people, well, they are working at home or they are sheltering in home, so you might not have seen us before. So we thank you for allowing us to provide you the latest updates from across the country regarding coronavirus cases, as well as feeds and news conferences. As soon as we get them in, we bring them to you right here on News Now, and we like to show them, for the most part, in its entirety, bringing you just like if you were a part of that news conference, if you were right in that room getting that information at the same time. So that's one of the great things that we like here on News Now. We keep it all going pretty fast and quick, so that's the way we push it out here. Let's show you the main map here. This is the main map that you've been seeing across the board for the last 2 or 3 weeks here. 175,000 cases now being reported in the U.S., unfortunately, and those numbers do continue to grow as the days and really hours go on. More cases are being submitted just because, well, there's just that many more really tests being made. So let's go to our first live event of the show right now. This is all happening right now. The governor of New Jersey is speaking. He'll be giving us those live updates, and we'll be pushing out as many different news conferences as we can in this 2-hour window on Fox 10 Extra. And of course, if you're watching on coronavirusnow.com, you know you're with us really for all morning and afternoon as well. Let's go out to the governor there of New Jersey giving us the latest.
Good afternoon. To her right, Dr. Ed Lifshitz. Dr. Lifshitz, great to have you with us, as always. To my left, Superintendent of the State Police, Colonel Pat Callahan. Director of the Office of Homeland Security, Jared Maples, is with us. And also this morning, or this afternoon rather, we're joined by the Commissioner of the Department of Environmental Protection, Catherine McCabe. Immediately to my left. Catherine, great to have you. As I've said many times, our response to COVID-19 is a whole of government endeavor, and lots of departments have key roles to play, and DEP is no exception, as you will hear. And I've asked Commissioner McCabe to join us to talk about her department's role in our response. And Catherine, it's great to have you with us. Thank you. Now, as we have done the past few days, we're going to go right to the numbers, and then we will fill in some details as we go from there. For the past 24 hours, we are reporting an additional 2,196 positive test results. So our statewide count stands at 18,696. Again, 2,196 positive test results overnight since yesterday, a total of 18,696 in total. And we continue to lose invaluable members of our New Jersey family to COVID-19 related complications, and this does not get any easier to speak to, never mind live through. Since yesterday, another 69 residents have died, and that total now stands at 267, each of them a precious life lost from our New Jersey family. A couple of taking that number of, which is a big one, and putting a face to it maybe in a couple of different ways. One of those precious souls lost was Passaic firefighter Israel Tolentino Jr. He became a firefighter about 1.5 years ago. He had been a volunteer before that. He had served as an EMT. He was only 33 years old. I spoke to his wife Maria earlier. They have 2 children, Ilani, who I think is 9, and Israel, who is 7. I also spoke to his Chief Trentacost, as well as I exchanged notes with the mayor of Passaic, Hector Laura. By all accounts, an incredible guy and somebody who we mourn with his family and friends. We keep his family in our prayers, as we do every single New Jersey family who was dealing with the absolute worst part from this emergency. Another name, another young person. You may have read about Ben Luderer, who was the head baseball coach at Cliffside Park, 30 years old, a star in that famous Don Bosco Prep, I think, undefeated team of 2008. They were #1 in the nation. He went on and played at Marist. To his wife, Brandy, and to his family, God rest his soul. Just stop for a second. You just heard about a 33-year-old and a 30-year-old. Now you're going to hear from Judy when she goes through the dimensions of the fatalities, that those are on the somewhat exception side, that clearly the demographic that is older is the one that's being hit the hardest. But may I just repeat to everybody who's listening, this is a reality for all of us. This is not abstract, no matter how good our health is, no matter how young we might be. And by the way, even if it doesn't impact you, never mind kill you, you may unwittingly carry this virus and pass it on to someone else who you hold dear. So to each of Israel and Ben, and to all the other 67 folks who we lost overnight, bless their hearts. The disease has taken service members, first responders, coaches, loved ones, many friends, and too many New Jerseyans, and sadly, we know that this number will grow. I cannot be any clearer in my call. Stay at home before this hits home, like it has now for 267 of our families. Please do your part to flatten this curve that we showed you yesterday, and think of what we saw and the totality of where this could go if it was left unchecked, and where social distancing can take us. Again, the chart on the left, best judgment. Again, this is as of yesterday. This changes every day. But look at where this virus would have taken us had we not stayed at home, had we not done everything we can to flatten the curve. And you see on the left, needing as many as just under 80,000 hospital beds, and there's no state in America that has the wherewithal or the resources to come up with that sort of a peak and surge and meet it. But look at the chart on the right. That's just if we behave as an average state based on past pandemics. That's what we can do. Now, the blue line that surges at the top is still north of that red line that's straight underneath it. The red line is the current capacity of hospital beds, and the blue line is the surge, but that's an average result. I repeat, we are not an average state. We are the quintessential all come together, one family, we can do the impossible state. That is New Jersey. And our job collectively is to stay at home, keep social distancing, and flatten the hell out of that curve to get it as close down to that red line as humanly possible. Let's all stay in this together. Let's prevent more losses like Israel and Ben and other blessed souls who have lost their lives. If we do our part, we can meaningfully slow the spread and save lives, and we can lessen the strain at the same time on our healthcare system and on our communities. And as we always do, we thank everyone on the front lines, especially the unsung and overlooked heroes who are out there working in our communities. And this is beyond the healthcare workers who are heroes, the first responders who are heroes. But how about the home health aides, sanitation workers, the retail employees in essential places of business to whom we've referred to before, the Teamsters and the truck drivers and the transit workers. Their commitment and dedication to the rest of us means the world, and it means that we know we will emerge from this stronger. But let's also help them. And how do we help them? We help them by staying home and doing our part to slow the spread of COVID-19. This isn't about you, it's about us. I've said it many times, I know this isn't fun, but now is the time to be selfless, not selfish, and for all of us to pull together. We accept and understand the anxiety, the cabin fever, the impatience, the restlessness, the unknowns. We get all that. The very best thing we can do together, and by the way, we'll shoot straight with you on what the facts are, where we are, and where we're headed, but the very best far and away thing any of us can do is to stay home and keep your distance from anybody else, even while you're at home. Okay, with that said, please allow me to switch gears a couple of times before I ask and invite my colleagues to speak. Tomorrow, Wednesday, April 1st, the PNC Bank Arts Center drive-through site operating in partnership with FEMA will open at 8 a.m. again for symptomatic New Jersey residents only. The Bergen County Community College testing site will be closed tomorrow. Again, we're in an on-off, hoping to accomplish the same amount of tests in aggregate, but to do it in a more coherent way. Additionally, 3 more county-sponsored sites either have or are preparing to open, and I'll go north to south. I've been in touch with each of them, and it's all good news as we continue to aggressively open up our testing regime again for symptomatic persons. In a perfect world, the federal government would give us all the testing material we need, all the personal protective equipment that we need, and we could be like South Korea. From moment one, we realized that wasn't the case. We didn't have that level of material and support from the federal government. So we made the decision, for obvious personal health reasons, to test symptomatic people only. And by the way, that has an added benefit to the colleagues to my right, because that's the most valuable data we can get, both positives and negatives, and Judy will go through both in a minute. That allows us to best get our arms around this and get out ahead of it. So, starting tomorrow, Middlesex County, in partnership with the New Jersey Motor Vehicle Commission, is opening a drive-through site located at the MVC's Kilmer Vehicle Inspection Center in Edison. That site will be open 3 days a week, Monday, Wednesday, and Friday, from 10 a.m. to 2 p.m. Testing there is by appointment only, and you must be both a Middlesex County resident and exhibiting symptoms of respiratory illness. The appointment window is now open, and you can find more information at middlesexcountynj.gov/COVID-19 testing. Again, that's middlesexcountynj.gov/COVID-19 testing, or you can call 732-745-3100, 732-745-3100. Ocean County opened its public testing site at Ocean County College yesterday, and they served 126 residents. This site is open Monday through Friday by appointment only, again, for Ocean County residents who are exhibiting symptoms. That's the case all over the state. For more information or to make an appointment, please visit the Ocean County Health Department online at ochd.org. That's ochd.org. And we also thank Ocean County's healthcare partners, Hackensack Meridian Health and RWJ Barnabas Health. And tomorrow, Camden County, in partnership with Cooper University Healthcare and Virtua Health, will be opening a testing site at Cooper's Point Park in Camden, which will be open from noon to 4 each weekday through April 15. Testing will be available by appointment to Camden County residents, and anyone seeking a test should contact their medical provider at Cooper, Virtua, CamCare, or another provider. And again, it's for symptomatic folks only. So I want to thank our partners and leaders in Middlesex County, Ocean County, and Camden County. They join a long list of other counties that are doing everything they can to test symptomatic persons. I've shown this exhibit several times to you this week, and you'll see now the total list of testing sites continues to grow. And by my count, there are 26 at least in the state. And so we will continue that. For any New Jerseyan, and again, I want to come back to our all-encompassing website. For any New Jerseyan who thinks they may need to be tested, a good first stop is our symptom self-test at our all-encompassing website, covid19.nj.gov, covid19.nj.gov. And if you do believe you may be exhibiting symptoms of COVID-19, call your healthcare practitioner. Before I leave testing, I had a very good conversation this morning, and my colleagues had preceded that with him both last night and today with Tom Evers, one of the senior guys at Abbott Laboratories. They have, as you probably saw over the past couple of days, they are developing a rapid turnaround test. And I'm honored to say that New Jersey has been picked as one of the early states that they're going to put that test equipment into. Right now into Bergen County. More details on that to come as we know more. It's a modest first step, but it's an important first step. And according to Tom, and he and his Abbott colleagues are going to continue to ramp up the ability to get that, that piece of equipment into as many hands as possible, or access as much as possible. So as I've said all along, it takes a village, and in this case I want to tip of the cap to Abbott Labs. Switching gears again to the topic of personal protective equipment, or PPE. Last night, and I'm going to ask Pat Callahan to say a few words about, before we go to Q&A, about both PPE and compliance or lack thereof. Last night we received a shipment of PPE, another one. This, I think, is now our fourth shipment out of FEMA. It consisted of more than 260,000 pieces, including masks and gloves. Again, deep appreciation. We are grateful for it. It by no means alleviates our need for more PPE, and we continue to work every single avenue to get more of our state, more for our state rather, and our frontline responders, and to also ensure that our community health personnel have what they need as well. Remember, this fight isn't just in our hospitals. This slide, I think we've got a slide, Mahan, that gives a quick glimpse into our current statewide PPE numbers. I'm hopeful that perhaps as early as tomorrow's briefing, I'll be able to give, along with Pat and team here, a greater accounting of our PPE supplies and how they fit into our current needs. Our work, both collectively and through Pat's efforts, is to ensure that we are distributing our PPE supplies as efficiently and effectively as possible. This is why we've put in place the daily reporting mandate for all of our health systems and hospitals, and why we're continuing to seek out every available piece of PPE and every available ventilator. Make no doubt, we appreciate every single piece of PPE that we're receiving, whether it's through the federal government in the national stockpile, from the many donations, large and small, that we have received, or through our own purchasing. But, and I repeat, we need a lot more, and I continue to push our case with the White House, with FEMA, and with everyone I speak to. And as always, if you have PPE to donate, please let us know through this website, covid19.nj.gov/PPE donations. And Colonel Callahan and his team will connect with you to take that off your hands. And it's not just PPE. We have also desperately mentioned many times that we need more ventilators. And I noted yesterday, we continue to pursue every avenue on that front. The 300 ventilators from the strategic stockpile that we referred to yesterday have arrived, and they're being tested as we speak. So far, so good. And George Helmy, my chief of staff, and I have each been on at the highest levels with the White House this morning, reiterating and underscoring, particularly with another 69 fatalities, the need for more ventilators. This is as good a spot as any to say that I mentioned it takes a village. I mentioned Tom Evers at Abbott Labs. I had a long and incredibly powerful conversation yesterday with a guy who we've been in regular touch with, and that's Alex Gorski, the CEO of Johnson & Johnson, one of our iconic corporate citizens. Alex and I spoke. I wanted to reiterate my thanks for the 10,000 goggles that they had contributed, an enormous amount of money. They're allowing their scientists and researchers to take, I forget what the sabbatical period is, but to go into hotspots and actually work at the front lines. You may have seen that they are working aggressively on a vaccine. Now, there are many working on a vaccine, but there are a few out there, and I mean out there anywhere in the world, never mind New Jersey or America, who can realistically hope to achieve the scale, and that's the key here, the scale of production. Alex and I also talked through sort of the likelihood of how this plays out in terms of the sequencing of, as we've said all along, we've got to break the back of the coronavirus first and meaningfully reduce the cases, if not towards zero, then begin to responsibly reopen our economy and society. He and I talked about, again, I'm operating above my pay grade with my two colleagues to the right, but talked about the likelihood of therapeutics, drugs that can treat the symptoms becoming much more broadly available in his judgment. I don't want to put words in his mouth, but sort of, if you look at sort of back to school time frame, and then a vaccine that, that they are literally out testing, retesting, making sure it's safe and efficacious. And then the ability, whether it's them or whoever, but obviously they are as big a dog on the hunt as any, to have vaccines at scale, God willing, by perhaps as early as spring of 2021. We have no bigger player in the healthcare space in the state than Johnson & Johnson, none with a deeper heritage. And again, to all the, I mentioned in the past week, Merck and so many other of the big companies that are proud to call New Jersey home. We wear their presence here as a badge of honor. They are all diving in like never before, proving that it not just takes a village in words, but in action. So hats off to each of them. And as I say, in particular, that conversation with Alex was particularly powerful and enlightening. Allow me to switch gears again. On Saturday, I mentioned that we were close to having 100% compliance from municipal water companies voluntarily halting all service shutoffs throughout this emergency. I'm proud to report that we now have that 100% compliance statewide. Between both municipal and private sector water utilities, no New Jerseyan should fear losing their access to clean water. And I thank everyone for their cooperation. I know Catherine's going to touch on this as well. Switching gears again from the Attorney General's office, I want to amplify the announcement made yesterday that we will crack down on any physician or pharmacist or anybody else hoarding certain prescription drugs or inappropriately prescribing them to friends and family. As we have read in the news, certain drugs are being investigated for their potential in treating COVID-19. I mentioned therapeutics a minute ago myself, and we must start now to protect that supply. Like a lot of other things, overwhelmingly, these are fields filled with good actors, but a few knuckleheads spoil it for the rest of us. And from the Department of Labor, again, switching again, we cannot urge employers enough to keep your workers on payroll throughout this crisis and allow them to benefit from the expanded paid sick and family leave programs made possible by the recently enacted federal response bills. If you do, you will be eligible for a dollar-for-dollar payroll tax credit against those costs. This is available, I think, to 99.8% of all businesses in New Jersey and all but our largest employers. Again, I urge you to do the right thing and keep your employees on payroll throughout this crisis so we can deliver them peace of mind and so we can get our economy going that much faster when this emergency ends. Also from the Department of Labor, residents who are eligible for unemployment will receive an additional $600 per week through July 31st because of the federal relief bills last week. This money should arrive, I believe, starting next week for those already collecting unemployment. For those of you who just filed, it will take a little longer, but the department is working overtime to process all of your claims, and we ask for your patience due to the record volume with which they are dealing. For more information, again, on any of these items, go to our all-encompassing website, covid19.nj.gov, covid19.nj.gov. There has already begun some chatter about the next coronavirus-related bill coming out of Congress. I spoke with Speaker Pelosi not once but twice yesterday on this very topic. Let me again reiterate our priorities. We need assistance for workers, small businesses, and flexible aid for states that have borne the brunt of this virus, and we certainly are at or near the top of that list. New Jersey and New Jerseyans who are in the eye of the storm should not be treated the same way as states less impacted by this invisible enemy. Also, as we continue to think about a Main Street stimulus, Congress should undo the SALT deduction cap to help New Jersey's middle-class homeowners. I thank in this one in particular Congressman Pascrell and Gottheimer for their continued efforts on this front. Speaker Pelosi and I spoke not just about the general need for another step and another bill and stimulus coming from Congress, but specifically spoke about lifting the SALT cap. Related to budget, to money, to impact, we had a good conversation late morning with our teams, with the Senate President and the Speaker. We are, as soon as we can, looking to come to folks with guidance about where the budget is headed and specifically about tax filing deadlines. It was a good conversation. Our teams are following up on that as we speak. More to come when we have information for you. Before I turn things over to Judy, I want to again express my thanks, and indeed our thanks, to the overwhelming number of New Jerseyans who are doing the right thing by all 9 million of us to get us through this crisis. I cannot thank enough the women and men who are out there every day in whatever capacity they're working, who are keeping us going. And I must give a special shout out to the many state employees who are assisting their fellow residents in any number of ways. To our state colleagues, which measure in the many tens of thousands, I tip my cap to you. I want to tip my cap actually as well to our educators up and down the state who are doing a phenomenal job in this just never before seen remote learning environment in which we're all living. As usual, we have the best educators in America, if not the world, and they are stepping up, in this case, from home, in most cases, and walking our kids through the most unusual time in any of their educational lives. And again, in general, I cannot thank enough the millions and millions more residents who are staying at home and doing their extraordinary part to flatten the curve. We take our hat off to you. Overwhelmingly, folks are doing the right thing. There are still, unfortunately, a few who are not. And so in addition to a quick comment on PPE, before we take questions, I'm going to ask Colonel Callahan to just give us a quick summary, because we have to remind folks we need 100% compliance with our stay-at-home mandate. By the way, you should know that we read practically everything you are sending us. If I don't personally read it, and I read a lot of it, I promise you we are reading it. We understand and completely appreciate the anxiety that so many of you feel, but I've said this before, and I'll say it as explicitly as I can. Leave the worrying to me. Leave it to us up here on this team. Our job is to lessen your anxiety, to be straight with you, to tell you the facts, and to give you some sense of where we're headed. We're doing all that we can to ensure the safety of our 9 million member New Jersey family. We're doing all that we can to make sure that we don't just get through this, but that we get through this stronger than ever before. We take your worries and your concerns to heart, and frankly, they educate our decisions just as much as we rely on the facts and the science. We're in this together. We will get through this together, and we will move forward together. I'd like to say it is going to be tomorrow. I'd like to say that we'll come through this unscathed. We've already lost 267 precious lives. I don't want anyone ever to look back on this day, March 31st, or any other day, and say you didn't warn us where this was headed. The numbers of positive cases will continue to rise. Sadly, so will the fatalities. But at some point, God willing, sooner than later, we will break the back of this damn virus. We will flatten that curve. We will have gotten the capacity in our healthcare system sufficient enough to deal with the cases that we have, and we will begin slowly but surely together, never having turned on each other, as one extraordinary, diverse New Jersey family. Slowly but surely, we will get back on our feet, and we will be stronger than ever before. With that, please help me welcome the person who needs no introduction, the Commissioner of the Department of Health, Judy Persicelli. Judy?
Thank you, Governor. Well, good afternoon. As I've shared in the past, we...
All right, folks, and when we come back here on News Now, we will take you out to New York, where the New York governor just spoke and gave a long news briefing there. That's coming up next here on News Now, everyone.
Facilities have reported at least one COVID-19 positive resident. Yesterday, the department issued updated guidance to these facilities that directs them to implement universal masking of all staff and anyone entering the facility. We are taking this step to reduce the risk of illness being introduced into the facilities. Also, all symptomatic facility residents, those who are showing respiratory virus symptoms, should be masked while staff is providing direct care. Concerning the readmission of their residents back into their facilities and acceptance of new residents, our guidance outlines methods facilities should use to return or admit patients safely into their facilities. In addition to monitoring them for symptoms, facilities must create separate wings, units, or floors to accept asymptomatic residents coming into or returning from the hospital. This may mean moving residents in a facility to create a new wing or a new unit. They must limit the staff working between the wings or units as much as possible to avoid spread of the virus.
We are live and worldwide here for you on Fox 10 Extra and coronavirusnow.com, showing you a live look at the Dow here, just down about 200 points there in the red. We'll continue to follow it for you right here on Fox 10 Extra. I'm your host, Mike Page. Thanks so much for joining us here as we are trying to give you news conferences and updates from around the country during this pandemic. We just saw New Jersey. Now let's go out to New York, where Governor Andrew Cuomo really, when he starts talking, it's really a national scene, national coverage for the governor, really, because New York is now the epicenter of these coronavirus cases. Let's go with the very latest from the governor, Andrew Cuomo.
Good news, 4,900, almost 5,000 people discharged. That's up 771. So people come in, they get treated, they go home. Excuse me. New York is at 75,000 cases. Next state is 16,000. California is at 7,000. So you can see New York is a magnitude of difference more than any other state. 1,550 deaths. That's up from 1,218 yesterday. Again, we're studying the charts. We're trying to study the data, follow the data. The data is uneven. It bounces. Numbers often bounce in any model. There are variables in this model. The hospitals are reporting it, so what every hospital reported that day, were they busy? Are they combining a couple of days in one? It's an imperfect reporting mechanism. But you see the basic line is still up. What the statisticians will tell you is you basically draw the straight line that the columns indicate. And you see that we're still going up, which is what we see on the overall trajectory, that we're still going up. Number of intubations was down, not much, but it was down, and that's a good sign. You also see the number of discharges going up, and that's consistent. The longer people are in, they either get treated and leave, or they get put on a ventilator, and the longer you're on a ventilator, the less likelihood you will come off the ventilator. That is the blunt truth of this situation. We have two missions overall that we are pursuing. One is the front line of this battle is our hospital system. That's what this is going to come down to. The second is social responsibility, stay at home. Don't get infected in the first place. Don't get infected in the first place because it goes back to you're creating a burden on our healthcare system that our healthcare system cannot handle. We're talking about exceeding the capacity of our hospital system by some estimates 2 times. So what does this come down to, besides all the other issues? It comes down to not overwhelming the hospital system because those people who need acute care may not be able to get the acute care. So it's all about the hospital system. That is the front line. What we're doing is we are following the mathematical projections of the experts. We're speaking to all the healthcare professionals, all the healthcare providers, World Health Organization, National Institute of Health, Dr. Fauci, CDC, FDA, the whole alphabet soup of healthcare experts. And the mathematicians who then have different models. And we talk to about 5 different models, and we compare the models, and we try to find the median through the models. That's how we plan everything. Follow the data, follow the science. People ask me, what do you think? What do you think? I don't think about this. What do I know? I'm not an expert. I'm not opining. I talk to experts, and I follow people who know. But for the hospitals, procure equipment, identify the beds, support the staff. That's what it's been all about. Of those priorities, number 1 is support the staff. They are the front line, and they need relief. They are physically exhausted. Even more, they are emotionally exhausted. This is unlike other disasters, hurricanes, earthquakes, floods. They happen, they're fast, they're over, you start rebuilding. This is different. This is ongoing, and the duration itself is debilitating and exhausting and depressing. I'm speaking to healthcare professionals who say, look, more than physically tired, I'm just emotionally tired. Seeing the pain, seeing the death that they're dealing with every day. In general, I am tired of being behind this virus. We've been behind this virus from day 1. The virus was in China. We knew it was in China. Unless we assume there's some immune system variation with Asian people, it was coming here. And we have been behind it from day 1 since it got here. And we've been playing catch up. You don't win playing catch up. We have to get ahead of it. The second rule is never underestimate your opponent. And we underestimated this virus. It's more powerful, it's more dangerous than we expected. And the third point is plan forward. Get ahead of it. Get ahead of it. Fight the fight today, yes, but anticipate the next battle and plan for the next battle. And the main battle is at the apex. We're still going up the mountain. The main battle is on the top of the mountain. That's where the main battle is going to be, the apex of the curve. And then we come down the other side of the mountain. We are planning now for the battle at the top of the mountain. That's what we are doing. Get a staffing plan ready now for the battle at the top of the mountain. Equipment stockpile now. We're gathering equipment that we don't need today because today is not the day of the battle. The battle is when we hit the apex, depending on who you believe, 14 days to 30 days from today. And also, we need a social acceptance of the time expectation. We're all anxious. We're all tired. We're all fatigued. It's been all bad news for a long time. Our whole lifestyle has been disrupted. Everybody wants to know one thing: when is it over? Nobody knows. Well, President said by Easter. This one said by this. Nobody knows. You can have a hypothesis, you can have a projection, you can have an opinion, but nobody knows. But I can say this: it is not going to be soon. If our apex is 14 to 21 days, that's our apex. You then have to come down the other side of the mountain once you hit the apex. So calibrate yourself and your expectations so you're not disappointed every morning you get up. Yesterday, we met with the entire state hospital system, Dr. Zucker and our team. First time they were all in one place. And we said to the hospital system, look, what I just said to you, we're dealing with a war. We're dealing with a war we've never dealt with before. We need a totally different mindset and organizational transformation. We can't do business the way we have always done business. We need an unprecedented sense of cooperation, of flexibility, communication, and speed. And that's what we talked through yesterday, and we have to do it now. The healthcare system is one of those balkanized systems. It's like our state education system. It's like our criminal justice system. It's in place. It's fragmented. They have their own identities, their own associations. It's regionally organized. That all has to change. We don't have the ability to meet the capacity of our healthcare system as an entirety. That assumes the healthcare system is working as an entirety. That's not how the healthcare system is organized now. We have New York City hospitals, and then we have Long Island hospitals, and then we have Westchester hospitals, and then we have upstate hospitals. That has to go. Even in New York City, you have two basic hospital systems in New York City. You have the private hospitals, voluntary hospitals, about 160 of them, which are some of the finest healthcare institutions in the United States of America. You know, this is Mount Sinai, Columbia Presbyterian, et cetera. Some of their members are also upstate, but they're the large private institutions. Greater New York Hospital Association. Ken Rasky runs that association of 160. You then have, in New York City, the public hospitals. The New York City Health and Hospitals Corporation. They are 11 public hospitals. They are a universe, and then you have the private hospitals as a separate universe. The 11 public hospitals are the hospitals that in many ways have always been under greater stress and greater need. We have to get those two systems, the private system and the public system in New York City, working together in a way they never did before. The distinction of private, public, that has to go out the window. We are one healthcare system. On top of that, it can't be the downstate hospitals and the upstate hospitals and the Long Island hospitals. When we talk about capacity of beds, when I say we now have 75,000 beds, that's a statewide number. That means those beds have to be available to the people in New York City or Nassau, even if those beds are up in Albany. So combining that whole system, and you're no longer just the Western New York hospitals or the Central New York hospitals. It's one coordinated system. It's much easier said than done, but we have to do it. On top of that, you have to overlay the new federal beds that came in, that are an entirely new component. We have Javits Center, 2,500 beds. We have the USNS Comfort, 1,000 beds. We're planning other federal facilities. These all have to be coordinated on top of the existing hospital network. So you see the organizational situation that we're dealing with. And let's be honest, and let's learn from the past. We know where we have to focus. We know where we're going to have problems in the next hospitals, because the hospitals that have the least capacity, that have already been stressed, are the hospitals that are not going to be able to handle the additional load. That is a fact. You know which hospitals were struggling. We do reports all the time about the financial capacity of hospitals and what hospitals are in stronger versus weaker position. The hospitals that are in a weaker position are the hospitals that are going to suffer when they then carry an added burden. That was Elmhurst Hospital. It happened to be a public hospital. It happened to be a public hospital in a place of density. It happened to get overwhelmed. And that's what, then you saw the burden on the staff. You saw the emotion. You saw the stress. That can't happen. And that's what we talked about yesterday. And people said, well, Elmhurst isn't my responsibility. Elmhurst is a public hospital. The city runs it. I don't run it. It's New York City. It's not a private hospital. I don't care which link breaks in the chain. The chain is still broken. It doesn't matter which hospital, which link. Any link breaks, the chain breaks. The healthcare system is a chain. It breaks anywhere, it breaks everywhere. That has to be our mentality. We laid out a full plan on how to do facility development, how to move people among hospitals so nobody gets overloaded, shifting patients, shifting staff, shifting supplies. None of us have enough supplies. Okay, then let's pool our supplies and let's put them out to the people who need them. And just because one hospital happened to have found a vendor from China who delivered 5 million masks, let's share those masks. And we talked about that yesterday. We also talked again at length about ventilators, which is, everybody knows, is a key piece of equipment, identifying all the ventilators in the state, who has them in a stockpile, who ordered them, who expects them to come in, and we'll have one stockpile of ventilators that we can distribute for everyone who needs them. We also talked about splitting of ventilators, because that's a technology that does exist. It's been used before. It's not ideal. You take one ventilator and it's used for 2 patients. The federal government is a partner in this, obviously. I spoke to the president again yesterday about this situation. I spoke to the vice president. I spoke to Jared Kushner. The White House has been very helpful. We have to get the federal agencies on the ground to understand how this operates, especially FEMA, because we have to be coordinated and people have to know what they're doing, and this is no time for anyone to be learning on the job, and we're going to be working through that today. PPE, same thing. We want to know what everybody has. One stockpile, we'll distribute it fairly. Testing. How do we get out? When does this end? This ends when we get a fast-track test an at-home test, a 15-minute test, and people can then find out when they can go back to work because they're negative. We're working on additional testing. As I said, the Department of Health has a new test, but that's when this ends. We're also working on the new medications. We're leading the country in many of those developments. We have saliva testing now. We're working on the antibody testing, and we're working on the plasma testing at the same time. We put together a central coordinating team. It's going to be led by the Department of Health. Westchester's on it, Greater New York is on it, Haines is on it, New York City is on it, Long Island is on it. If the federal government is going to participate, they have to be part of this team, because we have to know what we're doing, and I don't want FEMA coming in and blowing the coordination of what everyone is trying to do. The coordinating team is going to organize upstate, downstate transfers, set patient loads for hospitals, right? So if one hospital gets up near a overload capacity, let's call it, those hospitals start to send patients to other hospitals before they get up to their max within the New York City public hospital system, within the Greater New York private system, and then among the different systems. So different mentality, but we have to do it. We said 2 missions. One was hospitals, second was individual responsibility. Individual responsibility is about discipline, it's about selflessness, and it's about being informed. The basic point is stay at home. The point is stay at home. I know it's hard to stay at home. And I know everyone thinks, I can go out and I can be smart and I won't get infected because it's me. I'm a superhero. It's not going to be me. That is not true. And it's not just about you. It's not just about your health and your life that you're playing with here, my friend. You can infect other people. So I've been trying to communicate this many different ways for many days. We still see people coming out who don't need to be out. Even for essential workers, people have to be careful. And again, I've been trying to communicate that everyone is subject to this virus. It is the great equalizer. I don't care how smart, how rich, how powerful you think you are. I don't care how young, how old. This virus is the great equalizer. My brother Chris is positive for coronavirus, found out this morning. He is going to be fine. He's young, in good shape, strong, not as strong as he thinks, but he will be fine. But there's a lesson in this. He's an essential worker, member of the press, so he's been out there. If you go out there, the chance that you get infected is very high. I spoke to him this morning, and he's going to be quarantined in his basement at home. He's just worried about his daughter and his kids, that he hopes he didn't get them infected. You don't really know Chris. You see Chris, he has a show on 9 o'clock on CNN. But you just see one dimension, right? You see a person in his job. And in his job, he's combative and he's argumentative and he's pushing people. But that's his job. That's really not who he is. He's a really sweet, beautiful guy. And he's my best friend. My father was always working, so it was always just me and Chris. And he's a lawyer also, Chris. He's a lawyer because growing up, the decision point came to what do you want to do after college? And my father was a very strong personality. And my father basically suggested forcefully to Chris that he should be a lawyer. it was a different time and a different place, you know. Now, my daughters, Cara, who's here, you know, they all follow their individual stars. This is their destiny, which is right. If you had said to my father, I want to follow my individual star, he would say, yeah, you can follow your individual star right out that door. You know, that's what he would have said. So Chris went to law school, but he never really had a desire to practice law. He calls me when he's about 26. He's at a law firm. And he said, you know, I don't want to be a lawyer. I said, yeah, I know, but you are now a lawyer. You are. He said, yeah, but I don't want to be a lawyer. I said, what do you want to be? He said, I want to be a journalist. I said, you want to be a journalist? I said, it's too late. You're a lawyer. You have to pay law school bills. You didn't go to journalism school. It's too late. No, I think I can do it. And God bless him. He quit the law firm, went to work for Fox TV, which is a whole separate conversation in the House, and then worked his way up. He's at CNN. He does a beautiful job. But a sweet guy. And now he's quarantined in the basement. But he's funny as heck. He says to me, even the dogs won't come downstairs, he says. So, but he is concerned about his wife and his kids. But the reason I raise it is he's smart. He's social distancing, yes. But you wind up exposing yourself. People wind up exposing you, and then they find out they're positive a couple of days later. And I had a situation with Christopher 2 weeks ago that I even mentioned. My mother was at his house. And I said, that is a mistake. Now, my mother is in a different situation. She's older, and she's healthy, but I said, you can't have mom at the house. And he said, no, mom is lonely. She wants to be at the house. I feel bad. She's cooped up in the apartment. I said, yeah, I feel bad she's cooped up in the apartment too. But you bring her to your house, you expose her to a lot of things. You have the kids there. You have your wife there. You're coming and going. Your wife is coming and going. And you could expose mom to the virus. And love is sometimes needs to be a little smarter than just reactive. And we had a whole discussion. And truth, now he's informed, I'm informed. Was that dangerous? Was that not dangerous? So I went back to Dr. Zucker. I said, look, we have to tell people, what are the rules? How does this work? That's when I came up with Matilda's Law. And I said I named it for my mother. And it was very clear about people who are older and what they should be exposed to. My brother, that was 2 weeks ago, if my brother still had my mother at his house, again, out of love and comfort, and my mother wanted to be at the house anyway, by the way. She didn't want to be sitting at home in an apartment. So she would have been doing what she wanted to do. He would have been doing what he wanted to do. It would have seemed great and harmless, but now we'd have a much different situation. Because if he was exposed, chances are she may very well have been exposed, and then we would be looking at a different situation than just my brother sitting in his basement for 2 weeks. So think about that, right? My brother's smart. He was acting out of love. Luckily, we caught it early enough. But it's my family. It's your family. It's all of our families. And this virus is that insidious. And we have to keep that in mind. Keep in mind Matilda's Law. Remember who is vulnerable here and protect them. You want to go out and act stupid for yourself? That's one thing. But your stupid actions don't just affect you. You come home, you can infect someone else, and you can cause a serious illness or even death for them by your actions. And people have to really get this and internalize it, because it can happen to anyone. 2 weeks with my mother and Christopher. Today is a very different situation. Last point, there is nothing that I have said different since I started these briefings. And there's nothing that we have learned that is different since I've started these briefings. We know what to do. We just have to do it. It is individual discipline to stay at home. That's what it is. It's discipline. No social distancing. It's discipline. Well,
And we are back here worldwide for you on Fox 10 Extra and, of course, coronavirusnow.com. Live look at the White House, where later this afternoon there will be a White House news briefing featuring the president. Once again, that's a daily briefing that has been going on since this crisis and pandemic has started. We will feature that for you, of course, on our Fox 10 YouTube page as well as coronavirusnow.com. Hi, everyone. Mike Pace here. Welcome back here to News Now on Fox 10 Extra. Well, we have one more hour for you here, and then, of course, on coronavirusnow.com, we're going to go very long into the evening as well as we try to give you updates throughout the country as news conferences are happening, and we're bringing it to you live and raw, and just really it's like if you were part of that news briefing wherever it may be. But boy, times have changed, haven't they? I mean, they really have. I used to have Ron up here at the beginning of the show at 10 a.m. and now Ron's working at home. So many people at our Fox 10 studios are working from home, trying to do that safe distancing, social distancing as it continues. The whole month of April will be the same because that is what the latest recommendation from the CDC and President Trump administration put out earlier this week. So we're just all in a new territory right now where, I mean, every fabric of life has changed for us. Totally. Everything. You go to the grocery store, so much different right now. Concerts, sports events, all canceled. And you're thinking to yourself, when will things change? And the change will come when people hopefully take this very, very, very seriously. And I say very, very, very because I know there's some people taking it seriously, but maybe sometimes they're still going out and about, still having some sort of contact with other people. But maybe if we could all get through this together, it could lessen the burden and maybe lessen the time that we're all trying to find our way through this. And once we do that, I think we're going to be above it, and then we'll be hopefully in the summer months being much, much better about this all. And hopefully maybe it'll change things down the road for us, for life changes as far as, you know, just how we all think about washing our hands, and hopefully everyone was doing that ahead of the time. But, you know, this is all just new information for a lot of people, and it's really making us all think, especially at home when you're at home right now. And you may have never been able to work at home, and now you are, and you're having this weird feeling of, oh boy, this is just what it's like every day. I'm at home trying to work. These new types of things come up, and you're thinking, when will everything go back to normal? And we're hoping that that will, if everyone plays their part in doing the social distancing as well. All right, guys, this is what we have coming up for you in this hour, everybody. Live, a look at the markets here, down 146 points. They're in the red. We have a live event coming up in New York in just a little bit. This is New York City, where we are awaiting Mayor Bill de Blasio. He's going to be holding a media availability where a 350-bed temporary hospital is being built. So we'll feature that for you in just a little bit. Let's show you the latest numbers, what we're dealing with right now. 823,000 cases worldwide confirmed, and we have 175,000 in the U.S., and unfortunately 3,400 deaths being associated with it in this country. The biggest epicenter is New York, and that's where in just a little bit we will feature that news conference for you once it gets live. Let's go out to New Jersey, where they are still featuring their updated news conference.
It's going to happen in every instance because I always talk about discretion, but I think you're going to see if and when those large gatherings happen that everybody there is going to be charged.
Remember, there are 9 million of us, right? So the overwhelming vast majority of folks are doing the right thing. But this is a virus that wants to find the lowest common denominator, and this sort of gatherings are that. Real quick.
Follow up, if I may. Commissioner, you had mentioned with regard to the Shore Medical Center, the reason that they were putting out, not you had mentioned, but the letter had mentioned that they're losing money because they can't do elective surgery and they're trying to get as much PPE as possible, and that this could be a concern for other hospitals. Is there that concern, and how are we addressing it if we are?
I think all of the hospitals are concerned for the financial position that this epidemic puts them in. You know, obviously, hospitals that are full with COVID-19 patients would have a financial foundation for that, because most of them have insurance, they would be paid for. But the impact of the curtailment of elective surgeries, my past life would tell you that if you don't do over like 50% elective surgeries in your hospital, you're going to have difficulty managing your finances. So every single hospital in New Jersey will have difficulty with their finances.
May I just say this before we move back to Paul? And Paul, it's an honor to have you with us. That's why in the federal, Matt will correct me if I'm wrong, this federal stimulus bill has a huge chunk of money for hospitals for this very reason. There are certain sectors that desperately need the help, and particularly the hospitals on the front line of the COVID-19 are at the top of the list. According to Mahan, thank you, and Ed, thanks for passing it along. We have, as of now, 4,764 folks who have registered an interest in helping expand our medical services core. So we are going through that and processing that, but that's a big deal for us. Paul, thank you.
Hi, you've got a policy of letting people get out and exercise on the state level, which seems to be working quite well, but I'm hearing all these complaints from people. For example, this morning I got a picture from the Belmore Boardwalk. They shut that down for walkers. There's a person walking in traffic instead. Now, if they had another person with them and they were 6 feet apart, one would be in the middle of the road.
Yeah.
And you're seeing this all over, where beaches, boardwalks, local people are making these decisions to shut things down that on the state level would not be shut down.
Yep.
What are you going to do about, and by the way, when they shut them all down, everybody congregates at the one that's open, the federal or state, which creates the crowded parking lots and so forth.
Yep.
Are you going to do anything to have some sort of consistent statewide policy on that?
Can I ask Matt Plotkin to weigh in here with Chief Counsel Matt Plotkin? Thanks.
In Executive Order 108 laid out that with very limited exceptions, no county or local government can implement an order that contradicts with the governor's order. There are a few exceptions to that, one of which is we gave local jurisdictions the option in consultation with us to close parks, boardwalks, beaches, and that's in part because some towns are very dense and there's local circumstances that it just didn't make it manageable, especially with shortages in their law enforcement officers to monitor those public places. So it is a local decision that we work closely with them on, but that's one of the few exceptions to the statewide policy.
Thank you for that. Do you have one, sir? Please.
Governor, in the course of covering COVID across the globe, we've seen photos and video of other nations disinfecting public spaces. Is there any plans for that in New Jersey? And for the Colonel, do we know how many troopers are out sick at this time relative to the whole force? Thank you.
Thank you for that. I would just say this. I think we got asked this question, at least I answered it. I'm not sure why it fell to me at that point, about spraying versus wiping down. So there's an enormous amount of disinfecting going on. I think overwhelmingly it's wipe down mode. Is that correct, Madam Commissioner? And so I think you saw a lot, I think in Asia and to some extent in Europe, you saw the spraying routine. I have, Ed, any comments on the efficacy of wiping down versus spraying?
Not specifically as far as wiping down versus spraying. We certainly do encourage the wiping down of what we call high-touch surfaces, guardrails, handrails, any place that people are likely to touch with their hands on a regular basis.
NJ Transit has an aggressive protocol that they've had now in place for a number of weeks, which you would not be surprised by given the line of business they're in. Pat Callahan on state troopers.
I have the global law enforcement numbers, which I won't give out of my head because I was wrong on Saturday. This morning, law enforcement positive across the state, 383. Statewide quarantine law enforcement, 3,081. And statewide out of work for another reason is 618. But I do that from our road field operations standpoint. It is a small percentage of troopers that are out.
Thank you. Sir, are you asking or not? I can't tell. You're just on camera? Okay. We'll go to Nikita, Elise, and then John.
So I'll apologize like I did before because I have an obscene amount of questions again. But I'll start. Do you have a timeline for the June elections? And then are you close to a decision on whether you're going to take those to all vote by mail? And then since the Division of Elections is quarantining paper petitions, do you plan to extend the amount of days that candidates have to file a challenge or file bracketing letters? And it also seems like you've been a little bit less willing to criticize the president recently. Is there any concern on your part that doing so would endanger federal aid to New Jersey? And has the administration identified any other issues that would require legislative action? And if so, what are they? And have you ruled out calling the legislature in for another remote session?
Our administration?
Yes.
Okay. Does the obscene list go on, or is that okay? No closer on the June elections. I say this with respect because we respect each and every one of you. I think we thought after the last time you asked the question about our timeline, we have a very different timeline on when to make the decision on the June elections, but we've got nothing new on that. I missed the second part. Division of Elections are quarantining something, or?
Quarantining petitions for 24 hours, the petitions that were handed in person, they're just sitting in a room to, shed any viruses or whatever they may have. But given that not everyone's petitions have been checked as of yesterday.
Yep.
So, the candidates essentially have less time to file challenges.
Got it. I don't have a crisp answer for you, but I know Matt Placken is more likely to have one.
State as of now doesn't see a reason to change that deadline. They're actively working with the campaigns. They feel confident that they can count the ballots or count the petitions rather, and they're also working with the county clerks on that side.
Let me address the president, which has come up a couple of times. Again, I've said this before. And it's just a fact, and I would hope that the folks in the 9 million members of our family would appreciate this. I don't get to wake up in the morning and pick who's in what position in the country. And the President of the United States is Donald Trump, and the Vice President is Mike Pence. And there's one federal administration. And if we're going to get through this crisis sooner than later with a lower curve, with fewer fatalities, please God, and casualties in terms of sickness, it will be because we found, among other things, a lot of it will be due to what we do in this state, including the personal behavior of all of us, but a lot of it will also relate to how much common ground we can find with the administration. And so it has nothing to do with what I think a given person wants to hear. It is substantive, deeply substantive. And I would just say, so he's a Republican, I'm a Democrat, and just as similarly, I was on the phone twice yesterday with Speaker Pelosi talking about what elements we would like to see in the next stimulus bill. I was on, George Helmy and I were on at very high levels this morning with the administration. We will do what it takes to save as many lives as we can save in New Jersey. We will deal with everybody and anybody. There's no price too high, political or otherwise, that we will pay in order to save as many lives and keep the amount of folks who are sick in the state as low as possible. As it relates to our administration and the legislature, we had a good conversation this morning as it relates to things like the budget, tax deadlines. I hope that we're going to have news to report on that sooner than later, given that tomorrow's April 1st in particular. I don't know that there's, beyond dealing with the budget season and the tax reporting time frame, Those are the top two items, I think, Matt, it's fair to say that that's what we talked about this morning. Beyond that, I would have nothing else that they've been really good, I have to say, about, I'll give you one example, which is a few days old. They've been really good about making sure that we had a law in place where you couldn't foreclose on somebody, you couldn't evict somebody, just to pick one example. So I want to take my hat off to the Senate President, the Speaker, as well as the minority leaders in both chambers. This has been an overwhelmingly bipartisan endeavor, and I want to thank all of them for that. Thank you. Elise.
Hi, my first question is from Daniel Munoz from NJ Biz. Are you considering the sort of construction ban that New York has put in place in the next couple days? Are you reconsidering New Jersey's rules on that? And if so, are you likely to go less or more restrictive? And then the rest of the questions are mine. There's a $680 million pension payment due today, the quarterly payment. I'm wondering if you're going to make it, and if so, what's your guidance on cash flow over the next several weeks and months? And earlier you mentioned out-of-state restrictions on residents who come from out-of-state. Would those be as restrictive as those in Texas and Florida?
That's it?
Yes.
On Daniel, the answer is we're holding where we are in construction, but we look at that regularly, and we look at other areas as well, but that's one we look at. New York did tweak, I think, to eliminate non-essential construction. That's something we've considered, but we're still holding where we are. The pension payment will be made. I don't have any window on the cash levels, but that's, as you can imagine, a moving target. And that is something that we're in close touch with the treasurer on. And it's too early to say anything about what I mentioned that would be down the road, both in terms of how we reopen and get back on our feet, but also I just refuse, and I'm looking to the 9 million folks, many of whom are watching. We can't make the folks go through the pain that they're going through, which we have to go through, and that we're going through together. Just to emerge and find that some other state didn't take this as seriously, that they were basing decisions that weren't based on science and data and fact, and therefore through a back door we reignited the fire. Now exactly, Elise, how that looks, it's way too early to tell, because we ourselves, with our aggressive policies, haven't gotten that curve flattened yet. And we will do this, let there be no doubt about it, and I hope sooner than later. But when we do this, when the numbers in the back half of that curve begins to come way down, and the likes of Judy and Ed say, you know what, you're getting into a place where you can responsibly begin to shed some more daylight on the economy and the society, I'll be darned if we're going to let some lowest common denominator suck us back in. You had a quick one?
Yes, just a quick follow-up. The pension payment will be made on time today?
On time.
Okay, thank you.
I shouldn't have said that it was going to be made at some point. It will be made on time as it is stipulated. Thank you. John.
Are you keeping
John, if you sit there tomorrow, I promise you we'll start right to left.
Thank you. Are you keeping track of frontline medical workers, nurses, the way that the superintendent has available at his hands that data on police? And if so, how do things stand in hospitals? The PPE numbers that you gave earlier, what exactly were those? Were those the state stockpiles? Were they from the survey of hospitals, or were they from the federal deposit? And the CHIME model for COVID uses a social distancing percentage as one of its factors. What is the percentage that you're using right now in your estimates for your modeling, and what does that say about New Jersey's compliance rate in general?
Let me start, and Judy, you and Ed should jump in. Is that okay? PPE, that was state, I believe that's state levels at the moment, John. Secondly, on the COVID social distancing, the compliance, I think we've been showing is 31%, right? So we've been showing two models. One was 0, one was 31%. 31%, again, I'm going to hand this over to the experts, is based on historical pandemic experience. My call to arms to everybody is we're better than this. We can beat this. We can be better than 31%.
Right, but in your current models, are you using another number besides 31?
Yeah, 31%. In our current model, we're using 31%. We would hope it would get up to 44%. If it was 44%, we'd be okay. Our capacity, as we currently know it, would be fine. So we're expanding capacity because we're at 31%. We believe with working with the hospitals and the alternative care sites, of which there will be many, that we will be able to handle the capacity at 31%. As far as keeping track of nurses, the frontline nurses, those reports go to NJHA from the individual hospitals. We don't keep them at the Department of Health. So workforce is dedicated to each hospital.
John, may I use this as an opportunity, though, to go back? Can we pull up the two graphs, the two curve graphs, just for a sec? So if you look, the left one is Armageddon. Right, so that's assuming we did nothing. Go get them, enjoy yourselves. There's no state in America that can deal with that, and thank God that's not what we're dealing with. But even if you look at the right graph, which implies an average performance, I can't say two things enough because I don't want anyone else to look back on today or any other day. The numbers are going up of positive tests and sadly fatalities. Our job, and again, there's no price that's too high to pay to save lives, and we will lay it all out to save lives. The numbers are going up. Secondly, even if you get the performance on the right graphic, you still are short on beds, you are short on ventilators, and you're short on PPE. So we are doing everything we can to augment all of the above, and again, we're short on all, and at the same time, beat the crap out of that curve, to use a diplomatic phrase, to get it down as close, the blue line, as close to the red line as humanly possible. Does that do it for you, or do you have anything else?
That 31%, though, at least here, you haven't shut schools, you haven't done aggressive stay home, hide in your house kind of social distancing before here. So is 31% still the best way to model that, or is there a higher number? To get a sense of how we're complying.
Yep. Yeah. May I say this as a non-medical, non-health expert? Remember a couple of things, and we should have said this earlier. These are very good questions. We took a whole range of aggressive steps. You mentioned closing schools. That's now several weeks old. The most aggressive steps were taken a week ago Saturday. Brendan, you might want to move a little bit because Nikita's craning his neck there. Those are 10 days old. Judy and Ed, tell me if you disagree. We're getting specimens that are tested that may also be 7 to 10 days since the collection of them. Is that the results rather today? The results that we're reporting today, I can't say this in every case, but it is highly likely, given how jammed up the testing facilities are, including the private high-scale, high-speed ones, that these are also 7 to 10 days old. So the answer is you may be right. We're not going to know, though, would be my personal opinion, for another 7 to 10 days to have enough data to begin drawing conclusions. Is that fair to say?
It's totally fair to say. We're kind of looking in the rearview mirror because of the way tests come in. But again, we want to plan for what we think is the worst case and hope for the best. And the resiliency of...
And we were listening to a little bit of that New Jersey coronavirus update. We're going to keep it moving along here, everyone. Welcome everyone to News Now and Fox 10 Extra and worldwide for us on coronavirusnow.com. We're going to go out to Ohio now, where we're getting an update there from the Ohio governor.
Our household scheduling in leisure time too. And if we're able to create a space for school or work to do that away from our other activities to give us a sense of normalcy. And if you live alone, reach out to friends and family each day so that you're able to really connect with them and not feel lonely or isolated. If you have a neighbor that lives alone, Older adults for sure, but neighbors of any age, please reach out to them as well. Leave a kind and cheerful note, offer to run an errand, just give them a call to say hello. I want to emphasize checking on friends and family and neighbors who live alone is really important right now. It can be difficult to spend that much time by themselves. And so making sure that they're okay, giving them a chance to talk about their worries, their stresses, and also giving them an opportunity to enjoy memories together or talk about things they're looking forward to. Those are helpful for all of us in decreasing the isolation that people might be feeling. And if home is hard for you right now, maybe you don't have enough food or you're not living in a safe environment, it's important to reach out for help. There are food pantries, social service agencies that can help meet your needs. And we urge you to reach out to them and take advantage of the help that's being offered. Health is another essential element of staying well and being well, not just our physical health, but our mental, emotional, social, financial, and spiritual health too. So stay in touch with your primary care doctor if you have chronic illnesses and medication management issues, and if you have any new symptoms too. Also stay in touch with your mental health and addiction counselors if you're already in treatment for those issues, and if not, reach out to them. Both physical health care doctors and mental health and addiction centers are open, and you need to reach out to them and see if you can connect by telehealth or if there's an option for you to come in person if it's something that needs to be seen in person. Also, if you're involved in a faith community, stay connected to your faith leaders. Reach out and see ways that you can be connected to online or Facebook opportunities to gather with other members of your faith community. And go to the coronavirus ohio.gov page so that you can learn more about resources for faith communities too. And maybe just spending time in nature can be really helpful for your spirit as well. So we know that being outside, getting fresh air, listening to the birds, seeing the signs of spring, sitting by water, these can all have calming effects. And it's a good opportunity for us to do that for ourselves each day. Even just sitting still and breathing or just clearing your mind can be really helpful for all of us in terms of our mental health. Living with purpose contributes to our sense of wellness, and for all of us, that might look a little different. It might be working or volunteering, going to school, parenting, taking care of family members or pets. And that might be different today than it was a month ago. And so some things that we need to pay attention to in creating some balance and wellness for ourselves here are, if you're working or studying for home, you might find that you're at a relentless pace right now where you're not having the same kind of social opportunities with your coworkers or your teachers or your classmates. So build that in for yourself and set a schedule. Without that, you could work from the time you wake up to the time you go to bed. So really build in that social time for yourself as well. Also, if you're someone that likes to volunteer and your volunteer opportunities aren't the same right now, the state has created volunteer opportunities for the COVID-19 emergency that we're in. So go to togetherohio.gov and you can find volunteer opportunities there. Create some time and space in your home if you have the ability to do that, and that will help you create some opportunities for doing your purposeful activities in the work and school environment, and then having other space in your home to enjoy your family or leisure time. And then set boundaries for yourself too. Remember to halt. If you're hungry, angry, lonely, or tired, you can give yourself a break and take care of your own needs as well. And thinking about community, it's important to remember that school is community for the young people in our lives, and that after school activities like music, sports, and clubs are really important places that the kids in our lives find community too. Developmentally, friends are of primary importance to kids, especially to teenagers. So create opportunities for your kids to connect with their friends and their classmates in new and different ways right now. Remind them that this is a temporary way to connect and that they'll be able to see each other again in person in the future. Listen to questions that your kids have and answer them honestly. Monitor the media that they're exposed to so that you know the kinds of messages they're getting through social media, and use trusted resources of information. Let them express their feelings and help them manage their worries, and think about ways that they have opportunities to be in control right now in their lives. And for older kids, give them some time and space to connect with their friends to get this kind of support too. Kids get that support differently from their friends than they do from adults. I'm hearing a lot about people struggling to stay connected to their recovery supports. And this would include things like AA or NA or Smart Recovery for people struggling with alcoholism or addiction. And that connection is really a lifeline for many people. So I want to take a minute to talk about that. For our friends in recovery, these are really hard times and you can do hard things. The opposite of addiction is connection. So it's vitally important that you stay connected to your recovery supports. You can connect with peers in recovery through phone calls. There's recovery coaching opportunities that are available. There's online meetings and meditation groups. All of these things are available. They might be different than what you're used to and seeing people in person and getting that support, but they are effective and we urge you to use them. Ohio Citizens Advocates for Addiction Recovery has a website that has a lot of great information about linking to these resources, so I urge you to connect with that. And if you have a family member that's living with or recovering from alcoholism or addiction, I urge you to reach out and encourage them to stay connected to their recovery supports or to get help for the first time if they haven't before. Please don't let stigma or discomfort stand in the way. These are potentially life-threatening illnesses, so we need to make sure that all of our friends and family are taking care of themselves. So make that effort and do that today. Ask them how it's going, ask them if they're staying connected to their recovery supports, and let them know that you care and that you're here to help. The same is true for people living with mental illness. Reach out and support them and let them know that you care and that you would be able to be helpful to them in reaching out for their treatment and their recovery as well. And for the families of people living with mental illness and addiction, I urge you to stay connected to your support groups as well. Groups like the National Alliance for the Mentally Ill, NAMI, have local groups around the state, and they're there and available to help connect you to resources if you need. If you know someone who's feeling helpless or hopeless, or like they might hurt themselves, please, I urge you to have them call the Suicide Prevention Lifeline at 1-800-273-8255. And for all of us, there are lots of ways that we can connect to the emotional support that we need right now. The coronavirus.ohio.gov website has some really helpful tips on managing COVID-19 related stress and anxiety. And there's also a tab called Resources for Adults that will link you to videos and online support, apps that you can use to support your mental health and addiction recovery too. And finally, I'd like to just close with some wisdom that my friends and family in recovery live by and that I find helpful each day. Seek serenity to accept the things you cannot change, courage to change the things we can, and the wisdom to know the difference. Live one day at a time. This together, Ohio.
Director, thank you very much. We appreciate it. Good words. Lieutenant Governor.
Thank you, Governor. Lori, that was terrific. Director Chris is a real treasure. We are fortunate to have her as part of the team. Let me just say that I'm going to focus on two things today. Much of what I've been working on in the last 24 hours are kind of things that are going to happen in the future. But there are two really important things that I feel an obligation to address and hopefully give some relief to people who are in need of it. First of all, let me address unemployment, the unemployment compensation system. Right before I walked in here, I finished a call with the Ohio Department of Job and Family Services leadership, the CIO and the technology leadership of the state, and the vendors, the private sector vendors that support that system. I was very clear to them that the governor and I, our members of Congress, the legislature, our mayors, and the public in general have been communicating with us that some of them, many of them, have frustration getting through on the system. And I wanted to convey throughout the system, people are doing this, that folks out there are scared about both the health and the economic consequences of what's going on, and that we wanted to bring even greater sense of urgency to solving some of these challenges. I was reassured that the capacity of the system has been increased 20 times on the website, 20 times the capacity on the website. They've added 100 employees to the call center. And I said to them, that's not enough. We got to do more. And I was reassured that the vendors are adding capacity so we can take more phone calls, that they're going to put 180 new people, training them up to put them in the call center. And this is important to know because you can't just put anybody in there. This is a complicated system that has to comply with the rules and regulations outlined in state and federal law, and they need to be trained to do this right. And that also the Bureau of Workers' Compensation System is in the process of training and lending some of their employees to this effort. But the reason I'm bringing this up is because for all of you who have had challenges, I want you to know your voices are being heard and they're being acted upon. I also feel the obligation every time to reassure you that even if you have trouble, your benefits will be backdated to the date that you were eligible to receive them. The folks who are doing this, the ODJFS team on unemployment compensation who are on the front lines, when you get through to them, understand they're not the problem. They are working so hard to try to serve you. Don't express frustration to them. What they need are better tools. They're on the front lines. We need to give them better weapons, better tech tools, and more reinforcements. And we have ordered those reinforcements to the front lines to help them in the work that they are doing. But you also need to know, I think it's important to know that the system is working for most. As a matter of fact, to put this in perspective, I tried to think of a way to explain just what those folks are facing as they're trying to do this. And if you take the last 2 weeks, really since this is all picked up steam, they have handled twice as many people in 2 weeks as we typically have on average in the entire unemployment compensation system over the past 2 years. That just gives you a little insight into what has happened over that 2-week period. As Dr. Acton, I thought, thoughtfully said yesterday, there is no system in the world, no hospital system in the world that's designed to handle what we're dealing with. Well, our unemployment compensation system's the same way. It's just that they are not having time to prepare for the surge. The surge is now. And so they have been tasked with deploying a larger build out of that system. We ask that you be patient and understanding and know that they understand the sense of urgency that's involved here, and they are deploying even more resources than they already had toward solving this problem. So I wanted you to know that, wanted you to hear that, and understand for those of you who are experiencing some challenges that action continues to be taken to address it. Let me add something here on insurance. We have asked the Department of Insurance to do several things over the course of time, and perhaps I've not done a good enough job of communicating what all of those things are and what you're eligible for. So let me just take a moment to do that now. First of all, for employers and their employees, a grace period was issued on March the 20th for employers who can't pay their premiums as a result of the emergency declaration and the subsequent orders. Health insurers have been ordered to provide flexibility to help those employers and the employees to maintain employee eligibility for their health insurance during this period of time. Also on that same date, March the 20th, there was an order issued regarding out-of-care network for hospital bills through insurers to make sure that they provide the same rates as they would in-network. This is that they're also required to pay for COVID testing, the COVID-19 testing that people need, whether they're in or out of network. Those are two important things, actions that have been taken. Additionally, maybe you have an insurance policy that requires you to have a valid driver's license to be covered. Know that a bulletin has been sent to the insurance companies that they cannot cancel, not renew, or refuse to issue an auto insurance policy or deny a claim on the basis of that driver's license provision, because we know that our BMVs are not open to serve you. And so that has been also something important detail that's important to have incorporated into the insurance landscape. And then most recently, for property and casualty, life and long-term care insurance, they have been ordered, insurance companies have been ordered to provide their insureds with at least a 60-day grace period to pay insurance premiums and for non-cancellation, for non-payment. Now, I'm going to say this is similar to what the governor said earlier. This doesn't mean you don't have to pay your bills. You still have to pay your bills, but I encourage you to work with your insurer. They've been given an either order or given the latitude to work with you to work through all of these issues as issued by the Department of Insurance, and those services should be extended to you through your insurer. This is all available to view under the coronavirus.ohio.gov/business-help section, or you can contact the Department of Insurance for further information. And in closing, we are always on the phone, literally nonstop from the time we leave here to the time you see us again the next day, talking to different people across the sectors of the economy and on the front lines of this. Had a call with nursing home operators and just talking about the anxiety that the people there who are working on the front lines have every day. For all of you, whether you're in the nursing homes, wherever you are in this fight, we really, truly appreciate from the bottom of our hearts the sacrifices that people are making to help others. We keep using the line, we are all in this together, but we know that some people are in it a little more than others by the nature of what they're called to do during this period. We are grateful for you. You are lifesavers. You are inspirations for all of us. Keep up the good work. Governor?
Lieutenant Governor, thank you very much. Dr. Acton?
Thank you. Hi, everyone. Good afternoon to you. A couple of things. I do want to thank everyone for that lovely video yesterday. The good news of us not being close and you can't see all of us at one time is I was bawling, so got to miss that. And I was very moved by the video of sign language by the young folks as well. So I appreciate that. And thank you also to Director Lori Chris, my colleague in mental health. I think I'm spending a lot of time trying to explain, you know, a part of our public health response, but our health and well-being is a very holistic thing. It's all of us. And I think her tips were just outstanding. So thank you so much to everyone. We're going to start with taking a look at the numbers as usual. And today we are looking at 2,000, almost 2,200 cases as of this morning. Our hospitalizations at 585. I'm sorry to say that we have 55 deaths across the state of Ohio, and we do now have 71 counties reporting cases. Still difficulty, still limited testing. We are, as the great announcement with Battelle and OSU, are working on making our testing faster, and that's so important because the sooner we can turn that knowledge around, the better we are. But we are still dealing with a scarcity of testing, so saving that testing for the very sickest and most at risk. That means a lot of us, most of us actually, are working with our doctors, hearing that clinically we sound like we have the case and staying home.
Welcome back, everyone, here to News Now and coronavirusnow.com. We are going to be transitioning. We were listening to a little bit of the Ohio update before the break, and we will continue to bring you the live feeds as they are happening right now. That's exactly what we are going to do, everyone. I'm your host, Mike Page, navigating the feeds and the news conferences from across the country during this coronavirus pandemic. Let's go out to New York City, where the mayor, Bill de Blasio, just announcing the opening of a temporary hospital that will have 350 hospital beds for people that are in desperate need.
The federal government in the last couple of weeks has shown us a much more vigorous approach, and it's helping us, and we are very appreciative. I thank the president. I thank all the cabinet officers who have been a part of this effort, especially thank FEMA. But we must have that additional personnel to be able to get through next week and the weeks right after that. So I'm going to keep reiterating this specific request, and I'm waiting for an answer from the White House. It is a reasonable request given that we are the nation's largest city and we are the epicenter of this crisis. Now, ventilators, which I'm going to talk about constantly, we are grateful. Again, in the last week or so, the federal government really stepped it up. 2,500 ventilators came into New York City. That is amazing, but we're going to need a lot more, and we're going to need them soon. We're hearing that more help may be on the way shortly from the federal government. We're waiting for that to be confirmed. We need it. That number we put forward, 15,000 as the total need, remains the total need, and it is a very tight time frame, because none of us knows for sure. Is the worst week going to be in 1 week, 2 weeks, 3 weeks, 4 weeks, 5 weeks? We don't know when exactly it peaks. But we know April's going to be very tough, and I'm trying to gird people for the possibility it will continue on into May. And we're going to need those ventilators. And the moment we are done with them, we're going to send them wherever they're needed most in this country. Now, I'm going to put out a call now to others who could help us. And there are people in our communities right now, and I need them to step up. Some have, but I need all of them to. People who are part of the normal fabric of this city. Oral surgeons have ventilators for when they perform surgery. Plastic surgeons have ventilators wherever they perform surgery. Veterinarians, yes, veterinarians have, in many cases, ventilators that we could use. Every single one of them. If you've got a ventilator in your office, in your operating room, we need it now. It should not be sitting there doing nothing. This is a war effort. Everyone needs to contribute. You'll get it back when this battle is over. To donate ventilators, to find out how we can immediately get your ventilators where they're needed, anyone can go to nyc.gov/help-now. And I want to now talk to you about personal protective equipment. This has been such an important topic. There's deep concern all over the city, all over our healthcare system. Today, our city agencies are distributing to all New York City hospitals. I want to make that crystal clear, not just to our public hospitals, health and hospitals, but also voluntary hospitals, independent hospitals. We ensure that supplies go wherever the need is in an equitable fashion. So this day, today, we are distributing 3 million surgical masks all over New York City to our hospitals, 800,000 N95 masks, 600,000 pairs of gloves, 120,000 face shields, 40,000 surgical gowns. This is one day. Now, anyone out there who has supplies like this you can donate, or has a truly reliable source for these supplies, we need them. And again, if you can donate to this effort, every bit helps. Go to nyc.gov/help-now, or you can call, obviously, people from all over the country are helping New York City. You can call 833-NYC-0040. And thank you to all who have helped us. I'm going to give you some other quick updates before we go to questions. An update on our jail system, the efforts that we have made directly and working with district attorneys and the state to ensure that inmates who have the kind of medical problems that would put them in direct danger, and those who could be released for other reasons as well, again, with some very strict guidelines and safeguards. As of the end of yesterday, there have been 900 inmates released from our jail system. There will be more ahead. We will give you an update as soon as we know of any additional numbers. I want to talk about construction. There's been a lot of concern, obviously. We work closely with the state to affirm that only essential construction should be allowed at this point. Non-essential, non-emergency construction must end immediately. Our Department of Buildings agents are out as we speak. Yesterday, we gave education and warnings. Today, we are starting heavy fines and closing down construction sites that are in violation. They will be not just fined, they will be closed down immediately. If Department of Buildings has any difficulty from the people at a construction site who are non-emergency, non-essential, they will call in the NYPD to shut down that site immediately. There's no kidding around here. All non-essential, non-emergency construction must be ended right now. On tax lien sales, this is a really important issue for some folks. Tax liens, property that was going to be sold by Department of Finance for unpaid property taxes or water bills or other charges. We understand right now people's lives have been turned upside down. They don't have money to pay bills. We want to be fair. We want to be understanding. So all tax lien sales are going to be postponed. They were supposed to be in the month of May. They will be postponed to August initially. On alternate side parking, and we all know, everyone who's a New Yorker knows, few issues stir the hearts of New Yorkers more than alternate side parking. Well, I'm sorry it's because of coronavirus, but let me at least give you a little good news in your day. Alternate side parking will be suspended for the next 2 weeks. 2 weeks through Tuesday, April 14th. So leave your cars where they are. One less hassle and fewer people have to go out of their homes to deal with it. And we'll be looking after the 2 weeks to see what's the right thing to do at that point. On playgrounds, I have been talking daily, in fact, multiple times a day with Police Commissioner Dermot Shea to get feedback from his enforcement efforts, obviously from Parks Department as well. Overwhelmingly, we're seeing compliance in parks and playgrounds with some real problem spots too. So I've been very clear. We see a problem spot that's recurrent, we are going to shut it down. I have ordered 10 playgrounds to be closed at the end of today. Those are playgrounds that have had crowding multiple times. They will be shut down. They will be locked. There'll be signs put up. There'll be enforcement. My goal, again, is to try to preserve as many as possible if people follow the rules. If people will not follow the rules, we'll continue to shut them down aggressively. Another issue has come up, and it is an issue that's causing us real concern. We heard from Staten Island, from the Amazon Fulfillment Center, a specific charge that a worker who raised health and safety concerns, raised social distancing concerns, was fired. The allegation is because he spoke up for the safety of his fellow workers, he was fired. I have ordered the city's Commission on Human Rights to investigate Amazon immediately to determine if that's true. If so, that would be a violation of our city human rights law. We would act on it immediately. I should also note that the Sheriff's Office did an inspection of the facility to ensure that social distancing is being observed, and they will continue to inspect as needed. So I'll conclude. And again, we're going to see a lot of things we've never seen before. I know every one of us has walked down a sidewalk and looked up ahead the whole block and it was empty, and we can't remember when that ever happened. I was driving on the FDR the other day, looked ahead for a mile. It seemed like on the FDR there was no other car on the road up ahead. We're seeing things that are just strange and in so many ways troubling to us as New Yorkers. Some of these things are going to be painful. Some of these things are going to be hard to make sense of. But some things we're going to see, like this tennis center, are going to be signs of the fight back. The fact that New Yorkers don't take this crisis lying down. New Yorkers are not people who get defeated easily. So you go all over and you see this fight back. You see a place being turned into a hospital. It wasn't a hospital. You see people providing food for their neighbors. You see people helping in so many ways. You'll see unusual things, and some of them will be things we wish we'd never seen. And you're also going to see things that are going to tell you that New Yorkers are not going to accept defeat. I'm very, very proud of all of you for the way you've handled this extraordinary crisis, something we've never experienced in our lifetimes. I hope we never do again. But I have faith in New Yorkers. I have faith in New York City. We will see this through. A few words in Spanish. Sé que nuestra ciudad se ve muy diferente ahora, pero los neoyorquinos no deben tener miedo. Significa que estamos recibiendo la ayuda y los suministros que necesitamos para salvar vidas. Continuaremos haciendo todo lo que está a nuestro alcance para proteger a nuestros trabajadores esenciales. With that, again, a thank you to all our colleagues here, everyone who's doing so much work so quickly. Thank you all. Thank you, the amazing team at Emergency Management, at H&H, for all you're doing. And with that, we welcome your questions. Dave.
Mayor, I know you said that this location will eventually, in about a week, start taking non-ICU coronavirus patients.
Correct.
From Elmhurst. But is there a master plan in the city of, oh, this person goes to Mount Sinai, this person goes to the Javits, this person goes to the Comfort? I mean, is there a master plan, or is it each doctor decides, or what?
No, there actually is a master plan that's being built out as we speak in a cooperative effort between FEMA, the state, and the city, led by Emergency Management. So job one, Dave, is to build out the space immediately and to make sure as each space comes online that there's a clear protocol. And again, I'll start, and if my colleagues want to jump in at any point, just start walking toward me and I'll get out of the way because of social distancing. Stay there, Deanne. So, but no, in fact, the idea is to knit all this together into a coordinated effort. But I also want you to be clear, Dave, we have to immediately start building out the space first, because to meet these deadlines, before you work out all the protocols of how it's going to be staffed and where the patient's going to come from, you got to get the physical part moving instantly. And that's been an extraordinary effort, but every day more and more is going to be started and gotten online. Ultimately, yes, you have to get the right people in the right place, but remember, the hospitals right now are being converted to all ICU or maximum ICU, but they still have a long way to go before they get to that point. So a lot of the hospitals can handle, of course, other types of cases right now. What's going to happen over time? Every day each one becomes more and more ICU, more and more COVID related. So it is literally a day-by-day evolution. Deanne, I'm moving.
I don't need the step thing.
Okay, no step for you. And I'm going to go over here. No, I don't know what to do. I'm going to go here. Okay.
Yeah, the coordination piece is a really big piece, and what we have set up is the Healthcare Evacuation Coordination Center, which is going to be run out of the Javits. It's actually a system that's been in place, and it's run by the state, that was set up for coastal storm evacuations. That's just being put in hyper mode and being able to do that for this type of an event. What they're going to do is they are putting out protocols to all of the hospitals across the New York City area on how they request patient transfers, and then that coordination center will match the acuity of the patient with the acuity of the bed as these beds continue to stand up. Right now, the only places that are open are the Javits Center and the Comfort, and so they're matching patients to those two facilities, but as we continue to stand up facilities, and depending on what level of treatment we're going to be able to give, they will match those patients with the proper space.
Just while you're there, if you don't mind. So it is up and running?
It is up and running. It's located at the Javits Center.
Okay, and just between Comfort and Javits?
Because those are the only two that are open right now to move patients to.
Right, a quick follow-up. We were told we had to ask OEM this. There is a large tent set up in the parking lot of Citi Field. Is that somehow, what is that?
Yeah, the tent was originally set up at Citi Field to support the drive-through testing clinics that were going to come in from FEMA, but we, through this process, as other clinics were set up, we co-located the FEMA operations with our health and hospitals, and so we left the tent up there for right now to determine if we needed an additional use for it. So maybe it can be used for some of our food access distribution points. So we've been in contact with Citi Field on leaving it there for right now till we determine if we have a use for it there. So right now, it's just staged for us to use for something that we might need because the changes or the requirements continue to change every day.
You go around this side. Here we go. Get organized. So I want to note with real appreciation to Deanne that, she brings an extraordinary background to this work in emergency management because she started out as a firefighter, she served in the Air Force, then served at FEMA. So what is amazing is watching everyone be able to work with Deanne. Military folks immediately feel comfortable with Deanne because she was in the military. Firefighters, of course, she's one of them. FEMA folks from Washington, she knows all of them, including the national administrator. So I really want to give credit's due, not only to her team, which is great, but Deanne herself has been really one of the pivots here because she brings a wealth of experience and relationships and is really helping New York City right now. It's not a surprise that those ambulances, for example, showed up in record time. That's a lot of her doing and Tom Von Essen's doing. Yes?
Can you give us an update on Elmhurst Hospital and where that stands? And what's the number of fatalities that have come through there?
Dr. Way will join me. I just want to say to preface, and then we will artfully, in a ballet-like fashion, go around each other. It's been a really tough time for Elmhurst, but I want to note, and I give Dr. Mitch Katz and the whole team at Health and Hospitals and Elmhurst credit. They continually made the adjustments. We talk about how the NYPD, for example, constantly makes strategic adjustments through CompStat. You saw that at Elmhurst. They surged doctors there, nurses there, equipment there. 4 times they sent more ventilators to ensure that they could save lives, and also moved patients off to other places who could be. So they got some of the very toughest cases in the city, and in a sudden surge, and that has a lot to do with where the hospital is and how few public hospitals are in that area for so many people. But they really dealt with a sudden onslaught very, very powerfully. With that, in terms of the overall situation, Dr. Way, why don't you come over? You go that way, I'll go this way.
All right, so thank you for that question and thank you for the opportunity to speak on behalf of Health and Hospitals in Elmhurst. First and foremost, my heart breaks for all the patients and the families who have been inflicted with this terrible, terrible virus. I've practiced emergency medicine for a long time, and I am seeing things that I could never have imagined in terms of what this virus can do to all ages, people who are previously healthy, people with comorbidities. So our thoughts and prayers are with everybody who's lost somebody, as well as everybody who's in the ICU, and especially to our healthcare workers who have fallen ill. Elmhurst Hospital still continues to make all of us very proud. All the doctors, the nurses, the leadership, everybody is moving heaven and earth to do everything they can to take on the onslaught of COVID-19 patients. And so over the past 2 weeks, it's gone from more than double the volume of people coming to the emergency department to now the volume's actually down, but the people who are coming in are so much more ill and so much more critically ill with shortness of breath and respiratory failure. And so what we're seeing is more and more ICU type patients. And so I was just on the phone with the emergency department chief, Dr. Stu Kessler, to get a better picture. I speak to him every day. We have an ED action team that meets at 6 p.m. every night. I've also spent a lot of time at Elmhurst myself over the past 2 weeks. They intubated 19 patients in the past 48 hours, 42 patients in the past 4 days. And that is way more than normal for an emergency department, even a level 1 trauma center like Elmhurst. And so many patients are boarding, meaning they're admitted and waiting for space upstairs in the emergency department. Health and Hospital has been acting like a system in terms of literally flattening the curve. Everybody should be familiar with that term, with all the public health information about flattening the curve. What we've been doing is we've been transferring patients, both medical surgical acuity as well as ICU acuity, out of Elmhurst, Queens Hospital, Lincoln Hospital, Kings County Hospital, to our other hospitals that have not been are surging, but not nearly as much as Elmhurst and others. And so we've moved almost 200 patients in the last week and a half across the system. But the indicators I'm looking at are flashing red. right? The number of patients that are boarding in the emergency department, the number of patients that are filling our medical surgical units and our ICUs are surging well beyond our traditional ICU units into step-down units, to operating rooms, medical surgical units. And so this space is exactly what we need. We need to look outside of the four walls of our hospitals, not just tents in front of our hospitals, but where they can take admitted patients. And so the Javits Center, the Comfort are welcome reprieves. We have teams poring over every patient in our hospitals, matching it to the inclusion and exclusion criteria to see who we can get to Javits Center, which we've sent multiple people today, as well as to the Comfort. And so I want to thank the mayor, OEM, the governor, FEMA, everybody for stepping up and helping us.
Stay there if you would, Doctor. I just want to see if there's any other questions about either Elmhurst specifically or health and hospitals. Anybody else have questions about that? Yes, way back.
I just wanted to ask, I know you said other hospitals are surging. Which in the system do you say, especially here in the borough in Queens, which is the epicenter of the city's epicenter, could you specifically talk about Queens hospitals and Booth Memorial, the other hospitals here and how they're doing, and which ones are an area of concern for HHC?
Yes. So Queens Hospital is surging as well. They're about 4 or 5 days behind Elmhurst in terms of where they are on the curve, but it's a much smaller hospital, and therefore we've been putting a huge emphasis on getting ICU patients out of Queens Hospital to Bellevue, to Harlem Hospital, to Metropolitan, to North Central Bronx. So the borough of Queens is clearly on the front edge of this pandemic, but we're seeing it in Brooklyn, we're seeing it at Kings County, Coney Island, Woodhull are all surging as well. Jacoby in the Bronx and Lincoln in the Bronx are right there as well. So like I said, it went from being relatively easy to flatten the curve in terms of moving and shifting the surge across the system to now it's much more difficult. But I just really want to give the credit to the H&H leadership, especially the CEOs of all these other hospitals. Every time I pick up the phone and call them and say, can you take 10 med-surg and 2 ICUs? They say, of course. Let me figure it out on my end, but send those patients, please.
Anything else? Yeah, please.
Just as a understanding about Elmhurst, at this point, is it still receiving heart attacks, broken legs, standard ER visits? Because from what we saw from the inside, there were people at Elmhurst saying, we need this to be essentially COVID triage right now. We can't deal with all these other folks. Has that been straightened out?
Yes, so I was on the phone with FDNY leadership yesterday. Hospital Special Surgery has made a generous offer to take all ortho-related EMS runs there. So we are setting up a call with City Hall, with FDNY to figure out how to operationalize this, because this is not normal operating procedures. You take, within 10 minutes of where you pick a patient up. We are stabilizing traumas and immediately putting them in an ambulance if safe and transfer them to an ICU elsewhere in the system. So yes, we are doing everything we can. Memorial Sloan Kettering is offering to take our cancer patients. I mentioned special surgery for our ortho patients. We've also created capacity at Roosevelt Island Medical Center to get other patients. So we're making space. We're making space for COVID patients and especially ICU COVID patients.
Anything else on HHC, please?
Just, is it possible that patients that you have or generally at an H&H hospital that are not being treated specifically for COVID-19 might nonetheless be infected?
Yes. I think that was one of the initial most surprising things for us, that some of the positive tests that were coming back were from those that we least expected it. We thought travel, we thought fever, cough, right, all of these respiratory symptoms, but some people with just diarrhea and upset stomach, right? We had traumas come in, so people who got hit by cars or got beat up on the street, and we put them into the CT scanner. You see ground glass opacities, which show pneumonia that's consistent for COVID-19. And so we're operating under the understanding that anybody could have COVID at this point, any patient that we see.
And noting that when they are sent away from the hospital to other facilities, including here, what kind of precautions have to be taken just because of that?
Absolutely. And so droplet precautions for anybody who is a suspected, what we call a person under investigation, so they have a test pending, anybody who has a confirmed. If they have, yep, that means a mask, that means eye protection. Yeah. Yep. But if they have, if they're intubated, then we take even further precautions called airborne precautions. So that's an N95 mask, that's a face shield, eye protection, gowns, gloves, hat. And so for both our EMS and ambulance personnel who will be transporting these patients, they will all be in personal protective equipment, as well as the receiving providers at each of these facilities, and we will keep these patients in those isolation, precautions.
Anything else? Health and hospitals or Elmhurst? Okay, I'm going to go around. You go here, I'll go here. Everyone's.
All right, everybody, good afternoon. Thank you so much for watching News Now, whether you are on YouTube or on coronavirusnow.com. My name is Pilar Arias. I am one of 3 News Now hosts. I would like to officially say hello since I just got onto the set here and say happy Tuesday to you all. Believe it or not, it is already the last day of March. Tomorrow we start April. Hello, I hope you all are having a fabulous day. Feel free to let me know on our YouTube chat if you are an essential worker or if you are working from home right now and where you are across the world. Remember, we are trying to get all of these different news conferences from across the country in to show you, and that's because we've got viewers worldwide. So we want to make sure that we get your community in for sure. New York, of course, very hard hitting in terms of COVID-19 cases. I want to show you the numbers right now from Johns Hopkins University. Here it is. Here's the global picture. They are reporting 826,222 cases. Unfortunately, we've lost more than 40,000 people due to coronavirus. That number is right here. The total number of people worldwide who have contracted the virus and have recovered, 175,737. Right here at home, for many of us, the United States, more than 177,000 confirmed cases. Unfortunately, we've lost more than 3,400 people. Total number of people who have contracted the virus and have recovered, they're reporting exactly at 6,000. Remember, Johns Hopkins University trying to provide an update every 30 minutes, so those numbers are likely to change, but that is the picture there. So we've got California Governor Gavin Newsom speaking live right now. We've also got the governor of Texas, Greg Abbott, speaking. And remember, in Texas, they're actually requiring that people who are traveling to Texas from certain states quarantine. So let's take a listen to what they have to say.
Personal interactions of people in the state of Texas before the distancing practices that have gone into place the last couple of weeks. So it is one thing that is clear. When you look around your community, like I have here in Austin, or as I have seen either videos or photographs from so many different regions across the entire state of Texas, one thing that is clear, and that is distancing practices that you all are doing, they're working. There are fewer people out who can transmit the disease from one person to another. But, as President Trump said just 2 days ago, now is not the time for us to let up in these distancing efforts. Now is the time instead to redouble our efforts to make sure that we do more to rid ourselves of the coronavirus. 2 days ago, the president extended the nation's effort to stop the spread. He extended the deadline until April the 30th, and he reiterated the need for social distancing strategies that have proven to be effective. So consistent with the guidelines offered by the president, by the CDC, and based upon advice by Dr. Hellerstadt of the Texas State Health Services Department here in Texas, as well as Dr. Birx and Dr. Fauci, who advised the president and the United States operation to combat the coronavirus, I am also modifying my previous executive order about social distancing protocols in Texas. to further reduce the spread of COVID-19, to maximize the number of lives that we can save, I'm issuing Executive Order GA-14 that establishes or that maximizes the number of lives we can save. I'm establishing essential services and activities protocols. In short, what this provides is that Texans are expected to limit personal interactions that can lead to the spread of COVID-19, while also still having the freedom to conduct daily activities such as going to a grocery store, so long as you are following the presidential standard of good distance practices. This decision that I'm announcing today is based upon data and based upon recommendations by state and federal healthcare authorities. The Essential Services and Activities Guidelines, the Essential Services Guidelines are taken from the U.S. Department of Homeland Security guidance on the essential critical infrastructure workforce. The Essential Activity Guidelines are connected to the Essential Services Guidelines. The list of allowed services can be found at www.tdem.texas.gov/essential services. I'll repeat that, but you can find it online also. The list of allowed essential services can be found at www.tdem.texas.gov/essential services. Now, as I mentioned, essential activities are activities that the everyday Texan would be involved in. And the essential activities are kind of obvious based upon the essential services that are provided. But I want to give you some examples. Essential activities include any activity to access essential services like going to a grocery store, going to a bank, going to a gas station, getting supplies from a hardware store. Importantly, it includes maintaining physical activity, which is so important at this particular time. Activities like jogging or biking and hunting and fishing are permissible, so long as precautions are maintained to reduce the transmission of COVID-19 and to minimize in-person contact with others. Also importantly, religious activities may continue, but should either be conducted by remote services or, if conducted in person, should be consistent with the guidelines from the President and the CDC that describe appropriate social distancing to prevent the spread of COVID-19. An example of a type of service I've heard about that some churches are interested in having, especially at the time of Easter, would be what's called drive-up services, where a family unit would remain contained in a car that they drive in and would not expose themselves to others. That seems like it would satisfy the criteria that we're talking about. Importantly, all critical infrastructure will remain operational. Domestic travel is still allowed so long as it minimizes personal interaction. Governmental entities and businesses will continue providing essential services. Businesses not categorized as essential can continue to operate from home through the use of technology. This order will remain in place through April 30th, 2020. The order provides that schools will continue to remain closed until Monday, May the 4th, unless otherwise extended. As the coronavirus has spread across the land at a time when lives are literally at risk, Texans continue to rise to the occasion. The efforts of Texans across the entire state have slowed the spread of the coronavirus. But, as the President has made clear, we are not yet done with our response. We cannot forfeit the gains that we have already made by cutting short our task. We've come too far to falter now. We have made tremendous strides, but we have not yet reached our destination. We have more to do for Texas to reach its determined destiny. Together, we will persevere through this for another month. Together, we are going to heal our state. Together, we will ensure that the Lone Star State continues to shine. Now I'm going to pass it over to Lieutenant Governor Dan Patrick.
Thank you, Governor. A few weeks ago when we were in this room, I talked about 29 million Texans being really on the front line with our healthcare workers, our first responders, the folks that work in the grocery stores. But you're on the front lines, 29 million Texans. And because you follow the governor's orders and these guidelines over the last several weeks, per capita, if you look at the death rate in Texas, per capita of 29 million people, we're one of the lowest in the country. But we need to continue that for the rest of April and even be better at that so that we prayerfully and hopefully can keep our numbers low as all of us want. So as the governor said, follow these guidelines, be very smart in all of your travels when you leave home. If you do not have to leave home, do not do so. But this balance that we have struck in Texas and that the governor's led on has worked to date because 29 million Texans have taken it to heart, and we are standing and working together. And so please continue to do that.
Thank you. And now, Speaker Dennis Bonnen.
Thank you. I'll begin with a quote from Winston Churchill. He said, "It is not enough that we do our best. Sometimes we have to do what is requested." We're requesting Texans to continue to social distance, to continue to stay at home if you are not essential to the infrastructure of Texas. We're asking you to stick together like all of us and continue this process for 30 more days so that Texas can continue to be the leader in defeating COVID-19. Social distance, stay home if you're not essential. Go out and enjoy a walk, enjoy a jog, but be conscious of your friends and your neighbors because we were all in this together. And the better we do this together, the sooner we will be out of this together. And I appreciate the governor's leadership in this executive order, and we support him in getting Texas to the other side of this effort. Thank you.
Thank you, Speaker. And now, Dr. Hellerstedt.
Thank you, Governor Abbott. The executive order that the governor has announced is based on very sound public health policies and principles. And this will only increase our ability to slow down the spread of COVID-19 throughout Texas, and that is absolutely the goal. When we look around, we see people are responding. We should have great confidence in that. We should feel a great sense of our own community pride because we are doing the things that we know are going to work, and we should have confidence in that. And I believe that over time we're going to be able to measure the fact that we've had an impact on the rate of spread of COVID-19 in our state, and that's what everybody wants. We want to stay safe, and the measures that are outlined in the executive order are absolutely intended to make that happen. Thank you, Governor.
Thank you, Doctor. And now, Chief Nimkid.
Thank you, Governor. I'd like to reiterate the directions you've given to us, and one is to maintain the health and safety of Texans at the utmost priority. The second is to make sure that our healthcare workers and first responders have the necessary materials and supplies that they need. And the third is to ensure that our critical infrastructure safely stays up and running. The order today and the tools that we have give us that capability.
Thank you. And now, the Commissioner for the Texas Education Agency, Mike Morath.
Thank you, Governor. Our system of public education in Texas serves 5.5 million souls, little bundles of energy trying to become the best versions of themselves. And like many parents in Texas, I'm a parent with 2 young children, and we are wrestling with a new reality. For the parents listening at home, we will work through this. We will get through this together. For a little bit more time, we all must remain apart so that we can come back together. Our educators all over the state of Texas, working with love and diligence, are doing everything in their power to support parents all over the state of Texas, and we will continue to do so for the duration of this executive order and beyond.
Thank you. And let me just close with this. I want to say something to each one of you. Every single one of our fellow Texans is important to our state. We care about your health. We want you to stay healthy. Please do everything you can over the next days throughout the remainder of April to make sure that you stay healthy, that when we come out of this cloud of uncertainty, of this time period when we are minimizing our contact, that you'll be healthy, your family will be intact, and that we will be reinvigorated once again as the premier state in the United States. With that, we'll take some questions.
You've been adamant that your previous statewide restriction on the schools was not a shelter-in-place or stay-at-home order. These increased restrictions on businesses, would you classify it as that?
So would you repeat the last part of the question?
Yeah, with these now increased restrictions on businesses, it's essential services and non-essential. Would you classify now this as a shelter-in-place or stay-at-home order for statewide in Texas?
Well, candidly, when people talk in terms of shelter-in-place, what shelter-in-place really means as a term of art would mean that wherever you may be at a particular time, you need to take shelter immediately right there. Whether you are at your home or some other location or in a roadside ditch, wherever you may be, you're supposed to take shelter because of something like a tornado would be coming. So shelter-in-place is not a good term to use for any of these strategies that have been articulated by anybody. Similarly, this is not a stay-at-home strategy. A stay-at-home strategy would mean that you have to stay at home. You cannot leave at home under any circumstances. That obviously is not what we've articulated here. This is a standard that's based upon essential services and essential activities. Those who are involved in essential services, as defined by the United States Homeland Security, will be able to continue to provide those essential services. Similarly, those who want to access those essential services like grocery stores or hardware stores or financial facilities have the ability to access them. In order to access them, on occasion, that may mean leaving your house, going to wherever it is you need to go. Similarly, as I indicated, personal health and physical activity are important always, but particularly at this point in time. Going for a jog, going biking, other forms of outdoor exercise are very important. However, doing so in groups would be potentially hazardous to your health. So we encourage people to continue to maintain active lifestyles, but do so in ways that maintain the distancing practices that have been articulated by the President, by CDC, and make sure that you are not exposing yourself to anybody who may have COVID-19.
How can you enforce an order like this?
It's enforced. What the executive order does, it empowers any law enforcement officer in the state of Texas to enforce it. It's enforceable by either a fine or jail up to 180 days. And once again, any law enforcement officer in the state of Texas can impose it. And I can say this, if this executive order is violated, Commissioner Hellerstedt already has issued his own executive order that exists such that anybody who violates this can be subject to a quarantine order.
You mentioned that right now we do have enough hospital beds for the patients that we're seeing. What about when it comes to PPE equipment? We have heard some stories that in Dallas people are being asked to, reuse that equipment, things like that.
First I will tell you that we're so proud of our fellow Texans for stepping up and offering things such as PPE, whether it be masks, whether it be gloves, whether it be gowns, or whatever the case may be. Also, I'm proud that a team that's working with Chief Dim Kidd has been doing a terrific job to access all channels to increase our supply of PPE and other items. And I'll let Chief Dim Kidd explain more about that.
Thank you, Governor. And we're hearing the same thing. It's a very valid question. There's no secret that the supply chain has taken quite a shock. But what we also, when the governor's been talking to hospital CEOs, they're on a rationing program right now so that they don't completely run out. Where in normal days it might be one mask to one provider per each patient, CDC guidelines and the things that we're asking all of our responders and healthcare workers to do is to, at best if possible, try to use one mask per one provider per one shift. Now, if the mask gets compromised or gets wet, we want to change that out. I can tell you on the front end, how we use it will help determine how much we have. On the back end, our team is working very hard at an international level to find the right personal protective equipment that's going to come in and be distributed in a very rational and bed count and population driven manner. We want the most need going to where the resource is needed so that we don't have any waste at this critical point in time, and make sure that we don't have any shortages either. So we're working very hard around the clock to make that happen.
I'll add also that the governors have once or twice a week conference calls with the president, the vice president, Dr. Birx, sometimes Dr. Fauci, who was on the phone call yesterday. And the point was made yesterday by both the president and the vice president about the additional investments made for additional supplies that are coming. And so they are constantly, they at the federal level, are constantly working on increasing supplies, and we are anticipating far greater supplies coming forward, just like what we've seen with regard to the massive percentage increase in the number of tests that have been administered.
We've seen on a local level, even with local stay-at-home orders, on businesses, that there are kind of differences between counties. So with this kind of being statewide now, determinations of essential services, when questions arise maybe for businesses, if they're not kind of following those essential categories or those kind of gray areas, will they have to kind of go to the state then to get clarity on whether they're essential to remain open or?
So this executive order has some specific paragraphs talking about what it does and what it does not do to override local ordinances or county rules. To the extent that any county or local jurisdiction has any rule that's inconsistent with this executive order, it is overridden in this executive order. And so to the extent, for example, that religious services are permitted as specified in this executive order, they cannot be denied by a local ordinance or local order. However, to the extent that there are things that are not mentioned in this executive order, it still gives local jurisdictions the latitude to establish their own rules.
So local jurisdictions could go stricter in some areas?
Yeah, to the extent that it's not overridden by this executive order, local jurisdictions do still have the flexibility to impose standards that they may consider to be more strict.
Reports today say that the CDC is considering telling the public to wear face coverings. Is that under consideration in Texas?
Would you repeat the first part of the question again?
Yeah. So the CDC is now considering telling the public to wear face coverings, like masks, things like that. Is that something that's under consideration in Texas?
So what I will consider is any order or any type of item that is offered up by the CDC as a possible standard to consider will be something we will consider. My prior executive order was based upon CDC-based standards. This current executive order is largely based upon CDC standards as well as some other federal standards. And we want to stay connected to the standards that are established by the federal government. And we will look into any standards that are established by the CDC for consideration.
There's been reports that some local officials kind of not received the same data the state has in terms of hospital capacity and things like that. They've kind of issued their own kind of local requirements and to have that reported to them locally on a daily basis. Is there plans for that kind of that data, hospital capacity that the state's able to share that with local officials to collaborate on that response for healthcare facilities locally? Or?
We want to achieve the highest level possible of collaboration and sharing of information, and we know that's a two-way street. And so we've been mandated or required by the federal government to impose information gathering standards for the local governments to provide certain information to the state health services for us to be able to, in turn, provide to the CDC. On top of that, I could understand what I'm hearing from you. There may be needs or desires from local governments to get access to certain information that we have. To the extent that's possible, to the extent we can create information channels to accomplish that goal, I think we should do it. And so one thing that all of us do, it could be Dr. Hellerstedt, it could be Nim Kidd, it could be Mike Morath, or it could be any of us. We are constantly visiting with local officials to try to provide them either the resources that they need or the information they need. And we want to maximize that to the extent possible.
With this executive order now extending school closures through early May, does that also apply then to your earlier restrictions on kind of dining in restaurants? Will those also all be extended?
Yeah, absolutely. So contained in this executive order is the extension of the prohibitions of certain types of businesses from operating altogether. Bars and restaurants, however, want to clarify, we strongly encourage people to utilize restaurants for food, whether it be for pickup or delivery or otherwise. And then we have also outlined some additional businesses in here to make sure that everyone understands they are closed. I'll list what it says here, and that is that people shall avoid eating or drinking at bars, restaurants, and food courts, or visiting gyms, massage establishments, tattoo studios, piercing studios, or cosmetology salons, provided, however, that the use of drive-through pickup or delivery options for food and drink is allowed and highly encouraged throughout the limited duration of this executive order.
Are you at all concerned with the spread in these facilities across Texas? And can you share any more details on exactly what tests have been done and plans to get more person?
Right. First, I will tell you, as we also list in here, we emphasize the importance of making sure, whether they be state-supported living facilities or senior living facilities, and we have several different categories in here. I would categorize that as a top priority. Obviously, they often involve what are categorized as vulnerable populations. And so we want to elevate our surveillance and our assessment of those populations, as well as our protection of those populations, which is why in this order there are strict limitations on who can and cannot gain access to those facilities. But also, as you may have observed, we have increased testing at some of these facilities, and we look to continue that because of the vulnerability. And so we want to do all we can to protect all lives in Texas, especially those that fall into the categories that you mentioned who are the most vulnerable.
Are there any plans in place to help the Texas Workforce Commission at this time? Apparently they are saying that they are overwhelmed with calls. A lot of people aren't able to access the website, can't file their claims.
I know many of you are seeking unemployment and unemployment insurance claims that you want to get filed, and know that we are adding people by the hundreds to help you respond to those claims. We are dealing with truly an unprecedented number of people who are applying for unemployment insurance. The good news is the money is there. The federal government has done a fabulous job of making sure that the funding will be available for those who are experiencing unemployment at this time. So just know that you're not going to be denied your claim simply because you're having a hard time getting through. But know this, and that is we understand your need and your need for speed. As a result, we have both hired more people on a temporary basis to help respond to these claims, as well as bringing in current employees from other agencies or other employment status to help out in this crunch time to accelerate the timetable of response to help you get your claim.
Is the statewide stay-at-home order still considered or on the table? And what kinds of factors would that require for you to be issued
So I will always remain flexible on whatever standard is going to be best for the people of all 254 counties in the state of Texas. And those decisions will always be based in part on what Dr. Hellerstedt says, in part on what NIMKID says, in part upon what our federal advisors and counterparts say, whether it be the CDC or Dr. Birx, Dr. Fauci, and the presidents. All of them have, and the vice president obviously also. So all of them together provide information about what the appropriate standards are, and we look to them for that advice, and we base our decisions on input from them. Thank you all.
Scientists, public health researchers, epidemiologists, mathematicians, and modelers from the greatest institutions in the world, like the University of Illinois, Northwestern University, University of Chicago, SIU, and others whose guidance on infection rates and potential mortalities and protective measures is frankly second to none. It is based upon that advice that tomorrow I will be signing an executive order to extend Illinois' disaster proclamation, our stay-at-home order, and our suspension of on-site learning at schools through the end of the month of April. If we can end these orders earlier, I'll be the first one to tell you when we can start to make strides toward normalcy again. But that time is not today, and it's not April 7th. Illinois has one of the strongest public health systems in the nation, but even so, we aren't immune to this virus's ability to push our existing capacity beyond its limits. We need to maintain our course and keep working to flatten the curve. Here's what we know. As of March 30th, our preliminary reports from hospitals statewide show just 41% of our adult ICU beds are empty, staffed and ready for immediate patient use, a 2 percentage point decrease from the moment in time numbers that I ran you through last week. And 68% of our ventilators are available statewide, a 4 percentage point drop in a week. That doesn't mean that every hospital has that availability, but collectively, that's what we have across the state. Statewide, about 35% of our total ICU beds are now occupied by COVID patients, and about 24% of our total ventilators are occupied by COVID patients. We're still within our capacity, and we're working every day to acquire new ventilators or convert alternate use ventilators to increase that capacity. But from all the modeling that we've seen, our greatest risk of hitting capacity isn't right now, but weeks from now. The virus's spread is growing. So are its risks. We must not let up now. I'll remind everyone that these interventions don't work if they're piecemeal across the state. It was only a few weeks back when we had just a handful of cases, all in one county. That's up to 5,994 across 54 counties. And we know that there are even more people out there who have contracted COVID-19 and already recovered without realizing it, or recovered at home and never qualified for a test. That's true in all 50 states, and that's the price that we will continue to pay for the lack of early, robust national testing. So we have to stick to the knowledge that we have. No community is immune. To that point, I want to discuss our efforts to keep our Department of Corrections facilities as safe and socially distanced as possible to minimize the spread of COVID-19 within those facilities. Fortunately, DOC is at its smallest population since 1995, and it currently has 36,944 individuals. That's 1,069 fewer prisoners than on February 1 of this year. On March 14th, early in the process of my issuing executive orders addressing COVID-19, to reduce the spread of the virus, DOC suspended all visits, moved all facilities to administrative quarantine, and ensured access to hand sanitizer and cleaning supplies to all staff and incarcerated individuals. IEMA and IDPH have made multiple deliveries of personal protective equipment to the Department of Corrections, totaling over 160,000 N95 masks, over 200,000 surgical masks, and tens of thousands of gloves, and DOC is sending an additional shipment to Stateville today. DOC has been reviewing the case files of as many low-risk offenders as possible for early release during this crisis, with nearly 300 more released as of 1 p.m. today. This has included some of our female inmates who are pregnant or were in our Women and Babies program, as well as low-level offenders at the end of their sentences. All have been thoroughly vetted to make sure that there are no histories of violence, and particularly domestic violence, and all had homes to return to. I should note that places to reside for exiting offenders are one of our greatest challenges. We need to ensure that each person released in this manner has a place to return to, and those arrangements are more difficult for exiting offenders during these challenging times. We're working hard to balance the need to free up as much space in our prisons as possible with making sure that we're not releasing those who may pose a risk to their communities. Every step we take with regard to our prison population needs to solve an existing problem, not create a new one. I signed an executive order to suspend the daily flow of convicted transfers from county jails into IDOC facilities. And my office is working with the Department of Corrections to review the histories of all of our inmates to prioritize the release of older and more vulnerable residents while ensuring the public safety. Under the order, the director still has discretion to accept transfers from county jails when necessary, and he will exercise that discretion. Tragically, we have lost one patient to COVID-19 at Stateville Prison, the maximum security prison that's closest to the Chicago area, with 32 total positive cases among those in custody and more results pending. We have 18 staff members who have tested positive who are employed at various Department of Corrections facilities. The DOC is working diligently to prevent further spread by requiring all staff on duty to wear personal protective equipment and by opening parts of the facility that were closed to allow for further social distancing. We're using every mechanism available to us to prevent and contain the virus's spread in our Department of Corrections facilities, including standing up temporary facilities for an on-site medical mission with our National Guard. But I want to be clear, despite these measures, and any and every one of our DOC residents who falls seriously ill with COVID-19 will receive available medical assistance to get through it, including an ICU bed and a ventilator if necessary. An incarcerated person is a person, and my administration will not be in the business of claiming one life is worth more than another. I want to say to the local hospitals that are near the prison facilities, we will do all that we can to ensure that any patients receive the best care that we can provide, and we will work with local departments of public health to get you all the equipment and support that we can. But hospitals that refuse to take on residents of the Department of Corrections will be called out by name. And those that refuse to operate in accordance to their oath can and will be compelled to do so by law. We are asking everyone during this extraordinarily difficult time to do their part to keep residents, all residents of Illinois, safe. We inherited a prison system that has suffered from overcrowding after decades of tough-on-crime policies focusing on punishment without attention to rehabilitation. Democrats and Republicans agree on this and have worked together over the last number of years to make real changes. And while we have prioritized support services for the men and women in our care, we're still operating in facilities that were not built to support these kinds of efforts. When we get through this immediate crisis, we all need to have a real conversation about criminal justice reform and the status and conditions of our state prisons. But I'll be frank with you, we still don't know exactly when this immediate crisis will pass. And I know this continues to be an extraordinarily difficult time for families across our state, especially for our workers. I have directed my governor's office staff and agency directors to do everything and anything in our power to help our residents who are hurting. We've directed tens of millions of dollars to support our small businesses in impacted industries and offered sales tax payment delays wherever we can. We've expanded support for individuals through the ban of residential evictions, a delayed income tax filing deadline, increased unemployment eligibility, and worked to expand our Medicaid and SNAP programs. There are countless unseen people in state government who are working behind the scenes day and night, 7 days a week, to find every possible mechanism to support our working families. And I promise you, we will not stop until this virus passes. Lastly, I want to talk about what this extension means for our students. Well, first and foremost, I want to recognize the creativity of our Illinois State Board of Education and the superintendents and the school districts all across our state for their remarkably able and agile efforts that they've demonstrated, providing learning opportunities, meals, connection, and stability throughout this crisis. Under this extended order, schools will transition from Act of God days to remote learning days. All of these days count toward the school year, and absolutely no days need to be made up. Each district is working with ISB to create and implement a remote learning plan to ensure that all students, including students with disabilities and English language learners, receive instructional materials and can communicate with their teachers. Remote learning will look different for every district and maybe even for every school. School districts will create plans based upon their local resources and their needs. ISB recommends any grades that schools give during this time be used as feedback and not as an instrument for compliance. Students are going through a situation over which they have no control. Our first response must be empathy. I want to end with a message for our students who I know never envisioned a pandemic derailing their spring semester. Believe me, as a parent of 2 teenagers, you're not the only one. I won't try and tell you that texting and calling each other is the same as hanging out in the hallways or in the lunchroom. And I won't try and tell you that a Zoom prom is the same as a real prom. I won't try and tell you not to be sad about the lost goals and plans that you may have had for March and April. It's okay to be sad. And if you do feel sad or frustrated or angry, whatever you feel, please let yourself feel that way. Don't beat yourself up over being human. And if you're experiencing overwhelming anxiety or you have a friend who is, and you need someone to talk to, there are resources available to you by phone and online through both ISB and our Department of Human Services, as well as the City of Chicago. But I also want to say something else. Once you're ready, take a look around. Take in the incredibly unique moment that you're living in. Yes, it's scary, and it's uncertain, and it's difficult. But if you're looking for a lesson in the fundamental goodness of people and of your community, it's right there in front of you. Take a look at the districts across the state that have taken it upon themselves to support our healthcare workers, like Tinley Park High School's science department delivering goggles to Advocate Health's Christ Medical Center, or Decatur Public Schools donating over 200 iPads to promote contactless communication at area hospitals. Maybe those are your teachers and administrators, or maybe your school is one of the many that have made donations. Even if it's not, I bet people in your school are finding a way to help. Be one of those people. Or look at Michael Arundel, an Orland Park native, home from college while classes are out at the University of Alabama, where he's studying to go to medical school someday. He came home and he saw a need where his elderly relatives and neighbors were afraid to go to the grocery store. So he filled that need by creating Leave It to Us, his free service to go grocery shopping for senior citizens. Orders took off, and his network of mostly college-aged volunteers is now launching service in 5 other states nationwide. Michael, thank you for your movement, the movement that you have started. All of Illinois is proud of you. And I want to encourage our elderly Chicagoland residents, as well as healthy young people across the state looking to join Michael and start a local branch of their own, to visit his website. It's at covidseniorShoppers.com. covidseniorShoppers.com. And most of all, look at the people who make up our healthcare workforce, our doctors, our physician's assistants, our nurses, our nurse practitioners, yes, but also our hospital social workers, EMTs, pharmacists, our ER technicians, registration staffers, sanitation services, and the food service workers who keep patients fed. Maybe you call one of those people a parent, a sibling, a cousin, a friend. Maybe someday that'll be you. I can tell you that they didn't join this profession looking to fight a pandemic. They wanted to help people, to live a life of service. And they're doing that still, even though they share the fear and uncertainty that we all do. No, it's not the school year you bargained for, and I'm terribly sorry for that. But amidst these dire circumstances, I want you to know that there are plenty of people to learn from. There's plenty of reason to hope. And if all else fails, I've heard that Where's Lightfoot meme page is a good place to go for a laugh. So thank you, and I want to turn it over to the star of Where's Lightfoot, the City of Chicago's Mayor, Lori Lightfoot.
Thank you. Let me see if I can get this down. There we go. Well, we all do need a little bit of a laugh and some humor. As I said the other day, the thing that I like most about the memes and the videos that we put out is it gives people hope. And hope means healing. And that's what we need in this time. So thank you, Governor Pritzker. As we just heard from the governor, this virus is lethal and growing. That is why I fully support the governor's bold but necessary extension of the stay-at-home order. And this may not be what residents want, but it is what we need. And the City of Chicago stands ready to continue to partner with the state in any way possible as we navigate the challenges that lie ahead. Just as we heard, to pretend this crisis is anything less than dangerous, that would not only be irresponsible, but it would be deadly. And here's the reality that we all know. The numbers of cases will continue to rise and get worse before it gets better. That is why we've been directing the full power of our city government to stay ahead of this crisis, to flatten the curve and to save lives. Earlier today, I joined with local public safety union leaders to announce the City of Chicago will be opening up additional hotel space for our first responders who are fighting COVID in order to provide them with a safe space to stay during this crisis. This involves the Hotel Essex, providing 274 rooms for our first responders. And thanks again to the Oxford Group for their incredible civic leadership in partnering with us in this effort. Meanwhile, in partnership with the governor and his team, as well as the Army Corps of Engineers and IEMA, we are diligently working to convert McCormick Place into an alternative care site with the goal of 3,000 beds in order to relieve the strain on our hospital resources. And we will continue to take additional proactive measures based upon our anticipated need, all of which builds on the measures we have been putting in place now for weeks, related to everything from food assistance, child care, small business support, housing, and much, much more. However, more is still needed. That is why, again, we are calling on Chicagoans to explore volunteer and employment opportunities during this crisis. Now is the time to step up, as so many of you have. If you want to help, we have a job for you. This especially goes for individuals with medical training. Doctors, nurses, assistants, hospital administrators, and the governor ran through the list. Everyone in the entire hospital ecosystem, we need you. Medical professionals can connect with Chicago Medical Reserve Corps. This is a network of both medical and non-medical professionals who volunteer their time to assist during emergencies like the one that we're in. To register, please visit illinoishelps.net. That's illinoishelps.net. And anyone interested in stepping up in any way can visit our website, chicago.gov/coronavirus. Our needs don't end with health care. We also need help with food assistance, child care, financial donations, and much more. There are groups like the Greater Chicago Food Depository, the United Way, Salvation Army, and many, many more who are really stepping up in this time of need, the YMCA and others. If you go to the website, you'll find ways to volunteer and help, whether as a volunteer or as an employee. And I want to say thanks to the folks who have been going into their own pockets to feed our healthcare workers and our first responders, and give them some choices while restaurants are on reduced service. We especially have a need on the third watch. That's the midnight shift. All your donations are much appreciated. For all this, the first step in combating COVID-19 is following the governor's stay-at-home order. Stay home, save lives, period. The fewer people who stay home, the longer this crisis will last, and candidly, the more people who will die. And the longer it will take us to recover. It's just the simple facts. Finally, I'd like to say a word in respect to our schools and city colleges during this extended order. Obviously, consistent with this extension, CPS schools will remain closed through April 30th. CPS will reach out to faculty and staff and families to provide further guidance. Also, as announced yesterday, the remote learning plans of both the Chicago Public Schools and city colleges will continue as planned to ensure our students won't be shortchanged on their education despite these unprecedented circumstances. Our remote learning plans will remain in effect throughout the duration of the stay-at-home order. And as I said yesterday, we will not allow this crisis to stand in the way of our children's future and their dreams. And I'd like to once again express my heartfelt gratitude to our city's educators for their work to get this new curriculum model off the ground and running in a short amount of time. And thanks, of course, to the lunchroom staff and others who are working so hard to make sure that our students are fed. With that, I'd now like to welcome Illinois' Director of Public Health, Dr. Ezike, to the podium. Doctor?
Thank you, ma'am. So we come before you each day to encourage you to continue the fight against this deadly disease. To arm you, we want to bring you data, facts, and science. Several scientific studies have shown that physical distancing, social distancing, works in reducing the number of people infected. Extending the stay-at-home order is key to reducing the spread of the virus and the number of people who become ill. As you know, those who are moderately ill may need medical care. And although those individuals may not require an ICU bed, may not require intubation and a ventilator, they will still need doctors and nurses. And the medical professionals who tend to them will still need the personal protective equipment to care for those who are moderately ill. We want to make sure that we have enough resources for those who are the sickest in order to reduce the overall number of people who are exposed and infected with COVID-19. We see that there are some hospitals that are reaching capacity of the number of ICU and ventilators. And we want to make sure that everyone who needs an ICU bed, everyone who needs a ventilator will get the care they need. And that's why it's so important that we flatten the curve. The concern is that our medical resources will be stretched to their limits. And so that's why staying at home will help us have the healthcare capacity we need. We are seeing for today that the number of cases in Illinois is 5,994, including 99 deaths. This is an increase of 937 cases from yesterday, and we've added 26 fatalities. We did know that these numbers would increase, and we did unfortunately know that there would be additional fatalities. And we also know that all the illness is not reflected in these numbers because of the limits of testing. But I do want to put these numbers in perspective and remind you that the majority of those that get infected do not suffer severe illness, do not require hospitalization. What we do need to pay attention to with these numbers is what they mean for our healthcare capacity. So we keep reminding of the need to flatten the curve. The most severely ill will need hospitalization, and we want to be able to provide that. We are prioritizing testing for those who are 65 years and older and those with the most severe symptoms. We also want to test those in the correctional facilities. We also want to test those in the nursing home and other long-term care facilities. By testing those with the most severe illness and those at the highest risk, we will hopefully see the number of cases and the number of deaths increase with early identification. Early data does show that the vast majority of people, we think up to 80%, will not need any severe or critical care. We all need to do our part by staying home in order to reduce the spread. To better understand the effects of this virus, IDPH recently sent a survey to COVID-19 cases and asked about their recovery. It was sent to people who tested positive who were at least 7 days after their positive test result. Of those that responded, 48% indicated that they had recovered. And as we get more responses, we hope to show you that with more time, even more have fully recovered. I also want to share an update on the death of the infant that was reported earlier. Health officials are talking with pediatricians, are talking with the family, are talking with the hospital, the medical examiner, to discuss the entire medical history, all the way to acquiring all of the immunization dates. The CDC is on board and is partnering with the teams as we try to provide further information. Please understand that this investigation is ongoing, and I thank everyone for their patience as these details do take time to collect. Our focus right now is preventing infection and the need for hospitalization, and the science has shown us that physical distancing will help. So please stay home. And as we get more information, more data, more science, we'll share with you. The CDC just recently put out new guidance in the last 24 hours saying that we should be concerned about people transmitting the virus even 24 or 48 hours before symptoms become. So that's even further evidence that we need to stay home. You can't eyeball someone and think you know if they're sick or not. Let's continue to do what we've been telling ourselves to do, washing our hands, staying home, covering our cough, cleaning frequently touched surfaces. Let's do it all for ourselves, for our family, and for our community. And now I will summarize these comments in Spanish. Venimos aquí cada día a dar ánimo a todos por seguir la lucha contra la epidemia. Para hacer esto, ustedes necesitan ciencia, los hechos y datos. Varios estudios científicos demuestran.
All right, everybody, Chicago is one of the major cities across the U.S. that does provide comments in Spanish when they hold the coronavirus news conferences. We're going to head on over to Connecticut now, though, where the governor is holding a news conference I have been recording since the beginning. It is still going on live, but I'll take you back to the beginning.
Always impress upon the feds in any way I can. Think about this virus as a region, not state by state. A little disturbing today to find out that the national strategic stockpile is now empty. We did get 50 ventilators, for which I'm very thankful, but for now, we are on our own, and for now, we are working our heart out, scouring the globe for PPE as best we can. And I got to tell you, as your governor, this breaks my heart. We've got doctors, nurses, bus drivers, cops, firemen, baggers at the grocery store and food bank, court marshals, juvenile detention facility, a lot of our frontline heroes. I'm asking everybody else to stay at home. These are the folks who are what we call essential workers, frontline, every day, going to work. And I feel like a general sending our troops in the battle without the protective gear that they deserve. They don't have the defenses, and they're doing everything they can to save you. And I am working on that every day with my heart. We talk a lot about all the rules and regulations and orders that we can implement to make sure that those of you who are not essential workers stay at home, stay at home, stay at home. Maybe put a picture of one of those nurses or other first responders on your door, just as you think about him or her as you're about to leave. Think about the fact that you're not just endangering yourself, but you're endangering her and your greater community. I can't tell you how urgent this is as we head into April, which will be the horrible month. I'll tell you a little bit about some other industries we've got that are operating different ways. Manufacturing, we've had good conversations with the manufacturers. Most of them are still open. You may be saying, why are they still open? Well, almost all of them are related in the healthcare or defense-related aerospace industries. Those aerospace defense are protected as critical industries, but we're working very closely with them and all the other smaller manufacturers that are in their supply chain. And trying to make sure that they follow the best practices. Everybody going into that factory floor, take your temperature, get fever tested, on the way in. Make sure that everybody that doesn't have to be there isn't there on the factory floor, so at least they can have good social distancing. Make sure that between shifts, and this is what the other manufacturers are doing, there's no overlap. And there's maybe an hour between shifts so you can really do the cleanup and antiseptics that you have to do. And frankly, at lunch, most people have closed down their cafeterias and people are going out to their car for lunch. These are the type of smart things that our manufacturers are doing, especially since they are still in operation by law, and we're doing everything we can to keep them safe. Transportation, I can tell you that not only is Metro North 95% less occupied, which is really good. I hope that the only people there are essential workers, like those first responders. The airports are 95% without passengers now. Cargo traffic continues to go up. I was sort of struck talking to our Department of Transportation today, and which is striking to me. We still continue to do some of our major transportation projects, some of which we're in process already. We spent a lot of time talking about transportation this year. It was interesting to me that now, with 30, 40% less traffic on most of those roads, we can close a lane or two. And what that means is we can do the construction faster at a lot less cost. So where possible, we're continuing to do those major construction projects, again, making sure that there's proper social distancing and only people who have to be there, actually are there. I'll tell you that as we think about our first responders and everything we can do to make their lives easier, we had our unified command call again today, and I was just struck by the fact that 211 call, that's the call people can call anytime they have questions. Increasingly, the number of questions related to daycare more than doubled in the last few days. And Beth Byer, our amazing Commissioner of Early Childhood, is now working with more daycare providers, and many are considering reopening again. And we're opening the funnel for who has access to daycare, opening the funnel in terms of who is a necessary first responder that we actually have to get there. Obviously, at the beginning, it was nurses and doctors, and we co-located next to those hospitals. And now it's folks in nursing home, it's police, fire, corrections officers. We desperately need people safe and able to go in and be responsible there. Food. We continue to have, incredible food insecurity issues. Salvation Army is setting up a variety of additional local sites, and we do need more volunteers, folks who can help deliver, folks who can help package, folks who can drop that lunch out at some senior's home who we definitely do not want going out for lunch, but to have that delivered. When it comes to the homeless and nursing homes and corrections, all those places where people do tend to be in close proximity, we're doing everything we can to decongest, get anybody who is COVID infected or even suspected of COVID. We got them self-quarantined. We have them in separate quarters. And that's just incredibly important to make sure that we don't have these congested areas become a petri dish. And yes, for the folks in corrections, we continue to release those who are the most nonviolent, and a special focus on those who are older, those who are most at risk, trying to find out where they would be most safe. If there's a place outside of the corrections facility, or is it a separate negative air place that they can be safest going forward. I'll just say that from the health insurance folks, we've had a very good feedback from them. We're going to be able to make some announcements. You'll be able to tell you very soon. But I have a high degree of confidence that anybody who has been distressed by COVID in any way, shape, or form, I know this is March 31st. I know this is a date of some anxiety because bills are due, and I have it on very good confidence that your health insurance and all other insurance will go forward with a grace period, assuming that this is a COVID-related delay that maybe you have here. And, with that, I'm going to tell you just briefly and introduce George Perez, our amazing Commissioner of Banking. Our banks have been just extraordinary partners for us during this incredibly complicated time. And obviously, people have mortgages, people are worried about evictions, people are worried about foreclosures. And I think George has some good news on how we're going to handle that.
Thank you, Governor. Early on in this situation, the governor made it clear to us that he wanted us to reach out to our respective industry and figure out ways how we could lessen the impact on our citizens. So I've been working with Bruce Adam, who's the president of the Connecticut Credit Union League, and Tom Mangello, who's the president of the Connecticut Bankers Association. And they both represent their industries, and we come up with a proposal, an initiative. And I want to thank both of them, because without their help this Saturday and Sunday, and before then and today, we would not be here today. And I'm happy to announce that we have an initiative that 62 financial institutions, credit unions, and banks have signed on to it. And we expect within another day or so, we'll have quite a few others they're going to join us. And they have not, only simply because we have not been able to connect with them, or there's still some questions that need to be answered, especially for the smaller size institutions. But I'm happy to announce that, you want me to go with some of the details, or you will do that? That as a result of this initiative, there will be a 90-day grace period for all mortgage payments that are related to COVID-19. So if you have a mortgage and you were a barbershop worker, restaurant worker, any worker, and you were laid off or furloughed, or your income has changed, you're to call your financial institution or your mortgage servicer and let them know that you have been impacted by COVID-19, and they will work with you to at least give you up to a 90-day grace period for now. There's also a commitment that for the next 60 days, there will be no foreclosures as a result of COVID-19. Again, all they will ask you is to attest that that's the case. They're not going to ask you for a doctor's note. They're not going to make it go through a lot of loops. All these institutions have also committed to making it an easy process. So most likely, the way it will be done is you go to their website, there will be several questions asked, you submit the form, and then someone will contact you. I will ask consumers who are hearing this, please don't, in the next minute, start calling those banks. They're not ready for those calls yet. Give us a day or two to be able to trickle down the instructions and the directions that those call centers are going to need to be able to service you quickly and with as minimum frustration as possible. What I want to assure you is that every one of those banks and credit unions are committed to help you and to work with you if you're a residential mortgage holder, as well as if you are a commercial customer. In addition to what I already stated, they will work with you in waiving fees related to late payments for mortgages, early CD withdrawals, and other fees associated as an impact of COVID-19. Last but not least, and there are other parts to this announcement, there'll be no credit score changes for accessing relief. In other words, your credit score would not be impacted because you were given a 30-day, 60-day, 90-day, or in some cases, if it was warranted, something different. They will not report that as bad credit. They will not report that as a non-payment.
Thank you, George. Tom, thank you. What you're doing and everybody you represent.
Well, thank you, Governor, and thank you, Commissioner. And I'd just like to say that this is another example of a public-private partnership, if you will, with the business community that your administration has reached out to the third time, if I remember correctly. So it obviously does work. So our banks are obviously deeply concerned about our customers and essentially reaching out to them, which they have already done, and also having their customers that may be impacted by COVID-19 reaching out back to their banks, whether it be their branch managers, whether it be their commercial lending representative, so that they know exactly what's going on with their situation. The goal is to essentially do an early triage, if you will, as George was talking about before. Don't wait. Essentially go right in and contact your institution, especially when this program is up and running in a couple of days.
Bruce?
Thank you, Governor. You know, these past couple of days has been an amazing amount of collaboration, and you know, I think our industry is built on collaboration. I think back to, you know, FDR signed the Federal Credit Union Act in 1934 to pull people out of hard times, and that's really our purpose. In some ways, we feel like we've been training for this our whole lives, and you know, for the past couple of weeks now, or few weeks, we've been modifying and doing all sorts of creative options for our borrowers, mortgages, non-mortgage loans, and we're really grateful for the opportunity to come together under your leadership and really give some good service to the residents of Connecticut. You know, an old slogan for credit unions is not for profit, not for charity, but for service. And we're here to do that today. Thanks.
If I can say one more thing. I want to emphasize that this is not government heavy-handed. The governor was clear he wanted relief for the consumers, but his preference was to do it in a collaborative way. And that's what we're talking about today. And I also want to assure all the consumers that your deposits are safe. If you have your deposits in a federally insured bank, well, not federally insured bank, but it's insured by the FDIC in case of a bank, or the NCUA in case of a credit union, they're safe. I would like to encourage you to be careful with a lot of different scams that are going out there, people trying to take your money, whether it is because of the $1,200 we're supposed to be getting or because they're trying to get you to buy gold. If you want to buy gold, it's because you think it's a good investment, not because the world's coming to an end. So I just want to encourage consumers to be careful during this time because we've got a lot of complaints about scams.
I'll just follow up. I know the note of desperation we hear, talking to many people, all the calls we get, and we've talked a lot about what we're doing in terms of health care, and I just wanted to give people a little bit more confidence that you've got, government's got your back, the banks are doing everything we can, no foreclosures, to be able to help you get through this. What we're trying to do with the health insurance companies, we get through this federal bridge which comes in, that covers you know, interest payments, mortgage payments, and health insurance payments. So doing everything we can to give you confidence that even though you don't know what tomorrow will bring, at least you know that we've got your back going forward, at least for the next 4 months when hopefully we'll be on the backside of this crisis. Any questions?
On the level of verification, you were mentioning, Commissioner, the level of verification, if you are actually a worker, you're a restaurant worker, whatever. In other words, maybe you got your mortgage 3 years ago, you switched jobs, you don't necessarily tell that to your bank. What is the level of verification? I call up, I say I'm a restaurant worker. Is it pretty simple and I'm going to get it, or how does that work?
It is my understanding we're going to mimic the CARE Act, which is we're going to ask you to attest that you've been impacted by COVID-19, meaning you were laid off and so forth. If there's a reason to doubt you or to think there's fraud, then they will ask for additional information. But we're not, you know, I mean, we're in a crisis, and we're not thinking people are going to simply try and call me naive, I guess, you know, but it's way too many people, too much work, so we're going to try to facilitate it for everybody.
It sounds like it's going to be easy, but I'm just asking how easy this is supposed to be.
It's, you know what, there's an old saying that devil's in the details, right? And since we've never been here before, we've never done something like this, some of those details are still being worked out. But what I can tell you, the goal is to make it as simple as possible. So it is the discussion we have had with several of the bankers and the two leaders of the association is we're going to ask people to attest to it. And unless we have reasons otherwise.
Governor, you said 16 new fatalities. Is that within a 24-hour span? Is that like a catch-up over a couple of days?
You want to talk about the change of methodology, Josh?
Sure. So the 16 is in the last 24 hours. We're actually including an additional 17 reported deaths in the total, which are catch-ups over the last 2 weeks of deaths that were reported to the Office of the Chief Medical Examiner that had not been captured by our Department of Public Health. So as we've gone through this, we've been constantly looking for ways to get the most up-to-date information. And so there's a additional 17. So the total we'll report today is 69, actually. But there are 16 deaths that actually occurred in the last 24 hours.
So total 69.
Correct.
Okay.
They will report. And again, that's 16 that occurred in the last 24 hours, and then 17 that are essentially catch-ups over the last 2 weeks that had not been reported to DPH.
And how many total were tested positive?
3128.
And then how many people have been tested? Are we still running behind on testing?
We're up to 15,600 tests.
We did 1,000 yesterday.
So the medical examiner, these were autopsies? How is he confirming them?
They're being reported into the Office of the Chief Medical Examiner.
Hospitals are reporting to the medical examiner. Governor, I'm sure you must watch Governor Cuomo. He was talking about a peak within 7 to 21 days. Is that about right for us or not at this point? He's talking about 5 different algorithms that they're looking at, and that's why he's got.
We're looking at the same algorithms. We see that same chart that goes up and down. We see how you can flatten it out. If you flatten it out, it goes a little bit longer. But I think it's pretty certain, according to every model that we've looked at, that this is going to keep going in an aggressive way for at least another 2 to 3 weeks.
Are you satisfied that the hospitals can handle it at this point?
I've been amazed by our hospitals. They expanded capacity, like I said yesterday, by 50%. They're working together as one unit now, not 26 different hospitals and different associations. You know, we've got very little capacity in Fairfield County. We've got a lot more capacity in the greater Hartford area. That may turn on its head in another month. So that's how we're trying to build capacity every day. Do we have enough? No.
Information on recoveries?
We don't. We're looking at ways that we could possibly track that, but this is another thing that would have to be manually tracked. There's no automated reporting from the hospitals about that, and as you know, a lot of people are self-recovering at home, and so there's not kind of instrumentation around that, so we don't have reporting on that now.
And what about nursing homes? I know that other states are reporting their nursing home numbers separately. Is there any information that the state is collecting and that they can give us regarding nursing homes?
Yes. In fact, we are including in our daily release and DPH reporting package some additional nursing home data today that you'll be able to review, but we are reporting that at this point in time, out of the 216 nursing homes that we have in the state of Connecticut, 30 currently have at least one confirmed case of COVID-19, so that's 14% of the total nursing home count in the state. 14% has at least one case. And you'll see some additional charts and graphs in there that we're adding some more data around that now.
Just following up on that, just to our north in Holyoke, there was a facility, the Soldiers Home. They had 11 veterans that died and several staff members that were impacted or affected by COVID. Can you just talk about maybe some of the measures being taken here, whether it be at nursing homes or the VAs here in the state, to make sure that we have some preventative measures in place?
Well, we were one of the first in the country and to say no visitation in the nursing homes, just because of the nature of the contagion, which could be bringing into the nursing home or taking out of the nursing home. Obviously now we are screening the nurses going into the nursing home, and as I said before, we now can quarantine folks that are tested or at least been in contact, either in that nursing home or we're finding other facilities where people can be quarantined separate from the major.
Regarding that, I know that obviously everybody supports the decision not to have family members visit nursing homes. Is there anything you can do? I'm hearing from family members who find it very difficult to get a hold of their loved one virtually or by the phone. Is there anything that you can do as part of your executive authority to make sure that this happens?
I certainly don't know why phone would be interrupted in any way, shape, or form, but I can certainly look into that. We can also look into ways we can maybe set up a FaceTime or other ways you can at least look your loved one in the face. I think that's a good idea, Christine. We should focus on that.
I apologize if you've already mentioned this previously, but you know, talk about this is coming to the first of the month here. Mortgages now have a grace period. Anything for renters?
I can tell you one thing about renters is there won't be any evictions. Court is down. So I think, again, renters who are doing their best, affected by COVID, just like somebody with a mortgage, they don't have to be worried about a foreclosure or an eviction. You know, beyond that, obviously we're working with the cities because the cities need landlords who pay the property tax. But I think I can give people pretty good confidence for the next 90 days they're going to stay in their home and they don't have to worry about that eviction.
One thing, back to the banks and the credit unions, you mentioned 62. What percentage of the banks are doing this, and what percentage of the credit unions are doing this?
Sure. We've subscribed about 40 credit unions in Connecticut already, and I expect more to come on. That represents about 650,000 credit union members in Connecticut, which is just over, or just around about 2/3 of the total approximately 1 million members in Connecticut. So it's been a pretty busy past couple of days.
From a banking perspective, as Bruce had indicated, we literally began this yesterday morning at probably about 8 o'clock in the morning. There's about 52 banks that do business in the state of Connecticut. Of those 52 banks since yesterday morning, we have half of those on board. We have 25 on board, and we expect more to essentially be making a decision to essentially join the program in the near future. So we're very happy about that. That was a very quick turnaround on behalf of the industry, especially because they are doing a lot of other things right now, especially meeting the needs of all their customers, once again, whether it be on the mortgage side or whether it be on the commercial side. In talking with a few of our bankers just over these last couple of days, we've got anywhere between 4 and 10% of their commercial customers that have essentially reached out to them already. And as the CARES Act and the payroll protection piece rolls out, we expect that to increase dramatically, but we're gearing up for it and hopefully can do the best we can for the most number of customers.
Tom, if there's anybody you want me to give a call to, let me know.
Thank you, Governor.
Is there an updated list that has these banks? Because I imagine a lot of people are just wondering, is my bank included in this?
We put a maintained list on the website of the Cuomo Bank. So if you go there in the next half hour, there will be the most up-to-date list, and that list will get updated on a regular basis, at least twice a day for the next few days, because we expect it to go up.
Could you go into a little bit further about the reporting of the fatals? Yesterday we were reporting there were 64 dead. Today there's 69 dead. Yes? So what happened to the others? How did the 16 turn up over the course of time?
Can you repeat your question? I didn't follow the first part of it.
I'm trying to figure out how you got the discrepancy on the reporting of the fatalities.
Okay, so
Now, yesterday, I believe we're reporting 64 dead yesterday.
36 yesterday.
36 yesterday. Oh, maybe, well, gee, numbers, there you go. Okay, can you explain what happened to the 16 people you found in the last 24 hours?
So if I understand the question correctly, so 16 people passed away in the last 24 hours as a result of COVID-19 across the state. In addition, we've added to our count today an additional 17 reported deaths that had not been reported to DPH previously, but that we were able to identify that had been reported to the Office of the Chief State Medical Examiner over the course of the last 2 weeks. So there's a catch-up there.
About unemployment checks. A lot of people have filed for unemployment, haven't heard back, they haven't received their checks lately. Obviously, there's a whole overload in that department. Can you just talk about the all-hands-on-deck approach you guys are taking and just kind of a message to people who might be waiting for their next check right now?
Yeah, I can tell you that now we have 100,000 claims. I'm saddened to report that there's a 5-week lag time. I'm heartened to report that everything is retroactive, so even if it's slow for us to get back to you, It's not because our heart's not there, it's because the technology is 40 years old, and we're loading in more folks every day to help catch up with that backlog. We're processing as fast as we can, but the load is going up. But it is retroactive, so you're not going to be foreclosing or losing any money. It will take us a little time to process it. We'll get it done. And hopefully that $1,200 check is, what, 10 days away from the feds? That'll help as well.
Did you start reporting the numbers, the unemployment numbers?
Yeah, I thought we were already, but if we're not, we will.
We're hearing from essential workers who are still going to work. They might be presumptive positive, but they just can't get that official diagnosis, and without that official diagnosis, they can't get sick time. What's your advice for those people who are still going to work, who might be feeling under the weather?
If you feel like you may have flu-like symptoms, you've got to stay home. That's been our dictate for months now. It's tough because we're running short of bus drivers. We're running short of folks to serve in the grocery store, not to mention frontline workers that are in hospitals and nursing homes. The good news is we had another close to 1,000 volunteers stepping in, saying they'll be able to help in the healthcare crisis. These are nurses and other folks. So we're trying to fill that as best we can, but if somebody's not feeling right, stay home.
Non-essential businesses, Governor Charlie Baker, who you know very well, is extending his order until May 4th. What is the latest on your time frame on these things, as far as extensions go?
I didn't know we had a time frame on it, but look, right now it's for the foreseeable future. Charlie likes May 4th. Let's start with that.
Mr. Governor, on essential services, and I know you're a gun control advocate, the Newtown Alliance and some of the other groups are still asking, more guns make children in the home, and they're stuck there now, less safe. Are you going to reconsider allowing gun stores to stay open as quote-unquote essential services?
As I said before, I am making every decision right now based on public health. You're right, I am a strong gun safety person. Right now, my focus is public health. And what I really was worried about were some of those gun stores where I saw pictures of crowds in and out, hanging around. That's why we said it's going to be by appointment only. And we've asked public safety, they've patrolled, and I think people are honoring that commitment.
Governor, I know that we didn't do so well with testing on the front end, and we're still playing a little bit of catch up on that. Are you thinking in the future about getting antibody tests to the state so that we can figure out who has had this and who can safely go back to work?
Yeah, my understanding, and Josh can fill in, we're already doing some sampling on that right now in our hospital system and getting the blood plasma in ways that we can check that antidote. And more importantly, we're talking to the company that's the leader in that 15-minute test and what that would mean if we could get access to some of that, what that would mean in terms of those first responders.
All right, everybody, since we are continuing to record this update in Connecticut, I'm going to take you out to Florida, where the Governor Ron DeSantis is speaking live. Thank you so much for watching News Now, whether on YouTube or on coronavirusnow.com.
From the beginning, that you're going to be safer at home, and we urge all Floridians age 65 plus and those with significant underlying medical conditions, to stay at home during this time where we're fighting the virus. Obviously, if you need to get medicine, food, what have you, but you're safer at home, and we want you to come out of this thing on the other side strong and intact. We've also been very focused on protecting nursing homes and assisted living facilities. We did impose a visitation restriction for all visitors to nursing homes. That is for their safety, given that we don't know who may be carrying the virus. Now, as you have the advent of some of this rapid testing, that does allow us to be able to test people before they go into a nursing home, not only staff, but you could have some family members as well. So that is all in progress, but right now, we got to keep those folks safe there. And so what the Agency for Healthcare Administration has done is they've made over 907 on-site visits and over 2,000 calls to long-term care facilities to evaluate adherence to infection prevention protocols. And so it's very, very important. If you look at the fatalities in the state of Florida, I think the average age is between 75 and 80 years old. And so the senior citizens are going to be safer at home. And then also, if you have an underlying condition, regardless of age, you're going to be safer at home as well. So please heed that guidance. Another priority for us has been to expand testing in the state of Florida. We started this process. There was really very little testing available. Everything had to be done through the CDC. That obviously was inadequate. And so over the last several weeks, it's been the state's one of the state's top priorities to expand testing in the state of Florida. And, I'm happy to report we are increasing testing at a very fast rate. Today's numbers, I think we're over 60,000 tests, and most of those are over the last 2.5 weeks. But I think it's also interesting to note as you look at the number of new cases that come down the pike in the various states. That obviously is an important thing to look at, and we obviously monitor that very closely in the state of Florida. But it's also interesting and important to look at the number of new cases against the number of negative test results that you've seen. And so these numbers that we have on the screen are from yesterday, just because we didn't have all the other states' updated numbers. Obviously, our numbers have changed for today, and you guys have seen that report. But if you look, Massachusetts and Florida had about the same number of positives, Massachusetts a little more, but Florida had, about 13,000 more negative test results. You go down and look at a state like Michigan that had more positives than Florida, but Florida had 50,000 negatives. Michigan only had 12,000 negatives. And I think you look at that. So we are now at the point where Florida, and then California is interesting because they have 7,400 positives, only 21,000 negatives. So we have more than twice as many negatives as California. I think part of the reason is they have about 50, 60,000 tests that are, quote, pending. But we have expanded testing dramatically in the state of Florida. I think if you don't count California's pending results, I think we're just behind Washington State and obviously the state of New York. If California dumps those pending tests, then they would be ahead of us. But from where we started to where we went, that's taken a lot of hard work, and a lot of it is because we've set up testing sites with the Florida National Guard in the lead, things like the site with Broward Memorial. You had 700-800 people going through those drive-through testing sites every day. Those are not easy to run. Most of them that have been done throughout the country have failed. We have the Guard working with the local communities, local hospital systems, and we've been able to get many more people tested as a result of that. We are opening today the Palm Beach testing site. So that's going to be in West Palm where the baseball facilities are for the Astros and the Nationals. And that is a facility that we think can be very high volume as well. So we're excited about that. Of course, we do have the Broward facility still running. We have the facility at the Marlins Park in Miami-Dade, have the drive-through facility at Hard Rock Stadium in Miami-Dade, and now we're surging supplies for the a testing site in Hialeah, and we're surging supplies for a testing site in South Miami-Dade. So those are going to be coming online very soon. We're also going to be pushing down supplies and assisting with an additional testing site in southern Palm Beach County, and we're looking forward to doing that. And as many of you know, there's been a site in Jacksonville up now for a while, it seems, Orange County in Central Florida, and then we have been supporting the drive-through site at Raymond James Stadium that Tampa is running. You have Tampa General, Baycare, some of those health systems involved. I think the city's involved. So we've been supporting that, and we're happy to do so. So if you look at, we're over 60,000 tests. We're doing thousands and thousands every day. We're going to have some new technology come online very soon. We think we can continue doing this. Why is that important? South Korea is usually pointed to the country that they just did a whole bunch of testing. They were able to figure out, where exactly the virus was spreading, focus on those areas, and then they were able to have more freedom of movement in the rest of society. Their testing rate They got, I think, a little bit better, but the key marker that people would put at is 1 test for every 200 people in the country. In the state of Florida, if we get over 100,000 tests done, that will be about 1 test for every 200 people in the state of Florida. And so we would be, obviously Florida's a lot smaller than South Korea population-wise, but we will be getting to that number, and that's something that we're really looking to do. And as you see, the number of tests per day that we've done has gone up dramatically, and we want to continue to doing that. And so I just want to thank the folks at the National Guard. I want to thank the hospitals. I want to thank the local governments who've partnered with us. This was really, we had to grab ourselves by the bootstraps. I mean, some of the other areas that have tested a lot, you got a lot of federal supplies that really flow freely there. I mean, we've gotten some help, but a lot of this we really had to do on our own. So I want to thank them for doing that. And I think that one of the reasons we've been able to get some data on the trends in places like Southeast Florida is because you've increased testing so much, and we're going to continue to do that. I think it's very, very important. With these tests, we're having now these rapid tests, and that is going to come online. First of all, we have the 45-minute test. That's been deployed in southern Florida and in northeast Florida, 45-minute rapid test. That's a perfect thing to do for healthcare workers, because if someone gets exposed, you can test them. If they're negative, then they don't have to necessarily self-isolate, and that's very, very important. We also expect that hospital systems very soon will be getting this 5-minute test from Abbott Laboratories. And so the way they're going to do it at Abbott is they're just going to send it to various hospital systems throughout the state of Florida, and then they'll continue to send them additional tests every week. So we anticipate each hospital system, we think, is going to get about 2,000 tests per hospital. So this is going to be spread out. So that's going to be a lot of additional testing, and the data that we're going to get back from that is going to be very quick, and that's really going to help us identify some of the things that are going on in the state of Florida. One of the things we're seeking, and we may ask one of the hospitals to help, is, an Abbott lab test is perfect to do some spot checking of these nursing homes or assisted living facilities. And if you're able to do that, you really don't even need to test everyone. If you test a representative sample, you can see whether there's anything there. And if you do see anything, then you test everyone. So I think that there's ways to do it which would really make sense. So I'm asking folks at the Department of Health, Emergency Management, to try to get some of those rapid tests so we can use them in nursing facilities and in assisted living facilities. And that will also be great to test the staff. I mean, the problem in the Broward situation was you had 6 staff going in there, and these were people that shouldn't have been allowed to go in there. Here, you can just test, and if you're fine, then you work. If you're not, then you can't go in there. So, but we're really happy that this is going to get turned around relatively quickly. So we anticipate this to start landing in Florida probably within the next week, and I think that this will be an absolute game changer. We also have we've got a lot of the hydroxychloroquine that's now been delivered to a lot of these hospitals, and again, the FDA just came out with the emergency approval. Look, this is kind of anecdotal, but you see more and more people using it. Bottom line is we just want physicians and patients to be able to have that as available, and if the physician thinks that that's something that's good, we want to be able to do, but we were really glad to work with Teva Pharmaceuticals on that. And I'll talk about the hospital space, but when you're talking about the hospital beds and PPE, stopping those elective surgeries, you've seen beds being added and you've seen PPE being conserved, and so that's a very, very important thing for our folks working in the healthcare industry. We have sent a lot of supplies. Now, we're fighting for this every day. It's really cutthroat in terms of these masks, and 3M will make a bunch of them, but then they'll give them to this district, and there's this whole kabuki game that goes on, but it's probably the number one logistical priority that we have is getting more PPE, but we've been able, fortunately, to allocate a huge number of masks, including almost 60,000 N95 masks to nursing homes, and then 140,000 procedure masks to nursing homes. We think that the staff needs to be wearing the mask if they're going to be around any of the elderly residents, and so we think that that's something that was good, and we hope that they'll be able to use that. But we're continuing to fight for more PPE. We've ordered, right off the bat, we ordered millions of masks, but you know, this stuff gets put around and there's a lot of tomfoolery going on, so we're continuing the fight on that. But all told, you're looking at about 600,000 N95 masks that have been delivered to various counties and hospital systems in the state of Florida. It's important, and we want to continue supporting any way we can. Southeast Florida. I think if you look at the numbers, they're obviously pretty stark in terms of, you got about 60% of the cases in the state of Florida that are in Southeast Florida, Miami-Dade, Broward, Palm Beach, Monroe, not as many, but they're part of the family too. We've been working with them from the start, working with the local mayors, working with some of the things they've been doing, and they've been doing a lot right at the beginning. Mayor Jimenez, folks in Broward and Palm Beach. Yesterday we got everyone on the same page to do the Safer at Home South Florida order. If you look at South Florida, you have the most densely populated part of the state. And the way the virus has kind of come into Florida is, I think, kind of three main ways. One is we have Floridians that travel internationally and then come back, and a lot of them didn't know that didn't really know much about the virus. It's not their fault. We have international travelers come to Florida, of course, and Miami is a big destination for that. And then you have Floridians that will go and spend time in New York City and come back, and then we have people from New York that come down to Florida. Of course, the exodus that we've seen, that we've been working on. But even before that, that's just a normal part of life in southern Florida, to have that back and forth with the New York City area. So that's kind of how this has been seeded in that part of the state. And if you look, certainly Broward and Dade and Palm Beach, you look at those numbers, so we're basically trying to do whatever we can to be able to slow down those numbers. I do think that Miami in particular, there was just such a dearth of testing there. I mean, I don't think anyone even tested positive in Miami until there were some more rural counties, I think, that even had someone test positive. And so, that was kind of a function of the criteria. CDC said you had to be from China, come from China or visit China. When in fact of the matter is, as we got into February, this thing was circulating. I think it was circulating during the Super Bowl. And so as you've been able to get more testing in Miami, you've been able to identify cases. Their rate of positive is a lot higher than statewide. Broward has pretty consistently been about 10% of all the symptomatic people test positive. Dade is much higher than that. I think they're between 15 and 20% of the people who have symptoms test positive. And so that's an indication, that you have a wider spread. So we're looking at that. We do, though, notice that the demographic spread in places like Miami skew a little younger than what we had seen. And I think actually all our information is starting to skew a little younger, because I think a lot of the seniors have heeded the message about being safer at home. When we first started this, we had very limited data, but I mean, it really skewed 65 and plus much more significantly than it does now. The Dade and Broward, or Dade in particular, you're starting to see more of that 25 to 55. And doesn't mean there can't be any complications there, but if you look at the fatalities, they're overwhelmingly 65 plus. So that's something else that we're looking at. But basically, all 4 Southeast Florida counties are united. We're supporting them. We've put a lot of supplies down there. We're going to continue to do that. And we're happy that we have the Palm Beach testing site there today. And we have been able to do a lot of the monitoring of people coming in from the New York City area. We've done thousands and thousands of those. Look, our hope is that they will, be safer at home, just like everybody else in Southeast Florida, and not potentially spread the virus. So it's very, very important that you do that. So we're going to keep working with the folks down in Southeast Florida. I know there's this issue with these cruise ships, and I've been in touch with the White House about it, the Coast Guard about it. The way to deal with this is to send medical attention to the ships, to be bringing people into the state of Florida. I think most of these are foreign nationals. that's using up some of our resources here that we need to have available for Floridians. And so, I've asked the White House to work on getting medical supplies there, and I think the cruise ship should be, responsible for helping facilitate that. But just to drop people off at the place where, we're having the highest number of cases right now, just doesn't make a whole lot of sense. I'll talk about the hospital. The hospital situation looks really good right now, but obviously, we're preparing for that to change, and it could change any given day. As most of you know, we've been testing a lot more and seeing that. So the hospital bed availability. So right at the beginning, protecting the seniors, expanding the testing, and then protecting the healthcare workforce, but then also supporting the healthcare system, and that is the capacity. I mean, the whole idea of flattening the curve is so the healthcare system can absorb the infections and the people that require medical attention. The virus kind of, it's eventually gonna do what it's gonna do, but if you can shift that and suppress it, then you're going to have the healthcare system be able to handle it. So we track on a daily basis the availability of beds. So you can see statewide, we're close to 37%. Dade, we're about 41%. In Broward, we're 45%. Of course, you look at the ICU beds as well on that. This is just something that we monitor every day. I think the stopping the elective surgeries has opened up more beds, and I think that you've had fewer complications from things like influenza, even though we're kind of at the end of that season. But I think over the last couple of weeks, because I do think people have changed how they interact with others. I don't think you see shaking hands as much. I think people do keep their distance. So you have seen a decline in that, and hopefully that portends well for the fight against COVID-19. As we know, the chance of having a negative outcome in terms of a hospitalization or a fatality dramatically increases the older you get. And regardless of age, almost every fatality has had a serious underlying health condition. And I asked the health department to start putting how many of the fatalities did have that, because I know a lot of people are asking about that. So we are working on that. And of the 77 deaths, you've had 23 that have been in Broward and Palm Beach counties. I've mentioned, I think before, this is a picture of the field, one of the field hospitals. We have one in Fort Lauderdale, one in Miami-Dade, and of course we have identified other buildings that if there is a need to do that and have excessive beds where people can go, you're going to be able to do that. We're also in touch with the Army Corps and FEMA about what's going on with, or having them look at, they've already been down here, they've looked at different things, and so if there's a need to have a surge capacity, we're going to have the Army Corps help us out as well. But as soon as this started, we kind of knew where this may be necessary, and so we procured it. This was not done by the federal government, it was all done by the state government, and I think that was good planning by Jared and the folks at DEM. And then just an update on the travel. We've screened between the state line cars and then the flights, about 8,600 people. And again, this is just people coming from the hot zones. They are, when this was flaring up in China, there was monitoring of anybody that came back to Florida who had been in China. When it flared up in Italy, monitored the people who came back from Italy as well. So New York City being the epicenter in the world, same situation, just trying to keep Floridians safe and urging and requiring actually those folks to self-isolate for 14 days. So I think that there's, and we're going to be watching the President's news conference today. I've been in touch with some of the task force members earlier. They're going to update, I think, these guidelines, and basically, we're going to follow the guidelines. And so, whatever they're recommending, we'll go ahead and do that. And so I may take their guidelines, kind of create a streamlined version of what we've already done, but put it in there, add whatever needs to be added, and then send that out. But I think that there's been a lot of Floridians who've been working very, very hard, and I just want to thank them. I want to thank all the folks on the front lines in the healthcare industry, at our hospitals, our nurses, our doctors. They're working hard, and I think they're doing a great job. So let's just keep fighting. But I think that if we all do our part, I think we're going to be able to. I think we'll be able to get through this. And with that, take some questions.
We're hearing that the number of nurses are either having their hours reduced or they're being furloughed as a result of the order on elective surgeries. There just aren't patients there. What guidance would you give hospitals given the fact that there may be a surge in visits as this disease continues?
Well, you're right. So look, I totally get it. I mean, and that's one of the problems with doing the elective surgery suspension is that the surgeries are typically out. A lot of these medical outfits, are able to keep the lights on. So it's unfortunate, but I think that we want to make sure that folks are going to be able to be there, in the event of a surge. And so if there are folks who can be brought to the fight, we have hired a lot of contract nurses through the Department of Emergency Management. If there's a need in the hospitals for more folks, we want people to be able to go in there and work. I think it's very, very important. When you look at the healthcare workers, the danger is, first of all, this stuff, when you're in these hospitals, you're going to get exposed one way or another. Hopefully you don't get infected, but it's really difficult to do your job even with the PPE. I mean, it's just tough. So there's going to be times when people get exposed. If you have a quick test, that's great. If you don't have that, then all the contacts have to self-isolate. You can lose a lot of the staff, and that's a very, very difficult thing. So anybody who would be willing to pitch in, either on a volunteer or contract basis, I think that they should do so. We have brought in a lot of contract folks, but if there's a need for more, we'll certainly do more.
Yeah, Governor, a scientist sent by the White House spoke with Surgeon General Rickes yesterday advising Florida shutdown. Is the Surgeon General still, or is he recommending to you that the state not shut down?
Who recommended that?
That was a scientist sent by the White House. I don't have his name in front of me. Yeah, that's it.
Who? So I'm in contact with them, and basically, I've said, are you guys recommending this? The task force has not recommended that to me. If they do, obviously that would be something that would carry a lot of weight with me. We have done, really, and this has been going on for 2 weeks because, we're working with the Southeast Florida counties. There's not really any more you can do in Southeast Florida. You just got to kind of stay the course at this point. Some of the other areas, it's just a different situation. We're a big, diverse state. If you look at New York State, obviously New York City, surrounding areas, some of the other places, they're just in a different situation. But I look forward to the guidelines. We're obviously going to take whatever they say, and we're going to implement that in Florida. And if any of those task force folks, tell me that that we should do X, Y, or Z, of course we're going to consider it. But nobody has said that to me thus far. Well, first of all, we've gone through the testing numbers. I think they speak for themselves in terms of we're over 60,000 tests. We're doing thousands and thousands of tests a day. If we get over 100,000, given our population, that'll be about 1 in 200 people, which was considered the gold standard with South Korea. It's been a #1 priority for us. And the idea that there wasn't testing originally wasn't because of us. If I had the ability to do it, we would have done it. We were in kind of a different environment with the CDC regulations and what they wanted to do. We've broke through that, and we are testing, and we're going to continue to do it. We've set up probably more drive-through sites than just about anybody. Some of these sites are putting through 700, 800 people a day. And turning this stuff around. So we're going to continue to do it for sure. But part of the reason why, because we've tested so much, that's part of the reason we've been able to identify these things. I mean, you look at some of these other states, Michigan, they had more positives than us. They only had 12,000 negative. We had 50,000 negative based on yesterday's numbers. So as you test more, you're going to identify more. And I've talked about Dade and kind of how we're viewing that. The Palm Beach site, I think, is going to be very important. Palm Beach has had testing, but I think they need more. So we thought that that was a priority to send that to them.
Governor, if I can follow up on what Laurie said, it seems like you're saying that you're waiting for a signal from the task force, that you're really waiting for them to make a recommendation.
No, I'm not saying that. I'm just saying, we're kind of going, he's asked, has anyone recommended to me and an official, and it's, one thing for like a talking head or someone to do, but it's, someone in the official thing. So we'll, anytime, someone in this process, says something, I mean, I obviously consider it. I mean, I think you got to.
Governor, when you've been speaking about priorities, you said very little yet about the unemployment compensation system, and today there was another call for a statewide order for you to issue to ban evictions in this state. What about the economic upheaval?
Well, we've been talking about the unemployment a lot. I mean, as soon as this started happening, I told Ken Lawson, Department of Economic Opportunity, expand the capabilities. He's been working to hire as many people to help process claims. We knew that this was going to be something that was going to be really, really bad. It's going to hit Florida especially bad because, I mean, Disney World is closed. All these things are closed, and that's going to throw a lot of people into upheaval. But that's something that I consider in all of this, you know, because some of these things, when businesses are closing, there's going to be some parts of the state where if it closes for a month, it just ain't coming back. And it's going to be very difficult for a lot of people. So I've been mindful of the second and third order effects of some of these things, which is why I've tried to tailor the approach to see, you know, where the fight was in terms of, you know, the virus had taken hold, where it was really spreading throughout the community, but trying not to be as ham-handed, because I just feared that, you know, if you do that in an area that already has a lot of tools, has the ability to test, has all these other really stringent mitigation things that we have statewide. I mean, that's never been done, you know, in modern Florida history before. So those are things. So I think it's a huge, huge problem. We're going to work as fast as we can on it, but it is not going to be something that is going to happen where we're going to be able to field and process these things overnight, just simply because of the magnitude of it. It is orders of magnitude above what the financial crisis did, and that obviously hurt the state a lot because you had the housing bubble collapse. You had a lot of problems here in the state of Florida. One of the things I am working on is, you notice how the state is quiet. I mean, you look at the roads. There's just not a lot going on right now, and it's understandable. But given that the traffic is down and everything, you know, I'm going to be looking at accelerating some of these infrastructure projects, because when you're doing those on busy roads, it causes a lot of problems. Well, when those roads are no longer busy, if that's going to be the case for the next month, then we're going to need to make use of that time. And I think a lot of people will be here. We're going to do the unemployment system for sure. I mean, we want to be able to get that out. This bill that just passed, we're scrutinizing that, and obviously want to be able to assist in anything that's flowing there. I authorize for the small business folks who are either out of business or are in really tough shape, bridge loans. I've been working with Senator Rubio on the small business program that they did in the bill, which I think will benefit a lot of Floridians. Those regulations are being written now. On Friday, I think they're going to be done on Friday. I mean, there's a desire to turn that around quickly, and if they do that, we definitely want to get that information out to people so that they can apply. I think that'll be much more effective than a lot of government programs, because they're going to be able to go to the private sector, get the loan, federal government will back the loan, and a lot of these loans are just going to be forgiven, so that'll give people the ability to get through, you know, a tough period.
We've been trying to confirm a tip, whether it's true or not, I don't know, but that thousands of tests in North Florida got screwed up and had to be redone. Are you aware of any problems with testing in the states that are being made?
Where in North Florida? At the Duval testing site?
Leon County.
Okay, I'm not aware of it. I know Leon County they did their own site early on. That was something that we were glad to see, but it wasn't anything that we were necessarily involved with, so I just can't confirm that.
Are you hearing any problems anywhere else around this?
I mean, I think the biggest problems is, you know, you have the tests people go through, they gather up all these tests, and then they send it to a commercial lab, and there's just a nationwide crush. I mean, we went from, if you look at how many tests had been done by March 1st in this country, I bet you it wasn't even 100,000 tests. Now we just hit 1 million tests. Well, there's only a couple labs that do this, and so everyone around the country is sending it to just a handful of commercial laboratories, and what happens is you go through, you wait, and it's not a 24-hour turnaround. It's not a 48-hour, which is, well, I think their goal was 48 hours. So sometimes it'll take longer, and that's a problem. We do, with these instant tests, that's going to alleviate that, and I think that that'll be a wonderful thing. So we want to get as many of those instant tests as we can. We now are able, I mean, we've pushed out supplies for the traditional drive-through testing. We have the ability to do tens of thousands more of those. As soon as we get the Abbott test, now that'll be mostly done through the hospitals, but that'll really be a game changer, and so we're looking forward to that.
Is there anything your organization's doing to ensure?
If they need supplies, I mean, they should talk to, I'll tell General Lynch to talk to Jared at DEM. I mean, we do have the ability to provide some protective equipment for sure, and there are tests available. I mean, until we get the rapid test, I can't guarantee you're gonna get it turned around immediately, but there are tests available, and we've not only pushed out the test to all these sites, we're replenishing all the county health departments as well.
Governor, what is your message for those that are, state leaders held virtual press conference this morning asking for a statewide eviction moratorium? What is your message for those that are coming up short for their rent?
So we're looking at that. I know the president had talked about doing it, so we're trying to see what they did federally. Obviously, this is you're not going to be able to rent out a place right now, so I think it makes sense. So we're looking at it and see what we see what we have to do. So here's the thing, I don't have an enforcement arm here. Anything has got to be done by the locals anyway, so I could say this or that. I mean, the Southeast Florida folks asked me to do, to close their beaches, so we did in one of our earlier orders. I was flying out of Miami yesterday, looking at the coast. Guess what? Closed beach. Were there people out there? You damn right there were. So it's just like a water balloon. Restrictions here, people go, you can do this, you got to do this. So there's a group of people that are going to just kind of pop around, and it's really up to the locals to deal with them one way or another. So yeah, I think our guidance is no groups of 10 or more. Follow what the CDC said. I think that's the best way to be safe, and I think if people do that, they're good. But I mean, you see this in New York City. Huge crowds that they're doing, and they had greeted the ship. There were hundreds of people there. When California did their stay-at-home, Southern California, they're just packing on the beaches. So that's just the reality that we're dealing with, that not everybody believes that they need to, to govern themselves accordingly. But yeah, I would urge everybody to just take a step back and realize that, when we get on the other side of this, there's going to be times to have a party, a big party in someone's house, or do this or that. Now's the time to avoid crowds, take care of yourself, take the social distancing seriously, and I think if you do that, then we're going to be able to get back to normal much quicker. If you're disregarding that, but the bottom line is you are going to have people who are going to be doing this. We've seen that in every state in the country. We're a very big state. As much as I don't want to see that, and I know the locals are going to have to just police as best they can, but I think that we really are focused on getting all this stuff to people, testing, do all that, because that will make a difference, and it's just unfortunate. But I think no matter what you do, you're going to have a class of folks who just are going to do whatever the hell they want to.
From people who live north of the 4 stay-at-home counties, worried that those folks will do what the New Yorkers did, move north and move up places where it's safe.
So here's the deal. I mean, and so we'll look at that. I think it's a legitimate concern. But I mean, everything's pretty much closed. I mean, it's like there's not like there's anything to do. And so, but I do understand people just kind of want an outlet. They want to do this. So we'll look at that. We'll see how it's going. But I would say this. Those counties have been stay-at-home basically anyways. I kind of came in and just made them all one unit just so everyone was on the same page. And I'm not sure how much that had happened or not, but at the end of the day, it's I just think people need to be responsible. There's not a whole lot right now. I mean, there's certain, you can go to work and obviously in certain industries, very important you do that. But other than that, there's just really not a whole lot going on. So people should just kind of chill out and stay around the house as much as they can. And it doesn't mean like, you can't go for a walk or do some things, just get some fresh air. But in terms of being social right now, this is just not the time to have, any big social gatherings or doing anything like that. And I hope that people will respect it. I do think that there have been enough people in Florida who've just taken this thing seriously, in terms of their hygiene, in terms of how they keep their distance and do that. I do think you've seen a change in the past couple weeks, and we'll see how that impacts this going forward. And I think that that does really, really make a difference. And I really appreciate, because from the very beginning of this, we had enough information to see how the virus affected elderly or people who were frail. And, our stay at home, if you're 65 or plus, if you have a serious medical condition, doing that really makes a difference. If those folks continue to do that, I think many of them are. I think many of them are being very, very careful, which is the right thing to do. I mean, if they do that, then we're going to be in a situation we will be able to get through this. And so those folks, thank you for what you're doing, because I think it's made a very big difference. And so we're going to have an announcement tomorrow on the infrastructure, but I think now's a golden time. If we're going to be kind of in a down state for the next 2 to 4 weeks or whatever, however long the guidelines go for, that is the perfect time to really accelerate on some of these busy roads. There's not going to be any traffic jams. So we're going to identify some projects and hopefully be able to make a big difference. Thank you.
Is Dr. Ripke's advising you not to shut down the state?
All right, guys, we are still waiting for President Donald Trump and his coronavirus task force team to come out, give their daily briefing here. Just wanted to make sure everyone sees that note that we do have more than 180,000 cases of coronavirus here across the United States. Here's just a quick look at that interactive map. Thanks to Johns Hopkins University. As you can see, 181,099 cases have been confirmed of coronavirus here in the United States. Task force briefing is supposed to be underway here in just a few minutes, but until then, let's just play a little bit of Governor Newsom. He was speaking a little bit earlier about coronavirus in California, so we'll listen into that. And then, of course, as soon as we see President Trump and his team step out, we'll take that live.
People that are retirees, people that are in the profession but haven't finished their licensing requirements, be it nursing schools or medical schools. Remarkably, over 25,000 people already have filled out applications on our healthcorps.ca.gov website. Over 25 licensed Californians, phlebotomists, radiologists, EMTs, doctors, nurses. A remarkable, remarkable spirit and a remarkable number of individuals that stepped up and are willing to step in to meet COVID-19 head on. So I want to just begin my comments by thanking all 25,000 and those of you that are out there that have the kind of expertise, that may have retired recently or are looking to get their license renewed. Please check out the healthcorps.ca.gov website
and contribute your time in a compensated manner to meet this moment. We're also getting a lot of questions at this moment about masks, not just N95 masks, not just surgical masks, not just masks for our frontline employees, particularly our healthcare professionals, but people that are in the grocery stores wondering if they should have a mask, people walking the streets, walking their dog, going to do essential business in the state of California, whether it's appropriate for them, whether it's advisable for them to have face coverings. We've been processing this over the course of the last number of days. There's a number of viral videos that are filling up my inbox. I imagine many of you watching as well, Czechoslovakia and other parts of the globe that have moved aggressively to advance protocols on face masks or other kinds of face shields and the like. We have a team that is considering guidance in this space to make recommendations whether or not we think this is appropriate. But let me caution on this topic a number of things. We are in real need of traditionally, surgical masks and these N95 masks. We are out there sourcing them from all around the globe. We have distributed some 32.4 million N95 masks to date, 32.4 million N95 masks, but we have ordered over 100 million of these masks. We need 100+ million N95 masks just to meet the needs within our healthcare delivery system. The concern we have when we talk about face coverings in masks is people run to get the N95s or they run to get the surgical masks, of which we are procuring tens of millions of surgical masks at the same time. And so we want to be cautious in this space. We want to be guided by science, and I'll just say this respectfully, science is a bit incomplete in this space. A lot of people are promoting face coverings and masks. Others caution that it is not a substitute for physical distancing, which it is not, and that it could create a sense that it is and may reduce the protocols that have worked so effectively so far here in the state of California. But know that we are looking to put out guidance on this. We'll put out our recommendations in short order as it relates to face coverings, and those recommendations will include the principal obligation we all have to continue our physical distancing, our social distancing, to wash our hands, and if we are putting face coverings on, we'll lay out guidelines in specific terms of what that means and what it doesn't mean. The last thing we want are people putting on coverings and moving them in their hands, not washing their hands, and potentially creating additional issues, people getting the wrong kind of impression that somehow now they're absolutely immune from contracting the virus and the like. But I know that this is becoming a major issue all across the United States. CDC has implied they'll be putting out some guidelines. I know the President himself and others have made reference to the same. We get this question all the time. When you go to a grocery store, people are trying to practice appropriate physical distancing. You feel like you're not necessarily capable of doing that in a short queue. The appropriateness of having these masks or a version of face covering. We recognize that anxiety, and we want to meet that in terms of recommending specific strategies. And so expect in the next 24 or so hours that the state of California will put out more prescriptive guidelines in that space. We also are very proud here in California. We had incredible leadership that is demonstrable in the state by Cesar Chavez. That leadership was recognized formally as this day is every year Cesar Chavez Day. In the spirit of contribution, the spirit of service, in the spirit of meeting this moment, we are also announcing an effort to do more and do better to protect our seniors in the state of California. We have 5.3 million Californians that are 65 years and older. And we've been doing some remarkable things at the local level to check in on our seniors, wellness checks to make sure they're getting their medications, making sure they're getting their prescriptions. But we need to step things up significantly, and that's what we are announcing here today, a statewide initiative, working with our partners at the AARP, working with our partners at Alzheimer's, American Lung Association, Cancer Association, Heart Association, working with our local local partners, our CERT teams that are part of our mutual aid program, traditionally utilized in preparation for our wildfire seasons, our Listos program, which we rolled out a few months ago to do the same. We're now reconstituting all of those programs and building capacity and partnership to significantly increase our connectivity to our seniors, to check in not just for wellness checks related to food and medicine, but the deep anxiety people are feeling being isolated at home, and the loneliness people are feeling at home, not connected to the outside world, anxious about their life and their loved one's life. And so neighbor by neighbor, we're asking people to make 5 calls. We've worked in social media platforms next door to do just that in 22,000 neighborhoods across the state. We've already connected through that platform just shy of 8 million individuals, but we have to go deeper and we have to do more. And we have to do it in a way that not only just checks in on someone to see how they're feeling, but be able to deliver something on the back end, not just a meal or medical supplies. And that's why we've created a hotline for people across the state that will guide them to more substantively deliver on the needs of the individual they're contacting. And that site has a following number: 833-544-2374. 833-544-2374. That hotline will allow individuals to be able to get questions they may have answered in ways that they can individually participate in helping support this moment in the spirit of civic contribution, in the spirit of the commonwealth, in the spirit that defines this moment, that we're all bound, as Dr. King said, bound together by a web of mutuality. And that commonwealth, it is incumbent upon us to check in on the greatest generation. People have brought us the world's most vibrant middle class, and obviously have done so much for all of us. We have a unique obligation to do more for them. But in that spirit, to be able to do more, we need not just that one point of contact, that one hotline. We need to be able to drill down in a more substantive way. And so we've partnered with our 211 system. Our 211 system is an incredible system in the state of California that connects people to real services in real time. So if a loved one or a neighbor or a stranger is in need, and they need something more than just nice words and just a check-in, but need specific services, we've partnered now with 211 to provide those services at the local level all throughout the state of California. I'm going to have a representative here in a moment from 211 speak more about their robust system and what it provides. But I think this is a real opportunity for Californians to check in on the most vulnerable Californians and do so in a way that only Californians can. We'll elevate in that context the spirit, sense of pride that I think we all have at this moment. But let's do so in a way that's meaningful and substantive. And in that stead, I want to ask Richard to come up, who runs the local 211 system up here in Sacramento, to talk about the substance behind what that call center and those three numbers, 211, truly represent and will represent to potentially millions of Californians if we avail and take advantage of that system. Richard?
Thank you, Governor, and thank you to your teams also for the leadership that you're providing in these unprecedented times. I'm the board chair of 211 California and the local operator of 211 Sacramento. And 211 is really a 3-digit dial that makes it easy for our community members to get services at a very local level. Our call centers are staffed 24 hours a day, 365 days a year, and they're trained professionals on the other end of that line that will be there to assist you in doing some case management and getting you to the most fundamental needs. And together, we can work together as a community to start building those resources in those databases to ensure that the community members are getting access to services. Our call specialists are all trained in AIRS taxonomy, which means that they can help sort of provide guidance and determine what those unmet needs are. The 211s are operated by local nonprofits, and we're excited to be part of this program with the state, and we look forward to serving everybody soon.
Thank you, Richard. And I really encourage people, check in on your neighbors. make those phone calls, not just loved ones. Check in on strangers. People ask every day, what more can I do? Let's activate this kind of civic contribution. Let's activate this kind of resolve in real time in the spirit of Cesar Chavez, in the spirit of service, in the spirit of real contribution to help meet this moment. Let me thank our entire team for putting together this comprehensive overlay to really increase connections and increase our obligation to our seniors throughout the state of California. Let me as well just update all of you on the latest numbers in the state as it relates to the number of positives, 6,932, number of deaths, tragically 150 in the state of California. The number of hospitalized individuals with COVID-19 and the number of people on ICUs. We have 1,617 people currently hospitalized with COVID-19, and we have 657 individuals that are in the ICU. Those numbers represent a 17% increase in the total number of positives in the state. The number of hospitalized represents a 13% increase over yesterday, and a 10% increase in the terms of the number of ICU patients in the state versus yesterday. I should note, if you roll a 5-day average, again, we have seen more than a doubling the number of people hospitalized in the state over the last 5 days, and now more than triple the number of people in our ICUs, reinforcing the importance of preparation in meeting this moment. In terms of the preparation, I mentioned the incredible response yesterday. Again, 25,000 people strong through healthcorps.ca.gov. Again, licensed individuals. These weren't just people randomly checking in and welcoming themselves to a website and looking at it. These are people filled out forms with their specific license number, and they're ready to contribute. And we're triaging every single one of those individuals and looking at the geographic distribution so we can meet the moment, because we recognize in California we're many parts but one body, and different parts of the state have different needs. And so we're looking at the geographic disbursement of the individuals that are willing to participate in making sure that we are appropriating our surge capacity from a bottom-up perspective. By the way, I just want to thank again Facebook for their $25 million contribution.
All right, guys, just a heads up, we have gotten a notice that we are less than 2 minutes away from the president and his task force team stepping out here at the White House.
Rotation before.
Thank you very much, everyone. Our country is in the midst of a great national trial, unlike any we have ever faced before. You all see it. You see it probably better than most. We're at war with a deadly virus. Success in this fight will require the full, absolute measure of our collective strength, love, and devotion. Very important. Each of us has the power, through our own choices and actions, to save American lives and rescue the most vulnerable among us. That's why we really have to do what we all know is right. Every citizen is being called upon to make sacrifices. Every business is being asked to fulfill its patriotic duty. Every community is making fundamental changes to how we live, work, and interact each and every day. And I wouldn't be surprised to see this going on long into the future when this virus is gone and defeated. Some of the things we're doing now will be very good practice for the future, including for not getting the flu, which is very devastating also. So some of what we're learning now will live on into the future. I really believe that. Shaking hands or not shaking hands, washing hands all the time, staying a little apart. 15 days ago, we published our nationwide guidelines to slow the spread of the virus. On Sunday, I announced that this campaign will be extended until April 30th. In a few moments, Dr. Birx will explain the data that formed the basis for our decision to extend the guidelines, and Dr. Fauci will explain why it's absolutely critical for the American people to follow the guidelines for the next 30 days. It's a matter of life and death, frankly. It's a matter of life and death. I know our citizens will rise to the occasion, and they already have sacrificed a lot. We had the greatest economy in the history of our country. We had the greatest economy in the world. We had the best unemployment numbers and employment numbers that we've ever had by far. And in one instant, we said, we have no choice but to close it up. Just as Americans have always done, they will do a job like few have seen before, and they're proud to do it, and I see that. There's a great pride going on right now. Before we hear from our experts, we have a few other announcements today. The Treasury Department and Small Business Administration announced further details on the Paycheck Protection Program, which was made possible by the $2 trillion relief bill I signed into law last week. Nearly $350 billion in loans will soon be available through lending partners to help small businesses meet payroll and other expenses for up to 2 months. These loans will be forgiven as long as businesses keep paying their workers. This includes sole proprietors and independent contractors. Applications will be accepted starting this Friday, April 3rd. So on Friday, April 3rd, that's when it begins. Earlier today, I spoke with leading internet and phone providers who are doing a tremendous job of keeping our internet and lines of communication flowing under very strongly increased strain. The business is more than anybody's seen before because everyone's inside. They're all making calls. Among the leaders I spoke to were Hans Vestberg of Verizon Communications, Randall Stevenson of AT&T, Mike Sievert of T-Mobile, Thomas Rutledge of Charter Communications, Brian Roberts of Comcast, John Malone of Liberty Media, Dexter Goy of Altice, Michael Combs of Sprint, and Araya Borkoff of LionTree. Also, Pat Esser of Cox Communications and Jeffrey Story of CenturyLink. They're doing an incredible job. If you look at other continents, if you look at Europe, they went a different route than we did, and much different route. We were talking about that just a little while ago. And they're having tremendous problems. Other countries are having problems. Other continents are having problems. But with business at a level that nobody's seen it before on the internet, it's holding up incredibly well. And they expect that to continue no matter what happened. And no matter how much more it gains, which if it can gain more than it already is, I don't know, because they're setting records. Let me also update you on the distribution of urgently needed resources and supplies. And we have a lot of numbers. I'm going to let Mike Pence speak to that in a little while. But we're giving massive amounts of medical equipment and supplies to the 50 states. We also are holding back quite a bit. We have almost 10,000 ventilators that we have ready to go. We have to hold them back because the surge is coming, and it's coming pretty strong. And we want to be able to immediately move it into place without going and taking it. So we're ready to go, and we've also distributed. I just spoke with Governor of Michigan, had a great conversation, and we sent a large number of ventilators to Michigan. We're sending them to Louisiana. We sent additional ventilators to New York, additional ventilators to New Jersey. And I will say, in New York, FEMA is supplying 250 ambulances and 500 EMTs to help respond to the increasing caseload. That's a lot of ambulances. In California, the Army Corps of Engineers is developing 8 facilities to expand hospital capacity up to 50,000 beds, 50,000. And had a great conversation last night with Gavin Newsom. He's doing a really good job. We're in constant communications. The USNS Mercy hospital ship is now operational. It's in Los Angeles and receiving patients. And in New York, as you know, the Comfort, everybody watched that. It's in place and will be in a very short while receiving large numbers of patients, over 1,000 rooms and 12 operating rooms. FEMA has also provided 100 travel trailers to assist with housing needs, and we're ordering hundreds more. In Michigan, FEMA will soon deliver, in addition to the ventilators, 250-bed field hospital, and Army Corps of Engineers is evaluating locations to build alternate care facilities. So we're doing a field hospital in Michigan of 250 beds, and we may be doubling it up soon, depending on the need. They're doing a good job with beds in Michigan, but they may need more than the 250. So FEMA and the Army Corps of Engineers are prepared to go there quickly and get it done. In Louisiana, we're delivering 2 field hospitals to provide 500 new hospital beds. I've been talking with the governor, John Bell Edwards, and the Army Corps of Engineers has been really doing incredible work, establishing 3,000-bed alternate care site at the New Orleans Convention Center, which will be operational, believe it or not, this week. So we're doing a 3,000-bed alternate care site, and we're also doing a 500-bed new hospital. And that's in Louisiana, which really got hit. It started off very late, and it was looking good, and then all of a sudden it just reared up, came from nowhere. In addition to the supplies we're delivering, we're also giving hospitals the flexibility to use new facilities, including surgical care centers, to care for hospital patients who are not infected. For example, I know that many expectant mothers are understandably concerned about exposing their newborn babies to the virus, and they should be. With our action yesterday, hospitals now have the authority to create special areas for mothers to deliver their babies in a very safe and healthy environment, totally separate. Over the past 2 months, the U.S. State Department has organized one of the largest and most complex international evacuation operations in American history. Mike Pompeo has been working round the clock, along with Ambassador O'Brien. Since January 29th, we have successfully repatriated over 25,000 Americans from more than 50 countries where they were literally stuck, in some cases locked in. And I salute the incredible public servants at the Department of State, as well as their counterparts at DHS and HHS, who have played such an important role in doing this. You probably read about the young people in Peru and young people in Brazil, and they were absolutely stuck, and we got them out. Got them. Almost everybody is out now, back home with their parents, their wives, their husbands. I want every American to be prepared for the hard days that lie ahead. We're going to go through a very tough 2 weeks. And then hopefully, as the experts are predicting, as I think a lot of us are predicting after having studied it so hard, you're going to start seeing some real light at the end of the tunnel. But this is going to be a very painful, very, very painful 2 weeks. When you look and see at night the kind of death that's been caused by this invisible enemy, it's incredible. I was watching last night Governor Murphy of New Jersey say 29 people died today, meaning yesterday, and others talking about numbers far greater. But you get to know a state. I know New Jersey so well, and you hear 29 people, and hundreds in other locations, hundreds in other states. And this is going to be a rough 2-week period. As a nation, we face a difficult few weeks as we approach that really important day when we're going to see things get better all of a sudden. And it's going to be like a burst of light, I really think, and I hope. Our strength will be tested and our endurance will be tried. But America will answer with love and courage and ironclad resolve. This is the time for all Americans to come together and do our part. I appreciate a lot of the media. We've had a lot of really good things said. I think only good things can be said when you look at the job that's been done. I just spoke with Franklin Graham, who's an extraordinary person. And Samaritan's Purse has been, like so many others, just been amazing and so fast. They did it so fast. He's been doing that for a long time, but I think people are really seeing what they have done. Franklin Graham, very special family. As we send plane loads of masks and gloves and supplies to the communities battling the plague, and that's what it is. This is a plague. We also send our prayers. We pray for the doctors and the nurses, for the paramedics and the truck drivers and the police officers and the sanitation workers, and above all, the people fighting for their lives in New York and all across our land. I watched as doctors and nurses went into a certain hospital in Elmhurst this morning. I know Elmhurst, Queens. I grew up right next to it. I know the hospital very well. Been seeing it all my life, my young life. And I will tell you that to see the scenes of trailers out there and what they're doing with those trailers, they're freezers, and nobody can even believe it. And I spoke to some of my friends. They can't believe what they're seeing. And I watched the doctors and the nurses walking into that hospital this morning. It's like military people going into battle, going into war. The bravery is incredible, and I just have to take my hat. I would take my hat. If I were wearing a hat, I'd rip that hat off so fast, and I would say, you people are just incredible. They really are. They're very brave. They're going in, and they don't know you have lots of things flying around in the air. You don't know what you're touching. Is it safe? And you also see where you have friends that go into the hospital and you say, how is he doing 2 days later? And they say, sir, he's unconscious or he's in a coma. So things are happening that we've never seen before in this country. And with all of that being said, the country's come together like I've never seen it before. And we will prevail, we will win, and hopefully it will be in a relatively short period of time. With that, I'd like to ask Dr. Birx to come up and show you some of the latest, just the data that has been, I think, brilliantly put together. And right after that, I'm going to ask Dr. Fauci to speak. And Mike Pence is going to give you some of the recent events that have taken place and some of the statistics that we have that I think will be very interesting here. Thank you very much. Please, Dr.
Thank you, Mr. President. If I can have the first slide, please. So always, and that's what this slide is labeled, is goals of community mitigation, really highlighting that this begins in the middle and the end with community. It is community and the community of the American people that are going to have to do the things for the next 30 days to make a difference. I think you know from that large blue mountain that you can see behind me, and I just want to thank the 5 or 6 international and domestic modelers from Harvard, from Columbia, from Northeastern, from Imperial, who helped us tremendously. It was their models that created the ability to see what these mitigations could do, how steeply they could depress the curve from that giant blue mountain down to that more stippled area. In their estimates, they had between 1.5 million and 2.2 million people in the United States succumbing to this virus without mitigation. Yet through their detailed studies and showing us what social distancing would do, what would happen if people stayed home, what would happen if people were careful every day to wash their hands and worry about touching their faces, that what an extraordinary thing this could be if every American followed these. And it takes us to that stippled mountain that's much lower, a hill actually, down to 100 to 200,000 deaths, which is still way too much. Next slide, please. Simultaneously, there was a modeler out of the University of Washington that modeled from cases up, utilizing the experience around the globe to really understand how this information that we have from Italy and Spain and South Korea and China could really help us give insight into the hospital needs, the ventilator needs, and really the number of people who potentially could succumb to this illness. It is this model that we are looking at now that provides us the most detail of the time course that is possible. But this model assumes full mitigation. It's informed every morning or every night by the reality on the ground coming in from New York, New Jersey, and around the United States, and is modeled and informed every morning so that it is adjusted so it is up to date every day. This is the model of the predicted fatalities and mortality in the United States. And as the president said, it's very much focused on the next 2 weeks and the stark reality of what this virus will do as it moves through communities. Next slide, please. But this is a slide that gives us great hope and understanding about what is possible. On the bottom of the slide, where you can barely see that blue line at the very bottom, that's the current cases in California, the cumulative cases in California, where they're doing significant testing. The next line up is Connecticut. The orange line is New Jersey. The blue line is New York. The yellow line is Washington. We all remember Washington State. It was just a month ago when they started to have the issues in Washington State, but they brought together their communities and their health providers, and they put in strong mitigation methods and testing. And you can see what the result in Washington State and California is. But without the continuation for the next 30 days, anything could change. Next slide, please. So I'm sure you're interested in seeing all the states. So on this slide is all 50 states and the District of Columbia. But I think it shows in stark reality the difference between New York and New Jersey and other states with similar populations and urban areas. Our goal over the next 30 days is to ensure the states that you see, the 48 across the bottom, maintain this lower level of new cases with the hope that we don't have significant outbreaks in other states and other metro areas as the community comes together to work together and ensure that the healthcare providers around the globe and in the United States are strengthened by our resolve to continue to mitigate community by community. This is done community by community. We all know people are in their states and in their communities. And we're very dependent on each person in the United States doing the same thing, following the presidential guidelines to a T. I know it's a lot to ask because you've done it for 15 days. So if you can show the next slide, please. So this is what gives us a lot of hope. This is the case finding in Italy. And you can see that they're beginning to turn the corner in new cases. They're entering their 4th week of full mitigation and showing what is possible when we work together as a community, as a country, to change the course of this pandemic together. It is this graphic and the graphic of many of the states that gives us hope of what is possible with continuing for another 30 days. Amidst all that hope, I must say that like we warned about Detroit and Chicago, we start to see changes in Massachusetts. New Orleans continues to be a problem of new cases, although they're stabilizing. And I think it really shows the depth of dedication of the American people to the healthcare providers, because they can see the strain that this puts on every nurse, doctor, respiratory therapist, pharmacist, and laboratory technician that's working together to stem this tide of unrelenting sick people coming to their doors. No one has been turned away. No one who has needed ventilation has not received ventilation. But you can see how stressful it is for each of them. So I know it's stressful to follow the guidelines, but it is more stressful and more difficult to the soldiers on the front line. As we started, and we will end, with its communities that will do this, there's no magic bullet. There's no magic vaccine or therapy. It's just behaviors. Each of our behaviors translating into something that changes the course of this viral pandemic over the next 30 days. Thank you.
Thank you very much, Dr. Birx. Mr. President, Mr. Vice President. So what Dr. Birx has really said very simply is that there are really two dynamic forces that are opposing each other here. As I've mentioned several times in our briefings, the virus, if left to its own devices, will do that dark curve that Dr. Birx showed you. The other dynamic force is what we are doing, what we're trying to do, and what we will do in the form of mitigation. Now, these are very revealing bits of data, because you saw what happened in Italy, where you make the turn around the curve and you go. That doesn't happen all at once. It's a stepwise fashion. And if I explain the steps, which I will, you'll see why we are really convinced that mitigation is going to be doing the trick for us. Because what you have is you have an increase in new cases at a certain rate. When the increase in new cases begin to level off, the secondary effect is less hospitalizations, the next effect is less intensive care, and the next effect is less deaths. The deaths and the intensive care and the hospitalization always lag behind that early indication that there are less new cases per day, the way we saw in Italy, and the way we're likely seeing, I don't want to jump the gun on it, we're seeing little inklings of this right now in New York. So what we're going to see, and that's we got to brace ourselves, in the next several days to a week or so, we're going to continue to see things go up. We cannot be discouraged by that, because the mitigation is actually working and will work. The slide that Dr. Birx showed, where you saw New York and New Jersey, and then the cluster of other areas, our goal, which I believe we can accomplish, is to get the hotspot places, the New Yorks, the New Jersey, and help them to get around that curve. But as importantly, to prevent those clusters of areas that have not yet gone to that spike, to prevent them from getting that spike. And the answer to that is mitigation. Now, the 15 days that we had of mitigation clearly have had an effect, although it's tough to quantitate it because of those two opposing forces. But the reason why we feel so strongly about the necessity of the additional 30 days is that now is the time, whenever you're having an effect, not to take your foot off the accelerator and on the brake, but to just press it down on the accelerator. And that's what I hope and I know that we can do over the next 30 days. And as I said the other day and on one of the interviews, we are a very strong and resilient nation. If you look at our history, we've been through some terrible ordeals. This is tough. People are suffering. People are dying. It's inconvenient from a societal standpoint, from an economic standpoint, to go through this. But this is going to be the answer to our problems. So let's all pull together and make sure, as we look forward to the next 30 days, we do it with all the intensity and force that we can. Thank you.
Thank you, Mr. President, and to Dr. Birx and Dr. Fauci. I know I speak on behalf of the President and people all across this country when I express our great admiration and appreciation to both of you for helping to steer our nation through this challenging time. The American people have now seen what the President saw when he made the decision at the end of 15 days to slow the spread, to ask the American people to give us 30 more days, to continue to put into practice the President's coronavirus guidelines for America. And as you just heard from the experts, we have reason to believe that it's working. As Dr. Fauci just said, there are difficult days ahead. Our hearts and our prayers go out to the families that have lost loved ones, and those, as the President just reflected, who we know are struggling at this hour in hospitals across the nation. But to each and every one of us, do not be discouraged, because what you can do to protect your health, the health of your family, what you can do to ensure that our healthcare providers have the resources and our hospitals have the capacity to meet this moment is put into practice the President's coronavirus guidelines for America. It really is what every American can do. 30 days to slow the spread, 30 days to make a difference in the lives of the American people, American families, and the life of our nation. Allow me to give you a few brief updates before the President takes questions. First and foremost, we continue to work very closely with governors around the nation. The President and I spoke to all the governors, all the states and territories yesterday, and since we were last together, the President and I have spoken directly to several governors around the country, including Illinois, Louisiana, Michigan, New York, and other states. At the present moment, the President has declared 29 major disaster declarations and authorized 10 different states to use full federal funding, so-called Title 32 funding, to pay for their National Guard. And as of this afternoon, FEMA reports some 17,000 National Guard have been activated in states around the country to provide support for coronavirus response. On the subject of testing, we have now completed more than 1.1 million tests around the country. We're working very closely with governors around America to assist them in drive-through and community testing centers. I spoke with Governor J.B. Pritzker of Illinois today about a testing center that they've established in cooperation with the U.S. Public Health Service. We remind every governor and every laboratory and hospital in the country it's imperative that you continue to report daily to the CDC the results of those tests to give us the visibility on the data to best inform resource decisions. Also, we reiterated today to governors in person and also through correspondence to every governor the importance of using their National Guard, if need be, to move medical supplies. FEMA is very busy, as you'll hear in a moment, delivering literally millions of supplies to states around the country. But we're urging every governor to make sure to work with their state emergency management team and maybe use the National Guard to move those supplies from warehouses to hospitals. At the present moment, as the President said, we've distributed more than 11.6 million N95 masks, more than 8,100 ventilators around the nation, millions of face shields, surgical masks, and gloves. We initiated an air bridge that the President announced yesterday. Flights have arrived in New York, one arrived in Illinois yesterday, and a flight will arrive in Ohio in the next 24 hours. FEMA is literally working and contracting around the world with now more than 51 flights that will be bringing vital medical supplies. On the subject of ventilators, FEMA is currently delivering 400 ventilators to Michigan, 300 to New Jersey, 150 to Louisiana, 50 ventilators to Connecticut, and in the last week and in the week ahead, more than 450 ventilators to Illinois. This is in addition to more than 4,400 ventilators that the President and FEMA directed to the state of New York. We just want people that are working on the front lines that the President just spoke about, Dr. Birx and Dr. Fauci spoke about. We want you to know help is on the way. And at the President's direction, we're going to leave no stone unturned anywhere in America or anywhere in the world to make sure that you have the resources and the equipment to do your job. So again, I want to just say thank you, America. Thank you for stepping up. Thank you for putting into practice the 15 days to slow the spread. And thank you for the response that tens of millions have already had for the 30 days to slow the spread. We encourage each one of you, as we have governors around the country, to spread the word about the guidelines. Listen to your state and local authorities in areas that are more greatly impacted. We continue to urge people in the areas of New York, New Jersey, and Connecticut to refrain from travel around the country, and people who've traveled from that area, check your temperature and self-quarantine for 14 days. You can see from that chart the unique challenges people in the greater New York City area are facing with the coronavirus, and we want to do all that we can to protect your health, focus resources on the community, and prevent unnecessary spread. Lastly, as the President highlighted yesterday, businesses around America are stepping up as never before. Tomorrow, I'll travel with Secretary Sonny Perdue to Gordonsville, Virginia, to the Walmart Distribution Center, just so the American people can see firsthand how the food supply is continuing to roll on 18 wheels and through air freight all over America. And we thank again the grocery store operators around America and everybody that's working out on the highways and byways every day to keep that food supply rolling and rolling strong. And to the American people, though, we just want to assure you that we're going to continue to work our hearts out to make sure our healthcare providers have everything they need, that anyone struggling with coronavirus has the support and healthcare they need. I'm absolutely confident. Seeing the way our governors are responding, seeing this team the President has assembled in the White House Coronavirus Task Force, confident of the prayers of the American people that we'll get through this, but it will take all of us doing our part, and we'll get through it together.
Just to be clear, what is the projected death toll should people be reasonably good at following these mitigation measures?
Well, if they're reasonably good, I guess we could say that I'd like to have maybe Dr. Fauci or Deb come up and say, I mean, I have numbers, but I'd rather have them say the numbers if you don't mind. It's a big question.
So, of course, this is a projection, and it's a projection based on using very much what's happened in Italy and then looking at all the models. And so, as you saw on that slide, that was our real number, that 100,000 to 200,000. And we think that that is the range. We really believe and hope every day that we can do a lot better than that, because that's not assuming 100% of every American does everything that they're supposed to be doing. But I think that's possible.
Over the next 2 weeks, you said that the next 2 weeks are going to be very painful. Is the bulk of this going to happen over the next 2 weeks?
You have an upslope. So as mortality, the fatalities to this disease will increase, and then it will come back down, and it will come back down slower than the rate at which it went up. And so that is really the issue, how much we can push the mortality down.
Yeah. So our hope is to get that down as far as we possibly can. The modeling that Dr. Birx showed predicts that number that you saw. We don't accept that number that's what's going to be. We're going to be doing everything we can to get it even significantly below that. So, I don't want it to be a mixed message. This is the thing that we need to anticipate, but that doesn't mean that that's what we're going to accept. We want to do much, much better than that.
But doctor, when we look at the curve, it goes much further in time. So we would have death and cases for much longer. I mean, we do expect
So you can put up slide number 2. So that's a generic, I'm sorry, if you can go back to the slides and put up slide 2. Okay, so what I showed you was a generic picture of what happens in an epidemic when you mitigate. So no mitigation, mitigate. This is based on the experience around the globe with this particular virus. And so it does have a tail, but the peak you can see by this projection, and this is the IHME data, the peak is over the next 2 weeks, and this is tracking mortality, so the number of fatalities from this virus. And so that's the part that we think we can still blunt through the superb medical care that every client is receiving, but also even more stringent people following the guidelines.
I can't see the small characters, but are we seeing deaths until June? I can't really.
This is June.
This is June, so we would still see problems and deaths in June.
It's a projection.
It's a projection, of course.
So, just getting back to what I said about the stepwise thing, deaths always lag. So you will be seeing deaths at a time when, as an epidemic, we're doing really, really well, because the deaths will lag.
Dr. Fauci, should Americans be prepared for the likelihood that there will be 100,000 Americans who die from this virus?
The answer is yes. We need, as sobering a number as that is, we should be prepared for it. Is it going to be that much? I hope not, and I think the more we push on the mitigation, the less likelihood it would be that number. But as being realistic, we need to prepare ourselves that that is a possibility, that that's what we will see.
A very short period of time for that to happen.
Right.
Can the country handle that in such a short period of time, within a couple of months? 50,000 a month.
It will be difficult. No one is denying the fact that we are going through a very, very difficult time right now. We're seeing what's happening in New York. That is really, really tough. And if you extrapolate that to the nation, that will be really tough. But that's what it is, Jim, and we're going to have to be prepared for that.
Yeah, I think because the model that was from IHME, that's based and heavily laden by the data that has come in from New York and New Jersey and Connecticut. So, that can skew to a higher peak and more significant mortality. If all of the other states are able, and all the other metro areas are able to hold that case number down, then it's a very different picture. But you have to predict on the data you have, which is heavily skewed to New York and New Jersey.
Just one extra thing. Getting back to that, that's really an important slide that Dr. Burke showed. The cluster of other cities that are not New York and not New Jersey. If we can suppress that from any kind of a spike, the numbers could be significantly lower than what we're talking about.
Yes, some cities that are not following these guidelines.
Right, and that's the reason my plea at the end of my remarks, Jim, that now is the time to put your foot on the accelerator, because that's the only thing that's going to stop those peaks.
Dr. Fauci. And some of the cities are doing very well, as you see, very well at this early stage. But the number, the doctor said 100,000. The number is between 100 and 200,000, maybe even slightly more.
Who does it?
But we would hope that we could keep it.
Do we have the next slide or the slide after that? Just go, one more slide. Perfect, yeah, thank you.
Would you tell cities that aren't doing what, New York, New Jersey, Washington, the cities that have been taking charge in all of this, would you urge some of the cities that haven't been doing this, Mr. President, to get with the program?
Well, I would, but if you see New York, I believe the blue is New York. New York is having a much harder time than other of the cities. Certain cities are doing, actually, if you look down here, an incredible job. They were early, they were very, very firm, and they've done an incredible job. This is New Jersey, New York.
This is,
I mean, if you remember, California and Washington State were down here, and they had some of the earliest cases.
But we're seeing places in Florida not doing what New York and New Jersey have been doing, what Washington State has been doing.
they're doing very well by comparison.
Mr. President.
Mr. President?
Yes,
If I could maybe direct the question to you and then to Dr. Fauci as well. You told us yesterday that you're accomplishing, or the U.S. at least is accomplishing 100,000 tests per day, but we're still hearing difficult stories from the front lines of the first responders that you praised so appropriately a little while ago, that they can't test all of the people that they need to test. Do you have any kind of projection as to when everyone who needs a test will be able to receive one?
Yeah, I can only say that we're doing more than anybody in the world by far. We are testing highly accurate tests. These are tests that work. As you know, many tests are being sent to countries and they're broken. Well, we're doing, every day we get, and the word is exponential, we are getting more and more and more. And now we have the new test that you saw yesterday. That's going to be rolled out, I think, tomorrow or the next day. And that's going to take only a few minutes, literally a few minutes to see the result. And it's a highly accurate result. I mean, tests were given out, not by us, by other countries, where there was a 50-50 chance that it was wrong. What kind of a test is that? These are highly accurate tests, but the new tests that are coming out are very quick, and they were just developed. Abbott Labs did the one yesterday. So we're doing more than anybody in the world by far, and they're very accurate tests, and we're getting a lot of information from those tests.
The test President unveiled yesterday, the Abbott Laboratories test, which is a 15-minute test. Our team is working very closely with Admiral Giroir and FEMA to make sure that those are distributed around the country. Earlier this week, Abbott Laboratories is actually going to be producing 50,000 tests a day and distributing those around America. There's already the machines in some 18,000 different locations around the country. And they've told us they have several thousand on the shelf now. And what we're doing is trying to identify the areas where we may yet have pockets, or, as Dr. Birx often says, where we want to do more immediate testing so that we can do what's called surveillance testing to identify where there may be coronavirus cases where there's been very little incident. But if I could just amplify one other point, and that is that when you look at this chart, go back 15 days. And the reality is that, and this is me speaking as a layperson, but as I've listened to our experts, I mean, New York and the greater New York City area have unique challenges. It's a city that we really believe may have had exposure to the coronavirus much earlier on than we could have known, and had its own challenges. And New York, Connecticut, New Jersey are leaning into this effort. But when we look at this chart for all the other states, including Washington State.
All right, guys, just want to say thanks again for being here with us on Fox 10 Phoenix. You can continue to listen in to the coronavirus update from the task force team on coronavirusnow.com. One of the things I wanted to mention, the team's emphasizing, although the numbers will increase here in the next 7 to 10 days, they said don't be discouraged by it. Again, you can go and see more on coronavirusnow.com.
At these numbers in the other 48 states, and they can see that in the last 15 days, the president's coronavirus guidelines were working, and that's precisely why President Trump is asking every American to continue to put these guidelines into practice for 30 more days.
Mr. President, can I just follow up on testing? Just a quick question.
If I could. So right now, we're at about 4,000 deaths here in the United States. You're suggesting a spike of more than 90,000 deaths over the next few weeks. Do you have a demographic breakdown of the areas that are most at risk and where most of those deaths may occur?
Well, right now, and I think if you ask Chris Murray, he would say he's using the information coming out of New York and New Jersey and applying that to potentially other states having the same outcomes. I just want to say again, this yellow line, and this is all corrected for 100,000 residents. So this is normalized so we can compare apples to apples. This is still Washington State, this yellow. So they've been able to, for a long time of measuring cases, not have a spike. So it's possible, and we're watching very closely to make sure it doesn't have a spike. But that's what the people in Washington State are doing. This is what every community, Washington State early, about 2 weeks before New York or New Jersey. California, a week before New York or New Jersey. Really talked to their communities and decided to mitigate before they started seeing this number of cases. And now we know that that makes a big difference. Early, as Dr. Fauci said, if you wait till you see it, it's too late.
And again, do you have a demographic breakdown, Dr. Birx, of where these deaths may occur?
So there's a demographic breakdown that we've discussed before related to mortality. And it's as we're seeing in New York exactly what we saw in Italy. Very low mortality, not to say that young people under 30 or young people under 40 aren't getting ill. They are, but most of them are recovering. So the profile looks identical to Italy, with increasing mortality with age and pre-existing medical conditions. And so that is holding in the same way. But what we're hoping is that through the work of communities, and again, it comes down to communities. This is communities deciding that this is important to them to not have the experience of New York and New Jersey. And I think, we are worried about groups all around the globe. I mean, I don't know if you heard the report this morning, there's 8,000 ventilators in the UK. If you translate that to United States, that would be like the United States having less than 40,000 ventilators. We have 5 times that amount. So, I mean, these are the things that everybody is having to face. And I think the United States is in an excellent position from our medical care position, but we don't want to have to test that system. We want this to be a much smaller epidemic with much smaller mortality.
Can I just follow up on the testing question real quick before we move on? So the testing numbers, I understand 1 million tests done, it's a big increase, but we were told there would be 27 million tests available by the end of the month. So can you outline where in the supply chain, where in the logistics chain are those other 26? Yeah, where are the other 26 million tests right now?
I think this is just for purposes of clarifications. There's a difference between sending a test that can be administered to a test being done. Because a month ago or more, the president brought together the top commercial labs in America and said, we need you to partner with us to create a brand new system that would rapidly process tests. We're now at 1.1 million tests, and we believe it's a fair estimate that we're testing about 100,000 Americans a day. That'll continue to grow. It'll continue to accelerate. But I think the misunderstanding early on was there were many tests being distributed, many test kits being sent, but under the old system, as the president's described it, the antiquated system, those were being processed in state labs or at CDC or in private labs on a very slow, methodical system that could only produce maybe 30 to 50 tests a day. But this new partnership that we have with commercial laboratories allows the progress we're making. But the breakthrough with Abbott Laboratories now moves to point of care, which means you're going to have devices and tests that people will literally be able to take at their doctor's office, at a hospital, at a clinic, at a nursing home, and have the results in 15 minutes.
So those 26 million tests we were talking about, were those tests under the old antiquated system? And
yes.
Now, so are we still even using those 27 million tests, or have we just completely moved on to the point?
The answer is yes, now through the new system.
Even today, which is, I have to say, coming out of laboratories and developed tests and worked on vaccines and then gone to the field to actually combat epidemics, it is disappointing to me right now that we have about 500,000 capacity of Abbott tests that are not being utilized. So they are out, they're in the states, they're not being run and not utilized. So now we have to figure out, how do we create awareness? Because sometimes when you put an early platform out, like our first platform out in the high speed was Roche. So you get that out, people get dependent on that, and then don't see that there's availability of other tests. So right now, there's over 500,000 tests sitting, capacity, that are not being utilized. So we're trying to figure out, how do we inform states about where these all are? How do we work through every laboratory association so they're aware? And how do we raise awareness so people know that there's point of care, there's Thermo Fisher, there's Abbott testing, and there's Roche. And if you add those together, that's millions of tests a week.
They're not being reported.
And they're not, and so those are the,
But they're not being reported.
or they're not even being used. So that's what's really, so that's what we're working on.
What's the reason they're being used?
Because when people get used to a single platform, they keep sending it back to that lab. So it's getting in a queue to wait to get on a Roche machine rather than being moved to this other lab that may have Abbott capacity, because they're all in different laboratories. And so I think, well, actually, Admiral Giroir is figuring it out to really create some kind of visual so that every governor and every health commissioner can see all of their capacity in their countries, in their states, county by county, so that they know where the tests are. So we pushed a lot of tests out, but they're not all being utilized.
And it's up to the people when they don't send them back. They use them, they don't send them back. And Doctor, go ahead, please.
No, Dr. Birx explained it very, very well. I just want to get back, John, to your question. It's a logical question. When you look at the number, you want to know what the demography is going to be. This is a number that we need to anticipate, but we don't necessarily have to accept it as being inevitable. And that's getting back to what I'm saying about we can influence this to a varying degrees. And if we influence it to the maximum, we don't have to accept that. That's something we need to anticipate. But I want to do, not I, all of us want to do much, much better than that.
On that front, what do the models suggest is on the low end if you have full mitigation?
Well, it says
That was
between
full
100 and
mitigation.
200,000.
That was full mitigation.
It says 100 to 200,000, anything, which is a lot of people, right? It's a lot of people. Well, you didn't ask the other question. What would have happened, because this is the question that I've been asking Dr. Fauci and Dr. Birx for a long time, and they've been working on this for a long time. The question is, what would have happened if we did nothing? Because there was a group that said, let's just write it out. Let's write it out. What would have happened? And that number comes in at 1.5 to 1.6 million people, up to 2.2 and even beyond. So that's 2.2 million people would have died if we did nothing. We just carried on our life. Now, I don't think that would have been possible because you would have had people dying all over the place. This would not have been a normal life. How many people have even seen anybody die? You would have seen people dying on airplanes. You would have been seeing people dying in hotel lobbies. You would have seen death all over. So I think from a practical standpoint, that couldn't have been carried out too far. But if you did nothing on the higher side, the number would be 2.2 and maybe even more, and on the lower side, 1.6 million people.
Understood, but if 100,000 is the number with full mitigation, how do you push it? How do you push it lower?
So, no, we'll go together. We've been at this a long time. You go first.
So, John, it's an obvious, very good question. If this is full mitigation and it's 100,000, why am I standing here saying I want to make it better? Because that's what the model tells you it's going to do. What we do is that every time we get more data, you feed it back in and relook at the model. Is the model really telling you what's actually going on? And again, I know my modeling colleagues are going to not be happy with me, but models are as good as the assumptions you put into them. And as we get more data, then you put it in, and that might change. So even though it says, according to the model, which is a good model that we're dealing with, this is full mitigation. As we get more data, as the weeks go by, that could be modified.
Why does the model now, the top line on the lowball estimate, why does that not top out? I think it said 240,000, not 200,000. Is that a change? Is that because the states haven't been doing enough?
It just has to do with if you had more New Yorks and New Jerseys, Chicago, Detroit, LA, Dallas, Houston, all of our major cities modeled like New York. That's what gets us into trouble. But I am reassured by looking at the Seattle line, by looking at the LA line, by looking at what California's been able to do, that that is not something that I don't believe that's going to happen. That is the outside case of having 10, 15 metros like New York and the New Jersey metro area.
But New York had community spread pretty early undetected, so don't many of those other states, if not more of them, who had even less information, aren't they likely to see the same spike?
Well, California and Washington State reacted very early to this. I mean, yes, Washington State had some of the earliest infections. They have kept it low and steady, and for now a month has been tracking it with a small increase in the number of cases, but not this logarithmic form of the virus. And so that's the piece that we're trying to prevent. That's the piece that we're trying to prevent in New Orleans, in Detroit, in Chicago, and in Boston right now. And trying to make sure that each of those cities work more like California than the New York metro area.
Mr. President, I just wanted to get your thoughts on face masks. We asked you about this yesterday, and you signaled you were thinking about it.
Yeah, just to end the last topic, though, I think I could say this because I spoke to Dr. Birx before and to Dr. Fauci. For whatever reason, New York got off to a very late start. And you see what happens when you get off to a late start. New Jersey got off to, and I think both governors are doing an excellent job, but they got off to a very late start. When you look at Washington State, if you remember, that all started in a very confined nursing home. And you had 20-some-odd people, I believe, dying in one home. That doesn't mean it escaped that home, and so they have a very different statistic than other states. But, I mean, I remember it very vividly, the nursing home in Washington State, where you had many people dying. Every day people were dying in the one exact location. So they were able to keep that, relatively speaking, into that location.
Were you surprised when you saw these projections? The numbers are sobering.
They're very sobering. Yeah, when you see 100,000 people, that's at a minimum number. Now, what we're looking at, and as many people as we're talking about, whatever we can do under that number and substantially under that number, we've done that through really great mitigation. We've done that through a lot of very dedicated American people. That 100,000 is, according to modeling, a very low number. In fact, when I first saw the number, and I asked this a while ago, they said it's unlikely you'll be able to attain that. I think we're doing better than that. Now, I think we have to see, but I think we're doing better than that because, as John said, that would be, a lot of lives taking place over a relatively short period of time. But think of what would have happened if we didn't do anything. I mean, I've had many friends, business people with great, actually, common sense. They said, why don't we write it out? A lot of people have said, a lot of people have thought about it. Write it out. Don't do anything. Just write it out and think of it as the flu. But it's not the flu. It's vicious. When you send a friend to the hospital and you call up to find out how is he doing, it happened to me, where he goes to the hospital, he says goodbye, he's sort of a tough guy, a little older, a little heavier than he'd like to be, frankly. And you call up the next day, how's he doing? And he's in a coma? This is not the flu. So we would have seen things had we done nothing. But for a long while, a lot of people were asking that question, I think, right? I was asking it also. I mean, a lot of people were saying, well, let's just write it out. This is not to be written out, because then you would have been looking at potentially 2.2 million people or more. 2.2 million people in a relatively short period of time. If you remember, they were looking at that concept. It's a concept, I guess, it's a concept. If you don't mind death, a lot of death. But they were looking at that in the UK, remember? They were very much looking at it. And all of a sudden they went hard the other way because they started seeing things that weren't good. So they were, they put themselves in a little bit of a problem. Now Boris tested positive, and I hear I hope he's going to be fine. But in the UK, they were looking at that. And they have a name for it, but we won't even go by the name. But it would have been it would have been very catastrophic, I think, if that would have happened. But that was something that everybody was talking about, Steve, like, just don't do anything. Don't do anything. Forget about everything. Just write it out. They use the expression, write it out. We would have had, at a minimum, 1.5, 1.6, but you would have had perhaps more than 2.2 million people dying in a very short period of time. And that would have been a number that the likes of which we've never seen. So now when we look at our package that we just approved for $2 trillion, all of a sudden it seems very reasonable, right? When you're talking about 2 million lives, all of a sudden it seems very reasonable. I must say, a lot of people that have been seeing the more advanced numbers, because these are much more advanced numbers now. You know, when you first started, we didn't know, and this was a different kind of a virus, and nobody knew that much about it. Even the experts, you don't really know where it's going. But then they see what goes on in Italy, and they see what goes on in Spain. And you see France is having a very hard time, and other countries having a very, very hard time. But once they see what's going on, they start making projections. So I hope they're going to be very high projections, but based on everything else, that would be the number. Let's see if we can do much better than that. I hope we can. Yeah, John?
What about masks? You didn't answer a question about
Yeah, the
masks.
mask. What's your recommendation?
Okay.
Well, I understand there's an issue with supplies,
That's right.
but if there
Well,
was
it's
enough
this
for
way. You know, you can use a scarf. A scarf is, everybody, a lot of people have scarves, and you can use a scarf. Scarf would be very good. And my feeling is if people want to do it, there's certainly no harm to it. I would say do it, but use a scarf if you want, you know, rather than going out and getting a mask or whatever. We're making millions and millions of masks, but we want them to go to the hospitals. I mean, one of the things that Dr. Fauci told me today is we don't want them competing. We don't want everybody competing with the hospitals where you really need them. So you can use scarves. You can use something else over your face. It doesn't have to be a mask. But it's not a bad idea, at least for a period of time. I mean, eventually you're not going to want to do that. You're not going to have to do that. This is going to be gone. It'll be gone. Hopefully gone for a long time.
What did you think about Mr. President, the mitigation steps that are on your 30-day plan? Is that enough, or is more needed? Have you been discussing that?
Well, we're going to find out. We hope it's enough. We hope it's enough. We hope we're at a level where we can say, let's go, because our country wants to get back to work. We really want to get back. Everybody wants to get back to work. Now, I could ask the doctors to answer that question, but we discuss that all the time. What do you think?
Have they been recommending harsher
Well, I think
mitigation steps?
I think we've been very harsh. I mean, you look at the streets. I looked at Fifth Avenue today on camera, and I didn't see anybody walking on the street. And I'm used to watching that street. You can't even see. You can't see the asphalt. You can't see the concrete. And you look at this, nobody. There was one car. It looked like it might have been a taxi cab, and it was in a time of the morning that normally there'd be a lot of people. I mean, you know, I think the mitigation's been very strong. Please.
Mr. President, will you confirm your plans to defer tariff payments for 90 days? And secondly, on interest...
I didn't do anything about tariff payments. I don't know who's talking about tariff payments. They keep talking about tariff payments, and we haven't done that. China's paying us. We made a deal with China. Under the deal, they're paying us 25% on $250 billion, and they pay it. And I spoke with President Xi the other day, and he didn't mention that. We didn't mention that. We had a great conversation, by the way, a really productive conversation having to do with many things. Most of it was on the virus. But, you know, we're not talking. Who are you with? Who are you with?
If I could just clarify.
Who are you with?
Wall Street Journal. There's reporting by the Wall Street Journal and Bloomberg that there's a plan in motion.
I know it's incorrect reporting. Well, they might be, but I'm going to have to approve the plan. The one thing I will tell you, I approve everything, and they haven't presented it to me. So therefore, it's false reporting. So therefore, don't do the story. If we're going to do something, I'd be glad to let you know. There's nothing wrong with doing it, but we'll let you know. Yeah, please, a couple of facts, then we'll get back to you, Jim. Go ahead.
Thank you, sir. Philip White, I'm going to throw up their politics.
I wanted to ask you about individual states issuing stay-at-home orders. What do you think, for instance, in Florida, Ron DeSantis has resisted urges to issue one of those, but he said moments ago that if you and the rest of the task force recommended one, that would weigh on him heavily. What sort of circumstances need to be in place for you to make that call and say this is something you should consider?
Different kind of a state. Also, great governor, knows exactly what he's doing, has a very strong view on it. And we have spoken to Ron. Mike, do you want to just tell him a little bit about that?
Well, let me echo our appreciation for Governor DeSantis' leadership in Florida. He's been taking decisive steps from early on and working closely with our team at the federal level. But let me be very clear on this. The recommendation of our health experts was to take the 15 days to slow the spread and have the president extend that to 30 days for every American. Now, that being said, we recognize that when you're dealing with a health crisis in the country, it is locally executed by healthcare workers, but it's state managed. And so we continue to flow information to state governors. We continue to hear about the data that they're analyzing and consult with them. But at the president's direction, the White House Coronavirus Task Force will continue to take the posture that we will defer to state and local health authorities on any measures that they deem appropriate. But for the next 30 days, this is what we believe every American in every state should be doing at a minimum to slow the spread.
So unless we see something obviously wrong, we're going to let the governors do it. Now, if it's obviously wrong, I mean, people can make things, they can make a decision that we think is so far out that it's wrong, we will stop that. But in the case of Governor DeSantis, you know, there's two thoughts to it, and two very good thoughts to it. And he's been doing a great job in every respect, so we'll see what happens. But we only would exercise if we thought somebody was very obvious. So go ahead, your turn.
Thanks. I had a question in a minute for the Vice President about the National Strategic Stockpile, but while you're at the podium, I wanted to ask about your call with President Putin a couple days ago. Yeah. I know a big economic concern for a lot of people has been the state of oil prices right now. Yeah. So I'm wondering if you raised that with President Putin, if you were able to gain any
we had a call. It was probably about that, the oil prices, because as you know, Russia and Saudi Arabia are going at it, and they're really going at it, and by going at it to the extent that they are, the oil has dropped to a point where, look, it's the greatest tax cut we've ever given, if you look at it that way, because people are going to be paying 99 cents for a gallon of gasoline. It's incredible in a lot of ways. It's going to help the airlines, but at the same time, it's hurtful to one of our biggest industries. That's the oil industry. It's really, it's not even feasible what's going on. So I spoke to President Putin about that. I also spoke to the Crown Prince about that, Saudi Arabia.
Did they agree to do anything?
No, I think, yeah, they're going to get together, and we're all going to get together, and we're going to see what we can do, because you don't want to lose an industry. You're going to lose an industry over it. Thousands and thousands of jobs. We have, I don't know if you know, there's oil all over the oceans right now. The boats are all filled. The ships are, they're renting ships that were dying, that weren't doing well, and now, like, that's where they're storing oil, and they're sent out to sea, and they sit there for long periods of time. There's so much oil. In some cases, it's probably less valuable than water. In some parts of the world, water is much more valuable. So we've never seen anything like it. But the two countries are discussing it, and I am joining at the appropriate time if need be. We had a great talk with President Putin. We had a great talk with the Crown Prince. We also discussed, more so with President Putin in this case, the virus, because Russia's being hit pretty hard. And we discussed many things, trade. We discussed a lot of things with both. But in the case of both, we very much discussed the oil and the oil prices. I mean, you look, it's $22, but it's really much cheaper than that if you want to negotiate. Nobody's seen that. That's like from the 1950s. It really is. You know, to think that it was 50, 60, 70, 80 and now it's 22, but if you put a good bid in at 9, I think you could probably get what you wanted, right? John, please.
Mr. President, you tweeted earlier today that now would be a good time to start looking toward, if there is a light at the end of the tunnel, and work on an infrastructure bill. Again, you suggested it should be $2 trillion, which is twice what the last one was, or the proposal at least. Are you anticipating that, like after the economic crisis of 2008, 2009, America will need to have so-called shovel-ready jobs ready to go to get people back to work?
Well, the problem with that one is they had maybe shovel-ready jobs, maybe not, but they never used it for the purpose of infrastructure. So far, nobody's been able to find any money that was spent on infrastructure. I want to use it for infrastructure. And one of the reasons I'm suggesting it, John, is we're paying zero interest. The United States is paying almost zero interest rate. The Federal Reserve lowered the rate, the Fed rate, and that and a combination of the fact that everybody wants to be in the United States. We have a dollar that's very strong, and I know that sounds good, but it does make it hard to manufacture and sell outside because other currencies are falling and our currency is very strong. It's very, very strong. Proportionately, it's through the roof. So we have a strong dollar. People want to invest in the United States, especially nowadays where they're looking at safety. They have all of the problems, plus the virus at 151 countries. They all want to come into the United States. And so we have a zero interest rate, essentially. And I said, wouldn't this be a great time to borrow money at zero interest rate and really build our infrastructure like we can do it? So the plan was, the Republicans had a plan of about 750. I would say they were at 7.5. Well, you had the Democrats were a little less than $1 trillion. The Republicans were a little bit less than that. And I'm suggesting $2 trillion. We redo our roads, our highways, our bridges. We fix up our tunnels, which are many of them in bad shape, like coming into New York, as you know, a lot really bad shape. And we really do a job on our infrastructure. And that doesn't mean we're going to do the Green New Deal, because I won't do it. I won't approve it. We're not going to do the Green New Deal and spend 40% of the money on things that people just have fun with.
How would you pay for it, sir?
We're going to borrow the money at 0% interest. So our interest payments would be almost zero, and we can borrow long term. People want to be in the United States. They want to be invested in the United States. Go ahead, Jim.
I wanted to get back to the virus. You were saying at the beginning of the press conference that you're looking at holding back 10,000 ventilators. Is that because you need to pick and choose where these ventilators are going to have to go because of the nature of the pandemic,
Right.
how it's spreading? And also, I just wanted to ask Dr. Fauci and Dr. Birx, if it's possible after you finish, is that part of the reason why you're projecting 100,000 to 200,000 deaths, that there are going to be some people who aren't going to be able to get ventilators or be put on
Actually,
ventilators?
just the opposite, because we're holding back. We have almost 10,000, and we're holding because we're going to need them over the next couple of weeks as this surge goes on. You see the chart. We haven't hit the top yet, and we have to be able to move them immediately. And we can't take them, because it's going to be very hard to do that. We can't take them to places that aren't needing them. Plus, we have requests for ventilators in hospitals and in states and cities that don't need them, in our opinion. They don't need them. They won't need them at the top. So we're holding it back for flexibility. We actually just took 600 and we sent them to different locations today. But we have close to 10,000, and we'll be able to get them, and we're all set to march. We have the National Guards and we have FEMA, and we're all set to move them to the places. So as per your second question, what we're going to do is save lives because of it, because otherwise we would not be able to get to the ventilators. And we don't know what the hottest spot is.
Ventilator shortage right now?
In some areas we might, but we've done a great job with ventilators, and we're having them made unbelievable. We have now 11 companies making ventilators. Now they'll be starting to arrive in the next week, but we've also grabbed a lot of them. Some hospitals had more than they were saying, or at least more than we knew about, which is a good thing, not a bad thing. But we want to be able to have, I guess the word would be flexibility, so that if the surge turns out to be much stronger in Louisiana, which it could, that we can immediately bring 1,000 or 2,000 to Louisiana. Otherwise, we wouldn't be able to get them. We wouldn't be able to say, listen, Governor Cuomo in New York, we want to take ventilators away from New York. And they'll say, well, we can't do that. It would be a disaster. So we have great flexibility. Now, when the surge occurs, if it occurs fairly evenly, we'll be able to distribute them very quickly before they need them. but we have a reserve right now. It's like having oil reserves, except more valuable, frankly. But we have a reserve right now, and we'll be able, and we also have a great team of people ready to deliver. They can move them fast. So when we see it going up in a certain state, and Louisiana could be one, and Michigan could be another with Detroit, because Detroit is having a lot of hard time right now. Detroit came out of nowhere, and that's what happens with this. It comes out of nowhere. So we are ready, Jim, depending on what happens, and we have a stockpile, and that's why it's called a stockpile. Now, a lot of the ventilators and a lot of the other equipment, rather than sending it to the stockpile, we had it sent directly to a hospital, to a location, to a place. So we didn't have the cumbersome nature of having it come in, unboxed, put in, and then delivered. We have it brought, which they've never done before. They don't do that. Generally speaking, they don't do that. But I think, Mike, we've had tremendous success at doing that. That's for other items, including ventilators, where it's brought to the site that needs it. But we have a good supply of ventilators, and we're ready to go. We're all ready. We have trucks ready. We have everything ready, because, as we're saying, John, this could be a hell of a bad 2 weeks. This is going to be a very bad 2 and maybe even 3 weeks. This is going to be 3 weeks like we haven't seen before.
Should the hospitals be prepared for that? We're hearing
Well, I
some
think the
saying
hospitals,
that they're facing what looks like a medical war zone in some of these places.
they are going to be facing a war zone. That's what it is. I've heard some of the paramedics and some of the doctors. They said they've been in war zones. They've never seen anything like this. You look at Elmhurst Hospital in Queens. I've never seen. I mean, I just think it's so, because that's a hospital that's near where I grew up. And it is a war zone in a true sense. Yeah, please.
Yeah, on the ventilators, so we've been hearing from governors who say they are fighting amongst themselves, essentially bidding amongst
They
themselves to
shouldn't be
get these
doing that.
ventilators.
If that happens, they should be calling us. Look, we have ventilators, but we've distributed thousands of ventilators. But they shouldn't be doing that. And if they need them that badly, we know. We have pretty good ideas of where they're going to need them. Some people, frankly, think they need them and they don't need them. I don't want to mention names, but there are some people that want them, and it's really not the right thing. Then you have some people that, I guess, automatically hoard a little bit. They want to have more than they think they need. But, a ventilator is a very precious piece of equipment right now. It's hard to make. It takes a long time to make it. It's complex. Some of them are like the dashboard of an airplane. I mean, they're very complicated and very expensive machines, and some are much simpler. But we're ready to go depending on what happens. But we have some hospitals in some states that think they need ventilators, and we don't think they do. Now, if they do need them, we will have them there before they need them. We'll be able to move very quickly.
So you're confident that...
What about the hydroxychloroquine? Is there any early data on these trials?
Nothing that I've heard. I mean, that's the first question I make every morning. I tell you, I call up, we have 1,100 in New York right now, and we have other locations where where people are taking them. Now, the good news is it's only 3 days, and it's like a 7 or 8 day treatment. The good news is we haven't heard anything bad. In other words, there's been no catastrophic events. But we haven't, it's a little bit too soon to talk about it. It would be a total game changer, John, if that happened. If that happened, it would be a game changer. And we include that, and I think in all cases, the Z-Pack, you know what the Z-Pack is. So we're going to see what happens with the hydroxychloroquine. Just 1 second, Steve.
Are there antiviral drugs that have some promise of working soon?
We're looking at a lot of them. Some show promise. I think maybe the doctor might want to speak about the vaccines, because a lot of Johnson & Johnson is advanced, very advanced. We'll see what happens. The one thing with the vaccine is it doesn't help this group, because this group, you need to test the vaccine. The one thing with the drug you just mentioned, right, is that's been out. It's a malaria drug and also an arthritis drug, so it's been out there for a long time. Very powerful drug, but it's been out there for a long time. So it's tested in the sense that it doesn't kill you. But you may want to discuss the vaccines for a second, Dr.
Thank you, Mr. President. But just for a second before the vaccine, in answer to your question, Steve, there are a number of candidates. The drugs that are now being looked at in various ways, either compassionate use, clinical trials, are generally drugs that already exist for other things. There's a whole menu of drugs and interventions that are now going into clinical trials that are not approved for anything yet. I mean, for example, things like immune serum, convalescent plasma, or hyperimmune globulin, or monoclonal antibodies, a variety of other things. Right now, there's a lot of activity going on behind the scenes in the design of the kinds of clinical trials that will give us an answer. Because you need an answer, because if it doesn't work, you want to get it off the table and go to the next one. So there are a lot of things. Vaccine.
How long does that normally take? Weeks, months?
Yeah, no, it takes at least months, at least. So, I mean, that's the reason why you're seeing a lot of activity with drugs that already exist for other purposes, because they're already there. But the drugs that you want to show in a good randomized clinical trial, at very best, are going to take months. Just one word on the vaccine. You know, exactly like we said, we hope that as we get into the summer, if in fact there are cases out there, when you're in a phase 2 or phase 3 trial, or 2B, as we call it, that we might get an early efficacy signal. And an efficacy signal means that even though you haven't definitively proven that a vaccine works, you get enough information that if it were an emergency, you might be able to have an emergency use authorization for it.
That sounds good. And I have to say this, hydroxychloroquine and azithromycin, which is, you know, you take it with it, maybe, if you want, for the infection. I think some medical workers are doing that, using it maybe, or getting it prescribed perhaps as for another use. But the word is that some are and some aren't. I mean, I think it's not a bad idea to do it, but that's up to the doctors. But there is a theory going around that in our country and some other countries, people are taking that work in the hospitals, that work with the patients, because there is some evidence. And again, it's going to have to be proven. It's very early. You know, we're rushing this stuff through. This was supposed to take a long time to be approved, and I prevailed upon the FDA to get it approved immediately on the basis that it was already on the market for a lot of years for another use, malaria mostly, and arthritis, but mostly malaria. So we'll see what happens, but there is a theory out there that for the medical worker, doctor, it may work. It may work. And if you take it, it's, you know, it's been out there for a long time. Please, go ahead.
I just wanted to go back to Jim's question about the national stockpile. The governor of Connecticut today.
About which?
The national strategic stockpile. Governor of Connecticut today said that he was disturbed to learn that the stockpile is now empty. That's his words. And he said...
Well, it's not empty. Let me explain something. What we do, and I thought I said it accurately, I certainly meant to, rather than having it brought into the stockpile, where appropriate, other than certain things like we have quite a few of the ventilators, which is not a lot when you look at the whole country, actually. It sounds like a lot, almost 10,000. But we're trying to have supply sent directly to the states because we save a big state. We don't want medical supplies coming in to warehouses all over the place, and then we take them from there and bring them to another warehouse. So we're having it brought from ideally from the manufacturer directly to the hospital or the state where it's going. So we're trying to keep it that way as much as possible. Now, in some cases, we are having it brought. Remember this, we also took over a virtually empty, and I say it again, just like we had no ammunition in the military, and we had virtually no ammunition, well, we had very little in medical supplies, too, in our stockpile. So for the most part, we're trying very hard to have it delivered to the site where they need it. Yeah, please, go ahead.
President, here in the United States, domestically, we can practice social distancing, but some of our sailors, specifically on the USS Theodore Roosevelt, they're not able to. They're in confined spaces. What are your thoughts on that? Should they be offloaded? And then, sir, are you concerned?
I'm going to let the military make that decision.
Yes, sir, but are you concerned about U.S. military readiness during this pandemic? For instance, what would happen if, as reported, China was to increase patrols in the South China Sea? What would your response be?
We're going to see all about that. Don't worry about our military. You know, you saw the military put up a hospital in 3.5 days with 2,900 beds, with a lot of beds. Nobody's ever seen anything like it. And by the way, that wasn't the only one. It wasn't just at Javits Center. It was at other locations. And now it's Louisiana, and now it's New Jersey, and now it's other places. one thing that I think is indisputable is when I watch the Army Corps of Engineers and FEMA working with them, but when I watch the Army Corps of Engineers throw up these hospitals, and they're complex. I mean, these are incredible buildings, essentially, tents and various things, but they did it in such a short period of time. And our military is ready like you haven't seen. And you know who the best guests are, the different shows are? We watch the shows at night. And I think the best guests that I've seen in a long time are the military people, and they've never done it before. I've watched General Semonite, who I deal with a lot. I say, General, you got to give us 2 new hospitals in Louisiana. Yes, sir. And the next morning, they're building them at 6 o'clock in the morning, and they're up in 3 days. I think they're the best guests you have. I guess I'm tired of the other guests, in all fairness.
What kind of message do you have?
Okay, Jim, go ahead.
Yes, this may be an uncomfortable question, but what would the models have looked like that Dr. Birx and Dr. Fauci showed us if we had started these social distancing guidelines sooner, in February or January, when China, South Korea were doing those sorts of things?
Well, I'm going to let them answer that.
In terms of what information we're getting from them, but if we had started these practices sooner, could these models be different right
Yeah, I'm
now?
going to let them answer the question, but remember this, and again, I say it, and everybody says it. You know who says it better than anybody is Dr. Fauci. I had a decision to make. Maybe it was my biggest decision. China was heavily infected, and thousands of people were coming from China to the United States. And against the wishes, not even wishes, but they disagreed with the decision, I made a decision to stop China from coming in. Took a lot of heat, even from China. They weren't exactly happy. I just made a trade deal, a big one, $250 billion trade deal, and I'm shortly thereafter saying you can't come into our country. That was a big decision. That was earlier than the dates you're talking about. So that was a big decision. That was probably, and by the way, not because I did it, that was probably the biggest decision we made so far. But if you look at the one graph, the problem New York has is New York started late, but the other ones didn't start so late. Now, New York is also more complicated because, you know, for obvious reasons, but it got a late start. But do you want to maybe answer those questions?
I don't know if you can go back to slide 2, because I wanted to explain 2 things that I think is really important, because we had a lot of questions about mortality and what it meant. Okay, so you see this confidence interval? So here's the line. This is the confidence interval. This is where we have the ability to push it down. So you have a large confidence interval around the line. And so we're trying to move that gray down tighter and below the dotted line. So I think that's really important. And then if you can go to the next slide. So we really can't answer your question until we can get antibody testing out there. Because what we can't tell you is and we can always do this, there's always samples in hospitals and other things. It's the way we really defined the HIV epidemic in the United States. We were able to go back to blood samples when we had the test and really find out where it was and what was going on. We really need to look in here and really see, was there virus significantly circulating in early March and in late February, and what did it look like, and where was it? And was it all in the metro areas? And I think that's what Dr. Fauci and I are very, very focused on, is getting serology testing out there to really figure out when it came, and really have those samples to be able to do that.
Because you understand the painful part of my question, and please, I don't mean to put you on the spot.
No, we understand, but we
there may
can't
be
answer it
Americans
till,
at
yeah,
home
until
saying,
we
if we
see
had
that.
started this sooner, we might not have 100,000 to 200,000 Americans dying.
Well, that makes an assumption that it was here, there was a lot back here that we didn't see. And until we have the antibody test, I can't really answer that.
Just to underscore what Dr. Birx was saying, if there was no virus in the background, there was nothing to mitigate. If there was virus there that we didn't know about, then the answer to your question is probably yes. Now, the only trouble with that is that whenever you come out and say something like that, it always becomes almost a soundbite that gets taken out of context. But I think that's very important, what Dr. Birx has said, is that if there was covert infections here that we didn't know about, and we didn't mitigate then they would have made a difference. If there was virtually nothing there, then there's nothing to mitigate. And I don't know the answer to your question.
But we were watching South Korea, and China and Italy, and we weren't taking action when those countries were spiking.
Sure. In a perfect world, it would have been nice to know what was going on there. We didn't, but I believe, Jim, that we acted very, very early in that.
If we had adequate testing, would we have known?
Yeah, we would have known the same thing. We inherited obsolete tests.
Can I speak to that too as well? President made reference to the fact January 31, he suspended all travel from China. Shortly thereafter, we issued strong travel advisories for the sections of Italy implicated and sections of South Korea. And we reached agreements with those countries to screen all passengers from all airports coming into the United States of America. The president's initial efforts were designed at preventing the coronavirus from coming into the United States. And what our experts have told us again and again at the Coronavirus Task Force is that those actions bought us a significant amount of time on this curve to respond with the kind of mitigation efforts, standing up resources, testing, and supplies that are in effect. But we went from a prevention strategy the president acted on before the month of January was over to a mitigation strategy which continues to this day. And if I can also say, just to every American, all the questions about resources are very important, and I can assure you that the president and our task force are preoccupied with these issues and working with governors hour by hour to meet those needs. But if Americans will put into practice these guidelines for another 30 days, they'll do their part to lower the curve and save lives, most importantly, and limit the burden on our hospitals and our healthcare system in the country significantly. And so make no mistake about it, while we're going to work our hearts out, leave no stone unturned to find the resources, the masks, the ventilators that we need. And we are going to meet that moment with the full energy of the American economy and the whole of the American government. The American people have a role to play in preserving that medical capacity in a way that will ensure that people that are caught up in the coronavirus, particularly those that are vulnerable to the most serious outcomes, which are seniors with serious underlying health conditions or anyone with an immunodeficiency, have the resources to support and the health care that every American family would want their loved one to have.
I do think we were very early, but I also think that we were very smart because we stopped China. We had never done that before. You know, we had never closed our borders before, as I read, I don't know, maybe that's not right. And Dr. Fauci had also said I think it was maybe the biggest moment because we were stopping the source, we were stopping the infection, but we also stopped Europe very shortly thereafter. That was a big decision. That was not an easy decision either. I stopped them a long time before people started stopping anyway. So we stopped China, we stopped Europe, we stopped all of Europe. And then ultimately we stopped UK, Ireland. Yes.
Mr. President,
please in the back, the very back, please.
Mr. President and the team, going back to hydroxychloroquine, how many clinical trial tests numerically would you like to see before you put a stamp of approval on it? Because there are clinical trials being taking place around the world right now.
Sure, please.
Is there a number? How many cases would you like to see?
That is an FDA decision, and it really depends on a variety of factors. What I would like to see a clinical trial that has a comparison to something that is comparable to what it means without the drug. I mean, I keep saying it, I say it all the time, and I'll say it again. It's a controlled trial that compares it to something meaningful. When that
trials that you're watching taking place around the world right now?
Well, there are a number of trials going on, not only in the United States, but also in other parts of the world. You know, right now it's too early to make any determination, but I just want to get back to what I say all the time. The definitive way that you get an answer is by doing a randomized controlled clinical trial.
Mr. President, yeah, please go ahead.
Mr. Connell?
You're talking about the chloroquine? Is that what you're talking about? And specifically for the last question? Yeah. No, there are trials going on. But there are also trials going on. We're trying them on people that are now sick. That's a very important. That's a very important trial.
Experimented with around the world. So my question was really like, are there
We're watching
specific...
whatever happens around the world. We're watching those trials very closely. Yeah.
Mr. President, Mitch McConnell had a line today. He was on Mitch McConnell, yeah. He said that impeachment diverted the attention of the government. Do you think that in any way, this was happening and building at the same time, did it divert your attention or your team's attention or the Vice President's attention?
Well, I don't like to think I did. I think I handled it very well, but I guess it probably did. I mean, I got impeached. I think, I certainly devoted a little time to thinking about it, right? So, but think of it. It was a hoax. It was a total hoax. And when you think that I got impeached only because they had a majority in the House, they didn't get one Republican vote. 196 to nothing. Not one Republican. I don't think it's ever happened. The Republicans stuck together. And they stuck together in the Senate 52 to a half. A half. So, when you say that, yeah, I think it took a lot of, I see them going and saying about speed. Well, they probably illegally impeached me in the sense that if you look at the FBI today with what happened, the horrible things, nobody cares about that now because all they're thinking about is the virus, and that's okay with me. But you look at the report that came out from I.G. Horowitz, it's disgraceful what went on. It's disgraceful. It's a total disgrace. They got caught in the act. But you know what? We won't talk about that now. Did it divert my attention? I think I'm getting A+ for the way I handled myself during a phony impeachment, okay? It was a hoax. But certainly, I guess I thought of it, and I think I probably acted. I don't think I would have done any better had I not been impeached, okay? And I think that's a great tribute to something. Maybe it's a tribute to me. But I don't think I would have acted any differently, or I don't think I would have acted any faster. But the Democrats, their whole life, their whole being, their whole existence was to try and get me out of office any way they can, even if it was a phony deal. And it was a phony deal. And it turned out, and all you have to do is look today at the FBI reports, take a look at what the FBI did. Take a look at the people. Take a look at Comey's report, 78 pages of total kill. Take a look at that. Take a look at the report on McCabe. Just read it, and you'll see how horrible it was. And you know what? I don't think this country is going to take it. You want to know the truth?
Phone call you have time to make? How did it take you out?
What guidance are you offering to Florida when it comes to the 2 Holland American cruise ships that are seeking to dock here?
Yeah, well, I'll be speaking. I'm going to be in fact, he has a call in to me. We'll be speaking to the governor, and we'll be speaking to him soon. But there's a case. We have 2 ships. There are people that are sick on the ship. And we don't want to be like they're going to be ghost ships. People turn those ships away. There was a ship, as you know, in a certain part of Asia, and from port to port, nobody would take it. But in the meantime, you have people that are dying on the ship, or at least very sick, but they're dying on the ship. So I'm gonna do what's right, not only for us, but for humanity. I mean, these are 2 big ships, and they have a lot of very sick people. And I'll be speaking to the governor. Let's do just a couple of more back here. Yeah, go ahead, please. We'll get to it. Yeah, go ahead, please.
Thank you very much. I was hoping you could...
You ever run out of questions? It's the most unbelievable thing. You go through the room, but I have nothing else to do, so if you want, should we keep it going, John? I think so.
Can you clarify something for me, please? Andrew Cuomo today said that the system that you have where governors are trying to get ventilators, it's like being on eBay with 50 other states bidding on a ventilator plus FEMA. And then you just said tonight they
you mean he was complaining?
Well, he said...
Say it. What did he say exactly? What did he say?
He said that when you have states competing for ventilators in medical care, it's like being on eBay with 50 other states bidding on a ventilator.
Well, he shouldn't be complaining because we gave him a lot of ventilators. And if you take a look at the chart, it's down. But I wish he got going a little bit sooner. But we gave him a lot of ventilators. And you know what? He has a lot of ventilators. The problem is with some people, no matter what you give, it's never enough. It's never enough. Like they'll say, how's Trump doing? And you're a Democrat. Some of them said really good. I'll tell you, Gavin Newsom,
from California, who's doing a good job, by the way, and others said really good. But, generally your natural reflex, how's Trump doing? You ask that question to a Democrat. We don't like it. Oh, really? You don't like it? We're getting very high marks, but I'm not doing this for marks. I'm doing this to save lives. When John saw the numbers and when Jim saw those numbers, they're shocking numbers. You're talking about deaths. Even at the low end, you were shocked when you see 100 and 120,000 and 200,000 people over potentially a very short period of time. I want to save lives. I'm not doing this for any other reason. I want to save lives. But the governor of New York's gotten, I think maybe probably gotten more than anybody. He's gotten 4 hospitals. He's gotten 4 medical tents. He's gotten a ship, the likes of which nobody's ever seen before, other than Los Angeles, which has the twin. We've done a lot. But many ventilators were sent to New York. And Mayor de Blasio, I'm getting along with Mayor de Blasio great, and I think he's very happy with the job we're doing, too. We're sending a lot of, actually, Mayor de Blasio had an interesting request. He wanted people, and we're sending medical people. A lot of the states aren't having a problem with ventilators, they're having a problem getting medical people. And we're sending a lot of people in, military, very talented people. Who didn't go? Go ahead, and then I'll do you second.
Your response to that question earlier was that they shouldn't be doing that. If they need something, if they need them that
They shouldn't be doing what?
They shouldn't be, the governor shouldn't be competing with each other.
No, they shouldn't be competing, and they should call us. Wait, no, I don't want them to compete because all they're going to do is drive up the price. I don't want them to compete. They should be calling us, and we can work it so they get the ventilators and they get shipped directly. If they're competing, if they're calling, even if there's only 2 of them calling, they're going to just drive up the price because as nice as some of the people that do ventilators, they do want to make money, okay? Now, New York had a chance to buy 16,000 ventilators. I guess they didn't take that option. That was in 2016. And that's a hard option to take because it's a lot of money, and who would ever think you need 16,000 ventilators? Who would ever think it? But this is a very unique time in life. And I think, I'm dealing with New York, and we're having a very good relationship. And you see what just happened in Central Park with the tents. We're having a really good relationship. Go ahead. You didn't get one, and then we're going to you.
Thank you. Gavin Newsom, you mentioned Gavin Newsom and the job that he's doing. I'm interested in what you think California has done to contribute to the suppression of the curve.
Well, they've done a good job, California. Now, let's see what happens, because we could have a spike, doctors. You don't know. They could have a spike where all of a sudden it spikes upward. We had a couple, like Louisiana. I think they're doing a really good job, but they had nothing. Now, they had Mardi Gras, and then all of a sudden after Mardi Gras, which tells you about distancing, I guess. It's an example of what could happen, but they were, flawless. I was always surprised. I was looking at Louisiana, and I understand that state. I love that state. And I'm saying they're in great shape. Then they have Mardi Gras. It was a big success, tremendous success, and then all of a sudden it went like a rocket ship. So that tells you about distancing, please.
Are you concerned, though, about the homeless population in California? Because I know California officials think that it could spread like wildfire. Obviously, there's a
Say it again, louder.
There's a homelessness crisis in California.
Yeah,
they're obviously concerned that it could spread like wildfire in that community. So is there anything the administration...
Well, they're looking at that very strongly, and I know that it bothers Gavin. I don't know if it bothers Nancy Pelosi, but she's got it in her district at a very high level. They have to be very careful. They have a very big homeless population in an area which just a few years ago didn't have anybody in those areas. And they're living in the streets. And I know that some people in California are working on that very hard.
Mr. President, you spoke several times with Prime Minister Trudeau, President Macron, and at the end of last week, President Macron talked about an important initiative that you and him would launch. Any news on that?
No, we're talking about something that will be very positive for the world if we do it. We'll see if we do it or not. Well, I don't want to talk. It's a private thing, but it will become public if we decide to do it. But positive. Our relationship with the president, our relationship with France is, I think extraordinary, very good, probably as good as it's ever been.
Get back to your comments about what could have happened and the actions that you took. Is there any fairness to the criticism that you may have lulled Americans into a false sense of security when you were saying things like it's going to go away?
Well, it is.
And that sort of thing. But
Jim, it's going away.
But when you were saying
it's going to go away, hopefully at the end of the month, and if not, it hopefully will be soon after that.
But hasn't your thinking on this evolved?
Jim, it is going away.
Hasn't your thinking on this evolved? You're taking it more seriously now.
I think from the beginning, my attitude was that we have to give this country. I know how bad it was. All you have to do is look at what was going on in China. It was devastation. And well, yeah, look at the numbers from China, those initial numbers coming out from China. But, you know, I read an article today which was very interesting. They say, we wish President Trump would give more bad news. Give bad news. I'm not about bad news. I want to give people hope. I want to give people a feeling that we all have a chance. I mean, when you saw the numbers, and when John and all of you saw those numbers, and you're saying 120,000 people, you mean that's good? 100,000 dead people within a short period of time. I want to give people a feeling of hope. I could be very negative. I could say, wait a minute, those numbers are terrible. This is going to be horrible. This is a horrible thing. Hey, Jim.
Last month and said, okay, let's go to the beach. Let's go to the airport. Let's go down to Mardi Gras.
Well, there were a lot of people. There were a lot of people that could have said that. We didn't say that. Fortunately, I didn't say that. And that was an alternative. We talked about it. That was always an alternative. That's what I said. Let it rip. Let it ride. Do nothing. And we could have had 2.2 million dead people, more than that, because I didn't do that. And we did catch it early, and we stopped China really early, and we stopped Europe really early because I saw what was happening. What happened is I stopped Italy because Italy was really heavily infected. We started off with certain parts of Italy, then all of Italy, then we saw Spain. Then I said, stop Europe. Let's stop Europe. We have to stop them from coming here. Europe. I love Europe. But they were having problems. I don't think anybody did a better job than that, especially when you see the 2.2 million number. And I hope we're going to be substantially under the numbers that you're looking at on the minimum side. Then I think we will have, hey, look, it's still tremendous death.
You weren't just hoping that it would dissipate, that this would disappear.
I want to be positive. I don't want to be negative. I'm a positive person. Somebody said, oh, I wish you'd be more negative. They literally have that. It's in one of the wonderful newspapers today. I wish you'd be more negative. Well, this is really easy to be negative about. But I want to give people hope, too. You know, I'm a cheerleader for the country. We're going through the worst thing that the country's probably ever seen. Look, we had the Civil War. We lost 600,000 people, right? Here's the thing. Had we not done anything, we would have lost many times that. But we did something, and so it's going to be hopefully way under that. But, you know, we lose more here potentially than you lose in world wars as a country. So there's nothing positive, there's nothing great about it, but I want to give people in this country hope. I think it's very important.
It was going to be this severe when you were saying this was under control.
I thought it could be. I knew everything. I knew it could be horrible, and I knew it could be maybe good. Don't forget, at that time, people didn't know that much about it. Even the experts, we were talking about it. We didn't know where it was going. We saw China, but that was it. Maybe it would have stopped at China. We wish we could have killed it in China. But it didn't happen. It started spreading to Europe. It started spreading here. It started spreading all over. And I'm not blaming anybody. I'm just saying that we have an incredible thing. I think the people, our professionals, our military, our governors, our politicians, I think they've done an incredible job. I mean, with few exceptions, I think they've done an incredible job. But I don't want to be a negative person. It'd be so much easier for me to come up and say, we have bad news. We're going to lose 220,000 people, and it's going to happen over the next few weeks. And with that, I did start off by saying today, long before this question, I said, this is going to be a rough 2 or 3 weeks. This is going to be one of the roughest 2 or 3 weeks we've ever had in our country. We're going to lose thousands of people. When I see 28, 29 people from the governor of New Jersey, 29 people. When you see 173 people died in New York yesterday, or whatever the number was, I think it was more than that. When you see the kind of numbers that we're witnessing, we've never seen numbers like that. So it's easy to be negative. And then everybody can be negative. But I'm a cheerleader for our country, and I want them to do a great job. So the number can be kept, and I've always said it,
I want as few a number of people to die as possible, and that's all we're working on.
You don't like the question, but are you now taking
I don't mind the
responsibility?
question.
Do you mind?
I don't mind your question. I think it's actually, I think it's not meant to be. Look, I know you well enough, so it's not meant to be a fair question, but it is a fair question. I think we've done a fantastic job. Okay, fine, I'll accept your word. Look, Jim, I think we've done a great job. We're going to see how it comes out. But when you look at minimal numbers of 120,000 people, when you look at it could have been 2.2 million people died and more if we did nothing, if we just did nothing. It would have gone up, it would have come down. As per your statement, it would have been confined. It would have been a similar time, maybe even less time. It would have been a violence like we've never seen in this country before. We had great professionals, great military, really great governors and politicians. I cannot say enough about what's going on. And as per what you said, I think we're way ahead of schedule in terms of numbers. I hope. But if we can keep it under the minimum numbers, the country has done, not me, the country has done a great job. But I think I've done a really good job of mobilizing. I think Mike Pence has been fantastic. I put him in charge of the task force. We have wonderful people on the task force, Jim, wonderful people. This man was working, literally, he had days where he didn't go to bed, he didn't go to sleep, he went 24 hours and then started the next day. People don't know the job he did. I didn't even know he was that good of a manager, to be honest with you, Mike, okay? And you know, you never know that about somebody until they're tested under fire. But he saw it very early also. We both did. They saw it very early. They knew pretty soon, they probably knew sooner than anybody, because that's what they study, that's what they do. Must be a depressing business, right? Must be a little bit depressing, but they've seen it all. Go ahead, Jim.
Can I ask Dr. Fauci a question about a headline that's been running all day to get his perspective on it? There is a professor from MIT, Dr. Fauci, who suggests that coronavirus can be carried on droplets a distance of 27 feet. Do you buy into that? And if that might be the case, does that suggest that current social distancing guidelines may need to be extended?
This could really be terribly misleading, John. What it was looking at the distance that droplets fly by speaking, by coughing, by sneezing. So if you go way back and go, achoo, and go like that, you might get 27 feet. But so when you see somebody do that, get out of the way.
There are some people.
But that's not practical.
I know people that.
That is not practical, John. I'm sorry, but I was disturbed by that report because that's misleading. That means that all of a sudden the 6-foot thing doesn't work. That is a very, very robust, vigorous achoo sneeze. That's what that is. And that's not what we're talking about.
You want to keep going?
One more, I have one more, sir.
Go ahead. How about over?
I've got a follow-up on the masks, sir, but first, you mentioned Franklin Graham earlier,
Yes.
talking to him. As you know, his father, Billy Graham, was a trusted spiritual advisor and friend to many presidents. A lot of your predecessors in times of national emergency reached out to pastors and other spiritual counselors. Have you done that during this national emergency?
Well, I never say that, but Franklin Graham is somebody that's very special. I have many very special people, and very many special in the evangelical Christian community. You can talk rabbis, you can talk a lot of, I have tremendous support from religious leaders. And Franklin Graham, I just spoke to him today for an extended period of time. I told him what a fantastic job you're doing. And he does this. He loves doing it. He loves helping people. And he loves Jesus. That I can tell you. He loves Jesus. He's a great gentleman. Go ahead.
On the masks, sir. On the masks, maybe for the doctors.
The what?
On the masks, is the reason why there's no CDC recommendation for the public to wear masks because they're meant to save and preserve the masks for the medical workers, or is it because the virus is not primarily transmitted through the air?
So there was the CDC does have recommendations on their website about masks that came to the task force several weeks ago about if you're infected, wearing a mask to protect others. And if you can't, if you're working with someone who's sick and you have to be that worker in the household, because remember, we want people in the household being taken care of, that they should wear a mask. I know your question is broader than that, and it's just being considered by the task force now about whether that recommendation that already exists relevant to wearing masks should be altered in any way. So it's still under discussion.
And just about masks, you can get a mask, but you can also most people have scarves, and scarves are very good, and they can use a scarf. And we're only talking about a limited period of time. And it says in the recommendations you can substitute a scarf for a mask. So if people feel that, and I think, some people disagree with the mask for various reasons, and some people don't. But you can wear a scarf, you can do the masks if it makes you feel better. We have no objection to it, and some people recommend it. Let's go back
Thank you,
into the back.
Mr. President.
You people never get tired. Look at you. And there's still good questions, actually.
Mr. President, again, I'm looking at the cases around the world in Latin America and the Middle East, and still you don't want to impose a travel ban for these areas. In Brazil, for instance, the President Bolsonaro, he keeps on being very active with groups. Aren't you afraid that what we're doing here can be threatened?
You mean you people?
Not here, but I mean the United States.
I mean, you're pretty spread out already. I don't have any more.
But you
I don't think we'll have press conferences anymore. But
I understand what
look, we're very careful. I'm very careful personally, and.
But the travel ban, I mean, aren't you afraid?
We are looking at numerous countries as they get in a position. Brazil, as an example, you mentioned the president. Brazil had no problem until just a short time ago. And now they're starting to get inflamed. And yes, we are absolutely looking at a ban. There are two other countries you mentioned. Iran already has a ban. They had sort of an automatic ban. In addition to that, they have a ban. So we're looking at certain countries as they become hot.
So, Mr. President, you're starting a new 30 days now. What are your plans? Are you going to stay in the White House? Are you going to travel at all, or you shelter in place?
I doubt I'll leave. I wanted to go to the opening of the hospital in New York, and my people couldn't even believe it that I said it, but I did. I wanted to go. They didn't want me to do it. The Secret Service didn't want me to do it for reasons. I wanted to go to the boat sailing into New York Harbor, but the governor did a good job of that, and the mayor of New York. So, I'd love to go out, but now I'll be in the White House, and it's sort of like a nerve center, control center. And I think it's important, look, you see what happened with Boris Johnson, you see what happened with others. I think it's important that I remain healthy. I really do. So for the most part, we're staying here. I've canceled many different events, and we'll be staying here for the most part.
Mr. President, Tom Frieden, the former director of the CDC, wrote an article the other day in which he said what's really needed here, and he understands the work that the task force is doing, is an incident commander to really take command of where everything is going and how things are being coordinated.
We have it.
Is that something that could be useful in this particular instance?
We have it.
His name is Pete Gaynor. He's the administrator of FEMA. And when the president signed the National Emergency Declaration, he stood up the National Response Center at FEMA. And now I can tell you that when the White House Coronavirus Task Force meets, I'm at one end of the table, and Pete Gaynor and the whole FEMA team are by video conference at the other end of the table. And that's where, whether it be the air bridge that's literally bringing in millions of medical supplies from around the world, the thoughtful deployment of those supplies to hospitals, particularly with regard to ventilators. We're working very closely. HHS is fully integrated at FEMA now, but because of the president's decision to stand up FEMA in the lead, we have a coronavirus task force at the White House that's bringing the president the very best health experts and recommendations from every agency. But all the implementation, as we tell governors literally every day, is happening through FEMA. It's going down to the states through FEMA, and state requests are coming up through regional administrators for FEMA and back to the White House for consideration.
At the same time, we have 4,000 ventilators that are parked in a warehouse in New Jersey. No, but that was the case. We also have... We
moved them out.
I understand.
They had them a long time ago, but they didn't need them.
But the question is, this happened. We also have people not knowing about the new Abbott testing facility, or testing system. If there were an incident commander who was in charge of all of that and getting the word out, would that be a useful thing?
Nobody knew about the new Abbott. It was just
brought to life 2 weeks ago. They just came up with it.
That's right.
It was an invention that was just, so nobody knew about it. Nobody knew you could even do it. They did an incredible job. Their scientist came up with the idea a week and a half ago. I showed it to you yesterday in a box. I don't think you can do much better than that.
If I may, Mr. President, I think your point's well taken. The Abbott Laboratories point of contact test was approved Friday. The President announced it in the Rose Garden on Sunday.
Should have done it.
We're socializing that all across the country to every governor, to laboratories elsewhere. And I have to tell you, that this team that the President has assembled, the advisors on the White House Coronavirus Task Force, and then this team at FEMA, whether it be HHS Deputy Secretary Bob Kadlec, who's coordinating all supplies, whether it be Admiral Joie, who is literally working with every state on a county-by-county basis to deploy testing, is impressive. And I think it's given great encouragement to governors. President and I spoke to governors in all the states and territories again yesterday, because governors, I can tell you from my own experience as a governor, in Indiana, we had tornadoes and flooding. Governors know how to deal with FEMA. And as soon as the President stood up FEMA, declared that national emergency, what I'll call a certain amount of muscle memory kicked in states around the country. And we're really seeing a tremendous efficiency and communication, and that's how we're going to go forward. Again, the President's vision here is FEMA's vision, which is in response to a health crisis, it's locally executed, state managed, federally supported, and I have to tell you, we're seeing that whole process spinning up every day, and I hope Americans looking on are encouraged by that system. And I know they're hearing from governors around the country about the flow of resources and testing and supplies, and we'll continue to keep that, what you call an incident command, what we call the Federal Emergency Management Agency, working 24/7.
And I have to say this, I've had, in the last less than a week, 3 governors call up that truly have disliked me over the years, even before I decided to run for president. And they said, I have to tell you, you've done a great job. You and your team have done a great job. These are 3 governors, respected, very respected in 2 cases. And they said, like or not like, you and your team have done an incredible job. And I think they have. I think they've done an incredible job. Go ahead, please.
Mr. President, thanks so much. My first question is on modeling. Was there any kind of White House modeling based on whether or not there would be a national lockdown or some sort of guidance to every single state that they needed to have lockdowns?
So all of the modelers who presented I just want to thank them again, because they assembled from around the globe very quickly about 2 or 3 weeks ago to before we announced the first 15 days to show all the implications of closing the schools, having people stay in their homes, and that's how it was modeled. Stay in your homes, social distancing of 6 feet. So no one actually termed it a lockdown. As far as I remember, it was more about staying in your home. And I think the difference was, and these weren't in the models, and I think when you talk about could we have known something different, I think all of us, I was overseas when this happened in Africa, and I think when you looked at the China data originally and you said, oh, well, there's 80 million people or 20 million people in Wuhan and 80 million people in Hubei, and they come up with a number of 50,000, you start thinking of this more like SARS than you do this kind of global pandemic. I'll just be frank, that's when I looked at it, I was like, oh, well, this is not, if as close as those quarters are, so I think the medical community interpreted the Chinese data as that this was serious, but smaller than anyone expected, because I think probably we were missing a significant amount of the data now that when we see what happened to Italy and we see what happened to Spain. And so what was modeled is not a lockdown. 2 countries did remove people from homes that were positive and put them in separate spaces. That also wasn't modeled, but it could be modeled. And so we could go back and ask the modelers about lockdown versus not lockdown, but what they modeled was people staying at home.
I guess what I was asking is for best case scenario, since it says best case scenario is 100,000 people. I know you're trying to get that number even lower, but is best case scenario every state basically having lockdown behavior, not maybe actual lockdowns, but basically everyone staying in their homes. So if that's true, why not tell every state to do that?
It's everybody social distancing by 6 feet when they're outside. And that is probably absolutely the key more than anything else, is if you're never within 6 feet of any single individual, then you've controlled the virus. There are different methods to get you to that point. And I think what I've heard from our president and our vice president is they trust the American people to understand that they can be outside, take walks, be 6 feet away from anyone else, and be in their homes. And we trust them to do that without having to lock down.
And then, Mr. President, a question on ventilators.
I just want to add, I think the one thing nobody really knew about this virus was how contagious it was. It's so incredibly contagious, and nobody knew that. This is like, I don't know that anybody's ever seen anything like this. Normally you'd have to get close and touch and this, and a lot of things have to happen. This is just like, it's truly invisible and so contagious. And I don't think any doctor knew it at the time. I don't think anybody could have known it. People have not seen anything like this. Yeah, so
a question about ventilators. You talked about the fact that you don't want to see states bidding against each other. The governor of New York, Andrew Cuomo, said that there should be a federal system where the federal government sets the price, the federal government distributes the ventilators. Why not have that kind of system? Why have this?
Well, essentially we do. We've distributed thousands of ventilators, and we have now thousands of ventilators, and we're buying them at a good price, and we're actually making them by the thousands. We're making them. You saw yesterday where Ford is going to have a tremendous number. They're looking to make 100,000 ventilators. Ford has been great. General Electric Healthcare has been great. General Motors has come a long way. I have to be honest. They're working very hard. We're making thousands and thousands of ventilators. You know, at the end of this, and there will be, don't say I'm optimistic, because I don't want to, I wouldn't want to do that. But I am optimistic. I'm a very optimistic person. Let me tell you, we will have thousands of ventilators. And what I want to do is make sure that we always have plenty for the future, but then we want to help Italy and France and other countries that you don't even know about yet with all of the problems they have, because ventilators are very tough to come by. They're very hard to make. They're very complicated. They're very expensive. Yeah, please.
Is Governor Cuomo mistaken?
You could go ahead. Go ahead.
Is Governor Cuomo mistaken when he's saying?
Well, I don't know. I can't take your interpretation of what he said. I don't know what he said. I think he's been reasonably generous, considering he's a Democrat, and I think he'd like to run for president. So I think he's been pretty generous under those circumstances. But he's been very generous to me. Look, I got him ships, I got him hospitals, I got him a lot of things that he never thought he had pay dirt, okay? And I've been very generous on ventilators. If you look, they had 2,000 and 4,000. They had thousands of ventilators in his warehouse, in their warehouse, waiting to be picked up. They never picked them up. So I'd have to hear it from him, face to face. Do you want to? And how about one more, and we'll see you tomorrow. Is that okay? Don't say that I cut it short. They'll say he. That's right. It could be almost tomorrow. But you know what? In the meantime, I'm sure people are enjoying it. No, I will say this. It's an incredibly dark topic, an incredibly horrible topic, and it's incredibly interesting. That's why everybody is. They're going crazy. They can't get enough of it, and they want to be careful. And I guess they're studying it for themselves. They're studying if they get it. A lot of people have it. A lot of people are positive, and they hope for the best. Because when this gets the wrong person, meaning a person that qualifies, generally speaking, under the list, it is ravaging. It is horrible. Go ahead. How about you in the back?
Thank you. Is there any data to suggest that you're going to see a second wave at the point at which these stay-at-home orders, these lockdowns?
Well, if we do see a second wave, because I've heard Dr. Fauci answer this question, if we do, we're going to be, I think, very well prepared. And the second wave won't be like the first wave. And with that, I better let him give you a little bit more to that answer, because I don't want to have him upset with me and say, I wish you would have answered that question. Come on, doctor.
So when you talk about second wave, I think you really are talking about two different things that are a little bit different. So, for example, after the 30 days, if we get the mitigation that we hope will get us to the suppression that Dr. Birx was talking about, there's a danger if we don't continue to maintain that we have a resurgence right within the current outbreak. That's sort of a second wave, but it really is an exacerbation of the current wave. We hope that doesn't happen, and that's why we're really pushing and why I was so emphatic about making sure we abide by those mitigation strategies. The other aspect of a second wave is something that's just the nature of a virus that's, as the president said, highly transmissible and is going to be circulating in other parts of the world as we're going down, which I think we will, and I feel certain that we will. Then we have to worry about the next season. And as was just mentioned, that's when you use the experience that you have, the interventions that you've developed, and hopefully a vaccine that you'll be able to deploy as quickly as you possibly can. That's that second wave that really is more seasonal than an exacerbation of something that you pull back on.
Dr. Fauci, can I ask
And
you
a lot of very
mortality
positive
rates?
things are happening with the therapeutics and drugs of different kinds and the vaccines. I think a lot of very positive things are happening. Okay, one more. Please, go ahead.
So under some of the worst case scenarios, there is a real scarcity problem if you've given out, say, 7,000 ventilators and we've got 10,000 around. So I'm just curious, who signs off on those life and death decisions before GM and Ford ramp up?
Well, I would
who's
say
gonna sign
Mike
off?
Pence, myself, the head of FEMA, some of our generals that are working that are doing an unbelievable, we have generals that are working that are unbelievable talents, unbelievable leaders, and it'll go through one of 3 or 4 people if it comes down to that, and I hope it doesn't come down to that, because I think we're very well equipped. And it's an honor to be here tonight. I appreciate it. I appreciate your interest. I think there is a great interest in it. And we'll see you tomorrow. We'll see you tomorrow. Thank you. Thank you very much.
Thank you, sir. Thank you,
Marathon briefing at the White House, everyone. More than 2 hours long. President Trump just kept saying one more question. But again, that briefing longer than 2 hours. We're going to take you out to San Diego now. They're holding their briefing live, but I have been recording since the beginning.
Contact. Another item, don't take your whole family to the store. Keep it to as few shoppers as possible. And of course, customers and employees should always maintain a 6-foot distance while in the grocery store. We're also seeing many grocery stores taking preventive measures themselves. This includes, of course, adjusting their hours of operation, ensuring checkout line management with 6 feet physical distancing rules, and reinforcing over and over the importance of sanitation and worker health, and encouraging employees to contact their employer upon becoming sick so the store can take appropriate and immediate action. Some grocery stores have even taken these preventative measures, continue to take these preventative measures, and we encourage more to do the same. Yesterday, as I think many of you know, county officials announced that 3 grocery store employees contracted COVID-19, highlighting just how important all of these steps are. The measures that we are encouraging today will help reduce the chances that people get sick, whether they work at a grocery store or shop at a grocery store. Earlier today, I had the opportunity to have a conference call with the California Grocers Association President and CEO, Ron Fong, about actions that the industry is taking to help stop this crisis. He reiterated the importance of health and safety for shoppers and workers. He also reiterated the strength of our manufacturing supply. I think this is something that we need to continue to stress. The grocery stores will continue to remain open, and that essential supply lines remain plentiful. Truckloads of groceries every single day continue to come from food suppliers steadily. And we appreciate that all San Diegans have a role in helping, making sure that we're getting that food and that food is on our shelves. But again, I'm encouraging San Diegans to shop for only what you need. There is plenty to go around, and every day there is more on the way. The supply chains and the distribution centers are working. And taking these simple steps to get just what you need is going to ensure that when San Diegans go to the store, the customers and employees remain safe. That's how we're all going to help get through this together. I'm going to turn it over to some folks here in just a second to talk more about that on grocery stores. But before I do, I want to give an update regarding public safety professionals. As part of that daily update, I will continue to do this. Every morning, I, of course, remain updates from Chief Nislite, Chief Stoll, and Chief Gartland to see how all of our frontline troops are continuing to do. Today, the report remains at 7 total positive tests for our public safety professionals. With no new positive tests coming back at this time, I'm going to take this opportunity again to remind San Diegans that staying at home prevents fire, police, and lifeguards from being exposed to this deadly virus. And it continues to help keep all of us safe throughout the entire city. I said it before and I'll say it again. Our first responders, they go to work for you, so you should stay home for them. Now I'd like to turn it over to Todd Walters. As I said, he's with the United Food and Commercial Workers, Local 135, to speak on behalf of the grocery workers across our city that are doing phenomenal service to help keep our stores stocked, to keep these supplies moving, and as I said before, serving our San Diegan families and neighbors day in and day out. Todd?
And thank you, Mayor Faulkner, for taking this time. I reached out to the mayor on Saturday. We were at a food distribution. On Friday, I discovered that the first one of our food workers had become ill with COVID. The reason I'm here today is I want to thank the City of San Diego and the County of San Diego for your patience and support of grocery workers. Our workers continue to go to work, but are asking for more precautions to ensure they limit their exposure. This benefits both the frontline workers and the customers. I know many members who have parents and children like all of you, and they're concerned that they won't be able to take care of them. We are seeing retail and medical locations that are controlling foot traffic to a safe level. And we encourage all of these measures be implemented at all locations. We urge grocery workers to wash their hands every 30 minutes, as well as their workstations, and immediately notify their employers if they are sick. There will be sick retail workers and sick frontline medical workers. It's important that the community take care of them and not shun them or turn them away. These people are part of our community. They're risking their lives to serve us. We urge all retail and medical locations to control unsafe behaviors, bad actors. As a few individuals have been disruptive, and when they're denied purchasing items on limits, they cause unsafe work conditions. I've had grocery clerks who are not able to buy the supplies that they need at the end of their shift because it was out, because people don't want to follow the rules. These are the people that worked all day serving the community. We urge our frontline medical workers in all stores to enforce social distancing. We need to mark spots on the floor for customers and patients where they stand so they know we don't get too close. I've had many workers reach out to me in the last 2 weeks that the stores are being overcrowded and there's no way they can socially distance themselves. This has to stop. And lastly, we urge all retail stores to shorten the hours of operations to allow for workers to restock and sanitize, which benefits us all. We commend those locations who are implementing this practice as proactive and ensures safe and seamless shopping experience for everyone. Thank you to the members of Local 135 for serving your community, and thank you all for your time.
Thank you. Thank you for that very important message and another opportunity to thank all of our grocery workers for what they are doing for us every single day. Now it's my pleasure to introduce our City Council President, Georgette Gomez. Council President.
Thank you and good afternoon. I'm Council President Georgette Gomez, and I'm proud to stand here today supporting our grocery, pharmacy, and other essential retail workers. These workers are in the front line on the COVID outbreak. They've been working around the clock, keeping our grocery stores and drugstores open and ensuring that families in our communities have the essential food and supplies they need. Keeping our communities healthy and safe is the first priority, and the workers need strong protections. They're taking care of us. We must also do our part to take care of them. I ask all San Diegans to please follow the sanitation and social distancing guidelines to keep these workers in our communities healthy. If you have to go to the stores, be mindful of everybody around us. Treat them well. They are working hard for all of us. When you have to go and shop, there are things we can all do. Let's do them. Also, this morning, I urge Governor Gavin Newsom to classify grocery, pharmacy, and other categories of essential retail workers as emergency frontline personnel. This classification will provide access for these workers to receive additional protections and benefits they and their families deserve. In honor of Cesar Chavez, let's make sure we are all doing our part and protect one another because we are all in it together. Thank you so much.
Thank you, Council President Gomez. Now I'd like to introduce Jim Hayes, who represents a local nonprofit, Stay Home San Diego, to come up and say a few words. I think all of us know that going to the grocery store can be difficult for some, particularly seniors during this time. Stay Home San Diego, like many local nonprofits, is doing really great things to help the elderly and those that are ill. So Jim, thank you for being here.
Thank you, Mayor, for addressing this topic that's so close to our mission. Stay Home San Diego started exactly 2 weeks ago. It's simple. We know that there's certain people that are more at risk from this virus than we are. And so we shop for them. It started very basically just running out in the morning trying to find the supplies we know that they need. But now we've gotten much smarter, and a lot of businesses have started partnering with us. We're now headquartered out of Firehouse Eatery in Pacific Beach, and we are serving several hundred bags of groceries a day to local seniors and keeping them home safe. We've worked with nurses to make sure we are following the best procedures possible, and it's our belief that it's much safer for a senior to be at home dealing with one person who is carefully catering to what they need, rather than them competing in these grocery stores with hundreds of people. We started basically because we saw the battlefront you described, Mayor, about a lot of people hoarding and trying to buy as many things as they can, and then these senior citizens who don't have the luxury to stock up with 2 months worth of supplies. A lot of them are on fixed incomes or on Social Security. So they're just buying the weekly supplies that they walk to the store to buy every day, and they're putting themselves at risk. And it's a very simple, I say it's simple. I represent a crew of people that are working really hard to get the supplies to them. But there's a website and a hotline because a lot of them can't use the computers very well, so they call in all day long. And it's been amazing. And the grocery workers, they are exhausted, and they're doing everything they can. And they work with us to help us all they can. And so we're really grateful that this specific topic is addressed because it's close to our heart.
Thank you, Jim, thank you so much. That is powerful for all of the right reasons. Before we conclude today, I'd like to share a positive story, as I do, from San Diegans that continue to step up. We all know it's not easy to stay home. Understand that. But I cannot stress enough that that is our best defense in the fight against COVID-19. And as we do it for those in our community who are more vulnerable, because while this stay-at-home order may be an inconvenience for some, it is a true lifesaver for others, particularly our seniors, our disabled, our sick, and our young. They are the reasons why we are staying inside. But when they do, they have to leave home to have access to critical medical care, or receive free lunch from school, or a variety of other things. One ride share in our organization, in our city, Lyft, has really stepped up to provide a safe, free ride wherever they need to go. The San Diego Lift Up initiative has donated nearly $20,000 to rides to help those that are most in need in our community. They have supported San Diego's nonprofits and groups that are serving these at-risk populations by donating free or discounted rides to social services groups in healthcare, including Elder Help of San Diego, Somali Family Service, Red Cross San Diego, and Feeding San Diego. If an average ride is about $15, that's more than 1,000 rides that are going to help get at-risk San Diegans to the services that they need in these tough times. So thank you, Lyft. Thank you for making a difference in San Diego, and thank you for stepping up. This is what we continue to see throughout our great city of ours. I encourage everybody to continue to share these stories of San Diegans stepping up to help their neighbors in need, to use that hashtag San Diego Steps Up, because when we get through this, and we will, San Diego will do it because of our unwavering resolve and our spirit that we did this together. With that, I will conclude today's briefing and be available to answer any questions from members of the media.
Good afternoon, Mayor. I've got actually three questions.
Sure.
I guess a combination maybe between you and Mr. Walters. This is with regards to grocery stores.
Yeah.
We've had a number of grocery store employees who are concerned about social distancing, as you were saying that the stores aren't limiting the amount of people who are going into the stores. Some stores are doing it, some stores are not. Is there anything that you can do as a mayor to make sure that grocery stores limit how many people come in at the
We
same
are
time?
encouraging that, to your question, and I'll turn it back over to Todd. Again, it's helpful for the folks that are shopping. It's incredibly important for our grocery store workers. It helps protect them. It helps protect their health. As I said, we're seeing a lot of stores that are doing this. We want to encourage more to do the same.
More so than encouraging, is there any executive order or anything a little stronger than you can do outside of encouraging? I know this is a free country, but anything that you can do to make sure that companies are doing that, because some are saying that they're not profiting as much, and so they're letting more people inside.
Yeah, no, I appreciate that, and I will let Todd speak here in a second. Again, one of the reasons why it's so important to not only our Grocers Association, but our grocery workers. We're all in this together. We've got great examples of San Diego stores that are doing the right thing. It's not only important for the stores, but it's important for the public to respect that as well. Again, the issues of when you go to the store, go by yourself, don't bring your whole family. That's incredibly important. That's going to help out on some of the crowds that we're seeing in other places. So getting this message out, how important it is, not only having our stores and our workers work closely together, but again, because it's going to have that distance that we all need. Todd, I'm happy to have you jump up and anything else, because your workers have really been on the front lines of this.
Yeah, that's been an issue, and in the very peak of this, our stores were doing double and triple their normal sales, and it was very chaotic. Things have slowed down. I think we're seeing about 40 to 50% increase of normal sales, and what I'm seeing the most right now is everybody thinks that 7 to 8 o'clock in the morning is the best time to shop. It is not. I find that if you go at 11 or 12 or 1, you find that you can get better groceries or the same groceries and not have the crowd. We're also finding that a lot of stores are not curfew stores, meaning some of the stores in residential neighborhoods, they don't get loads from 10 p.m. to 6 a.m. So everybody rushes in there at 8 o'clock in the morning. That load doesn't come until 2 in the afternoon. So spread out the shopping. Our members have been calling our union reps, reporting stores that have no controls on the door. We've been addressing that when it happens. We've handed out the reps have actually had to call the police department on some occasions to get the fire marshal. I don't think it's ever come down to that. I think once we talk to the store managers, they deal with it, and we fix it there.
Yeah, and real quick, can you just readdress that? Because, I mean, that's a continuous issue that I keep hearing from people over and over again, is that how are you regulating the number of people that are going in to the stores? Some stores are doing it on their own, some stores are not. So how are you addressing that with the store owners and management?
As of last week, a lot of the stores had people at the door regulating, counting people going in, people going out. This week, the sales have dropped and they've quit doing the monitoring in a lot of the locations because hasn't been as big an issue this week. I found that it tends to be in waves, and so they're having a hard time knowing when to get up there. But when it does happen, we're having union members that will text us or call us. We'll call that manager and get somebody down there. We've had conference calls with Kroger and with Albertsons Vons upper management this week, and we've discussed some of these issues with them.
So you're looking for change in the future with regards to this, essentially?
Yes.
Okay. Other question I had was for the mayor also. Going back to business, we were talking about this last week, the foreclosures and things of that nature. What about those? There are some people who own multiple properties who are saying that the banks aren't necessarily working with them. What would you say to those folks out there who say the banks aren't working with them?
Yeah, that is, mortgage relief is incredibly important. It's at the other end of that spectrum. And particularly for a lot of folks that, to your point, own just, one property, maybe two properties. And so some of the actions that came from the state that were announced last week in some of our largest lending institutions should help with that, because you need that mortgage relief. And I would say to anybody in that category, ensure that you are talking to your lender, because there's been a lot of changes, particularly in the last 5 days, that should help give that mortgage relief.
And last question is with regards to small businesses. The Small Business Relief Fund is out there, $6 million. There are some small businesses that are part of franchisers, franchisees, but they're not going to be able to apply for that assistance. Is there any relief that they might be able to get, the small business as part of a franchise, that may not get help from the franchise?
Yeah, great question. And also to your point, we saw the incredible demand that shows how great the need is, and why we started this with the large amount that we had of $6 million, but we need more. We need more because small businesses are the backbone of our economy in San Diego. 90% of all our businesses are small businesses. And this is one of many things that keeps me up at night. But how do we make sure that we have that infrastructure for people to come back to those businesses once we get on the other side of this? And so we're looking at ways to not only to add dollars to that fund, but to your point, hopefully expand some of those folks that will be eligible to it, not only in combination with what we're doing here at the city, but also some of the federal stimulus in the state, because that is a huge, huge need right now for so many San Diego families.
So that would be contingent upon getting more money, essentially?
It will be,
Okay.
yeah.
Appreciate it.
Any other questions?
Hey there, Kasha from Fox.
Kasha.
Just a quick question for Todd. You mentioned limiting hours, recommending for grocery stores to limit hours. So I'm just wondering if Todd has any guidance for the grocery
Todd.
stores on a time frame that you would recommend. We have seen some shorten hours, but what is your recommendation there?
So last week, a lot of our retailers were open from 8 a.m. to 8 p.m., something similar to that. This week, we noticed that a lot of them started expanding hours again. The problem we're seeing is that the stocking that has to be done, the workers don't need somebody, don't want people standing and reaching over them, getting into their space. The stores that are opened up later hours, and even some of our union stores have done that, we're still fighting with that. It's causing problems with the workers, and we're trying to get it back to narrow it down. The shopping patterns are extremely unpredictable right now. They're going up and down, and we're still encouraging the operators to do something similar to an 8 to 8. It allows for the shelves to be full, the product to be put away and easily accessed, and we don't have train wrecks or people trying to run aisles and causing problems.
Perfect, thank you.
Thank you, Todd. If that concludes our questions, again, I want to thank all of our speakers here today for what they're doing to help keep San Diegans safe. These tips and these guidelines are very important for our grocery workers to help follow that and to ensure that we have those supply chains. So thank you all. That concludes today's briefing. Thank you, San Diego, for continuing to step up. Thank you.
All right, everybody watching on YouTube and on coronavirusnow.com, taking a live look at Times Square in New York City. Few stragglers hanging around. I see one person on a bicycle. Looks like a couple right there in the center, a couple other stragglers walking around, but very few people considering to what New York City would look like normally on a Tuesday evening. Now it's 5:03 here in Phoenix, Arizona, 8:03 there in New York. 3-hour difference between the East Coast and the West Coast. Arizona, we pretty much consider ourselves West Coast. But yeah, whole different scenario there. I was actually wondering the other day, I'm like, why hasn't Times Square gone dark like the Las Vegas Strip has? I don't know if it depends on each individual business. I don't know if there's like one, or I mean, obviously there's probably more than one switcher for all of Times Square, but I'm just saying, I don't know if it's controlled by the city. I don't know if the businesses have their own say with that, but yeah. Definitely looks like there's an 18-wheeler, though, that's trying to get in the right lane or head the right way there in the Times Square live picture here. But yeah, pretty desolate in terms of the number of people walking through Times Square. We're going to return to California, where Governor Gavin Newsom was giving an update earlier. Christie was playing a few moments of it for you right before that White House briefing started, so I'm going to finish it out for you right here on News Now and on coronavirusnow.com. What's it like where you live? Are people social distancing? Are they staying home, staying inside? Let me know on our YouTube chat.
I just want to thank again Facebook for their $25 million contribution to help with stipends for those same individuals, for accommodations in hotels so they're closer to patients, for transportation, and for child care. Many of them need child care at this moment, and those dollars are now readily available for individuals that wish to contribute to this moment, in addition to the ongoing support we'll provide from a salaried perspective. This is not a volunteer effort. Healthcare or healthcore.ca.gov. It is fully reimbursed beyond, again, the stipends that will be provided through the private sector. We in the state continue to do more to find respirators and ventilators. Let me specifically talk about ventilators. You've heard me say in the past the number of ventilators that we've identified in this state, 4,252. 2,000 of those being purchased through our Department of General Services from overseas, from China, the rest in hand. With that, we have a call out to get another 5,000+ ventilators. Our goal is about 10,000 ventilators. We have requests in from the federal government, national stockpile, and we have requests out from all across the globe. But one of the most spectacular responses, and I don't say that lightly, and I don't say that without consideration, because I don't want to express hyperbole, but I cannot impress upon you more how pleased I was to get a call back from Virgin Orbit. These are the folks that make rocket engines, launching systems. They're here in the state of California, down in southern part of the state, down in Long Beach area. They met the call and now already in action prototyping respirators that are not as nuanced and comprehensive as the respirators, or rather the ventilators that so many of us are speaking of. These are less complex but can meet the moment and are more readily available. They're bringing up a prototype in the next 48 hours right here at the State Operations Center, and they're already running additional prototypes to help not just the state of California, but to potentially help other parts of the country. I say that because they deserve credit for being willing to reprioritize their production efforts down there and look at meeting us where we need most support, and that's through the ventilator side of the procurement. And so thank you to Virgin Orbit. Thank you to their team down there. It's, again, part of the ingenuity, part of the entrepreneurial spirit that defines the best of California and Californians. Again, that was exampled this weekend by Bloom Energy that converted all of those 150+ ventilators that were down from the national stockpile down in LA County and refurbished them, and have already sent them back down into LA County. Again, spirit of meeting the moment, taking responsibility, taking into account that we have more that we can do than we even believe, that our mind needs to be stretched at this moment, and it is being, in terms of civic contribution, in terms of people, the private sector stepping up in ways that really do justice to what makes this great state what it is today. So that's broad strokes an update. I'll just close with one additional update, and that is census. We have to fill out those census forms. Many of you are at home. appropriately, fill out the forms. Send the census forms in. Tomorrow launches our census process. It ends December 31st. We may need to get that extended. That's another conversation. But please fill out your census forms. That's about representation. That's about remuneration. It's about appropriately getting supported from the federal government and making sure that our state gets its fair share. And we don't get that unless you fill out those forms. And obviously, the census process and protocols have changed since COVID-19, but that doesn't mean we're not going to be aggressive in sourcing as much as we can in terms of people's contribution. I will make, forgive me, one additional final point. I signed an executive order yesterday that we refer to as an omnibus executive order. Don't mean to confuse people, except to say it had a lot in it. But one of the things it had in it is very important to small businesses, and that's a 90-day extension. If you're a small business person, you have a 90-day extension on paying your sales taxes to the state. We also have license extensions, fee extensions that were also part of this package. As a former small business person myself, this, I hope, comes as welcome news. We continue to want to do more on commercial evictions. We now have 8 counties, a number of local cities that have done moratorium. We are continuing to work on that, as I've mentioned in the last few press conferences. More on that when we're ready to announce. But no, the small businesses are in our heart and mind, and we continue to do more. And I'll speak before I open it up to questions about more. We had a record number of people filing for unemployment insurance yesterday, over 150,000. So now it's well over 1.6 million Californians. So we all recognize we're going to have to do more to meet this moment for employees and employers and process this moment, get through it, and then get this economy back and growing as it was just a few months ago. So happy now to take any questions.
Jeremy White, Politico. Jeremy White, Politico.
Hear me?
Jeremy, we can
Hello?
hear you.
Can you hear me?
Yes.
Can you hear me?
Yes.
Hello? Okay.
Perfect.
Hey,
Thanks.
sorry about that. Thanks as always, Governor. You mentioned what the state is doing to procure enough ventilators and respirators. A week ago, you expressed some concern that California's large purchasing power there could work to the disadvantage of other states. Today, the governor of New York, Andrew Cuomo, said it's basically like eBay with other states, including California, essentially bidding one another up. And so I'm curious to know, to what extent is that a concern that California's purchasing power is coming at the expense of other states? And do you see a solution in which there's a more centralized federal effort, or in which California releases some of that equipment to other states that are in a dire need?
Yeah, not only a week ago did we express concern about this, we did something about it. And we reached out to Governor Jay Inslee, Governor Pritzker, a number of other governors, and said, let's connect our procurement teams together to make sure that we're going and working together. Governor Murphy and I, a few weeks back, had a similar conversation. So you're starting to see these partnerships at the gubernatorial level, at the state level, to help centralize. Look, I made a point that we have purchase order out for 101 million N95 masks. That, I hope, puts our purchasing power in perspective. That is a substantial amount of money that this state is capable of committing ourselves to, that not all states can. We also are working with our FEMA regional director, who happens to live out here and happens to spend a disproportionate amount of time here at our State Operations Center. And we're very sober with Bob Fenton in conversations about what other states need as it relates to even what's coming from the national stockpile, and making sure that none of us are being greedy at this moment, and that we have the capacity to move things around. And so that's the spirit, to answer your question, that we're bringing to this conversation and debate. We are, as a nation state, de facto a centralized purchaser of incredible capacity, but we want to help other states, even as large as Illinois and Washington State, some of the largest states in our nation, to see if we can help procure not only a reduction in costs per unit, but also procure a mindset where we're not playing in the margins of a zero sum, where it's us versus them.
Carlos Granda, KABC.
Hello, Governor. The state of New York
was concerned last week that the hospitalizations could double every 2 days. Today you said that here, at least for now, they're doubling every 5 days. Does that show that our numbers, are they moving in a good direction at least? Do you see some positive signs?
Yeah, no, I mean, we're seeing an increase, and those increases that I referenced as it relates to ICU beds, not just hospitalizations that have tripled ICU, doubled in our hospitals for COVID positive patients. That was not an insignificant increase from what we had seen in previous weeks. Look, the number of positives today at 17%, the number of hospitalization, the percentage increase, when I'm now looking at the percentage of 13%, ICU 10%, that is in line with some of our modeling, but no question we are not out of the woods yet. By no stretch of the imagination should people think that California is overly confident at all. We are continuing to procure the PPE, continuing to get the human resources that I spoke of at the top of this hour to continue to meet the surge capacity, not just the USNS Mercy, but now we have identified all 8 field medical stations and their sites from Shasta to Butte County to San Diego to Contra Costa County to Riverside to San Mateo County to Santa Clara and LA County. That's 2,000 bed capacity. We'll get the National Guard building those out, working with the Army Corps of Engineers. I said yesterday they had already had 19 site inspections. They're up to 24 now, and we'll be making some announcements about partnerships with them in the coming days. We're doing all of that because we're not out of the woods. We're doing all of that because we have the time to prepare. And that was the whole point of moving early on physical distancing. There is no regrets in the state of California on our protocols on physical distancing. The only regret we will have if people cut the parachute before they land. The only regret we will have if we prolong this is that we didn't take it seriously and we didn't recognize some of the early signs of success. But success is defined by buying us time to prepare. The announcement today on seniors was about preparing. I don't want you to be writing headlines, and I don't want to be hearing stories that someone finally knocked on a door and no one answered, only to find out when they opened that door that someone had passed away because we didn't meet the moment. And that's why we are building this capacity at every level of government, physical and human capacity. And so, yes, we are starting to see increases. Yes, that's consistent with our model. And yes, we are doubling down on our preparedness and our admonition to everyone, young and old, to continue their physical distancing.
Jeff Fowler, Washington Post.
Hi, Governor. Thanks for taking the question. Just sort of playing off what you were just talking about, the Bay Area in Northern California was the first in the nation to have that shelter-in-place order. So now that it's been 14 days, do you see evidence that it's a model for other U.S. cities that social distancing orders work? And, the Bay Area was also...
All right, everybody, this was previously recorded, but right now live, we have Los Angeles Mayor Eric Garcetti, so we're going to listen in.
An 18% increase. And additionally, and always the most difficult, there were 10 additional deaths. 10 deaths of people who we love and care for, who were connected to us and our families and our communities. And as always, our heart breaks for everyone who is mourning tonight. Those deaths represent a 23% increase over yesterday. Put differently, the number of deaths are doubling in our county every 4 days. As we heard from the White House today, COVID-19 could, in one projection, kill between 100,000 and 240,000 Americans. And that's if current physical distancing measures continue and hopefully are adopted throughout our country uniformly. Let me put that in perspective. That 100,000 figure at the lower end is nearly twice the number of Americans who died in the Vietnam War. Across the country in our across the county in our general emergency hospitals, right now there are 1,382 available beds, including 222 ICU intensive care unit beds. and an inventory of 861 available ventilators. And these numbers with the beds represent a 23% reduction over just the past 2 days. That's woefully insufficient, and we are working with suppliers to procure additional ventilators, but the need is urgent, and we need to have more partnerships, locally and globally, to build more medically sound ventilators. And I want to thank our friends in Northern California that are fixing the ventilators that were sent to us. I spoke last night with the mayor of San Jose, Sam Liccardo, and we appreciate the good work that he, our governor, are doing to make sure those are ready and available here in LA County. I want you to know that your decision to stay home may mean that there's one less person who needs a ventilator we do not have. And bringing case and death numbers down won't just happen because of physical distancing and isolation, but also because of testing, which every night I update you on, and we continue to grow our testing capacity. As of this afternoon, the City of Los Angeles testing program, which opened up a new site, completed 10,027 tests, including 1,623 tests alone today. And by Thursday, we'll have doubled our testing capacity, and we will administer 13,000 tests just this week alone. And tonight, I can announce that starting tomorrow, we are opening up testing to the entire county and expanding testing at 2 new sites. Thank you to Los Angeles County, who stepped up with 3 new sites, and also our first walk-up site as well. In cooperation with county partners, they're providing staffing, test kits, and resources to run the new sites. And to make signing up for a test seamless, we've integrated into the same portal. So tonight, as I promised folks who don't live in the city of Los Angeles, that we would make sure that testing is also available to anybody in LA County, because a life is a life is a life. You can go and sign up for one of those tests in one centralized location. We have, for tomorrow, 3,200 test slots that are available, and there's still room for more to sign up. So I encourage you to go to coronavirus.lacity.org and sign up to see if you're eligible to get tested. And if slots are filled for one particular day, as I mentioned last night, it'll now kick you over to the next day so we can get you in as soon as possible as we continue to grow our capacity. And I want to thank our nonprofit partners, I want to thank our corporate partners, I want to thank our government partners who are making sure that Los Angeles can get the tests that we need. We're continuing to see a strong response to our emergency shelter program, and I want to thank members of the Los Angeles City Council, neighborhood councils, and others, including our service providers, and of course our remarkable city employees who are stepping up together with county employees and others to make sure that all of those shelters are filled. In addition to those which are more than 95% filled, and 13 more we are building to open just this week alone, we have 900 motel and hotel rooms that the state, Homeless Services Authority, and county partners with the city have secured for isolation and quarantine. Some of those are already being used. And I'm grateful that FEMA and Administrator Gaynor approved the state's request for 75% reimbursement for all the hotels and motels that are being activated to meet the needs of this crisis. This is historic. This has never been done in a disaster before. And I'm grateful to you at FEMA, to Washington, D.C., and that allows us to feel good about that money that we're spending as quickly as we can get those rooms to help people as quickly as the need is there without having to worry about us being bankrupt. There's one final stat I'd like to share with you tonight. It's a number I haven't shared before. But every day, thousands of Angelenos call us. Yesterday alone, we answered 2,509 calls from folks seeking information on how to stay safe and healthy during this crisis. Others checking in on which city operations have not shut down. And these calls are picked up by an incredible team of 311 operators and members of my own office who have stepped up to volunteer, and volunteers who have come in to supplement those teams as well. And I want to thank those dedicated public servants for answering those tough questions, allowing us to continue to focus on the tough decisions ahead and making sure that we get this city continuing to work. With that, let me turn next to some announcements that I'd like to share with you on the steps we're taking to address the city's immediate needs and to plan for weeks ahead. As most of our city has stayed home or changed the way of doing business, much of our construction program has continued. Critical infrastructure projects like homeless shelters and housing should move forward, but never at the expense of our workers' health. never at the risk of anyone's life. Since I signed the Safer at Home directive, we've heard about some construction sites that are not following those guidelines. That's why our city's Department of Building and Safety has developed new guidelines for construction sites to ensure employers and workers are safe and protecting public health and their own health. The guidelines are posted at LADBS, that's Department of Building and Safety, ladbs.org, and they'll be up there tonight. But it requires all construction sites to develop a comprehensive COVID-19 exposure control plan, including protocols for symptom checking, physical distancing, and hygiene practices, and decontamination procedures. Additionally, we will send our city inspectors to visit construction sites every day to verify compliance with these safety guidelines. As we required in our Safer at Home order, workers must maintain a 6 feet physical distance, and they are discouraged from sharing phones, desks, offices, and tools. And every worker who is at an active site has to be trained on preventing the spread of COVID-19, including distancing, hand washing, facilities on site, and the most effective methods for disinfecting surfaces that are touched often. And any worker who is sick, like everyone else in Los Angeles, must stay home. We will not be shy about shutting down construction sites that do not comply. So comply. Continue the critical work that you are doing, but in the meantime, make sure you are keeping your people and all of us safe. As I mentioned in my first press conference on this, all of us are first responders when it comes to this virus, not just our brave police officers and firefighters and our healthcare workers. And that includes developers, construction companies, and workers. And while construction is very important to continue in this critical moment, any site that puts lives at risk will be shut down. It's as simple as that. And as we've stated repeatedly, if any non-essential businesses continue to operate in violation of the stay-at-home order, we're going to act to enforce the Safer at Home order and ensure their compliance. 1 week ago, I announced our Business Ambassadors program. This is a collection of city employees and members of my crisis response team who've stepped up to ask non-essential businesses to shut down, and where they won't, to refer them to law enforcement. As of this afternoon, our ambassadors had deployed to 540 businesses. Almost all responded as we hoped that they would, by simply complying with emergency order and immediately shutting their doors. LAPD has visited 144 of those locations to confirm that they were abiding by those rules, and we will keep following up, and we will bring forward misdemeanor filings to the city attorney if necessary. So far, 4 have been referred. That low figure is a sign that folks are complying, that our best enforcers are not government, but one another. And we need to make sure that everybody continues to let us know where those folks are. If you've observed recurring violations of the Safer at Home order, please continue to let us know at coronavirus.lacity.org/business-violation. You know the old expression about snitches? Well, in this case, snitches get rewards. We want to thank you for turning folks in and making sure we are all safe. Look, I know that this is tough. I know that life feels fundamentally changed. And trust me, I have no joy in, and the rest of our city government and county government has no joy in stopping our way of life temporarily. But we are doing that so that the deeper we abide by these rules, the quicker this can be over. And we want to make sure that nobody harms our small businesses, the backbone of our economy, or workers who keep them going. But these are not ordinary times. Everyone has to keep making these temporary sacrifices for the common good, for each one of us, because the person we make the sacrifice for could be ourselves. Our lives depend on us each doing our part. So thank you, and I ask everybody to continue complying. Helping Angelenos in greatest need is at the heart of so much of what we do. It's at the center of our campaign to bring the generosity of philanthropists and other leaders together through the Mayor's Fund for Los Angeles. And tonight I'd like to report another $1 million contribution from an anonymous donor. You know who you are, and I personally want to thank you on behalf of 4 million grateful souls here in Los Angeles. But they are helping us in a very direct way by allowing those Angelenos in greatest need to purchase groceries. And there's more assistance on the way to ensure people can keep putting food on their tables. We found that the best way to dole out this aid is through pre-loaded gift cards. And when we set out to acquire them at scale, our friends at Ralph's, Food for Less, and the Kroger Foundation, who are all part of the same team, and separately, our friends at Albertsons, Vons, and Pavilions, responded enthusiastically. And they're not only getting the cards set up, they're adding on to this anonymous contribution so that we will have a total of $1.2 million in groceries for some of the neediest people in this crisis. On top of that, I want to thank two people who have filled our lives with joy and happy moments, Rihanna and Jay-Z, who both stepped up as well with such generosity to help us out. They've already been giving through their foundations in other places like New York, in the Caribbean, but this is also a place that they know and love and call home. And I want to thank you for stepping up, and I hope it inspires some other folks in the music industry and other stars and athletes to do the same. We thank everybody who's given. Now is the time that our people need you. All of these donations go a long way to ensuring that we have that we have child care for our health workers, that we have meals for our seniors, and that we can ensure that people get the cash assistance that they need, things like groceries and the basics to pay the bills. It's still early on, but there is still much more we can all do. And as I say every night, give to somebody who's local, whether it's a food bank or your church or synagogue or mosque, give to the United Way, give to anywhere you can. And one place we've consolidated some of that is at themayorsfundla.org, and I thank you. There's another source of help that's heading here to Los Angeles. We've talked about it in the past couple days, but much needed relief from Washington, D.C., and it cannot come too soon. Remember, this has been a process. The first stimulus bill focused on preparedness and emergency response for FEMA. The second one was on free testing, on sick leave and unemployment insurance. And the third, the one on its way, is what I call the survival package, support for working Americans and small businesses. But I want to keep saying that the next step has to be on the recovery. We cannot let the punch to the stomach that is COVID-19 keep us on the ground economically after this is done. I was pleased to see both the President and Speaker Pelosi both talk about the need to make infrastructure the centerpiece of what's ahead. Because if we've witnessed anything in the past couple of weeks, it's not that we're lacking a human infrastructure of caring and compassion. We're lacking the physical infrastructure. In our health industry, we need it across our nation to rebuild and to get the stimulus into the economy that will help those who are out of work get back to work as quickly as possible. We need to reinforce our physical infrastructure from stronger waterways to power lines and broadband connections, just like the investments you have entrusted here with our public transportation, with our roads, at our airport and ports. We need to have a wider pool of medical equipment and a deeper well of medical personnel. We need investments in our ability to remain safer, healthier, stronger, and more secure for the next economic or health crisis, for the next phase of our economic development, and for the next era of American life. As we rise to this moment, let us set our sights on the horizon at that shared fixed point in front of us, that we will march towards and march to. And each one of us can say, looking back in these very darkest days, that we didn't picture how bad things would be in the future. We kept our eyes affixed on the hope and the help and the light that remains ahead. My friends, I know that this feels like we've been doing this for months, and for some it feels like normalcy was just yesterday. But we must keep with this. I'm so proud of Los Angeles. I'm so proud of the example that you are setting, of how you are sharing this love with one another, explaining this crisis to our children and grandchildren, and being the leaders that we need all of you to be right now. So keep up what you've been doing, and as I always say, stay safe, stay healthy, and stay home. Strength and love, Los Angeles. And with that, I'm happy to answer some questions. First question, please.
First question, please.
We'll go to Alex Michelson. Please go ahead.
Hey, Alex.
Hi, Mayor Garcetti. Thanks for taking my question.
Of course.
This isn't specifically a Los Angeles question, but it's the biggest story for our region right now. We just got news this afternoon about a nursing home in Yucaipa. 2 people dead, more than 50 people testing positive for coronavirus. It's raising a lot of concerns about nursing homes themselves. What kind of safety precautions do you advise for nursing homes, and are you looking at that as a specific issue going forward in the next few weeks?
Yes, thank you, Alex. We've been looking at nursing homes from the beginning. When we saw really the first beachhead in America was in Seattle, and we saw landing on the shores what happened in a nursing home that had the first kind of cluster of deaths. We immediately started talking together with the county at our senior home facilities. Our public health folks went out to those places, talked to people, and made sure that they knew that these are essentially medical facilities without many of the medical protections that a hospital has. Folks that didn't have personal protective equipment, and that is part of the cache that we have of those, is being shared with our senior homes. Second, that we don't have vents that protect from the spread like you would in a hospital, and so that people needed to be extra careful. And as we said early on, even before the stay-at-home order, cutting off visitor access, which I know is heartbreaking for so many families who have loved ones who sometimes may be confused about what's going on. Last week, I announced that we would start also to share our growing testing capacity with our seniors. And so I'm proud that starting yesterday, we began to work with senior professionals, senior doctors who work with our elder community, getting them testing so that we can make sure that testing is going. And where we've heard in the city of LA of potential outbreaks, we've surged in the ability to bring tests so that people can test everybody in those facilities. We've already done that in one where that happened. So we are continuing to focus on that. It is absolutely critical for every local government and all counties to be focused on that, because this is the place, as we're seeing, most of the deaths that are happening still, while the cases early on are, a reminder, over 50% under 50 years old. That said, the deaths are disproportionately, of course, our seniors. So to protect lives, to have our death rate come down, we need to make sure we are looking at seniors wherever they are, and that's a place that was brought home with that example in Yucaipa. Thanks, Alex. Next question, please.
We'll go to Mary Beth McDade. Please go ahead.
Hi, Mary Beth.
Hey, hi. Nice to speak with you again this
You
evening.
too.
Yeah, I just wanted to get your reaction on Cedars-Sinai. They are going to be testing out an experimental antiviral drug, and I guess the tests are going to be getting underway shortly here. Just your reaction that right here in Southern California that this is where the tests are going to be done, and then do you have any further input as to how they're going to be carried out?
So we have a lot of testing that's going on in California and Southern California. I would say maybe one of the biggest clusters in the world, if not the biggest cluster, not just here in the LA area, but in San Diego, up in the Bay Area as well. And it's very exciting that we have that capacity to not only help ourselves, but potentially help the entire world face this crisis. And we know there's a number of pharmaceutical interventions, treatment with drugs, and it's probably going to be a combination of drugs that are going to work best on the different aspects of both the symptoms and hopefully the prevention of a virus coming in and or expanding in someone's body. But secondly, too, to look obviously at the development of a vaccine. So I am familiar that Cedars-Sinai is doing that. They're not the only ones that are, but they're extraordinarily talented and have deep experience with this. I've spoken with other folks, people like Sean Parker and others, who are really helping lead a lot of this research. A lot of things that you will hear in the news take some time. So people saying the blood tests are ready, for instance, the pinprick, and you can get a drop of blood and find whether there's antibodies. I would slow down a little bit on how quick we think those are going to come to market at scale, and they have to go through the sort of clinical trials to make sure they don't have a lot of false positives or false negatives. In the end of the day, we will slow down this virus over the length of our battle with it, which will be, all experts have said, a year or a year and a half, by a combination of developing a vaccine and, of course, the medicine we can bring to bear that will help save lives. And much of that medicine will allow people to get COVID-19 but not die from it, especially those that are the most vulnerable. And those, to me, are the most exciting ones, like the antivirals that are being tested at Cedars-Sinai. And I know that there are a number of those studies going on up and down California with a lot of willing volunteers and, unfortunately, a lot of patients that are being tested right away. Thank you.
Thank you.
Next question.
We'll go to Dakota Smith. Please go ahead.
Hey, Dakota.
Good evening, Mayor. New York City Mayor Bill de Blasio has said that he's concerned hospitals in that city aren't getting the personal protective equipment that they need. To your knowledge, are there similar shortages of equipment, PPE equipment for hospitals within LA city limits? And what role is your office and the city of LA playing in making sure that LA city hospitals are acquiring the equipment that they need?
Thank you for that question. It's been heartbreaking to see those images come out of New York, where doctors and nurses and medical assistants are using page protectors and whatever they can find, Halloween masks, other things, because they've run out of what they need to stay safe. And we've seen it claim many medical professionals in New York who have become sick and some who have even died. Today, and we check in with the hospitals, we are making it through each day. My Emergency Operations Center has consolidated a lot of these purchasing, and we're trying to ask the hospitals what they need moving forward. Some feel like they have good supply lines, but I have Gene Soroka, the head of our Port of Los Angeles, as a chief logistics officer now for the city of Los Angeles, helping the region to buy all the PPE and or medical equipment and other things that we need. We're also talking with local manufacturers. I mentioned one last night, Wet Design, but there are many others too that are doing things like helping do the shields that doctors and nurses and others need, looking at what we can do to have non-medical grade masks from the apparel industry, looking at what we can do to make sure that the purchasing is done together so that we pool our resources instead of competing. But it still is a crazy world out there where people are spending 4 or 5 times more than the usual prices for things as basic as masks. So far, we've been able to help our hospitals get through where they're at, and they have been continuing to make their own purchases. The county has a cache that they have been really great with sharing, not just with healthcare professionals, but remember, healthcare professionals include our firefighter paramedics, include right now, they're not healthcare professionals, but people on the front line, include our grocery workers, and we're seeing in New York, many of them get sick. We have also folks that are out there right in the line in critical businesses, and we want to make sure that whether they're government workers working in a shelter or others, that they have the PPE that they need. So my honest answer is today was okay. Tomorrow I feel good. But if you look a few days up, we have got to nationally get ourselves ahead of this, because we can't have certain parts of the country have a big cache and us having nothing. We have to make sure that we share this across all of our hospitals, so it's not just those that have and those that don't. And we're doing everything we can using the power of this city and our experience with supply chains and with shipping and with international trade, given that we're this big port city, and our local manufacturers to get even more. So stand by. We'll be able to make some of those announcements of the actual production, maybe even share some footage of that on assembly lines that have never made things like this, that are already getting tooled up as we speak to make even more. Thank you. Next question.
We'll go to Ben Orestes. Okay. Please go ahead.
Hey, Ben.
Thank you, Mayor Garcetti. We just went up with a story about the first confirmed case on Skid Row, and I was hoping you might be able to update us on the latest numbers for homeless individuals and shelter workers. And then also, do you feel like the city is prepared for an outbreak on Skid Row? I know it's something that advocates and public health officials are very, very worried about.
I'm very worried about it too. I think that we have one case that's been confirmed that I've talked about. There's another case that I've heard of, and I think you probably have in that story. I have been from the beginning of this, even when I heard about this happening in China. We've been working since January and February on this. Great news yesterday, as I mentioned in the speech, FEMA said that they will reimburse for hotel and motel rooms. We can't get those booked quickly enough. And yesterday I said to the county, whatever we can do to really focus a lot more of those rooms in downtown, especially near Skid Row. We need to be able to have the potential to quickly bring people from one part of Skid Row and get them into isolation, quarantine if necessary, and to make sure that the spread doesn't continue. Second, I mentioned last Friday that we were going to start testing in Skid Row, and not just Skid Row, but in a lot of the health clinics that do serve our homeless neighbors throughout Los Angeles. That has started, and that's a good sign too, to have that capacity. Usually they would be the last in line, and when the last places to get things, I wanted to make sure that they were at the front of the line too. A third point I'd make is while there's vulnerability out there, of course we who were housed had COVID-19 before anybody on Skid Row, or anybody who was homeless was confirmed to have that. So it's come from us to there, but it has the potential like wildfire to spread. And so I talked yesterday to the judge. We're putting up more sanitary equipment. We've run out of any place to get more hand washing, but we're putting up more toilets, trying to procure them from across the country and the region to make sure that people can have more sanitary conditions and to quickly be able to take folks and isolate them when any cases do come forward positively. But yes, short answer is I'm absolutely worried, and we can't have too much help. But it was great news yesterday knowing that that would be reimbursed so that we can spend as quickly as the county can make these arrangements with hotels and motels, and we are very focused on those downtown. Thank you. Next question.
Thank you. We'll go to Arlene Freer. Please go ahead.
Hey, how you doing?
Thanks very much, Mayor Garcetti. We have received and continue to receive daily calls from grocery store workers who say that they don't have gloves or masks to wear, and in some cases their employers will not allow them to wear them. What, if anything, can be done to help them or to ease their concerns?
So we have a ordinance that's moving forward and that I'll be signing shortly that will help us make sure that grocery workers have that protective equipment. We've worked with grocers and many of the main companies to make sure that they had access to our personal protective equipment, masks, gloves, very early on. I think it was my first briefing we talked about that. And we want to continue that flowing. But I will say to any employer, whether it's a small store or a bigger one, this is something you need to do for your employees. These are folks on the front line. We have seen what happens in New York, and we are not playing. This is something that is a requirement. Like all of our stay-at-home order, anybody who continues to work who's a critical worker, it doesn't mean that they don't have to have the protective equipment and abide by the spacing that is part of that order. That's up to grocery stores to make sure happens with the spacing. That's happened much better now than it did at the beginning, but we see all the time still people much closer than 6 feet. And that training needs to happen for employees, even if it means you stand down for an hour of the shopping hours, to train everybody and to ensure that they have that. I want to have a very clear message to all our grocery stores to ensure that's happening. If you don't have that equipment, we are happy to continue sharing what we have. And there isn't a lot of it, but I do see these clerks as heroes, these folks who are stocking the shelves as heroes. They are literally keeping us alive and fed during this crisis, and they deserve not to get sick. Thanks for bringing it up.
Thank you.
Next question.
We'll go to Steve Gregory. Please go ahead.
Hey, Steve.
Hey, Mayor. Good evening. Listen, you just said a few moments ago that you said snitches get rewarded. A little over a week ago, you actually said on this very press conference that you didn't want a city of snitches and tattletales because when I asked you the question about holding people accountable, is this sort of a sign now that you realize that there are a great many people out there not paying attention to the stay-at-home order? I mean, the freeways are more busy now than they were last week. More people are gathering than I've ever seen. And also, I have to rapid-fire questions because we get cut off on
Go ahead.
the phone.
No worries.
The other question was the portal that you have to sign up for medical help. We talked to a couple nurses today that said that they signed up the first day that they registered or that you announced it, and no one has contacted them. So are you getting back to all of these medical volunteers? And I'll let you answer. Thank you.
Thank you. On the second one, the state of California now has put out a medical portal too. I spoke last night to the governor's chief of staff with the 13 big city mayors in California asking for guidance of whether they wanted to integrate those two together. And again, most of what we do, we're not a medical part of government. We don't have hospitals, we don't run things. We're trying to step up and help. So we have that available for hospitals. We have that available for the county to draw from in any of the facilities they have or fund, and for anybody else who needs them. We will draw from that where we see people that we need, for instance, somebody in a shelter, et cetera. But don't worry if you haven't been contacted. Not everybody's getting a call. We're keeping that and then going through and seeing, okay, we need an LVN here, we need an RN, we need a doctor over there, and trying to pull those out as we need them. And we appreciate that. We're also going to be sharing that database with the State of California database, which had, I think, 10,000 statewide just in the first night. So these are good consolidations, and just hold tight. I think early on I said a little tongue-in-cheek when I said snitches get rewards. We don't want to have folks that are snitching and putting people in jail, but we do want people to tell us where you see businesses that are open. And no, it is not a reflection that we see more slippage. We just want to tighten the screws up. We want to get, if we're at 98% compliance, I want to see 99% the next day. If we're at 99%, I want to get to 100% compliance, because these aren't just numbers. This isn't just a game. This isn't a competition. These are lives. And each one of those incidents could cost somebody their life. So we can't be perfect, but we're sure going to strive for perfection. And that network of people, look, you can snitch on each other. You can tell somebody, hey, you shouldn't be doing that. If somebody still is doing it, let us know. And we'll get compliance. As I said, with our program, we've gotten that 9 out of 10 times very willingly and very immediately. Where we need to visit somebody, we'll do that. And where we've had to refer folks to prosecution, like those 4 cases, we will do that swiftly as well. Thanks, Steve. Next question.
We'll go to Rosa Ordaz. Please go ahead.
Hi.
Yes, thank you, Mayor. The Superintendent of Public Instruction is saying that the school year, we're not going to go back to school this year. How prepared is the city to help LAUSD, especially kids who don't have access to online material? They're getting an anemic education. How can you help remedy the situation? And also another question from my colleague is, we're seeing a glaring number out of Melrose, 100 cases. Is there any explanation why that number is so high? And is there any information we need to get to our viewers who've been in Melrose to help abate the problem?
Let me find out the second one. We've seen those same numbers from the county public health, and I'm not even sure where they draw that around. That may be kind of a mid-city neighborhood, and it's obviously one of the densest parts of Los Angeles, so there probably are naturally many numbers that are there. Let me get back to you on that. Maybe I can share that with you tomorrow. In terms of LAUSD, I know LAUSD, which has a huge budget and even more employees than the city of Los Angeles, has been working really hard on those issues, whether it's getting new laptops and Chromebooks, which they've been handing out at the grab-and-go locations. So if you're a family that doesn't have access, you now can get not only the equipment, but they have a historic partnership with Verizon to have low-cost or even no-cost internet access, so there isn't an anemic education going on. That will sometimes take a week or two to spread the word for folks to know, but at those grab-and-go centers, that's one place where that can be done. And at LAUSD.edu, you can find the details of those programs, as well as for other school districts in the Southland, I know, that are also struggling with this. Many of us are teaching our children at home, trying to figure out how to do virtual meetings, pulling things off the internet. But it's a good point you make, but from the very beginning, I've listened very closely in LAUSD with a lot of people, with a big budget, and with some great donations that have come in from pillars of our community, have ensured, as well as with corporate sponsors, that will get to as many children as they can reach, and hopefully all children, because you shouldn't stop learning just because you're staying at home. And we look forward to working with them. One of the things we talked about doing is making those links as easy as possible. And in future weeks, I think we'll start sharing not just staying at home, but living at home, learning at home, working from home, staying healthy at home. So look forward to those, and we're going to continue working with LAUSD to develop that, and other educators as well. Thanks for both questions. Next question, please.
We'll go to Claudia Pesehuda. Please go ahead.
Hi, Claudia.
Hi,
I'll get the
Eric.
name right one night.
We were expecting an update on the numbers of positive cases in LAPD and LAFD. I haven't seen that just yet, so I'm wondering if you have those numbers. And then wanted to ask if you foresee a situation where people might be forcibly removed from the streets of Los Angeles. And how would that play out? How bad would things have to get for something like that to happen?
So you're talking about folks that are unhoused, that are homeless? On that, I'm going to assume that you are talking about that in the second question. So no, I mean, initially we have right now many more people on the streets than we have beds, and whether that's in a shelter or the hotels and motels. If something does get bad in an area, I will take the advice of public health, and if public health says that it is best to move people, but the guidance has been from CDC is it is better to space and to take cases of positives away someplace where they can be isolated and quarantined. In the rare cases where somebody might clearly be spreading and refusing to move and interacting with people, whether they're housed or unhoused, that of course is a danger to anyone. So whether that's somebody who'd be running through a grocery store saying I'm COVID-19 positive, or whether it's on the street with somebody who's unhoused, I think we treat those equally. But the guidance has been for spacing on the street, for as many shelter and now isolation beds through the hotel and motel area. But we will have to see where those kind of pockets are and what the guidance is from public health. It's been changing a little bit from the CDC from the beginning to the middle section of this. They now give advice for how to run a shelter well and also not to move people if there isn't a bed available for them. So I'm focused on the capacity of the beds, really continuing to push to get as many state, federal, and county resources. The county's doing a miraculous job of signing those leases as fast as possible. We're helping them. Council members and hotel owners and others are bringing us more rooms all the time. But that's something that we can only talk about when there are beds available, more than the people that are there. In the meantime, we will continue making that education, that testing on the street, and helping people space. The first question was the number of LAPD, LAFD. I don't have that offhand, but Claudia, we will follow up with you. My gut is it's less than 2 dozen between LAPD and LAFD. LAPD might be a little bit higher now, but I know it was low double digits for our fire department, and probably now, just given a bigger department, it might be a couple dozen LAPD officers, but I'll get you those numbers tonight. Next question, please.
And our last question in English comes from Elizabeth Chu. Please go ahead.
Hey, Liz. Go ahead, Liz.
Hi, Mayor. I was wondering if you have a number for how many tests have been administered among the homeless population, and also, if you don't have a number, how many tests you plan to administer next week.
Yep.
And also, I guess, I think that's all the questions I have.
Okay.
Now.
We don't have the numbers yet because we just started yesterday. I'll try to get those for you, but initially we offered to our healthcare partners that already have clinics on Skid Row, clinics in the community, and others, the tests. I don't know how many of them they've actually done. We have the capacity to give them over 1,000 a day, potentially, through the UPS partnership that we have, and maybe in future weeks up to 2,000 a day, though those tests are being shared also with those doctors I mentioned who work with seniors. So I hope by the end of this week we will have had certainly hundreds done, if not into the 4 digits, but I'll get a report back from probably in that 2 or 3 days from each of those providers about how many that they have done and how many we get. And if we get any initial numbers from the first day, I'll see if we can get those to you tonight. Okay? Thank you. I think that was the last English question, correct? Is there one more? Okay. So I will switch to Spanish now. Thank you all so much. Buenas tardes, Los Angeles.
All right, everybody, again, that was Los Angeles Mayor Eric Garcetti providing some comments there, the latest on the coronavirus situation out there. I'm going to take you back out to Connecticut, one of the hotspots here in the U.S. We were showing their briefing from earlier today with the Governor Ned Lamont, and then a live briefing came up, so we switched gears. Again, my name is Pilar Arias. You will probably not hear my voice again before I'm out of here for the night, but in about 33 minutes or so, Christy Larson's going to take over the stream for the rest of the evening. Me, Mike, and Christy, the full News Now host trio, will be here again tomorrow. And don't forget, even though we're not streaming on YouTube, we stream 24/7 on coronavirusnow.com, so you can always get your updates right there.
Those first responders we were just talking about over here who aren't sure whether they have a slight case of the cold or something more, that'll be invaluable to giving them the confidence they know whether to stay at home or can go to work safely.
Time, like a turnaround time? Because even last week we were hearing some people were waiting 8 days to get test results.
Yeah, it depends a lot on where the test is being conducted. So many of our
several of our hospitals now have in-house testing that they've set up for themselves, where they're turning those around very quickly for their inpatients, Yale New Haven, Hartford Healthcare in particular. Our state lab is a little backed up. It's taking a couple days to get through there at this point, but we've got additional staff on and working through that. Where you're hearing about some of the really severe lags, I think, have to do with some of the commercial labs, particularly the labs that are being fed by these drive-through testing centers, which are primarily sending those samples to LabCorp and to Quest, oftentimes out of state. And those commercial testing labs are significantly backed up right now. So we've been working to try to bring online additional testing capacity in state. So the Jackson Labs announcement last week, I think it was, they're working to increase the volume that they can test in state. And we're working with another lab that we hope to be able to announce in the coming days.
Everybody who gets tested doesn't necessarily have that test run. Do we have any numbers on that or no? There's a prioritization after you actually get the swab. So your test might not necessarily immediately go into the system to actually be tested.
Yeah, so again, I think it depends a lot on what the third parties are doing, the third party labs. I mean, in terms of like the state lab or the hospitals, the prioritization is all about admitted patients so that the decisions can be made quickly about what type of care they need, what room they need to be in. It has implications on how much PPE is consumed. So that's where the prioritization is happening for the in-state testing.
Health insurance in the state. You mentioned executives were meeting today. You mentioned, sounded like some promise would be coming either tomorrow or this week. Is there any guidance for a lot of these small business owners who have these group plans that maybe we found out that a lot of insurance companies are offering these extended grace periods, but they're not really advertised. You have to call up and they're doing it on a case-by-case basis. A lot of these employees are being terminated and having to terminate their employees. Any guidance or promise you can give?
Well, if they wanted to do it quietly, they can't with you keeping us on our toes on this. But I am very confident that nobody who's got COVID-related distress is going to have their health insurance cut off. I think the health insurers, and frankly all the insurers, property and casualty as well, are stepping up, just like the banks have done. And I'll be able to state that with more certainty tomorrow. Thank you for pressing that, because you're the guy that carried that water.
To mention that deposits are safe in federally insured banks and credit unions. Has there been an issue where people are trying to grab large sums of money out of banks locally, and is there some sort of guideline that banks are following right now?
There's been a couple, because people get nervous, but there has not been anything major. It's business as usual. Before this crisis, if you went to a bank, you want to take $100,000 out, good luck. Because they don't keep that kind of reserve in the actual branch. If you order ahead of time, yes, it could be arranged. There is no problem with cash. There's no problem with liquidity. And the Federal Reserve have made sure that the supply of actual cash is available. What we're concerned with is you walk out of a bank with a large sum of money, you could get robbed, you get hurt, you could lose the money. And unless there's a really good reason for that, I mean, we expect people, if you normally take out a couple $100 every week or $50, then you may take out a little bit more because you're doing more groceries or you may want to have a little reserve. But we don't expect that if you normally take out $50, then now you're going to take down $5,000, right? Now, if you want to do that, the money is there. We're not having any issues whatsoever with the money supply.
You have a 90-day grace period. At the end of 90 days, are they expected to pay 3 months back at once, or is it kicking the whole loan, kicking the can down the road, or how is it going to work after 90 days?
Every case is going to be a little different, but in general, what we expect is going to happen is it will be added at the tail end. So if you had 200 payments left, and you had 3 months forbearance, now you have 203 payments left.
For Josh, maybe. You gave a time frame on when individuals might be seeing that $1,200 check coming from the federal government. Any information or a time frame on the small business loans? I know a lot of small business owners might be waiting patiently to put that money to work and put it to the street. Any guidance on when that'll be coming?
I don't think we have any guidance to share on that today, but we're working hard on that.
Going back to the lag time you mentioned, I think you said 5 weeks lag time on the unemployment. If somebody is trying to apply today, are you also saying that their federal money, the $600 a week, will also be delayed since it's part of that process?
No, the federal, I believe, is a separate process, right, Josh? So that's independent from what we're doing in terms of getting our Connecticut checks out.
So it would not come to you all in one check? The federal and the state put together in one check does not work that way?
That's my understanding.
Federal legislation, some of it will be separate, some of it will be together. And it depends also on who the filer is and what the program is. So it's complex, but as the governor said, despite the challenges we're having processing all the claims, the payments will be retroactive, and so people will get their money.
And Chris, the toughest group are those independent contractors, those gig workers who maybe weren't traditional employees. And the Federal Act was good. It expanded unemployment compensation to that group. We have to set up that process, and so does 49 other states.
To us, actually, the 69 deaths reported, you said you got 50 ventilators sent to you this morning, was it, that they came in? Were any of those deaths specifically because of a lack of a ventilator present, do you know?
No.
No? Okay.
With that May 4th date, does that apply to schools? Do we expect schools to remain closed through at least May 4th now?
We haven't made any declaration post April 20th, and we'll be hearing from Miguel Cardona, the commissioner, on that very soon. But I've urged them, give parents, give superintendents as much notice as they can, because there's a high likelihood that it's going to go past April 20th.
Governor, so this morning you were interrupting the endless stream of Aerosmith songs on WPLR. You were talking about people over 60 staying inside. Knowing your age and what you said on the radio today, have you gotten tested yet? How do you feel, and when are you going to get tested?
I feel great. I have not, at this point, been tested. As I told Chaz and AJ, I'm at home probably 80% of the time, but I do feel some obligation to go get out in front of people every chance I can. I've been extraordinarily careful, I think, with social distancing. Test is to be determined.
Two last quick questions here. We keep getting messages about construction sites in the state. What are deemed essential, not essential? Is there a number that you're willing to put on how many people are on a job to make it essential, and if these people who are working should continue coming to work and working in close spaces?
Right now, we, as opposed to essential, non-essential, what we've said is if you can work safely. Those big outside projects, the Charter Oak Bridge, where you can easily have social distancing, those are the type of projects that we want to keep going. And I said in some cases we're able to do them better now because of the lack of traffic. Those tighter areas where you can't keep social distancing, maybe inside construction work, I just think that's dangerous, and I think that should stop.
Last question. A lot of people in the state might be fearful right now, seeing what's going on, if they have kids at home, if they're elderly, if they're parents, they haven't been able to see them. What's your message to the people of the state right now who might be scared?
That I'm a little scared as well. That this is something that's totally unique in American history. And this month could go a lot of different ways. And the only confidence I can give people is everything that we can control. I think we have the best people in the world working together, arm in arm, to get that done. Be it healthcare, be it economic security, what you hear here from the banks going forward. That which I don't control, like the PPE, like the ventilators, is a source of enormous frustration to me. And as I started out, you know, the fact that I'm asking first-line responders to go to war without all the protective gear they deserve is heartbreaking. But we are doing everything we can, and I know this state and this country is going to get out of this stronger. Thank you, everybody.
All right, everybody, that was shorter than I thought it was. So now we're going to head back out to California to finish out Governor Newsom's briefing from earlier today, unless we're getting another live briefing from somewhere else. I'm waiting here. Nope, we'll go back out to Newsom.
The Bay Area was also ahead of Los Angeles in that order. Do you see in your models a difference between the Bay Area and LA?
I think we have to be cautious in this space. I mean, you certainly can look at the numbers and you can jump to that conclusion, but all the experts around me want us to be cautious in terms of jumping to conclusions. It's still just too early to tell. I couldn't be more proud of the leadership within the San Francisco Bay region, but the leadership in Los Angeles is demonstrable as well. Mayor Garcetti was quick to move in this direction. So was the county. They all supported the stay at home for 65 and older, our seniors, which predated even those local announcements, and they began their preparations very, very early. So I think it's a sum total of all of these parts. But again, talk to me when we're doing our post-analysis, our post-action reporting. We are taking nothing for granted in this state, and we are doing everything we can to take advantage of these moments, not only to increase our surge capacity, but to continue to promote the slack within our hospital system that we have been able to advance by reducing the census, by eliminating those elected surgeries weeks ago in many instances, that are providing bed capacity that wouldn't even exist outside a COVID-19 epidemic.
Phil Willen, LA Times.
Governor, hi. I hope you're doing well.
Thanks, Phil.
This morning at the San Mateo County Board of Supervisors meeting, officials there expressed grave concern about the lack of PPE at Sinton Medical Center and also the need for more staffing. Just want to find out what the state is doing to address those needs.
Yeah, well, look, as you know, we brought Seton online. They have the capacity to go up to 220 rooms. They're not there yet for two reasons. The two you just brought up, staffing and PPE. So we're working to get that staffed up, as we are, Phil, it's relevant to you as the LA Times reporter, St. Vincent, and we're making real progress there, which we hope to announce in the coming days on staffing and PPE. I made the point, we have 100+ million N95 masks alone. That's not the coveralls, that's not the shields, that's not the gowns, that's not the glove sets, that's not the surgical masks. That's just a proxy for PPE writ large. The magnitude of 100+ million mask order gives you a sense of the magnitude of the anxiety at the local level about the need. And so we need to do more, and that includes San Mateo County, includes every county, candidly, in this state. And we are in real time. As soon as it comes in, we are getting it out. And now that includes making sure we pre-position our ventilators that are being refurbished, not only in the state cache, but also those ventilators that came from the federal cache, and making sure that they're geographically pre-positioned so that we don't get more questions like yours, which is completely legitimate and recognizable because it's amplified by hospitals, not just systems and counties throughout the state.
Christine May-Duck, Wall Street Journal.
Thanks for taking our questions, Governor. I appreciate it. You talked a little bit about the modeling and how, the state's increase in numbers recently has kind of matched their modeling. There's modeling coming out of the University of Washington researchers as well that has demonstrated that California so far is starting to flatten the curve that they had expected initially last week, that the total number of deaths in California could be in the 6,000 range. Now it's down to the 4,000 range. Does not match the modeling that the state has been doing. And we also wanted to know, how early you and others in the state looked at modeling and how that played into your decisions early on to do social distancing measures.
Well, we leaned in on the modeling very aggressively and generated a little controversy around putting out numbers in a very forthright manner that generated some headlines and some anxiety, but it was a proof point of our modeling protocols and practices. I mentioned at the time that we had early on, before we even socialized publicly, began our modeling protocols using not just our traditional health system modeling, but supplementing it with geographic movement and information that's publicly available from companies like Facebook and Google and others, working with Esri, working with Blue Dot, and looking at travel propensity within populations within the state, and running models along those lines before we socialized the quote-unquote attack rate that we did. That modeling is iterative. That modeling is constantly being reviewed, updated. We got John Hopkins numbers that we overlaid, obviously with the anxiety that we all had around what was happening in Italy. We had updated our modeling in real time a week or two ago around issues that were self-evident in Spain, not just Italy, and other parts of the globe. But I will say this, to be truthful and candid, the current modeling is on the lower end of our projection as I talk to you today. Very easily tomorrow, I could say something differently. And that's why just one has to be very cautious about this. We run best case, worst case, and a likely case. But it assumes the most important piece, not AI, not big data, not just mortality rates, hospitalization, and ICU rates from other parts of the state or around the globe. It is absolutely required of individuals to make the determination themselves of what those models look like through individual decisions. And modeling means nothing if individuals don't continue to practice physical distancing, social distancing, and continue to do the right thing at the stay-at-home order. That is the most profound and impactful part of bending the curve. And I think because Californians have done such, I think to date, an exceptional job of meeting this moment, and we see that in the data of movement that we have throughout the state, not just anecdotal as you walk or drive around, but we continue that practice, then I think we can meet this moment. But again, these numbers are dynamic, and a week ago, we were not anticipating necessarily a tripling in a few days, the ICU beds. We saw a 10% reduction, or down 10% increase, forgive me, yesterday, but it just shows you the dynamic nature. But I think it's well within our current projections, but I caution how we report those.
Kathleen Renane, AP.
Hi, Governor. I just want to understand a little bit more your comments yesterday that our peak is probably going to be in mid-May and how that peak relates to our hospital capacity. So you've talked about a surge capacity need for 50,000 additional hospital beds. So under our modeling, you know, when we hit our peak, are all of those beds filled up? When we hit our peak, is that when we start needing those surge beds? How does the peak kind of match with our available hospital beds?
So first, thank you for bringing up the 50,000 number, and I'll remind folks and folks that haven't been watching prior, the 50,000 number is phase one. When we launched the 50,000 number, when we made that public, 75,000 beds licensed within the existing 416 hospitals. The 50,000 phase one surged to 125,000 rooms that we are looking to procure, which 30,000 would be done within the hospital system, a 40% surge for the hospitals, and then the rest would come from the state. That was phase one. As it relates to our modeling, that is true. People are talking a lot about when's peak. I saw a headline today, someone saying peak in the country maybe April 15th. That does not reflect California's reality based on our modeling today. We expect that peak, as you suggest, as was mentioned by Dr. Galley yesterday, more likely in May. There is a worst-case scenario, phase two of our planning that we are working on with our Office of Emergency Services, Mark Gilladucci and others, working with the Army Corps of Engineers, working with our teams here that have capacity that's substantially greater than 50,000. Let me be specific. You heard from me a few weeks ago. I talked about the conversations we had with Janet Napolitano and Tim White at the UC system and the CSU system. Both systems have identified over 5,000 beds respectfully. As an example, that would be phase two. We've already identified a number of hotel opportunities beyond those that we're making available for our homeless, which would also be part of that second phase. We are working with the Army Corps of Engineers to look well beyond what we've already communicated, be it the Sleep Train Arena or Oakland Coliseum. We're also looking at LA Forum and other places that would be part of that extended phase. phase. So I hope that gives you some deeper clarification, and we're happy to have Dr. Galley flesh more of that out tomorrow and the next day. But I feel very confident in our current modeling and that 50,000 number for phase 1.
Tiffany Stecker, Bloomberg.
Yes, thanks, Governor. I had a question regarding your executive order yesterday in the health corps. Do you foresee at any point having to bring in healthcare professionals from out of state, perhaps states that are less affected by the virus?
You know, I'll be honest with you. If you asked me that this time yesterday, I may have said yes. We were overwhelmed. I don't want to be hyperbolic about this. I don't want to be accused of overstating, but 25,000 people with licenses that filled out the application, that went through that 5-step process, that said, you know what, we're ready to step up. That was extraordinary in less than 24 hours. So the answer today is no. Today. We'll vet all those 25,000. I'm not naive. Not everyone is going to fit a need particular. Maybe too many folks that are expert anesthesiologists. We don't need as many. Too many EMTs, too many pharmacists, too many nurses, too many, who knows. But I feel like, based on the spirit that I've seen the last few days, that we can meet this moment domestically within the state. And to the extent we have capacity beyond that, we're going to make ourselves available to anybody across this country that needs support as well.
Marissa Kendall, Bay Area News Group.
Hi. I was wondering, we've had several coronavirus infections reported here in the Bay Area among local grocery store workers. Yeah. And I was wondering if the state was doing anything to ensure the safety of those folks who work in essential fields like grocery stores and still have to go to work, and prevent them from getting infected, as well as infecting the customers who need those services.
I appreciate the question. I mentioned a couple of days ago, and it deserves to be restated. A close friend of mine, John Grant, who runs one of the largest grocery unions in the United States, UFCW, here in the state of California. And John called me very emotional about the loss of a life of one of his members, and said, you need to be reminded, Governor, that the grocery lines are also the front lines of this virus. And my members are showing up to work not on the unemployment line. They're volunteering themselves, and they're quite literally now putting their lives on the line to make sure that they meet the essential needs of Californians all up and down this state. And there was a frame of heroism in his recognition of his members, and I think it deserves to be socialized with the rest of us. These folks are putting their health at risk, and they are meeting the moment. And to answer your question specifically, we need to do more for them. And we haven't done as much as we need to do for them, to provide them the kind of breaks that they need to wash their hands, to provide the kind of support they need to get protective gear, and to make sure that they're safe and healthy. And I want you to know that I don't just identify a problem. We're trying to solve that problem in real time. And we're working with the grocers, representative associations, and the unions to see if we can accommodate more appropriate safety measures for those grocers that you rightly recognize deserve our respect, and in some case, reverence.
Felix Michelson, Fox 11.
Thank you, Governor. Alex Michelson here. Big picture question about you. This has got to be the biggest leadership test of your life. I'm wondering, how are you doing right now? And also, to that point, to see the extraordinary, as you mentioned, 25,000 Californians coming forward, and all the different Californians coming in, all different businesses and everything that they're doing, what you make of the way that California is responding to this, and what the rest of the country can learn from what California is doing.
There's an energy all across this country, and there's extraordinary leadership with governors of large states, small states, all across this country. They all deserve incredible credit for meeting this moment. But there's something I talk a lot about, Alex, and you know this. I talk about the issue of difference between people in formal positions of authority and people that every day exercise their moral authority. Today we're celebrating the life and times of Cesar Chavez, not the former governor of California, but one of the world's great leaders, happened to be from California, and led the work to organize the farm workers and have provided so much bounty that so many of us take for granted. What he had was moral authority. And leadership, I'm discovering at this moment, can be found everywhere. Individuals every day leading a cause at a church. And by the way, the churches are stepping up to reach out to our seniors. A leader in a school, I saw a DIY or DIY, do-it-yourself model that came out of a local.
All right, sorry about that, guys. Had a little bit of trouble there with our tape playback of Governor Newsom. Again, he's from California, talking about the latest with coronavirus. So let's move things along here. Going to take you down to Texas to listen into what their governor had to say about an update on schools. They are not going to be back in session until May 4th, and other updates about coronavirus in the state of Texas.
Gratitude to all of our fellow Texans for your tremendous efforts that you've made over the past few weeks to slow the spread of the coronavirus. By staying at home, by reducing personal interactions, you are saving lives and you are improving the health of people across our entire state. Let me give you some updated information and then go into more detail. One thing that we continue to do, we continue to administer more tests to determine whether or not someone has COVID-19. As of noon today, 42,922 Texans have been tested for COVID-19. Of those tested, 3,266 have confirmed positive for COVID-19. Now there are 122 counties in the state of Texas that have at least one reported case of COVID-19. Very importantly, if you look at the number of people who are hospitalized, we still have only 2.4% of the hospital beds available in the state of Texas for COVID-19 patients are occupied, meaning that 97.6 of those available beds still remain vacant, available for anybody who may contract COVID-19. With heavy heart, I share with you that we have now lost 41 Texans to fatality connected with COVID-19. Importantly, as you look at the numbers that we're talking about, it still remains true that less than 10% of the people who were tested test positive for COVID-19, and just over 11% of those who test positive need to go to the hospital. Most of these numbers, very importantly, were the result of personal interactions of people in the state of Texas before the distancing practices that have gone into place the last couple of weeks. So it is one thing that is clear. When you look around your community, like I have here in Austin, or as I have seen either videos or photographs from so many different regions across the entire state of Texas, one thing that is clear, and that is distancing practices that you all are doing, they're working. There are fewer people out who can transmit the disease from one person to another. But, as President Trump said just 2 days ago, now is not the time for us to let up in these distancing efforts. Now is the time instead to redouble our efforts to make sure that we do more to rid ourselves of the coronavirus. 2 days ago, the President extended the nation's effort to stop the spread. He extended the deadline until April the 30th, and he reiterated the need for social distancing strategies that have proven to be effective. So consistent with the guidelines offered by the President, by the CDC and based upon advice by Dr. Hellerstadt of the Texas State Health Services Department here in Texas, as well as Dr. Birx and Dr. Fauci, who advised the President and the United States operation to combat the coronavirus. I am also modifying my previous executive order about social distancing protocols in Texas to further reduce the spread of COVID-19, to maximize the number of lives that we can save. I'm issuing Executive Order GA-14 that establishes or that maximizes the number of lives we can save. I'm establishing essential services and activities protocols. In short, what this provides is that Texans are expected to limit personal interactions that can lead to the spread of COVID-19, while also still having the freedom to conduct daily activities such as going to a grocery store, so long as you are following the presidential standard of good distance practices. This decision that I'm announcing today is based upon data and based upon recommendations by state and federal healthcare authorities. The Essential Services and Activities Guidelines the Essential Services Guidelines are taken from the U.S. Department of Homeland Security guidance on the essential critical infrastructure workforce. The Essential Activity Guidelines are connected to the Essential Services Guidelines. The list of allowed services can be found at www.tdem.texas.gov/essential services. I'll repeat that, but you can find it online also. The list of allowed essential services can be found at www.tdem.texas.gov/essential services. Now, as I mentioned, essential activities are activities that the everyday Texan would be involved in. And the essential activities are kind of obvious based upon the essential services that are provided. But I want to give you some examples. Essential activities include any activity to access essential services like going to a grocery store, going to a bank, going to a gas station, getting supplies from a hardware store. Importantly, it includes maintaining physical activity, which is so important at this particular time. Activities like jogging or biking and hunting and fishing are permissible, so long as precautions are maintained to reduce the transmission of COVID-19 and to minimize in-person contact with others. Also importantly, religious activities may continue, but should either be conducted by remote services or, if conducted in person, should be consistent with the guidelines from the President and the CDC that describe appropriate social distancing to prevent the spread of COVID-19. An example of a type of service I've heard about that some churches are interested in having, especially at the time of Easter, would be what's called drive-up services, where a family unit would remain contained in a car that they drive in and would not expose themselves to others. That seems like it would satisfy the criteria that we're talking about. Importantly, all critical infrastructure will remain operational. Domestic travel is still allowed so long as it minimizes personal interaction. Governmental entities and businesses will continue providing essential services. Businesses not categorized as essential can continue to operate from home through the use of technology. This order will remain in place through April 30th, 2020. The order provides that schools will continue to remain closed until Monday, May the 4th, unless otherwise extended. As the coronavirus has spread across the land at a time when lives are literally at risk, Texans continue to rise to the occasion. The efforts of Texans across the entire state have slowed the spread of the coronavirus. But, as the President has made clear, we are not yet done with our response. We cannot forfeit the gains that we have already made by cutting short our task. We've come too far to falter now. We have made tremendous strides, but we have not yet reached our destination. We have more to do for Texas to reach its determined destiny. Together, we will persevere through this for another month. Together, we are going to heal our state. Together, we will ensure that the Lone Star State continues to shine. Now I'm going to pass it over to Lieutenant Governor Dan Patrick.
Thank you, Governor. A few weeks ago when we were in this room, I talked about 29 million Texans being really on the front line with our healthcare workers, our first responders, the folks that work in the grocery stores. But you're on the front lines, 29 million Texans. And because you followed the governor's orders and these guidelines over the last several weeks, per capita, if you look at the death rate in Texas, per capita of 29 million people, we're one of the lowest in the country. But we need to continue that for the rest of April and even be better at that so that we prayerfully and hopefully can keep our numbers low as all of us want. So as the governor said, follow these guidelines, be very smart in all of your travels when you leave home. If you do not have to leave home, do not do so. But this balance that we have struck in Texas and that the governor's led on has worked to date because 29 million Texans have taken it to heart, and we are standing and working together. And so please continue to do that.
Thank you. And now, Speaker Dennis Bonnen.
Thank you. I'll begin with a quote from Winston Churchill. He said, "It is not enough that we do our best. Sometimes we have to do what is requested." We're requesting Texans to continue to social distance, to continue to stay at home if you are not essential to the infrastructure of Texas. We're asking you to stick together like all of us and continue this process for 30 more days so that Texas can continue to be the leader in defeating COVID-19. Social distance, stay home if you're not essential. Go out and enjoy a walk, enjoy a jog, but be conscious of your friends and your neighbors because we are all in this together. And the better we do this together, the sooner we will be out of this together. And I appreciate the governor's leadership in this executive order, and we support him in getting Texas to the other side of this effort. Thank you.
Thank you, Speaker. And now, Dr. Hellerstedt.
Thank you, Governor Abbott. The executive order that the governor has announced is based on very sound public health policies and principles. And this will only increase our ability to slow down the spread of COVID-19 throughout Texas, and that is absolutely the goal. When we look around, we see people are responding. We should have great confidence in that. We should feel a great sense of our own community pride because we are doing the things that we know are going to work, and we should have confidence in that. And I believe that over time we're going to be able to measure the fact that we've had an impact on the rate of spread of COVID-19 in our state. And that's what everybody wants. We want to stay safe, and the measures that are outlined in the executive order are absolutely intended to make that happen. Thank you, Governor.
Thank you, Doctor. And now, Chief Nimkid.
Thank you, Governor. I'd like to reiterate the directions you've given to us, and one is to maintain the health and safety of Texans at the utmost priority. The second is to make sure that our healthcare workers and first responders have the necessary materials and supplies that they need. And the third is to ensure that our critical infrastructure safely stays up and running. The order today and the tools that we have give us that capability.
Thank you. And now, the Commissioner for the Texas Education Agency, Mike Morath.
Thank you, Governor. Our system of public education in Texas serves 5.5 million souls, little bundles of energy trying to become the best versions of themselves. And like many parents in Texas, I'm a parent with 2 young children, and we are wrestling with a new reality. For the parents listening at home, we will work through this. We will get through this together. For a little bit more time, we all must remain apart so that we can come back together. Our educators all over the state of Texas, working with love and diligence, are doing everything in their power to support parents all over the state of Texas, and we will continue to do so for the duration of this executive order and beyond.
Thank you. And let me just close with this. I want to say something to each one of you. Every single one of our fellow Texans is important to our state. We care about your health. We want you to stay healthy. Please do everything you can over the next days throughout the remainder of April to make sure that you stay healthy, that when we come out of this cloud of uncertainty, of this time period when we are minimizing our contact, that you'll be healthy, your family will be intact, and that we will be reinvigorated once again as the premier state in the United States. With that, we'll take some questions.
Governor, you've been adamant that your previous statewide restrictions on the schools was not shelter in place or stay-at-home order. These increased restrictions on businesses, would you classify it as that?
So would you repeat the last part of the question?
Yeah, with these now increased restrictions on businesses, it's essential services and non-essential. Would you classify now this as a shelter in place or stay-at-home order for statewide in Texas?
Well, candidly, when people talk in terms of shelter in place, what shelter in place really means as a term of art would mean that wherever you may be at a particular time, you need to take shelter immediately right there. Whether you are at your home or some other location or in a roadside ditch, wherever you may be, you're supposed to take shelter because of something like a tornado would be coming. So shelter in place is not a good term to use for any of these strategies that have been articulated by anybody. Similarly, this is not a stay-at-home strategy. A stay-at-home strategy would mean that you have to stay at home. You cannot leave at home under any circumstances. That obviously is not what we've articulated here. This is a standard that's based upon essential services and essential activities. Those who are involved in essential services, as defined by the United States Homeland Security, will be able to continue to provide those essential services. Similarly, those who want to access those essential services like grocery stores or hardware stores or financial facilities have the ability to access them. In order to access them, on occasion, that may mean leaving your house, going to wherever it is you need to go. Similarly, as I indicated, personal health and physical activity are important always, but particularly at this point in time. Going for a jog, going biking, other forms of outdoor exercise are very important. However, doing so in groups would be potentially hazardous to your health. So we encourage people to continue to maintain active lifestyles, but do so in ways that maintain the distancing practices that have been articulated by the President, by CDC, and make sure that you are not exposing yourself to anybody who may have COVID-19.
How can you enforce an order like this?
It's enforced. What the executive order does, it empowers any law enforcement officer in the state of Texas to enforce it. It's enforceable by either a fine or jail up to 180 days. And once again, any law enforcement officer in the state of Texas can impose it. And I can say this, if this executive order is violated, Commissioner Hellerstedt already has issued his own executive order that exists such that anybody who violates this can be subject to a quarantine order.
You mentioned that right now we do have enough hospital beds for the patients that we're seeing. What about when it comes to PPE equipment? We have heard some stories that in Dallas people are being asked to, reuse that equipment, things like that.
First I will tell you that we're so proud of our fellow Texans for stepping up and offering things such as PPE, whether it be masks, whether it be gloves, whether it be gowns, or whatever the case may be. Also, I'm proud that a team that's working with Chief Dim Kidd has been doing a terrific job to access all channels to increase our supply of PPE and other items. And I'll let Chief Dim Kidd explain more about that.
Thank you, Governor. And we're hearing the same thing. It's a very valid question. There's no secret that the supply chain has taken quite a shock. But what we also, when the governor's been talking to hospital CEOs, they're on a rationing program right now so that they don't completely run out. Where in normal days it might be one mask to one provider per each patient, CDC guidelines and the things that we're asking all of our responders and healthcare workers to do is to, at best if possible, try to use one mask per one provider per one shift. Now, if the mask gets compromised or gets wet, we want to change that out. I can tell you on the front end, how we use it will help determine how much we have. On the back end, our team is working very hard at an international level to find the right personal protective equipment that's going to come in and be distributed in a very rational and bed count and population-driven manner. We want the most need going to where the resource is needed so that we don't have any waste at this critical point in time and make sure that we don't have any shortages either. So we're working very hard around the clock to make that happen.
I'll add also that the governors have once or twice a week conference calls with the president, the vice president, Dr. Birx, sometimes Dr. Fauci, who was on the phone call yesterday. And the point was made yesterday by both the president and the vice president about the additional investments made for additional supplies that are coming. And so they are constantly, they at the federal level, are constantly working on increasing supplies. And we are anticipating far greater supplies coming forward, just like what we've seen with regard to the massive percentage increase in the number of tests that have been administered.
We've seen on a local level, even with local stay-at-home orders, on businesses, that there are kind of differences between counties, and with this kind of being statewide now, determinations of essential services, when questions arise maybe for businesses if they're not kind of following those central categories or those kind of gray areas, will they have to kind of go through the state plan to get clarity on whether they're essential to remain open or?
So this executive order has some specific paragraphs. I'm talking about what it does and what it does not do to override local ordinances or county rules. To the extent that any county or local jurisdiction has any rule that's inconsistent with this executive order, it is overridden in this executive order. And so to the extent, for example, that religious services are permitted as specified in this executive order, they cannot be denied by a local ordinance or local order. However, to the extent that there are things that are not mentioned in this executive order, it still gives local jurisdictions the latitude to establish their own rules.
So local jurisdictions could go stricter in some areas?
Yeah, to the extent that it's not overridden by this executive order, local jurisdictions do still have the flexibility to impose standards that they may consider to be more strict.
Reports today say that the CDC is considering telling the public to wear face coverings. Is that under consideration in Texas?
Would you repeat the first part of the question again?
Yeah. So the CDC is now considering telling the public to wear face coverings, like masks, things like that. Is that something that's under consideration in Texas?
So what I will consider is any order or any type of item that is offered up by the CDC as a possible standard to consider will be something we will consider. My prior executive order was based upon CDC-based standards. This current executive order is largely based upon CDC standards as well as some other federal standards. And we want to stay connected to the standards that are established by the federal government. And we will look into any standards that are established by the CDC for consideration.
There's been reports that some local officials kind of not received the same data the state has in terms of hospital capacity and things like that. They've kind of issued their own kind of local requirements and to have that reported to them locally on a daily basis. Is there plans for that kind of data, possible capacity that the state's going to share that with local officials to collaborate on that response for healthcare facilities locally? Or?
We want to achieve the highest level possible of collaboration and sharing of information, and we know that's a two-way street. And so we've been mandated or required by the federal government to impose information gathering standards for the local governments to provide certain information to the state health services for us to be able to in turn provide to the CDC. On top of that, I could understand what I'm hearing from you. There may be needs or desires from local governments to get access to certain information that we have. To the extent that's possible, to the extent we can create information channels to accomplish that goal, I think we should do it. And so one thing that all of us do, it could be Dr. Hellerstedt, it could be Nim Kidd, it could be Mike Morath, or it could be any of us. We are constantly visiting with local officials to try to provide them either the resources that they need or the information they need. And we want to maximize that to the extent possible.
With this executive order now extending school closures through early May, does that also apply then to your earlier restrictions on dining in restaurants? Will those also all be convicted?
Yeah, absolutely. So contained in this executive order is the extension of the prohibitions of certain types of businesses from operating altogether. Bars and restaurants, however, want to clarify, we strongly encourage people to utilize restaurants for food, whether it be for pickup or delivery or otherwise. And then we have also outlined some additional businesses in here to make sure that everyone understands they are closed. I'll list what it says here, and that is that people shall avoid eating or drinking at bars, restaurants, and food courts, or visiting gyms, massage establishments, tattoo studios, piercing studios, or cosmetology salons, provided, however, that the use of drive-through pickup or delivery options for food and drink is allowed and highly encouraged throughout the limited duration of this executive order.
Are you at all concerned kind of with the spread of these facilities across Texas? And can you share any more details on exactly what tests have been done and plans you have for state?
Right. First, I will tell you, as we also list in here, we emphasize the importance of making sure whether they be state-supported living facilities or senior living facilities, and we have several different categories in here. I would categorize that as a top priority. Obviously, they often involve what are categorized as vulnerable populations. And so we want to elevate our surveillance and our assessment of those populations, as well as our protection of those populations, which is why in this order there are strict limitations on who can and cannot gain access to those facilities. But also, as you may have observed, we have increased testing at some of these facilities, and we look to continue that because of the vulnerability. And so we want to do all we can to protect all lives in Texas, especially those that fall into the categories that you mentioned who are the most vulnerable.
Are there any plans in place to help the Texas Workforce Commission at this time? Apparently they are saying that they are overwhelmed with calls. A lot of people are able to access the website, can't file their claims.
I know many of you are seeking unemployment and unemployment insurance claims that you want to get filed, and know that we are adding people by the hundreds to help you respond to those claims. We are dealing with truly an unprecedented number of people who are applying for unemployment insurance. The good news is the money is there. The federal government has done a fabulous job of making sure that the funding will be available for those who are experiencing unemployment at this time. So just know that you're not going to be denied your claim simply because you're having a hard time getting through. But know this, and that is we understand your need and your need for speed. As a result, we have both hired more people on a temporary basis to help respond to these claims, as well as bringing in current employees from other agencies or other employment status to help out in this crunch time to accelerate the timetable of response to help you get your claim.
Is the statewide stay-at-home order still being considered or on the table? And what kinds of factors would that require you to issue one and continue?
So I will always remain flexible on whatever standard is going to be best for the people of all 254 counties in the state of Texas. And those decisions will always be based in part on what Dr. Hellerstedt says, in part on what NIMKID says, in part upon what our federal advisors and counterparts say, whether it be the CDC or Dr. Birx, Dr. Fauci, and the presidents. All of them have, and the vice president,